Hey, Alpha Nurses, I'm Messenger from alphanurseguide.com. This is 1,000 NCLEX questions. Without delay, let's get started.
A client has undergone a laparoscopic cholecystectomy. Which of the following instructions should the nurse include in the discharge teaching? 1. Empty the bile bag daily. 2. Breathe deeply into a paper bag when nauseated. 3. Keep adhesive dressings in place for 6 weeks. 4. Report bile-colored drainage from any incision. The correct answer is 4. Report bile-colored drainage from any incision. There should be no bile-colored drainage coming from any of the incisions post-operatively. A laparoscopic cholecystectomy does not involve a bile bag. Breathing deeply into a paper bag will prevent a person from passing out due to hyperventilation. It does not alleviate nausea. If the adhesive dressings have not already fallen off, they are removed by the surgeon in 7 to 10 days, not 6 weeks. A 78-year-old client is admitted to the emergency department with numbness and weakness of the left arm and slurred speech. Which nursing intervention is priority? 1. Prepare to administer recombinant tissue plasminogen activator. 2. Discuss the precipitating factors that cause the symptoms. 3. Schedule for a stat computed tomography scan of the head. 4. Notify the speech pathologist for an emergency consult. The correct answer is 3. Schedule for a stat computed tomography scan of the head. A CT scan will determine if the client is having a stroke or has a brain tumor or another neurological disorder. If a CVA is diagnosed, the CT scan can determine if it is a hemorrhagic or ischemic accident and guide treatment. The client diagnosed with chronic kidney disease is prescribed apoetin. Which statement best describes the scientific rationale for administering this medication? 1. This medication stimulates red blood cell production. 2. This medication stimulates white blood cell production. 3. This medication is used to treat thrombocytopenia. 4. This medication increases the production of urine. The correct answer is 1. This medication stimulates red blood cell production. Apoetin, a biologic response modifier, is a glycoprotein produced by the kidney that stimulates red blood cell production in response to hypoxia. It is prescribed to treat the anemia that occurs in clients diagnosed with CKD. Filgrastim is the biological response modifier that stimulates WBCs and is not used in the treatment of CKD. Oprelvacin is the biological response modifier that stimulates megakaryocyte and thrombocyte production, which stimulates platelet production to prevent thrombocytopenia in clients receiving chemotherapy. There is no medication that increases the production of urine. Diuretics increase the excretion of urine, but do not affect the production of urine. What can an electrocardiogram detect? Select all that apply. 1. Ischemia. 2. Injury. 3. Cardiac output. 4. Dysrhythmias. 5. Systemic vascular resistance. 6. Occlusion pressure. 7. Conduction delay. The correct answers are 1. Ischemia. 2. Injury. 4. Dysrhythmias. 7. Conduction delay. An electrocardiogram can indicate ischemia of the heart muscle. An electrocardiogram can indicate injury to the heart muscle. An electrocardiogram can show dysrhythmias. An electrocardiogram does show conduction delays. An electrocardiogram does not indicate cardiac output. An electrocardiogram does not show systemic vascular resistance. An electrocardiogram does not show occlusion pressures. The electrocardiogram checks the electrical system of the heart, not the mechanical system. Cardiac output is mechanical. Occlusion pressure does not have to do with the electrocardiogram, and systemic vascular resistance measures pressures in the peripheral system.
The nurse is planning care with a Mexican client who is diagnosed with depression. The client believes in Mal Oyo, the evil eye, and uses treatment by a root healer. The nurse should do which of the following? 1. Avoid talking to the client about the root healer. 2. Explain to the client that Western medicine has a scientific, not mystical, basis. 3. Explain that such beliefs are superstitious and should be forgotten. 4. Involve the root healer in a consultation with the client, primary healthcare provider, and nurse. The correct answer is for involve the root healer in a consultation with the client, primary healthcare provider, and nurse. Rationale. Including the root healer gives credibility and respect to the client's cultural beliefs. Avoiding talking about the healer demonstrates either ignorance or disregard for the client's cultural values. Negative comparison of root healing with Western medicine not only denigrates the client's beliefs, but is likely to alienate and cause the client to end treatment.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. Which statement by the student nurse to the 21-year-old pregnant woman who smokes would require the supervising nurse to intervene? 1. Pregnancy is an excellent time to quit smoking. 2. Vaping instead of smoking during pregnancy is less risky. 3. You should not allow anyone to smoke around you during pregnancy. 4. You should not allow anyone to smoke around the baby when she is born. The correct answer is 2. Vaping instead of smoking during pregnancy is less risky. The nurse would need to intervene to correct erroneous information being given to the patient. Vaping is not safer than smoking in pregnancy. Babies born to mothers who vape have levels of nicotine exposure, low birth weight, and shortened gestational age equal to infants born to mothers who smoke. Clear advice about pregnancy being an excellent time to quit and then providing resources to do so is appropriate education. Advising the mother to avoid secondhand smoke during the pregnancy and after delivery is appropriate advice. A client has chest pain rated at 8 on a 10-point visual analog scale. The 12-lead electrocardiogram reveals ST elevation in the inferior leads and troponin levels are elevated. What is the highest priority for nursing management of this client at this time? 1. Monitor daily weights and urine output. 2. Permit unrestricted visitation by family and friends. 3. Provide client education on medications and diet. 4. Reduce pain and myocardial oxygen demand. The correct answer is 4. Reduce pain and myocardial oxygen demand. Nursing management for a client with a myocardial infarction should focus on pain management and decreasing myocardial oxygen demand. Fluid status should be closely monitored. Client education should begin once the client is stable and amenable to teaching. Visitation should be based on client comfort and maintaining a calm environment. The nurse is completing a health assessment of a 42-year-old female with suspected Graves' disease. The nurse should assess this client for 1. Anorexia, 2. Tachycardia, 3. Weight gain, 4. Cold skin. The correct answer is 2. Tachycardia. Graves' disease, the most common type of thyrotoxicosis, is a state of hypermetabolism. The increased metabolic rate generates heat and produces tachycardia and fine muscle tremors. Anorexia is associated with hypothyroidism. Loss of weight, despite a good appetite and adequate caloric intake, is a common feature of hyperthyroidism. Cold skin is associated with hypothyroidism.
A client is admitted to the hospital for evaluation of recurrent episodes of ventricular tachycardia, as observed on Holter monitoring. The client is scheduled for electrophysiologist studies the following morning. Which statement should the nurse include in a teaching plan for this client? 1. You will continue to take your medications until the morning of the test. 2. You might be sedated during the procedure and will not remember what has happened. 3. This test is a non-invasive method of determining the effectiveness of your medication regimen. 4. During the procedure, the doctor will insert a special wire to increase the heart rate and produce the irregular beats that cause your signs and symptoms. The correct answer is 4. The purpose of EPS is to study the heart's electrical system. During this invasive procedure, a special wire is introduced into the heart to produce dysrhythmia. To prepare for this procedure, the client should be NPO for 6 to 8 hours before the test, and all antidysrhythmics are held for at least 24 hours before the test in order to study the dysrhythmia without the influence of medications. Because the client's verbal responses to the rhythm changes are extremely important, sedation is avoided if possible. An 11-year-old is admitted for treatment of an asthma attack. Which of the following indicates immediate intervention is needed? 1. Thin, copious mucus secretions. 2. Productive cough. 3. Intercostal retractions. 4. Respiratory rate of 20 breaths per minute. The correct answer is 3. Intercostal retractions indicate an increase in respiratory effort, which is a sign of respiratory distress. During an asthma attack, secretions are thick, the cough is tight, and respiration is difficult. If mucus secretions are copious but thin, the client can expectorate them, which indicates an improvement in the condition. If the cough is productive, it means the bronchospasms and the inflammation have been resolved to the extent that the mucus can be expectorated. A respiratory rate of 20 breaths per minute would be considered normal and no intervention would be needed. A nurse is caring for a client who has just returned from surgery to treat a fractured mandible. Which of the following items should always be available at this client's bedside? Select all that apply. 1. Nasogastric tube. 2. Wire cutters. 3. Oxygen cannula. 4. Suction equipment. 5. Code cart. The correct answers are 2 and 4. Following surgery for a fractured mandible, the client's jaws will be wired. The nurse should be prepared to intervene quickly in case the client develops respiratory distress or begins to choke or vomit. Wire cutters or scissors should always be available in case the wires need to be cut in a medical emergency. Suction equipment should be available to help clear the client's airway if necessary. It is not necessary to keep a nasogastric tube or oxygen cannula at the client's bedside. Cardiopulmonary arrest is unlikely, so a code card is not needed at the bedside.
A client is receiving an IV infusion of heparin sodium at 1,200 units per hour. The dilution is 25,000 units per 500 milliliters. How many milliliters per hour will this client receive? The correct answer is 24 milliliters per hour. To solve this problem, first, calculate how many units are in each milliliter of the medication. The questions gives us 25,000 units per 500 milliliters. 25,000 units divided by 500 equals to 50 units. 500 milliliters divided by 500 equals to 1 milliliter. So it's 50 units per 1 milliliter. Next, calculate how many milliliters the client receives per hour. Since the client is receiving 1,200 units per hour and there is 50 units per 1 milliliter, we divide 1,200 by 50, which equals to 24. So the client is receiving 24 milliliter per hour. The nurse is assessing a client experiencing motor loss as a result of a left-sided cerebrovascular accident. Which clinical manifestations would the nurse document? 1. Hemiparesis of the client's left arm and apraxia. 2. Paralysis of the right side of the body and ataxia. 3. Homonymous hemianopsia and diplopia. 4. Impulsive behavior and hostility toward family. The correct answer is 2. Paralysis of the right side of the body and ataxia. The most common motor dysfunction of a CVA is paralysis of one side of the body, hemiplegia. In this case, with a left-sided CVA, the paralysis would affect the right side. Ataxia is an impaired ability to coordinate movement. Which intervention should the nurse implement when administering epoetin subcutaneously? Select all that apply. 1. Do not shake the vial prior to preparing the injection. 2. Apply a warm washcloth after administering the medication. 3. Discard any unused portion of the vial after pulling up the correct dose. 4. Keep the medication vials in the refrigerator until preparing to administer. 5. Administer the medication intramuscularly in the deltoid muscle. The correct answers are 1. Do not shake the vial prior to preparing the injection. 3. Discard any unused portion of the vial after pulling up the correct dose. And 4. Keep the medication vials in the refrigerator until preparing to administer. Do not shake the vial because shaking may denature the biological response modifier, epoetin, rendering it biologically inactive. The nurse should only use the vial for one dose. The nurse should not re-access the vial and should discard any unused portion because the vial contains no preservatives. The medication should be stored in the refrigerator and should be warmed to room temperature prior to its being administered. The nurse should apply ice to numb the injection site, not a warm washcloth after administration. This injection is administered subcutaneously, not intramuscularly. A newborn is diagnosed with a congenital heart defect. The test results reveal that the lumen of the duct between the aorta and pulmonary artery remains open. This defect is known as blank. The correct answer is patent ductus arteriosus. This is a defect with increased pulmonary flow. It should close in the first few weeks of life. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
After a period of unsuccessful treatment with amitriptyline, a woman diagnosed with depression is switched to tranylcypromine. Which statement by the client indicates the client understands the side effects of tranylcypromine? 1. I need to increase my intake of sodium. 2. I must refrain from strenuous exercise. 3. I must refrain from eating aged cheese or yeast products. 4. I should decrease my intake of foods containing sugar. The correct answer is 3. I must refrain from eating aged cheese or yeast products. Rationale. Cheese and yeast products contain tyramine, which the client should avoid to prevent a negative interaction with tranylcypromine, a monoamine oxidase inhibitor. Sodium will not interact with tranylcypromine, and neither exercise nor sugar needs to be limited.
A 30-year-old woman with type 1 diabetes mellitus comes to the clinic for preconception care. Which information would be the priority to communicate to her at this time? 1. Her insulin requirements will likely increase during the second and third trimesters of pregnancy. 2. Infants of mothers with diabetes can be macrosomic, which can result in a more difficult delivery and a higher likelihood of cesarean section. 3. Breastfeeding is highly recommended, and insulin use is not a contraindication. 4. Achievement of optimal glycemic control at this time is of utmost importance in preventing congenital anomalies. The correct answer is 4. Achievement of optimal glycemic control at this time is of utmost importance in preventing congenital anomalies. The incidence of congenital anomalies is 3 times higher in the offspring of women with diabetes. Good glycemic control during preconception and early pregnancy significantly reduces this risk and would be the highest priority message to this patient at this point. The other responses are correct, but are not of greatest importance at this time. A client with chest pain is prescribed intravenous nitroglycerin. Which assessment is of greatest concern for the nurse initiating the nitroglycerin drip? 1. Serum potassium is 3.5 milliequivalents per liter. 2. Blood pressure is 88/46. 3. ST elevation is present on the electrocardiogram. 4. Heart rate is 61 beats per minute. The correct answer is 2. Blood pressure is 88/46. Nitroglycerin is a vasodilator that will lower blood pressure. The client is having chest pain, and the ST elevation indicates injury to the myocardium, which may benefit from nitroglycerin. The potassium and heart rate are within normal range. When conducting a health history with a female client with thyrotoxicosis, the nurse should ask about which of the following changes in the menstrual cycle. 1. Dysmenorrhea. 2. Metrorrhagia. 3. Oligomenorrhea. 4. Menorrhagia. The correct answer is 3. Oligomenorrhea. A change in the menstrual interval, diminished menstrual flow, oligomenorrhea, or even the absence of menstruation, amenorrhea, may result from the hormonal imbalances of thyrotoxicosis. Oligomenorrhea in women and decreased libido and impotence in men are common features of thyrotoxicosis. Dysmenorrhea is painful menstruation. Metrorrhagia, blood loss between menstrual periods, is a symptom of hypothyroidism. Menorrhagia, excessive bleeding during menstrual periods, is a symptom of hypothyroidism.
During physical assessment, The nurse should further assess the client for signs of atrial fibrillation when palpation of the radial pulse reveals 1. 2 regular beats followed by 1 irregular beat. 2. An irregular rhythm with pulse rate greater than 100. 3. Pulse rate below 60 beats per minute. 4. A weak, steady pulse. The correct answer is 2. Characteristics of atrial fibrillation include pulse rate greater than 100 beats per minute, totally irregular rhythm, and no definite P waves on the ECG. During assessment, the nurse is likely to note the irregular rate and should report it to the physician. A weak, thready pulse is characteristic of a client in shock. 2 regular beats followed by an irregular beat may indicate a premature ventricular contraction. A 12-year-old with asthma wants to exercise. Which of the following activities should the nurse suggest to improve breathing? 1. Soccer. 2. Swimming. 3. Track. 4. Gymnastics. The correct answer is 2. Swimming is appropriate for this child because it requires controlled breathing, assists in maintaining cardiac health, enhances skeletal muscle strength, and promotes ventilation and perfusion. Stop and start activities, such as soccer, track, and gymnastics, commonly trigger symptoms in asthmatic clients. Which of the following interventions is most appropriate for a client who has stomatitis? 1. Drinking hot tea at frequent intervals. 2. Gargling with antiseptic mouthwash. 3. Using an electric toothbrush. 4. Eating a soft, bland diet. The correct answer is 4. Clients with stomatitis have significant discomfort, which impacts their ability to eat and drink. They will be most comfortable eating soft, bland foods and avoiding temperature extremes in their food and liquids. Gargling with an antiseptic mouthwash will be irritating to the mucosa. Mouth care should include gentle brushing with a soft toothbrush and flossing.
A 40-year-old client is admitted to the hospital with a diagnosis of acute cholecystitis. The nurse should contact the physician to question which of the following prescriptions? 1. IV fluid therapy of normal saline solution to be infused at 100 ml per hour until further prescriptions. 2. Administer morphine sulfate 10 mg IM every 4 hours as needed for severe abdominal pain. 3. Nothing by mouth until further prescriptions. 4. Insert a nasogastric tube and connect to low intermittent suction. The correct answer is 2. Administer morphine sulfate 10 mg IM every 4 hours as needed for severe abdominal pain. A nurse should question the prescription for morphine sulfate because it is believed to cause biliary spasm. Thus, the preferred opioid analgesic to treat cholecystitis is meperidine. Elderly clients should not be given meperidine because of the risk of acute confusion and seizures in this population. An alternative pain medication will be necessary. IV fluid therapy is used to maintain fluid and electrolyte balance that may result from NPO status and gastric suctioning. NPO status and gastric decompression prevent further gallbladder stimulation. Which client would the nurse identify as being most at risk for experiencing a CVA? 1. A 55-year-old African American male. 2. An 84-year-old Japanese female. 3. A 67-year-old Caucasian male. 4. A 39-year-old pregnant female. The correct answer is 1. A 55-year-old African American male. African Americans have twice the rate of CVAs as Caucasians, and men have a higher incidence than women. African Americans suffer more extensive damage from a CVA than do people of other cultural groups. Which statement best describes the scientific rationale for administering aluminum hydroxide to a client diagnosed with chronic kidney disease? 1. This medication neutralizes gastric acid production. 2. It binds to phosphorus to help decrease hyperphosphatemia. 3. The medication is administered to decrease the calcium level. 4. It will help decrease episodes of constipation in the client with CKD. The correct answer is 2. It binds to phosphorus to help decrease hyperphosphatemia. Clients with CKD experience an increase in serum phosphorus levels, and administering aluminum hydroxide, an antacid, binds with phosphorus to be excreted in the feces. Option 1 is the scientific rationale for administering antacids to clients with peptic ulcer disease or gastritis, not clients with CKD. Aluminum hydroxide does not affect the calcium level. Aluminum hydroxide can cause constipation. It is not used to treat constipation. Tetralogy of Fallot involves which defects? Select all that apply. 1. Ventricular septal defect. 2. Right ventricular hypertrophy. 3. Left ventricular hypertrophy. 4. Pulmonic stenosis. 5. Pulmonic atresia. 6. Overriding aorta. 7. Patent ductus arteriosus. The correct answers are 1. Ventricular septal defect. 2. Right ventricular hypertrophy. 4. Pulmonic stenosis. And 6. Overriding aorta. Tetralogy of Fallot is a congenital defect with a ventricular septal defect, right ventricular hypertrophy, pulmonary valve stenosis, and overriding aorta. Pulmonary stenosis causes decreased pulmonary flow.
A client is scheduled for the first electroconvulsive therapy treatment in the morning. The client has been unable to sleep, but at 10 p.m. refused to take Restoral, as the nurse suggested. The client is still unable to sleep at 11:15 p.m. In what order should the nurse do the following? 1. Sit quietly with the client. 2. Encourage the use of Restoral. 3. Offer use of MP3 player with relaxing music. 4. Discuss specific concerns. The correct order is 1. Sit quietly with the client. 4. Discuss specific concerns. 3. Offer use of MP3 player with relaxing music. And 2. Encourage the use of Restoral. Rationale. The client is likely anxious about the procedure. The nurse should first spend time with the client and then discuss the client's concerns about the procedure. Next, the nurse could suggest the client listen to relaxing music. The use of the sleeping medication would only be considered as a last resort since it might interfere with the effectiveness of the seizure required for the treatment.
Several patients have just come into the obstetric triage unit. Which patient should the nurse assess first? 1. A 17-year-old gravida 1, para-0 woman at 40 weeks gestation with contractions every 6 minutes who is crying loudly and is surrounded by anxious family members. 2. A 22-year-old G3P2 woman at 38 weeks gestation with contractions every 3 minutes who is requesting to go to the bathroom to have a bowel movement. 3. A 32-year-old G4P3 woman at 27 weeks gestation who noted vaginal bleeding today after intercourse. 4. A 27-year-old G2P1 woman at 37 weeks gestation who experienced spontaneous rupture of membranes 30 minutes ago but feels no contractions. The correct answer is 2. A 22-year-old G3P2 woman at 38 weeks gestation with contractions every 3 minutes who is requesting to go to the bathroom to have a bowel movement. A multiparous patient in active labor with an urge to have a bowel movement will probably give birth imminently. She needs to be the first assessed. The healthcare provider must be notified immediately, and the patient must be moved to a safe location for the birth. She should not be allowed to go to the bathroom at this time. The other patients all have needs requiring prompt assessment, but the imminent birth takes priority. Vaginal bleeding after intercourse could be caused by cervical irritation or a vaginal infection, or could have a more serious cause such as placenta previa. The nurse is caring for a client diagnosed with an anterior myocardial infarction 2 days ago. Upon assessment, the nurse identifies a systolic murmur at the apex. The nurse should first 1. Assess for changes in vital signs. 2. Draw an arterial blood gas. 3. Evaluate heart sounds with the client leaning forward. 4. Obtain a 12-lead electrocardiogram. The correct answer is 1. Assess for changes in vital signs. Infarction of the papillary muscles is a potential complication of an MI causing ineffective closure of the mitral valve during systole. Mitral regurgitation results when the left ventricle contracts and blood flows backward into the left atrium, which is heard at the 5th intercostal space, left midclavicular line. The murmur worsens during expiration and in the supine or left side position. Vital sign changes will reflect the severity of the sudden drop in cardiac output, decrease in blood pressure, increase in heart rate, and increase in respirations. A 12-lead ECG views the electrical activity of the heart, and echocardiogram views valve function. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. A 34-year-old female is diagnosed with hypothyroidism. The nurse should assess the client for which of the following? Select all that apply. 1. Rapid pulse. 2. Decreased energy and fatigue. 3. Weight gain of 10 pounds. 4. Fine, thin hair with hair loss. 5. Constipation. 6. Menorrhagia. The correct answers are 2. Decreased energy and fatigue. 3. Weight gain of 10 pounds. 5. Constipation. And 6. Menorrhagia. Clients with hypothyroidism exhibit symptoms indicating a lack of thyroid hormone. Bradycardia, decreased energy and lethargy, memory problems, weight gain, coarse hair, constipation, and menorrhagia are common signs and symptoms of hypothyroidism.
When teaching the client about complications of atrial fibrillation, the nurse should instruct the client to avoid which of the following? 1. Stasis of blood in the atria. 2. Increased cardiac output. 3. Decreased pulse rate. 4. Elevated blood pressure. The correct answer is 1. Atrial fibrillation occurs when the sinoatrial node no longer functions as the heart's pacemaker, and impulses are initiated at sites within the atria. Because conduction through the atria is disturbed, atrial contractions are reduced and stasis of blood in the atria occurs, predisposing to emboli. Some estimates predict that 30% of clients with atrial fibrillation develop emboli. Atrial fibrillation is not associated with increased cardiac output, elevated blood pressure, or decreased pulse rate. Rather, it is associated with an increased pulse rate. When preparing the teaching plan for the mother of a child with asthma, which of the following should the nurse include as signs to alert the mother that her child is having an asthma attack? 1. Secretion of thin, copious mucus. 2. Tight, productive cough. 3. Wheezing on expiration. 4. Temperature of 99.4 degrees Fahrenheit. The correct answer is 3. The child who is experiencing an asthma attack typically demonstrates wheezing on expiration initially. This results from air moving through narrowed airways secondary to bronchoconstriction. The child's expiratory phase is normally longer than the inspiratory phase. Expiration is passive as the diaphragm relaxes. During an asthma attack, secretions are thick and are not usually expelled until bronchioles are more relaxed. At the beginning of an asthma attack, the cough will be tight, but not productive. Fever is not always present unless there is an infection that may have triggered the attack. A client who has a history of a mitral valve prolapse is scheduled to get her teeth cleaned. Which of the following replies by the nurse is most appropriate? 1. The physician will need to reevaluate the status of your heart condition before your dental appointment. 2. Be sure to remind your dentist that you have a heart condition. 3. It is important for you to care for your teeth because your heart condition makes you more susceptible to developing oral infections. 4. We will prescribe a prophylactic antibiotic for you to take before getting your teeth cleaned. The correct answer is 4. Clients who are at risk for developing infective endocarditis due to cardiac conditions such as mitral valve prolapse must take prophylactic antibiotics before any dental procedure that may cause bleeding. The client is not more susceptible to developing oral infections. Rather, the client is more susceptible to developing endocarditis that results from oral bacteria that enter the circulation during the dental procedure. The physician does not necessarily need to reevaluate the heart condition of a client who is stable, but antibiotics must be prescribed. It is not enough to simply remind the dentist about the heart condition.
The nurse is assessing a client who has had a myocardial infarction. The nurse notes the cardiac rhythm on the monitor. See the electrocardiogram strip below. The nurse should 1. Notify the physician. 2. Call the rapid response team. 3. Assess the client for changes in the rhythm. 4. Administer lidocaine as prescribed. The correct answer is 3. Assess the client for changes in the rhythm. The client is experiencing a single PVC. PVCs are characterized by a QRS of longer than 0.12 second and by a wide, notched, or slurred QRS complex. There is no P wave related to the QRS complex, and the T wave is usually inverted. PVCs are potentially serious and can lead to ventricular fibrillation or cardiac arrest when they occur more than 6 to 10 in an hour in clients with myocardial infarction. The nurse should continue to monitor the client and note if the PVCs are increasing. It is not necessary to notify the physician or call the rapid response team at this point. Lidocaine is not indicated from the data on this ECG. The client diagnosed with a right-sided cerebrovascular accident is admitted to the rehabilitation unit. Which interventions should be included in the nursing care plan? Select all that apply. 1. Position the client to prevent shoulder adduction. 2. Turn and reposition the client every shift. 3. Encourage the client to move the affected side. 4. Perform quadriceps exercises 3 times a day. 5. Instruct the client to hold the fingers in a fist. The correct answers are 1. Position the client to prevent shoulder adduction, and 3. Encourage the client to move the affected side. Placing a small pillow under the shoulder will prevent the shoulder from adducting toward the chest and developing a contracture. The client should not ignore the paralyzed side, and the nurse must encourage the client to move it as much as possible. A written schedule may assist the client in exercising. Which statement best describes the scientific rationale for administering calcitriol to a client diagnosed with end-stage renal disease? 1. This medication increases the availability of vitamin D in the intestines. 2. This medication stimulates excretion of calcium from the parathyroid gland. 3. This medication helps the body excrete calcium through the feces. 4. This medication increases serum calcium levels by promoting calcium absorption. The correct answer is 4. This medication increases serum calcium levels by promoting calcium absorption. Calcitriol, a vitamin D analog, increases serum calcium levels by promoting calcium absorption and thereby helps to manage hypocalcemia, which is a symptom of chronic kidney disease. Calcitriol does not affect the availability of vitamin D. Calcitriol is used to treat hypoparathyroidism, but it does not stimulate excretion of calcium from the parathyroid gland. The client in ESRD has hypocalcemia, not hypercalcemia. A 10-year-old child is recovering from a severe sore throat. The parent states that the child complains of chest pain. The nurse observes that the child has swollen joints, nodules on the fingers, and a rash on the chest. The likely cause is blank. The correct answer is rheumatic fever. To make the diagnosis of rheumatic fever, major and minor criteria are used. Major criteria include carditis, subcutaneous nodules, erythema marginatum, chorea, and arthritis. Minor criteria include fever and previous history of rheumatic fever. Rheumatic fever is an inflammatory disease caused by group A beta-hemolytic streptococcus.
The client is receiving 6 milligrams of selegiline transdermal system every 24 hours for major depression. The nurse should judge teaching about selegiline to be effective when the client makes which statement? 1. I need to avoid using the sauna at the gym. 2. I can cut the patch and use a smaller piece. 3. I need to wait until the next day to put on a new patch if it falls off. 4. I might gain at least 10 pounds from the medication. The correct answer is 1. I need to avoid using the sauna at the gym. Rationale. Selegiline transdermal system is the first transdermal monoamine oxidase inhibitor. The client needs to avoid exposing the application site to external sources of direct heat, such as saunas, heating lamps, electric blankets, heating pads, heated waterbeds, and prolonged direct sunlight, because heat increases the amount of selegiline that is absorbed, resulting in elevated serum levels of selegiline. Cutting the patch and using a smaller piece will result in a decreased amount of medication absorption, most likely leading to a worsening of the symptoms of depression. The client should apply a new patch as soon as possible if one falls off to ensure an adequate amount of medication absorption. Selegiline is not associated with significant weight gain, although a weight gain of 1 to 2 pounds is possible.
A 19-year-old Gravida 1, para-0 patient at 40 weeks gestation who is in labor is being treated with magnesium sulfate for seizure prophylaxis in preeclampsia. Which are priority assessments with this medication? Select all that apply. 1. Check deep tendon reflexes. 2. Observe for vaginal bleeding. 3. Check the respiratory rate. 4. Note the urine output. 5. Monitor for calf pain. 6. Watch for early fetal heart rate decelerations. The correct answers are 1. Check deep tendon reflexes. 3. Check the respiratory rate. And 4. Note the urine output. Magnesium sulfate toxicity can cause fatal cardiovascular events or respiratory depression or arrest, so monitoring of the respiratory rate is of utmost importance. The drug is excreted by the kidneys, and therefore monitoring for adequate urine output is essential. Deep tendon reflexes disappear when serum magnesium is reaching a toxic level. Vaginal bleeding is not associated with magnesium sulfate use. Calf pain can be a sign of a deep vein thrombosis, but is not associated with magnesium sulfate therapy. Early fetal heart rate decelerations are not associated with use of magnesium sulfate. A client with acute chest pain is receiving IV morphine sulfate. Which of the following results are intended effects of morphine? Select all that apply. 1. Reduces myocardial oxygen consumption. 2. Promotes reduction in respiratory rate. 3. Prevents ventricular remodeling. 4. Reduces blood pressure and heart rate. 5. Reduces anxiety and fear. The correct answers are 1. Reduces myocardial oxygen consumption. 4. Reduces blood pressure and heart rate. And 5. Reduces anxiety and fear. Morphine sulfate acts as an analgesic and sedative. It also reduces myocardial oxygen consumption, blood pressure, and heart rate. Morphine also reduces anxiety and fear due to its sedative effects and by slowing the heart rate. It can depress respirations. However, such an effect may lead to hypoxia, which should be avoided in the treatment of chest pain. Angiotensin-converting enzyme inhibitor drugs, not morphine, may help to prevent ventricular remodeling. Propylthuracil is prescribed for a client with Graves' disease. The nurse should teach the client to immediately report which of the following? 1. Sore throat. 2. Painful excessive menstruation. 3. Constipation. 4. Increased urine output. The correct answer is 1. Sore throat. The most serious adverse effects of PTU are leukopenia and agranulocytosis, which usually occur within the first 3 months of treatment. The client should be taught to promptly report to the healthcare provider signs and symptoms of infection, such as a sore throat and fever. Clients having a sore throat and fever should have an immediate white blood cell count and differential performed, and the drug must be withheld until the results are obtained. Painful menstruation, constipation, and increased urine output are not associated with PTU therapy.
When teaching a client about self-care following placement of a new permanent pacemaker to the left upper chest, the nurse should include which information? Select all that apply. 1. Take and record daily pulse rate. 2. Avoid air travel because of airport security alarms. 3. Immobilize the affected arm for 4 to 6 weeks. 4. Avoid using a microwave oven. 5. Avoid lifting anything heavier than 3 pounds. The correct answers are 1 and 5. The nurse must teach the client how to take and record the pulse daily. The client should be instructed to avoid lifting the operative side arm above shoulder level for 1 week post-insertion. It takes up to 2 months for the incision site to heal and full range of motion to return. The client should avoid heavy lifting until approved by the physician. The pacemaker metal casing does not set off airport security alarms, so there are no travel restrictions. Prolonged immobilization is not required. Microwave ovens are safe to use and do not alter pacemaker function. Which assessment findings should lead the nurse to suspect that a toddler is experiencing respiratory distress? Select all that apply. 1. Coughing. 2. Respiratory rate of 35 breaths per minute. 3. Heart rate of 95 beats per minute. 4. Restlessness. 5. Malaise. 6. Diaphoresis. The correct answers are 1, 2, 4, 6. Coughing, especially at night and in the absence of an infection, is a common symptom of asthma. Early signs of respiratory distress include restlessness, tachypnea, tachycardia, and diaphoresis. Other signs also include hypertension, nasal flaring, grunting, wheezing, and intercostal retractions. A heart rate of 95 beats per minute is normal for a toddler. Malaise typically does not indicate respiratory distress. Amoxicillin trihydrate 300 milligrams PO has been prescribed for a client with an oral infection. The medication is available in a liquid suspension that is available as 250 milligrams per 5 milliliters. How many milliliters should the nurse administer? Blank ml. The correct answer is 6 milliliters. The formula is 300 milligrams over X ml equal to 250 milligrams over 5 milliliters. You cross-multiply and get 250X equals to 1500. You divide by 250 on both sides, and you get 6 milliliters.
A client is admitted to the hospital with a diagnosis of cholecystitis from cholelithiasis. The client has severe abdominal pain and nausea and has vomited several times. Based on these data, which nursing action would have the highest priority for intervention at this time? 1. Manage anxiety. 2. Restore fluid loss. 3. Manage the pain. 4. Replace nutritional loss. The correct answer is 3. Manage the pain. The priority for nursing care at this time is to decrease the client's severe abdominal pain. The pain, which is frequently accompanied by nausea and vomiting, is caused by biliary spasm. Opioid analgesics are given to relieve the severe pain and spasm of cholecystitis. Relief of pain may decrease nausea and vomiting and thereby decrease the client's likelihood of developing further complications, such as severe fluid loss and inadequate nutrition. There are no data to suggest that the client is anxious. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. The nurse is planning care for a client experiencing agnosia secondary to a cerebrovascular accident. Which collaborative intervention will be included in the plan of care? 1. Observe the client swallowing for possible aspiration. 2. Position the client in a semi-Fowler's position when sleeping. 3. Place a suction setup at the client's bedside during meals. 4. Refer the client to an occupational therapist for evaluation. The correct answer is 4. Refer the client to an occupational therapist for evaluation. A collaborative intervention is an intervention in which another healthcare discipline, in this case, occupational therapy, is used in the care of the client. The client diagnosed with end-stage renal disease is taking calcitriol. Which assessment data warrants intervention by the nurse? 1. The client reports nausea. 2. The client has had 2 episodes of diarrhea. 3. The client has an increase in the serum creatinine level. 4. The client has blood in the urine. The correct answer is 4. The client has blood in the urine. Hematuria is an adverse effect of calcitriol, a vitamin D analog, and the nurse should notify the HCP. This would warrant taking the client off the medication. Nausea is a side effect of calcitriol and can also result from ESRD itself. Diarrhea is an expected side effect of the medication. Therefore, it would not warrant intervention from the nurse. The client in ESRD would have an increased serum creatinine level. Therefore, this would not warrant immediate intervention by the nurse. What should the nurse assess prior to administering digoxin? 1. Sclera. 2. Apical pulse rate. 3. Cough. 4. Liver function test. The correct answer is 2. Apical pulse rate. The apical pulse rate is assessed because digoxin decreases the heart rate. If the heart rate is less than 60 beats per minute, digoxin should not be administered. The sclera has nothing to do with congestive heart failure. Cough would not be assessed before administration. It is more commonly seen in patients who have been prescribed ACE inhibitors. Liver function tests are not assessed before digoxin is administered. Digoxin can lower the heart rate and cause dysrhythmias.
A client has been taking 30 milligrams of duloxetine hydrochloride twice daily for 2 months because of depression and vague aches and pains. While interacting with the nurse, the client discloses a pattern of drinking a 6-pack of beer daily for the past 10 years to help with sleep. What should the nurse do first? 1. Refer the client to the dual diagnosis program at the clinic. 2. Share the information at the next interdisciplinary treatment conference. 3. Report the client's beer consumption to the primary healthcare provider. 4. Teach the client relaxation exercises to perform before bedtime. The correct answer is 3. Report the client's beer consumption to the primary healthcare provider. Rationale. The nurse should report the client's beer consumption to the primary healthcare provider. Duloxetine should not be administered to a client with renal or hepatic insufficiency because the medication can elevate liver enzymes and, together with substantial alcohol use, can cause liver injury. Referring the client to the dual diagnosis program, sharing information at the next interdisciplinary treatment conference, and teaching the client relaxation exercises are helpful interventions for the nurse to implement. However, reporting the findings to the primary healthcare provider is most important.
Which action would best demonstrate evidence-based nursing practice in the care of a patient who is 1 day postpartum and reporting nipple soreness while breastfeeding? 1. Inform the mother that a certain amount of soreness is normal. 2. Assess the mother-baby couplet for nursing position and latch and correct as indicated. 3. Advise the use of a breast pump until nipple soreness resolve. 4. Advise alternating breastfeeding and pumping to avoid excess sucking at the nipple. The correct answer is 2. Assess the mother-baby couplet for nursing position and latch and correct as indicated. Improper latch and position are the most common causes of nipple soreness and can be corrected with assessment and assistance to the mother. This practice supports the perinatal core measure of increasing the percentage of newborns who are fed breast milk only. Advising the mother that soreness can be normal does not provide any assessment or assistance to the mother with her problem. Using a pump may be appropriate at some times during lactation, but the first priority is to assess and correct the issue that is causing the soreness. A client is receiving an IV infusion of heparin sodium at 1,200 units per hour. The dilution is 25,000 units per 500 milliliters. How many milliliters per hour will this client receive? The correct answer is 24 milliliters per hour. To solve this problem, first, calculate how many units are in each milliliter of the medication. The questions gives us 25,000 units per 500 milliliters. 25,000 units divided by 500 equals to 50 units. 500 milliliters divided by 500 equals to 1 milliliter. So it's 50 units per 1 milliliter. Next, calculate how many milliliters the client receives per hour. Since the client is receiving 1,200 units per hour and there is 50 units per 1 milliliter, we divide 1,200 by 50, which equals to 24. So the client is receiving 24 milliliter per hour. A client with thyrotoxicosis says to the nurse, "I am so irritable. I am having problems at work because I lose my temper very easily." Which of the following responses by the nurse would give the client the most accurate explanation of her behavior? 1. Your behavior is caused by temporary confusion brought on by your illness. 2. Your behavior is caused by the excess thyroid hormone in your system. 3. Your behavior is caused by your worrying about the seriousness of your illness. 4. Your behavior is caused by the stress of trying to manage a career and cope with illness. The correct answer is 2. Your behavior is caused by the excess thyroid hormone in your system. A typical sign of thyrotoxicosis is irritability caused by the high levels of circulating thyroid hormones in the body. This symptom decreases as the client responds to therapy. Thyrotoxicosis does not cause confusion. The client may be worried about her illness, and stress may influence her mood. However, irritability is a common symptom of thyrotoxicosis, and the client should be informed of that fact rather than blamed.
A client has been admitted to the coronary care unit. The nurse observes third-degree heart block at a rate of 35 beats per minute on the client's cardiac monitor. The client has a blood pressure of 90/60. The nurse should take which of the following actions first? 1. Prepare for transcutaneous pacing. 2. Prepare to defibrillate the client at 200 joules. 3. Administer an IV lidocaine infusion. 4. Schedule the operating room for insertion of a permanent pacemaker. The correct answer is 1. Transcutaneous pacemaker therapy provides an adequate heart rate to a client in an emergency situation. Defibrillation and a lidocaine infusion are not indicated for the treatment of third-degree heart block. Transcutaneous pacing is used temporarily until a transvenous or permanent pacemaker can be inserted. A 10-year-old child who is 5'4" tall with a history of asthma uses an inhaled bronchodilator only when needed. She takes no other medications routinely. Her best peak expiratory flow rate is 270 liters per minute. The child's current peak flow reading is 180 liters per minute. The nurse interprets this reading as indicating which of the following? 1. The child's asthma is under good control, so the routine treatment plan should continue. 2. The child needs to use her short-acting inhaled beta-2 agonist medication. 3. This is a medical emergency requiring a trip to the emergency department for treatment. 4. The child needs to use her inhaled cromolyn sodium. The correct answer is 2. The peak flow of 180 liters per minute is in the yellow zone, or 50% to 80% of the child's personal best. This means that the child's asthma is not well controlled, thereby necessitating the use of a short-acting beta-2 agonist medication to relieve the bronchospasm. A peak flow reading greater than 80% of the child's personal best would indicate that the child's asthma is in the green zone or under good control. A peak flow reading in the red zone, or less than 50% of the child's personal best, would require notification of the healthcare provider or a trip to the emergency department. Cromolyn sodium is not used for short-term treatment of acute bronchospasm. It is used as part of a long-term therapy regimen to help desensitize mast cells and thereby help to prevent symptoms. During the assessment of a client's mouth, the nurse notes the absence of saliva. The client reports having pain behind the ear. The client has been nothing by mouth for several days, but now can have liquids. Based on these findings, the nurse should do which of the following? 1. Request a prescription for an antifungal mouthwash. 2. Instruct the client to brush the gums as well as the teeth. 3. Encourage the client to suck on hard candy. 4. Give the client a hydrogen peroxide-based mouthwash. The correct answer is 3. The lack of saliva, pain near the area of the ear, and the prolonged NPO status of the client are indications that the client may be developing parotitis or inflammation of the parotid gland. Parotitis usually develops with dehydration combined with poor oral hygiene, or when clients have been NPO for an extended period. Preventive measures include the use of sugarless hard candy or gum to stimulate saliva production, adequate hydration, and frequent mouth care. The client does not have indications of stomatitis, which produces excessive salivation and a sore mouth. The client does not have indications of oral candidiasis, which causes bluish-white mouth lesions, and a nurse does not need to request a prescription for an antifungal mouthwash. There are no indications that the client has gingivitis, which can be recognized by the inflamed gingiva and bleeding that occur during toothbrushing, and while the client should brush the teeth and gums, increasing salivation to prevent parotitis is a priority at this time.
The nurse is monitoring a client admitted with a myocardial infarction who is at risk for cardiogenic shock. The nurse should report which of the following changes on the client's chart to the physician? 1. Urine output. 2. heart rate. 3. Blood pressure. 4. Respiratory rate. The correct answer is 1. Urine output. Oliguria occurs during cardiogenic shock because there is reduced blood flow to the kidneys. Typical signs of cardiogenic shock include low blood pressure, rapid and weak pulse, decreased urine output, and signs of diminished blood flow to the brain, such as confusion and restlessness. Cardiogenic shock is a serious complication of MI, with a mortality rate approaching 90%. Fever is not a typical sign of cardiogenic shock. The other changes in vital signs on the client's chart are not as significant as the decreased urinary output. The nurse and an unlicensed assistive personnel are caring for a client with right-sided paralysis. Which action by the UAP requires the nurse to intervene? 1. The assistant places a gait belt around the client's waist prior to ambulating. 2. The assistant places the client on the back with the client's head to the side. 3. The assistant places a hand under the client's right axilla to move up in bed. 4. The assistant praises the client for attempting to perform ADLs independently. The correct answer is 3. The assistant places a hand under the client's right axilla to move up in bed. This action is inappropriate and would require intervention by the nurse because pulling on a flaccid shoulder joint could cause shoulder dislocation. The client should be pulled up by placing the arm underneath the back or using a lift sheet. The client diagnosed with chronic kidney disease is taking aluminum hydroxide liquid. Which information should the nurse discuss with the client? 1. Drink at least 500 milliliter of water after taking the medication. 2. Do not drink any water for 1 hour after taking the medication. 3. Drink 2 to 4 ounces of water after taking the medication. 4. Eat 30 minutes prior to taking the aluminum hydroxide. The correct answer is 3. Drink 2 to 4 ounces of water after taking the medication. Liquid antacids should be taken with 2 to 4 ounces of water to ensure that the medication reaches the stomach. The client should not drink more than 4 ounces of water because water quickens the gastric emptying time. Antacids should be taken on an empty stomach and are effective for 30 to 60 minutes before passing into the duodenum. Which statement by a parent of an infant with congestive heart failure who is being sent home on digoxin indicates the need for further education? 1. I will give the medication at regular 12-hour intervals. 2. If he vomits, I will not give a makeup dose. 3. If I miss a dose, I will not give an extra dose. 4. I will mix the digoxin in some formula to make it taste better. The correct answer is 4. I will mix the digoxin in some formula to make it taste better. If the medication is mixed in his formula and he refuses to drink the entire amount, the dose will be inadequate. Options 1, 2, and 3 are appropriate for digoxin administration.
A client was admitted to the inpatient unit 3 days ago with a flat affect, psychomotor retardation, anorexia, hopelessness, and suicidal ideation. The primary healthcare provider prescribed 75 milligrams of venlafaxine, extended release to be given every morning. The client interacted minimally with the staff and spent most of the day in his room. As the nurse enters the unit at the beginning of the evening shift, the client is smiling and cheerful and appears to be relaxed. What should the nurse interpret as the most likely cause of the client's behavior? 1. The Effexor is helping the client's symptoms of depression significantly. 2. The client's sudden improvement calls for close observation by the staff. 3. The staff can decrease their observation of the client. 4. The client is nearing discharge due to the improvement of his symptoms. The correct answer is 2. The client's sudden improvement calls for close observation by the staff. Rationale. The client's sudden improvement and decrease in anxiety most likely indicate that the client is relieved because he has made the decision to delete himself and may now have the energy to complete the deletion. Symptoms of severe depression do not suddenly abate because most antidepressants work slowly and take 2 to 4 weeks to provide a maximum benefit. The client will improve slowly due to the medication. The sudden improvement in symptoms does not mean the client is nearing discharge, and decreasing observation of the client compromises the client's safety.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. A 24-year-old Gravida 2, Para 1 woman is being admitted in active labor at 39 weeks gestation. Which prenatal data would be most important for the nurse to address at this time? 1. Hemoglobin level of 11 grams per deciliter at 28 weeks gestation. 2. Positive result on test for Group B streptococci at 36 weeks gestation. 3. Urinary tract infection with Escherichia coli treated at 20 weeks gestation. 4. Elevated level on glucose screening test at 28 weeks gestation, followed by normal 3-hour glucose tolerance test results at 29 weeks gestation. The correct answer is 2. Positive result on test for Group B streptococci at 36 weeks gestation. The positive Group B streptococci result requires immediate action. The healthcare provider must be notified, and orders obtained for prompt antibiotic prophylaxis during labor to reduce the risk of mother-to-newborn transmission of Group B streptococci. The other data are not as significant in the care of the patient at this moment. Intrapartum appropriate antibiotic treatment of the mother with Group B streptococci supports the perinatal core measure of reducing healthcare-acquired bloodstream infections in newborns. An older adult has chest pain and shortness of breath. The healthcare provider prescribes nitroglycerin tablets. What should the nurse instruct the client to do? 1. Put the tablet under the tongue until it is absorbed. 2. Swallow the tablet with 120 milliliter of water. 3. Chew the tablet until it is dissolved. 4. Place the tablet between the cheek and gums until it disappears. The correct answer is 1. Put the tablet under the tongue until it is absorbed. The client is having symptoms of a myocardial infarction. The first action is to prevent platelet formation and block prostaglandin synthesis. The client should place the tablet under the tongue and wait until it is absorbed. Nitroglycerin tablets are not effective if chewed, swallowed, or placed between the cheek and gums. The nurse is evaluating a client with hyperthyroidism who is taking propylthuracil 100 milligrams per day in 3 divided doses for maintenance therapy. Which of the following statements from the client indicates the desired outcome of the drug? 1. I have excess energy throughout the day. 2. I am able to sleep and rest at night. 3. I have lost weight since taking this medication. 4. I do perspire throughout the entire day. The correct answer is 2. I am able to sleep and rest at night. PTU is a prototype of thioamide antithyroid drugs. It inhibits production of thyroid hormones and peripheral conversion of T4 to the more active T3. A client taking this antithyroid drug should be able to sleep and rest well at night, since the level of thyroid hormones is reduced in the blood. Excess energy throughout the day, loss of weight, and perspiring through the day are symptoms of hyperthyroidism, indicating the drug has not produced its outcome.
A client is scheduled for the insertion of an implantable cardioverter defibrillator, ICD. The spouse expresses anxiety about what would happen if the device discharges during physical contact. The nurse should tell the spouse, 1. Physical contact should be avoided whenever possible. 2. They will not feel the countershock. 3. The shock will be felt, but it would not cause any harm. 4. A warning device sound before countershock, so there is time to move away. The correct answer is 4. An implanted defibrillator always provides at least 3 beeps before delivering a countershock, and the nurse should tell the spouse to move away when they hear those beeps. The spouse can have physical contact with the client, but if the ICD were to discharge while the spouse had contact with the client, the spouse would feel the shock and could also be harmed. The spouse will feel the countershock if touching the client, and it would harm the spouse. An adolescent with chest pain goes to the school nurse. The nurse determines that the teenager has a history of asthma, but has had no problem for years. Which of the following should the nurse do next? 1. Call the adolescent's parent. 2. Have the adolescent lie down for 30 minutes. 3. Obtain a peak flow reading. 4. Give 2 puffs of a short-acting bronchodilator. The correct answer is 3. Problems of chest pain in children and adolescents are rarely cardiac. With a history of asthma, the most likely cause of the chest pain is related to the asthma. Therefore, the nurse should check the adolescent's peak flow reading to evaluate the status of the airflow. Calling the adolescent's parent would be appropriate. But this will be done after the nurse obtains a peak flow reading and additional assessment data. Having the adolescent lie down may be an option, but more data need to be collected to help establish a possible cause. Because the adolescent has not experienced any asthma problems for a long time, it would be inappropriate for the nurse to administer a short-acting bronchodilator at this time. The nurse is preparing a community presentation on oral cancer. Which of the following is a primary risk factor for oral cancer that the nurse should include in the presentation? 1. Use of alcohol. 2. Frequent use of mouthwash. 3. Lack of vitamin B12. 4. Lack of regular teeth cleaning by a dentist. The correct answer is 1. Chronic and excessive use of alcohol can lead to oral cancer. Smoking and use of smokeless tobacco are other significant risk factors. Additional risk factors include chronic irritation such as a broken tooth or ill-fitting dentures, poor dental hygiene, overexposure to sun and syphilis, use of mouthwash, lack of vitamin B12, and lack of regular teeth cleaning appointments have not been implicated as primary risk factors for oral cancer.
A client's stools are light gray in color. The nurse should assess the client further for which of the following? Select all that apply. 1. Intolerance to fatty foods. 2. Fever. 3. Jaundice. 4. Respiratory distress. 5. Pain at McBurney's point. 6. Peptic ulcer disease. The correct answers: 1. Intolerance to fatty foods. 2. Fever. And 3. Jaundice. Bile is created in the liver, stored in the gallbladder, and released into the duodenum, giving stool its brown color. A bile duct obstruction can cause pale-colored stools. Other symptoms associated with cholelithiasis are right upper quadrant tenderness, fever from inflammation or infection, jaundice from elevated serum bilirubin levels, and nausea or right upper quadrant pain after a fatty meal. Pain at McBurney's point lies between the umbilicus and right iliac crest and is associated with appendicitis. A bleeding ulcer produces black, tarry stools. Respiratory distress is not a symptom of cholelithiasis. The client diagnosed with atrial fibrillation has experienced a transient ischemic attack, TIA. Which medication would the nurse anticipate being ordered for the client on discharge? 1. An oral anticoagulant medication. 2. A beta blocker medication. 3. An anti-hyperuricemic medication. 4. A thrombolytic medication. The correct answer is 1. An oral anticoagulant medication. The nurse would anticipate an oral anticoagulant, warfarin, to be prescribed to help prevent thrombi formation in the atria secondary to atrial fibrillation. The thrombi can become embolic and may cause a TIA or CVA. The client diagnosed with chronic kidney disease is receiving oral sodium polystyrene. Which assessment data indicates the medication is effective? 1. The client's serum potassium level is 5.8 milliequivalents per liter. 2. The client's serum sodium level is 135 milliequivalents per liter. 3. The client's serum potassium level is 4.2 milliequivalents per liter. 4. The client's serum sodium level is 147 milliequivalents per liter. The correct answer is 3. The client's serum potassium level is 4.2 milliequivalents per liter. Sodium polystyrene is a medication that is administered to decrease an elevated serum potassium level. A potassium level within the normal range of 3.5 to 5.2 milliequivalents per liter, like in option 3, indicates the medication is effective. The elevated serum potassium in option 1 would indicate the medication is not effective. Sodium polystyrene is not used to alter the serum sodium level. Which finding might delay a cardiac catheterization procedure on a 1-year-old? 1. 30th percentile for weight. 2. Severe diaper rash. 3. Allergy to soy. 4. Oxygen saturation of 91% on room air. The correct answer is 2. Severe diaper rash. A child with severe diaper rash has potential for infection if the interventionist makes the standard groin approach. Option 1 and 4 may be a reason the child needs catheterization. Shellfish, not soy, is an allergy concern.
The client is taking 50 milligrams of lamotrigine daily for bipolar depression. The client shows the nurse a rash on his arm. What should the nurse do? 1. Report the rash to the primary healthcare provider. 2. Explain that the rash is a temporary adverse effect. 3. Give the client an ice pack for his arm. 4. Question the client about recent sun exposure. The correct answer is 1. Report the rash to the primary healthcare provider. Rationale. The nurse should immediately report the rash to the primary healthcare provider because lamotrigine can cause Stevens-Johnson syndrome, a toxic epidermal necrolysis. The rash is not a temporary adverse effect. Giving the client an ice pack and questioning the client about recent sun exposure are irresponsible nursing actions because of the possible seriousness of the rash.
The telephone triage nurse in the prenatal clinic receives the following calls. Which telephone call would require immediate notification of the healthcare provider? 1. Patient reports leaking vaginal fluid at 34 weeks gestation. 2. Patient reports nausea and vomiting at 8 weeks gestation. 3. Patient reports pedal edema at 39 weeks gestation. 4. Patient reports vaginal itching at 20 weeks gestation. The correct answer is 1. Patient reports leaking vaginal fluid at 34 weeks gestation. Leaking vaginal fluid at 34 weeks gestation requires immediate attention because it could indicate premature rupture of membranes with the risk of premature birth. A nurse in a prenatal clinic can safely give telephone advice regarding nausea, vomiting, and pedal edema, which can be considered normal in pregnancy. The nurse would assess the complaint, give the patient evidence-based advice, and define the circumstances under which the patient should call back. Vaginal itching at 20 weeks gestation could indicate a yeast infection. Depending on clinic protocols, the nurse could, after phone assessment, safely recommend an over-the-counter medication or arrange an office visit for the patient. The nurse has completed an assessment of a client with a decreased cardiac output. Which findings should receive the highest priority? 1. BP 110/62, atrial fibrillation with heart rate 82, bibasilar crackles. 2. Confusion, urine output 15 milliliter over the last 2 hours, orthopnea. 3. Oxygen saturation 92% on 2 liters via nasal cannula, respirations 20, 1 plus edema of lower extremities. 4. Weight gain of 1 kilogram in 3 days, BP 130/80, mild dyspnea with exercise. The correct answer is 2. Confusion, urine output 15 milliliter over the last 2 hours, orthopnea. A low urine output and confusion are signs of decreased tissue perfusion. Orthopnea is a sign of left-sided heart failure. Crackles, edema, and weight gain should be monitored closely, but the levels are not as high a priority. With atrial fibrillation, there is a loss of atrial kick, but the blood pressure and heart rate are stable. The nurse should teach the client with Graves' disease to prevent corneal irritation from mild exophthalmos by 1. Massaging the eyes at regular intervals. 2. Instilling an ophthalmic anesthetic as prescribed. 3. Wearing dark-colored glasses. 4. Covering both eyes with moistened gauze pads. The correct answer is 3. Wearing dark-colored glasses. Treatment of mild ophthalmopathy that may accompany thyrotoxicosis includes measures such as wearing sunglasses to protect the eyes from corneal irritation. Treatment of ophthalmopathy should be performed in consultation with an ophthalmologist. Massaging the eyes will not help to protect the cornea. An ophthalmic anesthetic is used to examine and possibly treat a painful eye, not protect the cornea. Covering the eyes with moist gauze pads is not a satisfactory nursing measure to protect the eyes of a client with exophthalmos because treatment is not focused on moisture to the eye, but rather on protecting the cornea and optic nerve. In exophthalmos, the retrobulbar connective tissues and extraocular muscle volume are expanded because of fluid retention. The pressure is also increased.
An older adult is admitted to the telemetry unit for placement of a permanent pacemaker because of sinus bradycardia. A priority goal for the client within 24 hours after insertion of a permanent pacemaker is to 1. Maintain skin integrity. 2. Maintain cardiac induction stability. 3. Decrease cardiac output. 4. Increase activity level. The correct answer is 2. Maintaining cardiac induction stability to prevent arrhythmias is a priority immediately after artificial pacemaker implantation. The client should have continuous electrocardiographic monitoring until proper pacemaker functioning is verified. Skin integrity, while important, is not an immediate concern. The pacemaker is used to increase heart rate and cardiac output, not decrease it. The client should limit activity for the first 24 to 48 hours after pacemaker insertion. The client should also restrict movement of the affected extremity for 24 hours.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
A 7-year-old child with a history of asthma control without medications is referred to the school nurse by the teacher because of persistent coughing. Which of the following should the nurse do first? 1. Obtain the child's heart rate. 2. Give the child a nebulizer treatment. 3. Call a parent to obtain more information. 4. Have a parent come and pick up the child. The correct answer is 3. Because persistent coughing may indicate an asthma attack, and a 7-year-old child would be able to provide only minimal history information, it would be important to obtain information from the parent. Although determining the child's heart rate is an important part of the assessment, it would be done after the history is obtained. More information needs to be obtained before giving the child a nebulizer treatment. Although it may be necessary for the parent to come and pick up the child, a thorough assessment, including history information, should be obtained first. A client has entered a smoking cessation program to quit a 2-pack-a-day cigarette habit. The client has not smoked a cigarette for 3 weeks and tells the nurse about fears of starting smoking again because of current job pressures. What would be the most appropriate reply for the nurse to make in response to the client's comments? 1. Don't worry about it. Everybody has difficulty quitting smoking, and you should expect to as well. 2. If you increase your self-control, I am sure you'll be able to avoid smoking. 3. Try taking a couple of days of vacation to relieve the stress of your job. 4. It is good that you can talk about your concerns. Try calling a friend when you want to smoke. The correct answer is 4. It is important for individuals who are engaged in smoking cessation efforts to feel comfortable with sharing their fears of failure with others and seeking support. Although fewer than 5% of smokers successfully quit on their first attempt, it is not helpful to tell a client to anticipate failure. Telling the client to exercise more self-control does not provide support. Taking a vacation to avoid job pressures does not address the issue of how to manage the desire to smoke when in a stressful situation.
The nurse is assessing a client who has had a myocardial infarction. The nurse notes the cardiac rhythm shown on the electrocardiogram strip below. The nurse identifies this rhythm as 1. Atrial fibrillation. 2. Ventricular tachycardia. 3. Premature ventricular contractions. 4. Sinus tachycardia. The correct answer is 4. Sinus tachycardia. Sinus tachycardia is characterized by normal conduction and a regular rhythm, but with a rate exceeding 100 beats per minute. A P wave precedes each QRS, and the QRS is usually normal. The client has been diagnosed with a cerebrovascular accident, stroke. The client's wife is concerned about her husband's generalized weakness. Which home modification should the nurse suggest to the wife prior to discharge? 1. Obtain a rubber mat to place under the dinner plate. 2. Purchase a long-handled bath sponge for showering. 3. Purchase clothes with Velcro closure devices. 4. Obtain a raised toilet seat for the client's bathroom. The correct answer is 4. Obtain a raised toilet seat for the client's bathroom. Raising the toilet seat is modifying the home and addresses the client's weakness in being able to sit down and get up without straining muscles or requiring lifting assistance from the wife. The nurse is administering hydrochlorothiazide to a client diagnosed with chronic kidney disease. Which assessment data should cause the nurse to question the administration of this medication? Select all that apply. 1. The client's skin turgor on the upper chest is tented. 2. The urine output was 90 milliliter for the last 8 hours. 3. The client's oral mucosa is moist and pink. 4. The client has 3+ sacral and peripheral edema. 5. The client's blood pressure is 90/60 in the left arm. The correct answers are 1. The client's skin turgor on the upper chest is tented, and 5. The client's blood pressure is 90/60 in the left arm. Tented skin turgor indicates the client is dehydrated, and the nurse should question administering the thiazide diuretic hydrochlorothiazide. Diuretics reduce circulating blood volume, which may cause orthostatic hypotension. Because the client's blood pressure is low, the nurse should question administering this medication. The client with CKD would have a less than normal urine output, so the nurse would not question giving the client a diuretic. A moist and pink mucosa indicates the client is hydrated. Therefore, the nurse would not question administering this medication. In option 4, the medication is being administered to help decrease the sacral edema. Therefore, the nurse would not question administering this diuretic. The nurse is caring for a child who has undergone a cardiac catheterization. During recovery, the nurse notices the dressing is saturated with bright red blood. The nurse's first action is to 1. Call the interventional cardiologist. 2. Notify the cardiac catheterization laboratory that the child will be returning. 3. Apply a bulky pressure dressing over the present dressing. 4. Apply direct pressure 1 inch above the puncture site. The correct answer is 4. Apply direct pressure 1 inch above the puncture site. Applying direct pressure 1 inch above the puncture site will localize pressure over the vessel site. Options 1 and 2 are not appropriate actions. Option 3 can be done after applying direct pressure 1 inch above the puncture site.
The nurse is reviewing the laboratory report with the client's lithium level taken that morning prior to administering the 5 p.m. dose of lithium. The lithium level is 1.8 milliequivalents per liter. The nurse should 1. Administer the 5 p.m. dose of lithium. 2. Hold the 5 p.m. dose of lithium. 3. Give the client 8 ounces of water with the lithium. 4. Give the lithium after the client's supper. The correct answer is 2. Hold the 5 p.m. dose of lithium. Rationale: the nurse should hold the 5 p.m. dose of lithium because a level of 1.8 milliequivalents per liter can cause adverse reactions, including diarrhea, vomiting, drowsiness, muscle weakness, and lack of coordination, which are early signs of lithium toxicity. The nurse should report the lithium level to the primary healthcare provider, including any symptoms of toxicity. Administering the 5 p.m. dose of lithium, giving the client the lithium with 8 ounces of water, or giving it after supper would result in an increase of the lithium level, thus increasing the risk of lithium toxicity.
The nurse identified late fetal heart decelerations and decreased variability in the fetal heart rate of a woman in active labor and notified the healthcare provider on call, who advised the nurse that the pattern is acceptable. What would be the priority action at this time? 1. Advise the patient that a different HCP will be called because the first HCP's response was not adequate. 2. Discuss the concerns with another labor and delivery nurse. 3. Document the conversation with the HCP accurately, including the HCP's interpretation and recommendation, and continue close observation of the fetal heart rate. 4. Go up the chain of command and communicate the assessment of the fetal heart rate findings clearly to the next appropriate person per unit protocol. The correct answer is 4. Go up the chain of command and communicate the assessment of the fetal heart rate findings clearly to the next appropriate person per unit protocol. The nurse must follow through on the findings of a non-reassuring fetal heart rate. When patient safety is concerned, the nurse is obligated to pursue an appropriate response. Documenting the conversation with the HCP and discussing it with a colleague are appropriate, but something must be done to address the immediate safety concern and possible need for intervention at this time. The nurse must persist until the safety concern has been addressed appropriately. The nurse notices that a client's heart rate decreases from 63 to 50 beats per minute on the monitor. The nurse should first 1. Administer atropine 0.5 mg IV push. 2. Auscultate for abnormal heart sounds. 3. Prepare for transcutaneous pacing. 4. Take the client's blood pressure. The correct answer is 4. Take the client's blood pressure. The nurse should first assess the client's tolerance to the drop in heart rate by checking the blood pressure and level of consciousness and determine if atropine is needed. If the client is symptomatic, atropine and transcutaneous pacing are interventions for symptomatic bradycardia. Once the client is stable, further physical assessments can be done. A client with Graves' disease is treated with radioactive iodine in the form of sodium iodide, I-131. Which of the following statements by the nurse will explain to the client how the drug works? 1. The RAI stabilizes the thyroid hormone levels before a thyroidectomy. 2. The RAI reduces uptake of thyroxine and thereby improves your condition. 3. The RAI lowers the levels of thyroid hormones by slowing your body's production of them. 4. The RAI destroys thyroid tissue so that thyroid hormones are no longer produced. The correct answer is 4. The RAI destroys thyroid tissue so that thyroid hormones are no longer produced. Sodium iodide, I-131, destroys the thyroid follicular cells, and thyroid hormones are no longer produced. RAI is commonly recommended for clients with Graves' disease, especially the elderly. The treatment results in a medical thyroidectomy. RAI is given in lieu of surgery, not before surgery. RAI does not reduce uptake of thyroxine. The outcome of giving RAI is the destruction of the thyroid follicular cells. It is possible to slow the production of thyroid hormones with RAI.
The client, who had a permanent pacemaker implanted 2 days earlier, is being discharged from the hospital. The client understands the discharge plan when the client 1. Selects a low cholesterol diet to control coronary artery disease. 2. States a need for bed rest for 1 week after discharge. 3. Verbalizes safety precautions needed to prevent pacemaker malfunction. 4. Explains signs and symptoms of myocardial infarction. The correct answer is 3. Education is a major component of the discharge plan for a client with an artificial pacemaker. The client with a permanent pacemaker needs to be able to state specific information about safety precautions, such as to refrain from lifting more than 3 pounds or stretching and bending, and to count the pulse once per week that are necessary to maintain proper pacemaker function. The client will not necessarily be placed on a low cholesterol diet. The client should resume activities as he is able and does not need to remain on bed rest. The client should know signs and symptoms of MI, but is not at risk because of the pacemaker. When developing a teaching plan for the mother of an asthmatic child concerning measures to reduce allergic triggers, which of the following suggestions should the nurse include? 1. Keep the humidity in the home between 50% and 60%. 2. Have the child sleep in the bottom bunk bed. 3. Use a scented room deodorizer to keep the room fresh. 4. Vacuum the carpet once or twice a week. The correct answer is 1. To help reduce allergic triggers in the home, the nurse should recommend that the humidity level be kept between 50% and 60%. Doing so keeps the air moist and comfortable for breathing. When air is dry, the risk for respiratory infections increases. Too high a level of humidity increases the risk for mold growth. Typically, the child with asthma should sleep in the top bunk bed to minimize the risk of exposure to dust mites. The risk of exposure to dust mites increases when the child sleeps in the bottom bunk bed because dust mites fall from the top bed, settling in the bottom bed. Scented sprays should be avoided because they may trigger an asthmatic episode. Ideally, carpeting should be avoided in the home if the child has asthma. However, if it is present, carpeting in the child's room should be vacuumed often, possibly daily, to remove dust mites and dust particles. A client who was in a motor vehicle accident has a fractured mandible. Surgery has been performed to immobilize the injury by wiring the jaw. In the immediate postoperative phase, the nurse should 1. Prevent nausea and vomiting. 2. Maintain a patent airway. 3. Provide frequent oral hygiene. 4. Establish a way for the client to communicate. The correct answer is 2. The priority of care in the immediate postoperative phase is to maintain a patent airway. The nurse should observe the client carefully for signs of respiratory distress. If the client becomes nauseated, antiemetics should be administered to decrease the chance of vomiting with obstruction of the airway and aspiration of vomitus. Providing frequent oral hygiene and an alternative means of communication are important aspects of nursing care, but maintaining a patent airway is most important.
A client who has been scheduled to have a cholecystectomy expresses anxiety about having surgery. Which nursing intervention would be the most appropriate to achieve the outcome of anxiety reduction? 1. Providing the client with information about what to expect post-operatively. 2. Telling the client it is normal to be afraid. 3. Reassuring the client by saying that surgery is a common procedure. 4. Stressing the importance of following the physician's instructions after surgery. The correct answer is 1. Providing the client with information about what to expect post-operatively. Providing information can help to answer the client's questions and decrease anxiety. Fear of the unknown can increase anxiety. Telling the client not to be afraid, that the procedure is common, or to follow her physician's prescriptions will not necessarily decrease anxiety. The client is diagnosed with expressive aphasia. Which psychosocial client problem would the nurse include in the plan of care? 1. Potential for injury. 2. Powerlessness. 3. Disturbed thought processes. 4. Sexual dysfunction. The correct answer is 2. Powerlessness. Expressive aphasia means that the client cannot communicate thoughts, but understands what is being communicated. This leads to frustration, anger, depression, and the inability to verbalize needs, which, in turn, causes the client to have a lack of control and feel powerless. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. The client diagnosed with chronic kidney disease on hemodialysis is prescribed lanthanum carbonate. Which laboratory data indicates the medication is effective? 1. A decreased serum potassium level. 2. A normal serum sodium level. 3. A decreased serum blood urea nitrogen level. 4. A normal serum phosphorus level. The correct answer is 4. A normal serum phosphorus level. Lanthanum carbonate, an electrolyte and water balancing agent, decreases phosphate absorption in the intestines, and the phosphorus is excreted in the feces. A decreased potassium level indicates the dialysis is effective, but not that the medication is effective. This medication does not affect sodium level. A decreased BUN level indicates the dialysis is effective, but not the medication. Which interventions decrease cardiac demands in an infant with congestive heart failure? Select all that apply. 1. Allow parents to hold and rock their child. 2. Feed only when the infant is crying. 3. Keep the child uncovered to promote low body temperature. 4. Make frequent position changes. 5. Feed the child when sucking the fists. 6. Change bed linens only when necessary. 7. Organize nursing activities. The correct answers are 1. Allow parents to hold and rock their child. 4. Make frequent position changes. 5. Feed the child when sucking the fists. 6. Change bed linens only when necessary. And 7. Organize nursing activities. Rocking by the parents will comfort the infant and decrease demands. Frequent position changes will decrease the risk for infection by avoiding immobility with its potential for skin breakdown. An infant sucking the fists could indicate hunger. Change bed linens only when necessary to avoid disturbing the child. Organize nursing activities to avoid disturbing the child. The infant would not be fed when crying because crying increases cardiac demands. The infant might choke if the nipple is placed in the mouth and the child inhales when trying to swallow. Keep the child normothermic to reduce metabolic demands.
A nurse is conducting a psychoeducational group for family members of clients hospitalized with depression. Which family member's statement indicates a need for additional teaching? 1. My husband will slowly feel better as his medicine takes effect over the next 2 to 4 weeks. 2. My wife will need to take her antidepressant medicine and go to group to stay well. 3. My son will only need to attend outpatient appointments when he starts to feel depressed again. 4. My mother might need help with grocery shopping, cooking, and cleaning for a while. The correct answer is 3. My son will only need to attend outpatient appointments when he starts to feel depressed again. Rationale. Additional teaching is needed for the family member who states her son will only need to attend outpatient appointments when he starts to feel depressed again. Compliance with medication and outpatient follow-up are key in preventing relapse and rehospitalization. The statements expressing expectations of feeling better as medication takes effect, needing medicine and group therapy to stay well, and needing help with grocery shopping, cooking, and cleaning for a while indicate the family's understanding of depression, medication, and follow-up care.
The nurse is caring for a patient in labor at 39 weeks gestation and has identified mild variable fetal heart rate decelerations. Which action would the nurse take first? 1. Change the maternal position. 2. Notify the healthcare provider. 3. Prepare for delivery. 4. Readjust the fetal monitor. The correct answer is 1. Change the maternal position. The cause of variable fetal heart decelerations is compression of the umbilical cord, which can often be corrected by a change in maternal position. It is usually a benign condition and would not require the nurse to prepare for delivery or to notify the healthcare provider unless the variable decelerations are severe and persistent. Adjusting the fetal monitor may be needed after the change in maternal position, but would not directly address the variable decelerations. A client is admitted with a myocardial infarction and atrial fibrillation. While auscultating the heart, the nurse notes an irregular heart rate and hears an extra heart sound at the apex after the S2 that remains constant throughout the respiratory cycle. The nurse should document these findings as 1. Heart rate irregular with S3. 2. Heart rate irregular with S4. 3. Heart rate irregular with aortic regurgitation. 4. Heart rate irregular with mitral stenosis. The correct answer is 1. Heart rate irregular with S3. An S3 heart sound occurs early in diastole as the mitral and tricuspid valves open and blood rushes into the ventricles. To distinguish an S3 from a physiologic S2 split, a split S2 occurs during inspiration and S3 remains constant during the respiratory cycle. Its pitch is softer and best heard with the bell at the apex, and it is one of the first clinical findings in left ventricular failure. An S4 is heard in late diastole when atrial contraction pumps volume into a stiff, non-compliant ventricle. An S4 is not heard in a client with atrial fibrillation because there is no atrial contraction. Murmurs are sounds created by turbulent blood flow through an incompetent or stenotic valve. After treatment with radioactive iodine in the form of sodium iodide, I-131, the nurse teaches the client to 1. Monitor for signs and symptoms of hyperthyroidism. 2. Rest for 1 week to prevent complications of the medication. 3. Take thyroxine replacement for the remainder of the client's life. 4. Assess for hypertension and tachycardia resulting from altered thyroid activity. The correct answer is 3. Take thyroxine replacement for the remainder of the client's life. The client needs to be educated about the need for lifelong thyroid hormone replacement. Permanent hypothyroidism is the major complication of RAI I-131 treatment. Lifelong medical follow-up and thyroid replacement are warranted. The client needs to monitor for signs and symptoms of hypothyroidism, not hyperthyroidism. Resting for 1 week is not necessary. Hypertension and tachycardia are signs of hyperthyroidism, not hypothyroidism.
An 85-year-old client is admitted to the emergency department at 8 p.m. with syncope, shortness of breath, and reported palpitations. Pulse is 150, blood pressure is 90/62, oxygen saturation is 92% on room air, and respiration is 22. Client has shortness of breath and states, "My heart is jumping out my chest, and it hurts some. I am having trouble catching my breath. I don't want to faint again." At 8:15 p.m., the nurse places a client on the ECG monitor and identifies the following rhythm. See the picture below. The nurse should do which of the following? Select all that apply. 1. Apply oxygen. 2. Prepare to defibrillate the client. 3. Monitor vital signs. 4. Have the client sign consent for cardioversion as prescribed. 5. Teach the client about warfarin, Coumadin, treatment, and the need for frequent blood testing. 6. Draw blood for a CBC count and thyroid function study. The correct answers are 1, 3, and 4. The client has atrial fibrillation and will have a regular pulse and will commonly be tachycardic, with rapid ventricular responses typically in the 110 to 140 range, but rarely over 150 to 170. The goal of treatment is the restoration of sinus rhythm. With a heart rate greater than 150 and symptoms such as shortness of breath, dizziness and syncope and chest pain, synchronized cardioversion will most likely be the treatment of choice. With more controlled heart rates and more minor signs and symptoms, chemical conversion with drugs such as cardizem and digoxin, prior to other interventions, such as synchronized cardioversion with appropriate anticoagulation, may be attempted. Because of the decreased cardiac output, monitoring is essential. Obtaining consent for cardioversion requires a prescription from a healthcare provider. But with the current heart rate, having cardioversion is a very strong possibility for this client. Defibrillation is used for ventricular fibrillation, not atrial fibrillation. Teaching the client about warfarin will be a possibility, but not an immediate intervention. Clients in continued atrial fibrillation usually require some form of anticoagulation. Drawing labs for CBCs to detect anemia or infection and thyroid function studies to determine thyrotoxicosis, a rare but not to be missed cause, especially in older adults. Serum electrolytes in blood, urea, nitrogen/creatinine, looking for electrolyte disturbances or renal failure, are commonly drawn for determining the cause of the atrial fibrillation, but they are not an immediate action. After discussing asthma as a chronic condition, which of the following statements by the father of a child with asthma best reflects the family's positive adjustment to this aspect of the child's disease? 1. We try to keep him happy at all costs, otherwise he has an asthma attack. 2. We keep our child away from other children to help cut down on infections. 3. Although our child's disease is serious, we try not to let it be the focus of our family. 4. I'm afraid that when my child gets older, he won't be able to care for himself like I do. The correct answer is 3. Positive adjustment to a chronic condition requires placing the child's illness in its proper perspective. Children with asthma need to be treated as normally as possible within the scope of the limitations imposed by the illness. They also need to learn how to manage exacerbations and then resume as normal a life as possible. Trying to keep the child happy at all costs is inappropriate and can lead to the child's never learning how to accept responsibility for behavior and get along with others. Although minimizing the child's risk for exposure to infections is important, the child needs to be with his or her peers to ensure appropriate growth and development. Children with a chronic illness need to be involved in their care so that they can learn to manage it. Some parents tend to overprotect their child with a chronic illness. This overprotectiveness may cause a child to have an exaggerated feeling of importance or later, as an adolescent, to rebel against the overprotectiveness and the parents. A client has returned from surgery during which the jaws were wired as treatment for a fractured mandible. The client is in stable condition. The nurse is instructing the unlicensed nursing personnel on how to properly position the client, which instructions about positioning would be appropriate for the nurse to give a UAP. 1. Keep the client in a sideline position with the head slightly elevated. 2. Do not reposition the client without the assistance of a registered nurse. 3. The client can assume any position that is comfortable. 4. Keep the client's head elevated on 2 pillows at all times. The correct answer is 1. Immediately after surgery, the client should be placed on the side with the head slightly elevated. This position helps facilitate removal of secretions and decreases the likelihood of aspiration should vomiting occur. A nurse does not need to be present to reposition the client, unless the client's condition warrants the presence of a nurse. Although it is important to elevate the head, there is no need to keep the client's head elevated on 2 pillows unless that position is comfortable for the client.
A client has an open cholecystectomy with bile duct exploration. Following surgery, the client has a T-tube. To evaluate the effectiveness of the T-tube, the nurse should 1. Irrigate the tube with 20 ml of normal saline every 4 hours. 2. Unclamp the T-tube and empty the contents every day. 3. Assess the color and amount of drainage every shift. 4. Monitor the multiple incision sites for bile drainage. The correct answer is 3. Assess the color and amount of drainage every shift. A T-tube is inserted in the common bile duct to maintain patency until edema from the duct exploration subsides. The bile color should be gold to dark green, and the amount of drainage should be closely monitored to ensure tube patency. Irrigation is not routinely done unless prescribed using a smaller volume of fluid. The T-tube is not clamped in the early post-op period to allow for continuous drainage. An open cholecystectomy has 1 right subcostal incision, whereas a laparoscopic cholecystectomy has multiple small incisions. Which assessment data would indicate to the nurse that the client would be at risk for a hemorrhagic stroke? 1. A blood glucose level of 480 milligrams per deciliter. 2. A right-sided carotid brute. 3. A blood pressure of 220 over 120. 4. The presence of bronchogenic carcinoma. The correct answer is 3. A blood pressure of 220 over 120. Uncontrolled hypertension is a risk factor for hemorrhagic stroke, which is a ruptured blood vessel inside the cranium. The client diagnosed with chronic kidney disease on hemodialysis is prescribed lanthanum carbonate. Which interventions should the nurse discuss with the client? Select all that apply. 1. Chew the tablets completely before swallowing. 2. Monitor the dialysis graft for bleeding. 3. Take an over-the-counter proton pump inhibitor. 4. Check the radial pulse prior to taking the medication. 5. Take the medication with or right after meals. The correct answers are 1. Chew the tablets completely before swallowing, and 5. Take the medication with or right after meals. Lanthanum carbonate, an electrolyte and water balancing agent, should not be swallowed. The medication must be chewed for absorption in the intestines. Lanthanum carbonate should be taken with or right after meals. Lanthanum carbonate may cause graft occlusion, not bleeding. Lanthanum carbonate does not increase gastric acid secretion. Therefore, the client would not need to take a proton pump inhibitor. Lanthanum carbonate may cause hypotension, and the blood pressure must be checked, not the pulse rate. Indomethacin may be given to close which congenital heart defect in newborns? Blank. The correct answer is patent ductus arteriosus. Prostaglandins allow the duct to remain open. Thus, a prostaglandin inhibitor, such as indomethacin or ibuprofen, can help close the duct.
A 16-year-old client is prescribed 10 milligrams of paroxetine at bedtime for major depression. The nurse should instruct the client and parents to monitor the client closely for which adverse effect. 1. Headache. 2. Nausea. 3. Fatigue. 4. Agitation. The correct answer is 4. Agitation. Rationale. The nurse closely monitors the client taking paroxetine for the development of agitation, which could lead to a self-deletion attempt. Headache, nausea, and fatigue are transient adverse effects of paroxetine.
A 24-year-old Gravida 1 para-0 patient is receiving oxytocin during her labor at 41 weeks gestation. Which nursing actions are appropriate when late fetal heart rate decelerations are identified? Select all that apply. 1. Discontinue the oxytocin. 2. Decrease the maintenance IV fluid rate. 3. Administer oxygen to the mother by mask. 4. Place the woman in high Fowler position. 5. Notify the healthcare provider. 6. Discontinue epidural anesthesia. The correct answers are 1. Discontinue the oxytocin. 3. Administer oxygen to the mother by mask. And 5. Notify the healthcare provider. Late fetal heart rate decelerations can be an ominous sign of fetal hypoxemia, especially if repetitive and accompanied by decreased variability. Notification of the HCP is indicated. Turning off the oxytocin and administering oxygen to the mother are recommended nursing interventions to improve fetal oxygenation. An increase, not a decrease, in the IV rate can improve hydration, correct hypovolemia, and increase blood flow to the uterus. Putting the woman in a lateral position can increase blood flow to the uterus and increase oxygenation to the fetus. The high Fowler position would not be helpful. Discontinuation of epidural anesthesia would not be indicated in the presence of late fetal heart rate decelerations. The anesthesia may be vitally important if the condition continues or worsens and necessitates a cesarean section. Promptly addressing fetal heart rate changes may allow intrauterine resuscitation and may decrease the need for cesarean section if those measures are effective. This supports the perinatal core measure of reducing cesarean section rates. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. A 60-year-old comes into the emergency department with crushing substernal chest pain that radiates to the shoulder and left arm. The admitting diagnosis is acute myocardial infarction. Admission prescriptions include oxygen by nasal cannula at 4 liters per minute, complete blood count, a chest radiograph, a 12-lead electrocardiogram, and 2 milligrams of morphine sulfate given IV. The nurse should first 1. Administer the morphine. 2. Obtain a 12-lead ECG. 3. Obtain the blood work. 4. Prescribe the chest radiograph. The correct answer is 1. Administer the morphine. Although obtaining the ECG, chest radiograph, and blood work are all important, the nurse's priority action should be to relieve the crushing chest pain. Therefore, administering morphine sulfate is the priority action. A client with a large goiter is scheduled for a subtotal thyroidectomy to treat thyrotoxicosis. Saturated solution of potassium iodide is prescribed preoperatively for the client. The expected outcome of using this drug is that it helps 1. Slow progression of exophthalmos. 2. Reduce the vascularity of the thyroid gland. 3. Decrease the body's ability to store thyroxine. 4. Increase the body's ability to excrete thyroxine. The correct answer is 2. Reduce the vascularity of the thyroid gland. SSKI is frequently administered before a thyroidectomy because it helps decrease the vascularity of the thyroid gland. A highly vascular thyroid gland is very friable, a condition that presents a hazard during surgery. Preparation of the client for surgery includes depleting the gland of thyroid hormone and decreasing vascularity. SSKI does not decrease the progression of exophthalmos, and it does not decrease the body's ability to store thyroxine or increase the body's ability to excrete thyroxine.
Upon assessment of third-degree heart block on the monitor, the nurse should first 1. Call a code. 2. Begin cardiopulmonary resuscitation. 3. Have transcutaneous pacing. 4. Prepare for defibrillation. The correct answer is 3. Transcutaneous pads should be placed on the client with third-degree heart block. For a client who is symptomatic, Transcutaneous pacing is the treatment of choice. The hemodynamic stability and pulse should be assessed prior to calling a code or initiating CPR. Defibrillation is performed for ventricular fibrillation or ventricular tachycardia with no pulse. An 8-year-old child with asthma states, "I want to play some sports like my friends. What can I do?" The nurse responds to the child based on the understanding of which of the following? 1. Physical activities are inappropriate for children with asthma. 2. Children with asthma must be excluded from team sports. 3. Vigorous physical exercise frequently precipitates an asthmatic episode. 4. Most children with asthma can participate in sports if the asthma is controlled. The correct answer is 4. Physical activities are beneficial to asthmatic children, physically and psychosocially. Most children with asthma can engage in school and sports activities that are geared to the child's condition and within the limits imposed by the disease. The coach and other team members need to be aware of the child's condition and know what to do in case an attack occurs. Those children who have exercise-induced asthma usually use a short-acting bronchodilator before exercising. A client who has had the jaws wire begins to vomit. What should be the nurse's first action? 1. Insert a nasogastric tube and connect it to suction. 2. Use wire cutters to cut the wire. 3. Suction the client's airway as needed. 4. Administer an antiemetic intravenously. The correct answer is 3. The nurse's first action is to clear the client's airway as necessary. Inserting an NG tube or administering an antiemetic may prevent future vomiting episodes, but these procedures are not helpful when the client is actually vomiting. Cutting the wires is done only as a last resort or in case of respiratory or cardiac arrest.
At 8 a.m., the nurse reviews the amount of T-tube drainage for a client who underwent an open cholecystectomy yesterday. After reviewing the output record, the nurse should 1. Report the 24-hour drainage amount at 12 noon. 2. Clamp the T-tube. 3. Evaluate the tube for patency. 4. Irrigate the T-tube. The correct answer is 3. Evaluate the tube for patency. The T-tube should drain approximately 300 to 500 ml in the first 24 hours, and after 3 to 4 days, the amount should decrease to less than 200 ml in 24 hours. With the sudden decrease in drainage at 8 a.m., the nurse should immediately assess the tube for obstruction of flow that can be caused by kinks in the tube or the client lying on the tube. Drainage color must also be assessed for signs of bleeding. The tube should not be irrigated or clamped without a prescription. The 85-year-old client diagnosed with a stroke is complaining of a severe headache. Which intervention should the nurse implement first? 1. Administer a non-narcotic analgesic. 2. Prepare for stat magnetic resonance imaging. 3. Start an intravenous infusion with D5W at 100 milliliters per hour. 4. Complete a neurological assessment. The correct answer is 4. Complete a neurological assessment. The nurse must complete a neurological assessment to help determine the cause of the headache before taking any further action. The nurse in the long-term care facility is caring for a client with an indwelling catheter. Which preparation should the nurse order for the client? 1. Cranberry juice with breakfast daily. 2. Nitrofurantoin, 100 milligrams every 12 hours for 7 days. 3. Vitamin C every night at bedtime. 4. Golden Seal 2 milliliters in water 2 to 3 times daily. The correct answer is 1. Cranberry juice with breakfast daily. Cranberry juice is acidic and will change the pH of the urine, making it harder for bacteria to survive in the environment. It can be used prophylactically to prevent UTIs. It does not treat an infection. The nurse can arrange with the dietitian to include this in the client's dietary plan. Nitrofurantoin, a sulfa drug, is a prescription medication that is used to treat chronic UTIs, but the nurse could not order this medication. In a long-term care facility, over-the-counter vitamin C would require an HCP order. Golden Seal is an herb used for UTIs, but in a long-term care facility, it would require an HCP order. For the child with hypoplastic left heart syndrome, Which drug may be given to allow the patent ductus arteriosus to remain open until surgery? Blank. The correct answer is prostaglandin E. Prostaglandin E maintains ductal patency to promote blood flow until the Norwood procedure is begun. Consider the opposite of wanting to close the patent ductus arteriosus.
A client diagnosed with major depression spends most of the day lying in bed with a sheet pulled over his head. Which of the following approaches by the nurse is most therapeutic? 1. Wait for the client to begin the conversation. 2. Initiate contact with the client frequently. 3. Sit outside the client's room. 4. Question the client until the client responds. The correct answer is 2. Initiate contact with the client frequently. Rationale: the nurse should initiate brief, frequent contacts throughout the day to let the client know that he is important to the nurse. This will positively affect the client's self-esteem. The nurse's action conveys acceptance of the client as a worthwhile person and provides some structure to the seemingly monotonous day. Waiting for the client to begin the conversation with the nurse is not helpful because the depressed client resists interaction and involvement with others. Sitting outside of the client's room is not productive and not necessary in this situation. If the client were actively suicidal, then a one-on-one client-to-staff assignment would be necessary. Questioning the client until he responds would overwhelm him because he could not meet the nurse's expectations to interact.
A pregnant woman at 12 weeks gestation tells the nurse that she is a vegetarian. Which action would the nurse take first? 1. Recommend vitamin B12 and iron supplementation. 2. Recommend consumption of protein drinks daily. 3. Obtain a 24-hour diet recall history. 4. Determine the reason for her vegetarian diet. The correct answer is 3. Obtain a 24-hour diet recall history. The care of a vegetarian woman who is pregnant should begin with an assessment of her diet because vegetarian practices vary widely. The nurse must first assess exactly what the woman's diet consists of and then determine any deficiencies. It is probable that the woman will need a vitamin B12 supplement, but the assessment comes first. Vegetarian diets can be completely adequate in protein, and therefore protein supplementation is not routinely recommended. The reason for the diet is less important than what the diet actually contains. An older adult had a myocardial infarction 4 days ago. At 9:30 a.m., the client's blood pressure is 102/64. After reviewing the client's progress notes, see the chart on PDF download, the nurse should first 1. Give a fluid challenge/bolus. 2. Notify the healthcare provider. 3. Assist the client to walk. 4. Administer Lasix as prescribed. The correct answer is 2. Notify the healthcare provider. All of the 12 p.m. assessments are signs of decreased cardiac output and can be an ominous sign in a client who has recently experienced an MI. The nurse should notify the healthcare provider of these changes. Cardiac output and blood pressure may continue to fall to dangerous levels, which can induce further coronary ischemia and extension of the infarct. While the client is currently hypotensive, giving a fluid challenge bolus can precipitate increased workload on a damaged heart and extend the myocardial infarction. Exercise or walking for this client will increase both the heart rate and stroke volume, both of which will increase cardiac output, but the increased cardiac output will increase oxygen needs, especially in the heart muscle, and can induce further coronary ischemia and extension of the infarct. The client is hypotensive. Although the client has decreased urinary output, this is the body's response to a decreasing cardiac output, and it is not appropriate to administer Lasix. The nurse is administering a saturated solution of potassium iodide. The nurse should 1. Pour the solution over ice chips. 2. Mix the solution with an antacid. 3. Dilute the solution with water, milk, or fruit juice and have the client drink it with a straw. 4. Disguise the solution in a pureed fruit or vegetable. The correct answer is 3. Dilute the solution with water, milk, or fruit juice and have the client drink it with a straw. SSKI should be diluted well in milk, water, juice, or a carbonated beverage before administration to help disguise the strong, bitter taste. Also, this drug is irritating to the mucosa if taken undiluted. The client should sip the diluted preparation through a drinking straw to help prevent staining of the teeth. Pouring the solution over ice chips will not sufficiently dilute the SSKI or cover the taste. Antacids are not used to dilute or cover the taste of SSKI. Mixing in a puree would put the SSKI in contact with the teeth.
The nurse observes a cardiac rhythm. See the image below for a client who is being admitted with a myocardial infarction. What should the nurse do first? 1. Prepare for immediate cardioversion. 2. Begin cardiopulmonary resuscitation. 3. Check for a pulse. 4. Prepare for immediate defibrillation. The correct answer is 3. The nurse should first check the client for the presence of a pulse. The presence of a pulse determines the treatment for ventricular tachycardia. It is also important to assess the client's heart rate and level of consciousness. Cardioversion may be used to treat hemodynamically unstable tachycardias. Assessment of instability is required before cardioversion. It is not appropriate to begin CPR unless the pulse is absent. Defibrillation is used to treat ventricular fibrillation or pulseless ventricular tachycardia. A 9-month-old child with cystic fibrosis does not like taking pancreatic enzyme supplement with meals and snacks. The mother does not like to force the child to take the supplement. The most important reason for the child to take the pancreatic enzyme supplement with meals and snacks is 1. The child will become dehydrated if the supplement is not taken with meals and snacks. 2. The child needs these pancreatic enzymes to help the digestive system absorb fats, carbohydrates, and proteins. 3. The child needs the pancreatic enzymes to aid in liquefying mucus to keep the lungs clear. 4. The child will experience severe diarrhea if the supplement is not taken as prescribed. The correct answer is 2. The child must take the pancreatic enzyme supplement with meals and snacks to help absorb nutrients, so he can grow and develop normally. In cystic fibrosis, the normally liquid mucus is tenacious and blocks 3 digestive enzymes from entering the duodenum and digesting essential nutrients. Without the supplemental pancreatic enzyme, the child will have voluminous, foul, fatty stools due to the undigested nutrients and may experience developmental delays due to malnutrition. Dehydration is not a problem related to cystic fibrosis. The pancreatic enzymes have no effect on the viscosity of the tenacious mucus. Diarrhea is not caused by failing to take the pancreatic enzyme supplement.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
A nurse teaches a client experiencing heartburn to take 1.5 ounces of Maalox when symptoms appear. How many milliliters should the client take? Blank ml. The correct answer is 45 milliliters. 1 ounce equal to 30 milliliters. You multiply 30 by 1.5. You get 45 milliliters.
The nurse measures the amount of bile drainage from a T-tube and records it by which one of the following methods? 1. Adding it to the client's urine output. 2. Charting it separately on the output record. 3. Adding it to the amount of wound drainage. 4. Subtracting it from the total intake for each day. The correct answer is 2. Charting it separately on the output record. T-tube bile drainage is recorded separately on the output record. Adding the T-tube drainage to the urine output or wound drainage makes it difficult to accurately determine the amounts of bile, urine, or drainage. The client's total intake will be incorrect if drainage is subtracted from it. The male client is admitted to the medical floor with a diagnosis of pyelonephritis. Which intervention should the nurse implement first? 1. Initiate IV access with a 20-gauge catheter. 2. Administer the IV antibiotic within 2 hours of admission. 3. Obtain a urine specimen for culture and sensitivity. 4. Notify the dietary department to order the client a regular diet. The correct answer is 3. Obtain a urine specimen for culture and sensitivity. The nurse should obtain a clean voided midstream specimen for culture and sensitivity before initiating the antibiotics. This is the first intervention to implement. The IV is important to initiate therapy, but the nurse should obtain a clean voided midstream urine for culture and sensitivity before initiating the treatment. If the culture is not obtained prior to initiating the antibiotic, the results of the laboratory test will be skewed. A diet order is not a priority over getting the treatment started. UTIs in males are difficult to treat and can be life-threatening. A client diagnosed with a subarachnoid hemorrhage has undergone a craniotomy for repair of a ruptured aneurysm. Which intervention will the intensive care nurse implement? 1. Administer a stool softener, BID. 2. Encourage the client to cough hourly. 3. Monitor neurological status every shift. 4. Maintain the dopamine drip to keep blood pressure at 160/90. The correct answer is 1. Administer a stool softener, BID. The client is at risk for increased intracranial pressure whenever performing the Valsalva maneuver, which will occur when straining during defecation. Therefore, stool softeners would be appropriate. On examination, a nurse hears a murmur at the left sternal border in a child with diarrhea and fever. The parent asks why the healthcare provider never said anything about the murmur. The nurse explains. 1. The healthcare provider is not a cardiologist. 2. Murmurs are difficult to detect, especially in children. 3. The fever increased the intensity of the murmur. 4. We need to refer the child to an interventional cardiologist. The correct answer is 3. The fever increased the intensity of the murmur. The increased CO of the fever increases the intensity of the murmur, making it easier to hear. Option 1 is not a therapeutic response. This child does not need to see an interventional cardiologist. The murmur needs to be diagnosed first, and then a treatment plan would be developed.
The client exhibits a flat affect, psychomotor retardation, and depressed mood. The nurse attempts to engage the client in an interaction, but the client does not respond to the nurse. Which response by the nurse is most appropriate? 1. I'll sit here with you for 15 minutes. 2. I'll come back a little bit later to talk. 3. I'll find someone else for you to talk with. 4. I'll get you something to read. The correct answer is 1. I'll sit here with you for 15 minutes. Rationale. The most appropriate action is for the nurse to remain with the client even if the client does not engage in conversation with the nurse. A client with severe depression may be unable to engage in an interaction with the nurse because the client feels worthless and lacks the necessary energy to do so. However, the nurse's presence conveys acceptance and caring, thus helping to increase the client's self-worth. Telling the client that the nurse will come back later, stating that the nurse will find someone else for the client to talk with, or telling the client that the nurse will get her something to read conveys to the client that she is not important, reinforcing the client's negative view of herself. Additionally, such statements interfere with the client's development of a sense of security and trust in the nurse.
A 26-year-old Gravida 1, Para 1 patient who underwent a cesarean section 24 hours ago tells the nurse that she is having some trouble breastfeeding. Which tasks could be appropriately delegated to the assistive personnel on the postpartum floor? Select all that apply. 1. Providing the mother with an ordered abdominal binder. 2. Assisting the mother with breastfeeding. 3. Taking the mother's vital signs. 4. Checking the amount of lochia present. 5. Assisting the mother with ambulation. 6. Checking the incision site. The correct answers are 1. Providing the mother with an ordered abdominal binder. 3. Taking the mother's vital signs. And 5. Assisting the mother with ambulation. The AP could provide an abdominal binder, measure the vital signs of the patient, and assist her to ambulate. The nurse would be responsible for evaluating the normality of the vital sign values. The AP should be given parameter limits for vital signs and told to report values outside these limits to the nurse. Assisting in breastfeeding for a first-time mother is a very important nursing function because the nurse needs to give consistent, evidence-based advice to enhance success at breastfeeding. A common complaint of postpartum patients is inconsistent help with and advice on breastfeeding. The nurse should also be the one to check the amount of lochia and the surgical incision site because the evaluation requires nursing judgment. The use of the professionally educated nurse to provide evidence-based and consistent information and assistance with breastfeeding supports the perinatal core measure of increasing the percentage of newborns who are fed breast milk only. When administering a thrombolytic drug to the client who is experiencing a myocardial infarction and who has premature ventricular contractions, the expected outcome of the drug is to 1. Promote hydration, 2. Dissolve clots, 3. Prevent kidney failure, 4. Treat dysrhythmias. The correct answer is 2. Dissolve clots. Thrombolytic drugs are administered within the first 6 hours after onset of an MI to dissolve clots and reduce the extent of myocardial damage. Following a subtotal thyroidectomy, the nurse asks the client to speak immediately upon regaining consciousness. The nurse does this to monitor for signs of which of the following? 1. Internal hemorrhage. 2. Decreasing level of consciousness. 3. Laryngeal nerve damage. 4. Upper airway obstruction. The correct answer is 3. Laryngeal nerve damage. Laryngeal nerve damage is a potential complication of thyroid surgery because of the proximity of the thyroid gland to the recurrent laryngeal nerve. Asking the client to speak helps assess for signs of laryngeal nerve damage. Persistent or worsening hoarseness and weak voice are signs of laryngeal nerve damage and should be reported to the physician immediately. Internal hemorrhage is detected by changes in vital signs. The client's level of consciousness can be partially assessed by asking her to speak, but that is not the primary reason for doing so in this situation. Upper airway obstruction is detected by color and respiratory rate and pattern.
The nurse is preparing the client for a cardioversion. The nurse should do which of the following? Select all that apply. 1. Explain the procedure to the client. 2. Place a self-adhesive patch between the skin and the paddles. 3. Place the paddles over the client's clothing. 4. Call clear before discharging the electrical current. 5. Record the delivered energy and the resulting rhythm. The correct answers are 1, 2, 4, and 5. The nurse should first explain the procedure to the client, and then place the patch electrodes per agency procedure. The nurse must make sure to call clear before discharging the electrical current to prevent injury to others who may be helping with the procedure. After the procedure, the nurse must record the amount of electrical current delivered and the resulting rhythm. The paddles are placed on the patch adhered to the client's skin, not over the client's clothing. A client's diagnosis of cystic fibrosis was made 13 years ago, and she has since been hospitalized several times. On the latest admission, the client has labored respirations, fatigue, malnutrition, and failure to thrive. Which nursing actions are most important initially? 1. Placing the client on bed rest and prescribing a blood gas analysis. 2. Prescribing a high-calorie, high-protein, low-fat, vitamin-enriched diet and pancreatic granules. 3. Applying an oximeter and initiating respiratory therapy. 4. Inserting an IV line and initiating antibiotic therapy. The correct answer is 3. Clients with cystic fibrosis commonly die from respiratory problems. The mucus in the lungs is tenacious and difficult to expel, leading to lung infections and interference with oxygen and carbon dioxide exchange. The client will likely need supplemental oxygen and respiratory treatments to maintain adequate gas exchange, as identified by the oximeter reading. The child will be on bed rest due to respiratory distress. However, although blood gases will probably be prescribed, the oximeter readings will be used to determine oxygen deficit and are, therefore, more of a priority. A diet high in calories, proteins, and vitamins with pancreatic granules added to all foods ingested will increase nutrient absorption and help the malnutrition. However, this intervention is not the priority at this time. Inserting an IV to administer antibiotics is important and can be done after ensuring adequate respiratory function. The nurse has been assigned to provide care for 4 clients. In what order should the nurse assess these clients? 1. A client awaiting surgery for a hiatal hernia repair at 11 a.m. 2. A client with suspected gastric cancer who is on nothing by mouth status for tests. 3. A client with peptic ulcer disease experiencing a sudden onset of acute stomach pain. 4. A client who is requesting pain medication 2 days after surgery to repair fractured jaw. The correct order is 3, 4, 2, and 1. The client with peptic ulcer disease who is experiencing a sudden onset of acute stomach pain should be assessed first by the nurse. The sudden onset of stomach pain could be indicative of a perforated ulcer, which would require immediate medical attention. It is also important for the nurse to thoroughly assess the nature of the client's pain. The client with a fractured jaw is experiencing pain and should be assessed next. The nurse should then assess the client who is NPO for tests to ensure NPO status and comfort. Last, the nurse can assess the client before surgery.
The nurse is caring for a client who had an open cholecystectomy 24 hours ago. The client's vital signs have been stable over the last 24 hours, with most recent temperature 37 degrees Celsius, blood pressure 118/76, respiratory rate 16 breaths per minute, and heart rate 78 beats per minute, but are now changing. Which of the following indicate that the nurse should contact the physician? 1. Temperature 38.8 degrees Celsius, blood pressure 140/86, heart rate 94 beats per minute, respiratory rate 24 breaths per minute. 2. Temperature 38.2 degrees Celsius, blood pressure 118/68, heart rate 84 beats per minute, respiratory rate 20 breaths per minute. 3. Temperature 37.5 degrees Celsius, blood pressure 126/80, heart rate 58 beats per minute, respiratory rate 16 breaths per minute. 4. Temperature 36.4 degrees Celsius, blood pressure 98/64, heart rate 98 beats per minute, respiratory rate 18 breaths per minute. The correct answer is 1. Temperature 38.8 degrees Celsius, blood pressure 140/86, heart rate 94 beats per minute, respiratory rate 24 breaths per minute. This client is exhibiting 3 of 4 signs of systemic inflammatory response syndrome: temperature greater than 38 degrees Celsius or less than 36 degrees Celsius, heart rate greater than 90 beats per minute, respiratory rate greater than 20 breaths per minute. The fourth indicator is an abnormal white blood cell count, greater than 12,000, less than 4,000, or greater than 10% bands. At least 2 of these variables are required to define systemic inflammatory response syndrome. The client diagnosed with a mild concussion is being discharged from the emergency department. Which discharge instruction should the nurse teach the client's significant other? 1. Awaken the client every 2 hours. 2. Monitor for increased intracranial pressure. 3. Observe frequently for hypervigilance. 4. Offer the client food every 3 to 4 hours. The correct answer is 1. Awaken the client every 2 hours. Awakening the client every 2 hours allows the identification of headache, dizziness, lethargy, irritability, and anxiety, all signs of post-concussion syndrome that would warrant the significant others taking the client back to the emergency department. The client diagnosed with glomerulonephritis is receiving trimethoprim sulfa. Which data indicates the medication is effective? 1. A urine-specific gravity of 1.010. 2. Urinalysis with 35 white blood count high power field. 3. Urine pH of 6.9. 4. A negative urine leukocyte esterase. The correct answer is 4. A negative urine leukocyte esterase. A negative urine leukocyte esterase indicates the antibiotic trimethoprim sulfa is effective in treating the infection. Leukocytes and nitrates are used to determine bacteriuria and other sources of UTIs. Urine-specific gravity can indicate dehydration or water intoxication, but it will not provide information about a UTI. A microscopic value of 35 white blood count high power field indicates a UTI, not that the antibiotic is effective. The normal value is less than 5 WBC-HPF. Normal urine pH is 5.0 to 9.0, but the pH does not evaluate a UTI. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. While assessing a newborn with respiratory distress, the nurse auscultates a machine-like heart murmur. Other findings are a wide pulse pressure, periods of apnea, increased PaCO2, and decreased PO2. The nurse suspects that the newborn has 1. Pulmonary hypertension, 2. Patent ductus arteriosus, 3. Ventricular septal defect, 4. Bronchopulmonary dysplasia. The correct answer is 2. Patent ductus arteriosus. The main identifier is the machine-like murmur, which is the hallmark of a patent ductus arteriosus. Pulmonary hypertension is a pulmonary condition which does not create a heart murmur. A ventricular septal defect does not produce a machine-like murmur. Bronchopulmonary dysplasia is a pulmonary condition which does not create a heart murmur.
After a few minutes of conversation, a female client who is depressed wearily asks the nurse, "Why pick me to talk to? Go talk to someone else." Which of the following replies by the nurse is best? 1. I'm assigned to care for you today if you'll let me. 2. You have a lot of potential and I'd like to help you. 3. I'll talk to someone else later. 4. I'm interested in you and want to help you. The correct answer is 4. I'm interested in you and want to help you. Rationale. The nurse tells the client that the nurse is interested in her to increase the client's sense of importance, worth, and self-esteem. Also, stating that the nurse wants to help conveys to the client that she is worthwhile and important. Telling the client that the nurse is assigned to care for her is impersonal and implies that the client is being uncooperative. Telling the client that the nurse is there because the client has potential for improvement will not help the client with low self-esteem because most people develop a sense of self-worth through accomplishment. Simply saying that the client has a lot of potential will not convince her that she is worthwhile. Telling the client that the nurse will talk to someone else later is not client-focused and does not address the client's question or concern.
Which action by a newly graduated nurse during a delivery complicated by shoulder dystocia would require immediate correction by the nurse who is orienting her? 1. Applying fundal pressure. 2. Applying suprapubic pressure. 3. Requesting the immediate presence of the neonatologist. 4. Flexing the maternal legs back across the maternal abdomen. The correct answer is 1. Applying fundal pressure. Fundal pressure should never be applied in a case of shoulder dystocia because it may worsen the problem by impacting the fetal shoulder even more firmly into the symphysis pubis. This issue of patient safety would require the supervising nurse to intervene immediately. The other responses are appropriate actions in a case of shoulder dystocia. The nurse is assessing a client who has had a myocardial infarction. The nurse notes the cardiac rhythm on the monitor. See the electrocardiogram strip below. The nurse should 1. Notify the physician. 2. Call the rapid response team. 3. Assess the client for changes in the rhythm. 4. Administer lidocaine as prescribed. The correct answer is 3. Assess the client for changes in the rhythm. The client is experiencing a single PVC. PVCs are characterized by a QRS of longer than 0.12 second and by a wide, notched, or slurred QRS complex. There is no P wave related to the QRS complex, and the T wave is usually inverted. PVCs are potentially serious and can lead to ventricular fibrillation or cardiac arrest when they occur more than 6 to 10 in an hour in clients with myocardial infarction. The nurse should continue to monitor the client and note if the PVCs are increasing. It is not necessary to notify the physician or call the rapid response team at this point. Lidocaine is not indicated from the data on this ECG. A client who has undergone a subtotal thyroidectomy is subject to complications in the first 48 hours after surgery. The nurse should obtain and keep at the bedside equipment to 1. Begin total parenteral nutrition. 2. Start a cut-down infusion. 3. Administer tube feedings. 4. Perform a tracheotomy. The correct answer is 4. Perform a tracheotomy. Equipment for an emergency tracheotomy should be kept in the room in case tracheal edema and airway occlusion occur. Laryngeal nerve damage can result in vocal cord spasm and respiratory obstruction. A tracheostomy set, oxygen and suction equipment, and a suture removal set for respiratory distress from hemorrhage make up the emergency equipment that should be readily available. Total parenteral nutrition is not anticipated for the client undergoing thyroidectomy. Intravenous infusion via a cut-down is not an expected possible treatment after thyroidectomy. Tube feedings are not anticipated emergency care.
A client who has been given cardiopulmonary resuscitation is transported by ambulance to the hospital's emergency department, where the admitting nurse quickly assesses the client's condition. The most effective way to determine the effectiveness of CPR is noting whether the 1. Pulse rate is normal, 2. Pupils are reacting to light, 3. Mucous membranes are pink, 4. Systolic blood pressure is at least 80. The correct answer is 2. Pupillary reaction is the best indication of whether oxygenated blood has been reaching the client's brain. Pupils that remain widely dilated and do not react to light probably indicate that serious brain damage has occurred. The pulse rate may be normal, mucous membranes may still be pink, and systolic blood pressure may be 80 or higher, and serious brain damage may still have occurred. A child with cystic fibrosis is receiving gentamicin. Which of the following nursing actions is most important? 1. Monitoring intake and output. 2. Obtaining daily weights. 3. Monitoring the client for indications of constipation. 4. Obtaining stool samples for hemical testing. The correct answer is 1. Monitoring intake and output is the most important nursing action when administering an aminoglycoside, such as gentamicin, because a decrease in output is an early sign of renal damage. Daily weight monitoring is not indicated when the client is receiving an aminoglycoside. Constipation and bleeding are not adverse effects of aminoglycosides.
After a cholecystectomy, the client is to follow a low-fat diet. Which of the following foods would be most appropriate to include in a low-fat diet? 1. Cheese omelet. 2. Peanut butter. 3. Ham salad sandwich. 4. Roast beef. The correct answer is 4. Roast beef. Lean meats, such as beef, lamb, veal, and well-trimmed lean ham and pork, are low in fat. Rice, pasta, and vegetables are low in fat when not served with butter, cream, or sauces. Fruits are low in fat. The amount of fat allowed in a client's diet after a cholecystectomy will depend on the client's ability to tolerate fat. Typically, the client does not require a special diet, but is encouraged to avoid excessive fat intake. A cheese omelet and peanut butter have high fat content. Ham salad is high in fat from the fat in salad dressing. The resident in a long-term care facility fell during the previous shift and has a laceration in the occipital area that has been closed with steri strips. Which signs/symptoms would warrant transferring the resident to the emergency department? 1. A 4 centimeters area of bright red drainage on the dressing. 2. A weak pulse, shallow respirations, and cool, pale skin. 3. Pupils that are equal, react to light, and accommodate. 4. Complaints of a headache that resolves with medication. The correct answer is 2. A weak pulse, shallow respirations, and cool, pale skin. These signs, symptoms, weak pulse, shallow respirations, cool, pale skin, indicate increased intracranial pressure from cerebral edema secondary to the fall, and they require immediate attention. The nurse is administering medications to clients on a urology floor. Which medication should the nurse question? 1. Ceftriaxone to a client who is pregnant. 2. Cephalexin to a client who is allergic to penicillin. 3. Trimethoprim sulfa to a client post-prostate surgery. 4. Nitrofurantoin to a client diagnosed with urinary stasis. The correct answer is 2. Cephalexin to a client who is allergic to penicillin. A cross-sensitivity exists in some clients between penicillin and cephalosporins, such as cephalexin. The nurse should assess the type of reaction that the client experienced when taking penicillin. If the client indicates any symptom of an anaphylactic reaction, the nurse will hold the medication and discuss the situation with the HCP. Ceftriaxone, a third-generation cephalosporin, is in the pregnancy risk category B. No research has shown harm to the fetus in humans or in animals. The nurse would not question this medication. There is no reason for the nurse to question trimethoprim sulfa, a sulfa antibiotic, for a client who has had prostate surgery. There is no reason for the nurse to question nitrofurantoin, a sulfa antibiotic, for a client who has urinary stasis. Nitrofurantoin is used to prevent or treat chronic UTIs. Which are the most serious complications for a child with Kawasaki disease? Select all that apply. 1. Coronary thrombosis. 2. Coronary stenosis. 3. Coronary artery aneurysm. 4. Hypocoagulability. 5. Decreased sedimentation rate. 6. Hypoplastic left heart syndrome. The correct answers are 1. Coronary thrombosis, 2. Coronary stenosis, and 3. Coronary artery aneurysm. Thrombosis, stenosis, and aneurysm affect blood vessels. The child with Kawasaki disease has hypercoagulability and an increased sedimentation rate due to inflammation. Hypoplastic left heart syndrome is a congenital heart defect and has no relation to Kawasaki disease.
A client is receiving paroxetine 20 milligrams every morning. After taking the first 3 doses, the client tells the nurse that the medication upsets the stomach. Which of the following instructions should the nurse give to the client? 1. Take the medication an hour before breakfast. 2. Take the medication with some food. 3. Take the medication at bedtime. 4. Take the medication with 4 ounces of orange juice. The correct answer is 2. Take the medication with some food. Rationale. Nausea and gastrointestinal upset is a common, but usually temporary, side effect of paroxetine. Therefore, the nurse would instruct the client to take the medication with food to minimize nausea and stomach upset. Other more common side effects are dry mouth, constipation, headache, dizziness, sweating, loss of appetite. Taking the medication an hour before breakfast would most likely lead to further gastrointestinal upset. Taking the medication at bedtime is not recommended because paroxetine can cause nervousness and interfere with sleep. Because orange juice is acidic, taking the medication with it, especially on an empty stomach, may lead to nausea or increase the client's gastrointestinal upset.
A 27-year-old patient underwent a primary cesarean section because of breech presentation 24 hours ago. Which assessment finding would be of the most concern? 1. Small amount of lochia rubra. 2. Temperature of 99 degrees Fahrenheit. 3. Slight redness and pain of the left calf. 4. Pain rated as 3 of 10 in the incisional area. The correct answer is 3. Slight redness and pain of the left calf. Slight redness and pain in the left calf could be suggestive of thrombophlebitis and requires further investigation. The other findings are within normal limits for this point in the postpartum and post-operative course. A client admitted for a myocardial infarction develops cardiogenic shock. An arterial line is inserted. Which of the following prescriptions from the healthcare provider should the nurse verify before implementing? 1. Call for urine output less than 30 milliliters per hour for 2 consecutive hours. 2. Metoprolol 5 milligrams IV push. 3. Prepare for a pulmonary artery catheter insertion. 4. Titrate dobutamine to keep systolic BP greater than 100. The correct answer is 2. Metoprolol 5 milligrams IV push. Metoprolol is indicated in the treatment of hemodynamically stable clients with an acute MI to reduce cardiovascular mortality. Cardiogenic shock causes severe hemodynamic instability, and a beta blocker will further depress myocardial contractility. The metoprolol should be discontinued. The decrease in cardiac output will impair perfusion to the kidneys. Cardiac output, hemodynamic measurements, and appropriate interventions can be determined with a PA catheter. Dobutamine will improve contractility and increase the cardiac output that is depressed in cardiogenic shock. One day, following a subtotal thyroidectomy, a client begins to have tingling in the fingers and toes. The nurse should first 1. Encourage the client to flex and extend their fingers and toes. 2. Notify the physician. 3. Assess the client for thrombophlebitis. 4. Ask the client to speak. The correct answer is 2. Notify the physician. Tetany may occur after thyroidectomy if the parathyroid glands are accidentally injured or removed during surgery. This would cause a disturbance in serum calcium levels. An early sign of tetany is numbness and tingling of the fingers or toes and in the circumferal region. Tetany may occur from 1 to 7 days post-operatively. Late signs and symptoms of tetany include seizures, contraction of the glottis, and respiratory obstruction. The nurse should notify the physician. Exercising the joints in the fingers and toes will not relieve the tetany. The client is not exhibiting signs of thrombophlebitis. There is no indication of nerve damage that would cause the client not to be able to speak. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
A client is given amiodarone in the emergency department for a dysrhythmia. Which of the following indicates the drug is having the desired effect? 1. The ventricular rate is increasing. 2. The absent pulse is now palpable. 3. The number of premature ventricular contractions is decreasing. 4. The fine ventricular fibrillation changes to coarse ventricular fibrillation. The correct answer is 3. Amiodarone is used for the treatment of premature ventricular contractions, ventricular tachycardia with a pulse, atrial fibrillation, and atrial flutter. Amiodarone is not used as initial therapy for a pulseless dysrhythmia. When developing a plan of care for a child with cystic fibrosis who is scheduled to receive postural drainage, the nurse should anticipate performing postural drainage at which of the following times? 1. After meals. 2. Before meals. 3. After rest periods. 4. Before inhalation treatments. The correct answer is 2. Postural drainage, which aids in mobilizing the thick, tenacious secretions commonly associated with CF, is usually performed before meals to avoid the possibility of vomiting or regurgitating food. Although the child with CF needs frequent rest periods, this is not an important factor in scheduling postural drainage. However, the nurse would not want to interrupt the child's rest period to perform the treatment. Inhalation treatments are usually given before postural drainage to help loosen secretions.
A client with cholecystitis continues to have severe right upper quadrant pain. The nurse obtains the following vital signs: temperature 38.4 degrees Celsius, pulse 114, respirations 22, blood pressure 142/90. Using the S-bar technique for communication, the nurse recommends to the primary care provider for the client to receive 1. Hydromorphone IV. 2. Dultayazem PO. 3. Meperidine IM. 4. Promethazine IM. The correct answer is 1. Hydromorphone IV. Hydromorphone should be considered for pain management. It should be administered intravenously for rapid action to address the severe pain the client is experiencing. Intramuscular injections are painful and slower acting. Since meperidine's toxic metabolite can cause seizures, it is no longer the treatment choice for pain. Dultayazem, a calcium channel blocker, is not indicated. Elevation of heart rate and blood pressure is likely due to pain and fever. Promethazine is used to treat nausea. The nurse is caring for the following clients. Which client would the nurse assess first after receiving the shift report? 1. The 22-year-old male client diagnosed with a concussion who is complaining someone is waking him up every 2 hours. 2. The 36-year-old female client admitted with complaints of left-sided weakness who is scheduled for a magnetic resonance imaging scan. 3. The 45-year-old client admitted with blunt trauma to the head after a motorcycle accident who has a Glasgow Coma Scale score of 6. 4. The 62-year-old client diagnosed with a cerebrovascular accident who has expressive aphasia. The correct answer is 3. The 45-year-old client admitted with blunt trauma to the head after a motorcycle accident who has a Glasgow Coma Scale score of 6. The Glasgow Coma Scale is used to determine a client's response to stimuli, eye-opening response, best verbal response, and best motor response, secondary to a neurological problem. Scores range from 3 to 15. The nurse observes the unlicensed assistive personnel performing delegated tasks. Which action by the UAP requires immediate intervention? 1. The UAP measures the output of a client who had a transurethral resection of the prostate. 2. The UAP tells the client taking bethanechol, whose urine is green, that something must be wrong for the urine to be such an odd color. 3. The UAP encourages the client to drink a glass of water after the nurse has administered the oral antibiotic. 4. The UAP assists the client diagnosed with a urinary tract infection to the bedside commode every 2 hours. The correct answer is 2. The UAP tells the client taking bethanechol, whose urine is green, that something must be wrong for the urine to be such an odd color. A green-blue color indicates the client is taking bethanechol, a urinary stimulant used for clients with a neurogenic bladder. This is an expected color, and the UAP should not indicate that something is wrong with the client. In option 1, the urinary output should be measured frequently in a client who has had a transurethral resection of the prostate. The client will have bladder irrigation, and the indwelling catheter bag will need to be emptied frequently. The nurse would not intervene to stop this action. In option 3, the client should be encouraged to drink fluids. The nurse would not intervene to stop this action. In option 4, this action encourages bowel and urine continence and is part of falls prevention protocol. The nurse would not intervene to stop this action. A child who has reddened eyes with no discharge, red, swollen, and peeling palms and soles of the feet, dry, cracked lips, and a strawberry tongue most likely has blank. The correct answer is 1. Kawasaki disease. Classic signs of Kawasaki disease include red eyes with no discharge, dry, cracked lips, strawberry tongue, and red, swollen, and peeling palms and soles of the feet. Incidence of Kawasaki disease is higher in males. The strongest indicator for this disease is the hallmark strawberry tongue.
The primary healthcare provider prescribes fluoxetine orally every morning for a 72-year-old client with depression. Which transient adverse effect of this drug requires immediate action by the nurse? 1. Nausea. 2. Dizziness. 3. Sedation. 4. Dry mouth. The correct answer is 2. Dizziness. Rationale. The presence of dizziness could indicate orthostatic hypotension, which may cause injury to the client from falling. Nausea, sedation, and dry mouth do not require immediate intervention by the nurse.
A 22-year-old Gravida 1, para-0 woman is being given an epidural anesthetic for pain control during labor and birth. Which are appropriate nursing actions when epidural anesthesia is used during labor? Select all that apply. 1. Request the anesthesiologist to discontinue the epidural anesthetic when the patient's cervix is completely dilated to allow the patient to sense the urge to push. 2. Insert an indwelling catheter because the woman is likely to be unable to void. 3. Encourage ambulation to encourage descent of the fetal head. 4. Encourage the patient to turn from side to side during the course of labor. 5. Teach the patient that pain relief can be expected to last 1 to 2 hours. 6. Explain to the patient that she will feel very drowsy after the epidural is given. The correct answers are 2. Insert an indwelling catheter because the woman is likely to be unable to void, and 4. Encourage the patient to turn from side to side during the course of labor. Insertion of an indwelling catheter is indicated because the woman will usually be unable to void because of the effect of the anesthetic in the bladder area. Positioning the patient on her side enhances blood flow and helps to prevent hypotension. Changing maternal position encourages progress in labor. With epidural anesthesia, ambulation is not usually an option due to decreased sensation in the legs. It is not recommended to routinely discontinue an epidural anesthetic at complete dilation. A continuous epidural infusion provides pain relief throughout labor and birth. Drowsiness is not a common side effect with epidural anesthesia. Drowsiness would be more likely with the use of IV narcotics for pain relief in labor. Use of evidence-based practices with a laboring woman supports the perinatal core measure of reducing the percentage of women who are delivered by cesarean section. The nurse is monitoring a client admitted with a myocardial infarction who is at risk for cardiogenic shock. The nurse should report which of the following changes on the client's chart to the physician? 1. Urine output. 2. Heart rate. 3. Blood pressure. 4. Respiratory rate. The correct answer is 1. Urine output. Oliguria occurs during cardiogenic shock because there is reduced blood flow to the kidneys. Typical signs of cardiogenic shock include low blood pressure, rapid and weak pulse, decreased urine output, and signs of diminished blood flow to the brain, such as confusion and restlessness. Cardiogenic shock is a serious complication of MI, with a mortality rate approaching 90%. Fever is not a typical sign of cardiogenic shock. The other changes in vital signs on the client's chart are not as significant as the decreased urinary output. Which of the following medications should be available to provide emergency treatment if a client develops tetany after a subtotal thyroidectomy? 1. Sodium phosphate. 2. Calcium gluconate. 3. Ecothiopate iodide. 4. Sodium bicarbonate. The correct answer is 2. Calcium gluconate. The client with tetany is suffering from hypocalcemia, which is treated by administering an IV preparation of calcium, such as calcium gluconate or calcium chloride. Oral calcium is then necessary until normal parathyroid function returns. Sodium phosphate is a laxative. Ecothiopate iodide is an eye preparation used as a miotic for an anti-glaucoma effect. Sodium bicarbonate is a potent systemic antacid.
During cardiopulmonary resuscitation, the xiphoid process at the lower end of the sternum should not be compressed when performing cardiac compressions. Which of the following organs will be most likely at risk for laceration by forceful compressions over the xiphoid process? 1. Lung. 2. Liver. 3. Stomach. 4. Diaphragm. The correct answer is 2. Because of its location near the xiphoid process, the liver is the organ most easily damaged from pressure exerted over the xiphoid process. During CPR, the pressure on the victim's chest wall should be sufficient to compress the heart, but not so great as to damage internal organs. Injury may result, however, even when CPR is performed properly. When teaching the parents of an older infant with cystic fibrosis about the type of diet the child should consume, which of the following would be appropriate? 1. Low-protein diet. 2. High-fat diet. 3. Low-carbohydrate diet. 4. High-calorie diet. The correct answer is 4. CF affects the exocrine glands. Mucus is thick and tenacious, sticking to the walls of the pancreatic and bile ducts and eventually causing obstruction. Because of the difficulty with digestion and absorption, a high-calorie, high-protein, high-carbohydrate, moderate-fat diet is indicated.
The nurse prepares to administer promethazine 35 mg IM as prescribed PRN for a client with cholecystitis who has nausea. The ampule label reads that the medication is available in 25 mg per ml. How many milliliters should the nurse administer? To solve this problem, you set up the formula as 35 mg over X equals to 25 mg over 1 milliliter. You cross-multiply 35 times 1 and X times 25. You get 25X equals to 35. You divide 25 on both sides, and you get X equals to 1.4 milliliters. The client with a head injury is experiencing increased intracranial pressure. The neurosurgeon prescribes mannitol. Which intervention should the nurse implement when administering this medication? 1. Monitor the client's arterial blood gases during administration. 2. Do not administer if the client's blood pressure is less than 90/60. 3. Ensure that the client's cardiac status is monitored by telemetry. 4. use a filter needle when administering the medication? The correct answer is 4. Use a filter needle when administering the medication. The nurse must use a filter needle when administering the osmotic diuretic mannitol because crystals may form in the solution and syringe and be inadvertently injected into the client if a filter needle is not used. A client enters the labor and delivery suite stating that she thinks she is in labor. Which of the following information about the woman should the nurse note from the woman's prenatal record before proceeding with the physical assessment? Select all that apply. 1. Weight gain. 2. Ethnicity and religion. 3. Age. 4. Type of insurance. 5. Gravidity and parity. The correct answers are 1. Weight gain. 2. Ethnicity and religion. 3. Age. And 5. Gravidity and parity. Before proceeding with a physical assessment, the nurse should check the client's weight gain reported in her prenatal record. The client's ethnicity and religion should be noted before physical assessment. This allows the nurse to proceed in a culturally sensitive manner. The client's age should also be noted before the physical assessment is begun. The type of insurance the woman has is not relevant to the nurse. The client's gravidity and parity, how many times she has been pregnant and how many times she has given birth, should also be noted before a physical assessment is begun. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. The nurse is caring for clients in an oncology unit. Which neutropenia precautions should be implemented? 1. Hold all venipuncture sites for at least 5 minutes. 2. Limit fresh fruits and flowers. 3. Place all clients in reverse isolation. 4. Have the clients use a soft bristle toothbrush. The correct answer is 2. Limit fresh fruits and flowers. Fresh fruits and flowers may carry bacteria or insects on the skin of the fruit or dirt on the flowers and leaves, so they are restricted around clients with low white blood cell counts. Option 1 would be done for thrombocytopenia, not neutropenia. Clients with severe neutropenia may be placed in reverse isolation, but not all clients with neutropenia will be placed in reverse isolation. Clients are at a greater risk for infecting themselves from endogenous fungi and bacteria than from being exposed to non-infectious individuals. Option 4 is an intervention for thrombocytopenia. Option 3 has the word all in it, which would make you not select this option.
A nurse manager considers that there are the rights of delegation, which is a right of delegation in addition to right task, right person, right communication, and right time. 1. Place. 2. Route. 3. Feedback. 4. Supervision. The correct answer is for supervision. Rationale. The one who delegates a task is responsible for ensuring that the task is performed safely and according to standards of practice. The right place is not one of the rights of delegation. The right route refers to the rights of medication administration, not the rights of delegation. Feedback is part of communication, which is one of the rights of delegation already cited in the stem of the question.
A 36-year-old Gravida 1, Para 0, patient has received an epidural anesthetic. Her cervix is 6 centimeters dilated. Her blood pressure is currently 60/38. Which nursing actions would be the priority? Select all that apply. 1. Place the patient in high Fowler position. 2. Turn the patient to a lateral position. 3. Notify the anesthesiologist. 4. Prepare for emergency cesarean section. 5. Decrease the IV fluid rate. 6. Observe closely for fetal heart rate decelerations. The correct answers are 2. Turn the patient to a lateral position. 3. Notify the anesthesiologist. And 6. Observe closely for fetal heart rate decelerations. The patient may be experiencing supine hypotension caused by the pressure of the uterus on the vena cava and the effects of the epidural medication. Maternal hypotension can cause uteroplacental insufficiency, leading to fetal hypoxia. Placing the woman in a lateral position can relieve the pressure on the vena cava. the anesthesiologist should be notified and may need to treat the patient with ephedrine to correct the hypotension. Fetal heart rate decelerations are common if maternal hypotension is not promptly corrected. IV fluids are increased per protocol when supine hypotension occurs. The physician prescribes continuous IV nitroglycerin infusion for the client with myocardial infarction. The nurse should 1. Obtain an infusion pump for the medication. 2. Take the blood pressure every 4 hours. 3. Monitor urine output hourly. 4. Obtain serum potassium levels daily. The correct answer is 1. Obtain an infusion pump for the medication. IV nitroglycerin infusion requires an infusion pump for precise control of the medication. Blood pressure monitoring would be done with a continuous system and more frequently than every 4 hours. Hourly urine outputs are not always required. Obtaining serum potassium levels is not associated with nitroglycerin infusion. A 60-year-old female is diagnosed with hypothyroidism. The nurse should assess the client for which of the following? 1. Tachycardia. 2. Weight gain. 3. Diarrhea. 4. Nausea. The correct answer is 2. Weight gain. Typical signs and symptoms of hypothyroidism include weight gain, fatigue, decreased energy, apathy, brittle nails, dry skin, cold intolerance, hair loss, constipation, and numbness and tingling in the fingers. Tachycardia is a sign of hyperthyroidism, not hypothyroidism. Diarrhea and nausea are not symptoms of hypothyroidism.
When performing external chest compressions on an adult during cardiopulmonary resuscitation, the rescuer should depress the sternum. 1. 0.5 inch. 2. 1 inch. 3. 1.5 inches. 4. 2 inches. The correct answer is 4. An adult sternum must be depressed 2 inches with each compression to ensure adequate heart compression. At a follow-up appointment after being hospitalized, an adolescent with a history of cystic fibrosis describes his stools to the nurse. Which of the following descriptions should the nurse interpret as indicative of continued problems with malabsorption? 1. Soft with little odor. 2. Large and foul-smelling. 3. Loose with bits of food. 4. Hard with streaks of blood. The correct answer is 2. In children with CF, poor digestion and absorption of foods, especially fats, results in frequent bowel movements that are bulky, large, and foul-smelling. The stools also contain abnormally large quantities of fat, which is called steatorrhea. An adolescent experiencing good control of the disease would describe soft stools with little odor. Stool described as loose with bits of food indicates diarrhea. Stool described as hard with streaks of blood may indicate constipation.
A client undergoes a laparoscopic cholecystectomy. Which of the following dietary instructions should the nurse give the client immediately after surgery? 1. You cannot eat or drink anything for 24 hours. 2. You may resume your normal diet the day after your surgery. 3. Drink liquids today and eat lightly for a few days. 4. You can progress from a liquid to a bland diet as tolerated. The correct answer is 3. Drink liquids today and eat lightly for a few days. Immediately after surgery, the client will drink liquids. A light diet can be resumed the day after surgery. There is no need for the client to remain on nothing by mouth status after surgery because peristaltic bowel activity should not be affected. The client will probably not be able to tolerate a full meal comfortably the day after surgery. There is no need for the client to stay on a bland diet after a laparoscopic cholecystectomy. The client should, however, avoid excessive fats. The client with increased intracranial pressure is receiving mannitol. Which data would cause the nurse to hold the administration of this medication? 1. The serum osmolality is 330 milliosmoles per kilogram. 2. The urine osmolality is 550 milliosmoles per kilogram. 3. The blood urea nitrogen level is 8 milligrams per deciliter. 4. The creatinine level is 1.8 milligrams per deciliter. The correct answer is 1. The serum osmolality is 330 milliosmoles per kilogram. The normal serum osmolality is 275 to 300 milliosmoles per kilogram. The osmotic diuretic mannitol is held if the serum osmolality exceeds 310 to 320 milliosmoles per kilogram. A woman who states that she thinks she is in labor enters the labor suite. Which of the following assessments will provide the nurse with the most valuable information regarding the client's labor status? 1. Leopold maneuvers. 2. Fundal contractility. 3. Fetal heart assessment. 4. Vaginal examination. The correct answer is 4. Vaginal examination. Leopold maneuvers, although performed on a woman in labor, assess for fetal position, not the progress of labor. Fundal contractility will assess for uterine contractions, but this is not the most valuable information. Assessment of the fetal heart is critically important in relation to fetal well-being, but it will not determine the progress of labor. A vaginal examination will provide the nurse with the best information about the status of labor. The nurse is assessing a client diagnosed with acute myeloid leukemia. Which assessment data support this diagnosis? 1. Fever and infections. 2. Nausea and vomiting. 3. Excessive energy and high platelet counts. 4. Cervical lymph node enlargement and positive acid-fast bacillus. The correct answer is 1. Fever and infections. Fever and infection are hallmark symptoms of leukemia. They occur because the bone marrow is unable to produce white blood cells of the number and maturity needed to fight infection. Nausea and vomiting are symptoms related to the treatment of cancer, but not to the diagnosis of leukemia. The clients are frequently fatigued and have low platelet counts. The platelet count is low as a result of the inability of the bone marrow to produce the needed cells. In some forms of leukemia, the bone marrow is not producing cells at all, and in others, the bone marrow is stuck producing tens of thousands of immature cells. Cervical lymph node enlargement is associated with Hodgkin's lymphoma, and positive acid-fast bacillus is diagnostic for tuberculosis. Option 3 could be eliminated right off the bat because of the excessive energy. Illness normally drains energy reserves. It does not increase them.
Which should the manager do first to overcome resistance to change? 1. Ensure that the plan change is within the current beliefs and values of the group. 2. Provide incentives to encourage commitment of participants to the change. 3. Implement change by employing small steps rather than large steps. 4. Use influence power to ensure that goals of change are met. The correct answer is 1. Ensure that the plan change is within the current beliefs and values of the group. Rationale. Change that is consistent with current values and beliefs is easier to implement than change that is inconsistent with current values and beliefs. Values and beliefs are difficult to change. Option 2 is not the priority intervention. Although incentives might motivate some individuals, they do not motivate all because some people have an internal rather than an external locus of control. In option 3, although small steps are more effective than large steps because they are easier to achieve and once achieved, are motivating, this approach is not the first thing the nurse should do to overcome resistance to change. In option 4, although one person sharing explanations with another is helpful when trying to change behavior, it is not the most effective type of power to use when trying to affect change.
While assessing a 29-year-old Gravida 2, Para 2 patient who had a normal spontaneous vaginal delivery 30 minutes ago, the nurse notes a large amount of red vaginal bleeding. Which nursing action would be the priority? 1. Check vital signs. 2. Notify the healthcare provider. 3. Firmly massage the uterine fundus. 4. Put the baby to breast. The correct answer is 3. Firmly massage the uterine fundus. Fundal massage would be the priority nursing action because it helps the uterus to contract firmly and thus reduces bleeding. The first 2 answer choices are appropriate nursing actions, but do nothing to stop the immediate bleeding. Putting the baby to the breast does release oxytocin, which causes uterine contraction, but it will be slower to do so than fundal massage. The client is admitted to the telemetry unit due to chest pain. The client has polysubstance abuse, and the nurse assesses that the client is anxious and irritable and has moist skin. The nurse should do the following in which order from first to last? 1. Obtain a history of which drugs the client has used recently. 2. Administer the prescribed dose of morphine. 3. Position electrodes on the chest. 4. Take vital signs. The correct order is 3. Position electrodes on the chest. 4. Take vital signs. 2. Administer the prescribed dose of morphine. And 1. Obtain a history of which drugs the client has used recently. The nurse should first connect the client to the monitor by attaching the electrodes. Electrocardiography can be used to identify myocardial ischemia and infarction, rhythm and conduction disturbances, chamber enlargement, electrolyte imbalances, and the effects of drugs on the client's heart. The nurse next obtains vital signs to establish a baseline. Next, the nurse should administer the morphine. Morphine is the drug of choice in relieving myocardial infarction pain. It may cause a transient decrease in blood pressure. When the client is stable, the nurse can obtain a history of the client's drug use. The nurse should assess a client with hypothyroidism for which of the following? 1. Corneal abrasion due to inability to close the eyelids. 2. Weight loss due to hypermetabolism. 3. Fluid loss due to diarrhea. 4. Decreased activity due to fatigue. The correct answer is 4. Decreased activity due to fatigue. A major problem for people with hypothyroidism is fatigue. Other signs and symptoms include lethargy, personality changes, generalized edema, impaired memory, slowed speech, cold intolerance, dry skin, muscle weakness, constipation, weight gain, and hair loss. Incomplete closure of the eyelids, hypermetabolism, and diarrhea are associated with hyperthyroidism. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
If a client is receiving rescue breaths and the chest wall fails to rise, during cardiopulmonary resuscitation, the rescuer should first 1. Try using a bag mask device. 2. Decrease the rate of compressions. 3. Intubate the client. 4. Reposition the airway. The correct answer is 4. If the chest wall is not rising with rescue breaths, the head should be repositioned first to ensure that the airway is adequately opened. A bag mask device allows for delivery of 100% oxygen, but is difficult to manage if there is just one rescuer. Ideally, 2 persons are used to operate the bag mask device, one to maintain the seal, and the other to provide the ventilations. Compression should be maintained at 100 per minute. When developing a recreational therapy plan of care for a 3-year-old child hospitalized with pneumonia and cystic fibrosis, which of the following toys would be appropriate? 1. 100-piece jigsaw puzzle. 2. Child's favorite doll. 3. Fuzzy stuffed animal. 4. Scissors, paper, and paste. The correct answer is 2. The child's favorite doll will be a good choice of toys. The doll provides support and is familiar to the child. Although a 3-year-old may enjoy puzzles, a 100-piece jigsaw puzzle is too complicated for an ill 3-year-old child. In view of the child's lung pathology, a fuzzy stuffed animal would not be advised because of its potential as a reservoir for dust and bacteria, possibly predisposing the child to additional respiratory problems. Scissors, paper, and paste are not appropriate for a 3-year-old unless the child is supervised closely.
Which of the following discharge instructions would be appropriate for a client who has had a laparoscopic cholecystectomy and has sutures covered by steri-strips? 1. Avoid showering for 1 week after surgery. 2. Return to work within 1 week. 3. Leave steri-strips in place until you see the surgeon at the post-operative visit. 4. Use acetaminophen to control any fever. The correct answer is 3. Leave steri-strips in place until you see the surgeon at the post-operative visit. After a laparoscopic cholecystectomy, when there are sutures covered by a dressing or steri-strips, the client should not remove dressings from the puncture sites, but should wait until visiting the surgeon. The client may shower 48 hours after surgery. A client can return to work within 1 week, but only if approved by the surgeon and no strenuous activity is involved. The client should report any fever, which could be an indication of a complication. Which discharge instructions should the emergency room nurse discuss with the client who has sustained a concussion? Select all that apply. 1. Do not drink any type of alcoholic beverage until allowed by the HCP. 2. Take 2 acetaminophen up to every 6 hours for a headache. 3. If experiencing a headache, take 1 hydrocodone every 8 hours. 4. It is all right to take a couple of aspirin if experiencing a headache. 5. Notify the HCP if the medication does not relieve your headache. The correct answers are 1. Do not drink any type of alcoholic beverage until allowed by the HCP. 2. Take 2 acetaminophen up to every 6 hours for a headache. And 5. Notify the HCP if the medication does not relieve your headache. Traumatic brain injuries can impair many brain functions that can be significantly worsened by alcohol, so the client should not drink alcoholic beverages until allowed by the HCP. Acetaminophen, a non-narcotic analgesic, can be taken for a headache in a patient who has sustained a concussion. If acetaminophen does not relieve the client's headache, then the client should notify the HCP because this may indicate a worsening condition, such as increased intracranial pressure. A client in labor, G2P1001, was admitted 1 hour ago at 2 centimeters dilated and 50% effaced. She was talkative and excited at that time. During the past 10 minutes, she has become serious, closing her eyes and breathing rapidly with each contraction. Which of the following is an accurate nursing assessment of the situation? 1. The client had poor childbirth education prior to labor. 2. The client is exhibiting an expected behavior for labor. 3. The client is becoming hypoxic and hypercapnic. 4. The client needs her alpha-fetoprotein levels checked. The correct answer is 2. The client is exhibiting an expected behavior for labor. There is no indication that this woman has had poor preparation for childbirth. The woman is showing expected signs of the active phase of labor. There is no indication that this woman is showing signs of hypoxia and/or hypercapnia. The alpha-fetoprotein assessment is a test to screen for Down syndrome and neural tube defects in the fetus. It is done during pregnancy. The client diagnosed with leukemia has central nervous system involvement. Which instruction should the nurse teach? 1. Sleep with the head of the bed elevated to prevent increased intracranial pressure. 2. Take analgesic medication for pain only when the pain becomes severe. 3. Explain radiation therapy to the head may result in permanent hair loss. 4. Discuss end-of-life decisions prior to cognitive deterioration. The correct answer is 3. Explain radiation therapy to the head may result in permanent hair loss. Radiation therapy to the head and scalp area is the treatment of choice for central nervous system involvement of any cancer. Radiation therapy has longer-lasting side effects than chemotherapy. If the radiation therapy destroys the hair follicles, the hair will not grow back. Sleeping with the head of the bed elevated might relieve some intracranial pressure, but it will not prevent increased intracranial pressure from occurring. Analgesic medications for clients with cancer are given on a scheduled basis with a fast-acting analgesic administered PRN for breakthrough pain. Cognitive deterioration does not usually occur. You must be aware of the treatments used for the disease processes to answer this question, but might eliminate option 2 because it violates basic principles of pain management. A 25-year-old Gravida 2, Para 1 patient has come to the obstetric triage room at 32 weeks gestation, reporting painless vaginal bleeding. The nurse is providing orientation for a new nurse on the unit. Which statement by the new nurse to the patient would require the nurse to promptly intervene? 1. I'm going to check your vital signs. 2. I'm going to apply a fetal monitor to check the baby's heart rate and to see if you are having contractions. 3. I'm going to perform a vaginal examination to see if your cervix is dilated. 4. I'm going to feel your abdomen to check the position of the baby. The correct answer is 3. I'm going to perform a vaginal examination to see if your cervix is dilated. Painless vaginal bleeding can be a symptom of placenta previa. A digital vaginal examination is contraindicated until ultrasonography can be performed to rule out placenta previa. If a digital examination is performed when placenta previa is present, it can cause increased bleeding. The other statements reflect appropriate assessment of an incoming patient with vaginal bleeding.
A nurse is caring for a client who has just returned from surgery to treat a fractured mandible. Which of the following items should always be available at this client's bedside? Select all that apply. 1. Nasogastric tube. 2. Wire cutters. 3. Oxygen cannula. 4. Suction equipment. 5. Code cart. The correct answers are 2 and 4. Following surgery for a fractured mandible, the client's jaws will be wired. The nurse should be prepared to intervene quickly in case the client develops respiratory distress or begins to choke or vomit. Wire cutters or scissors should always be available in case the wires need to be cut in a medical emergency. Suction equipment should be available to help clear the client's airway if necessary. It is not necessary to keep a nasogastric tube or oxygen cannula at the client's bedside. Cardiopulmonary arrest is unlikely, so a code card is not needed at the bedside. During rescue breathing and cardiopulmonary resuscitation, the victim will exhale by 1. Normal relaxation of the chest. 2. Gentle pressure of the rescuer's hand on the upper chest. 3. The pressure of cardiac compressions. 4. Turning the head to the side. The correct answer is 1. The exhalation phase of ventilation is a passive activity that occurs during CPR as part of the normal relaxation of the victim's chest. No action by the rescuer is necessary.
Several nurses complained to the nurse manager that one of the nursing assistants constantly takes extensive lunch breaks. Which should the nurse manager do? 1. Convene a group meeting of all the nursing assistants to review their responsibilities related to time management. 2. Talk with the nursing assistant to explore the reasons for the behavior and review expectations. 3. Arrange a meeting with the nurses so that they can confront the nursing assistant as a group. 4. Document the nursing assistant's behavior and place it in the AIDS personnel file. The correct answer is 2. Talk with the nursing assistant to explore the reasons for the behavior and review expectations. Rationale. Recognition of a problem is the first step in the problem-solving process. Once the unacceptable behavior is identified and acknowledged, then the reasons for the problem can be explored, solutions suggested, and expectations reinforced. In option 1, it is the nursing assistant who is late and takes extensive lunch breaks who needs to review the responsibilities related to time, not the nursing assistants who follow the rules. It is not the responsibility of others to confront the employee who is late for work and takes extensive lunch breaks. The employee reports to the nurse manager, who is superior in the chain of command of the organization. The nurse manager should meet with the employee. In addition, counseling sessions with employees should be confidential and conducted in private. Option 4 is premature. The nurse manager first should implement an action identified in another option.
When discussing recent onset of feelings of sadness and depression in a client with hypothyroidism, the nurse should inform the client that these feelings are 1. The effects of thyroid hormone replacement therapy will diminish over time. 2. Related to thyroid hormone replacement therapy and will not diminish over time. 3. A normal part of having a chronic illness. 4. Most likely related to low thyroid hormone levels and will improve with treatment. The correct answer is 4. Most likely related to low thyroid hormone levels and will improve with treatment. Hypothyroidism may contribute to sadness and depression. It is good practice for clients with newly diagnosed depression to be monitored for hypothyroidism by checking serum thyroid hormone and thyroid-stimulating hormone levels. This client needs to know that these feelings may be related to her low thyroid hormone levels and may improve with treatment. Replacement therapy does not cause depression. Depression may accompany chronic illness, but it is not normal.
Which of the following, if described by the parents of a child with cystic fibrosis, indicates that the parents understand the underlying problem of the disease. 1. An abnormality in the body's mucus-secreting glands. 2. Formation of fibrous cysts in various body organs. 3. Failure of the pancreatic ducts to develop properly. 4. Reaction to the formation of antibodies against streptococcus. The correct answer is 1. CF is characterized by a dysfunction in the body's mucus-producing exocrine glands. The mucus secretions are thick and sticky rather than thin and slippery. The mucus obstructs the bronchi, bronchioles, and pancreatic ducts. Mucus plugs in the pancreatic ducts can prevent pancreatic digestive enzymes from reaching the small intestine, resulting in poor digestion and poor absorption of various food nutrients. Fibrous cysts do not form in various organs. Cystic fibrosis is an autosomal recessive inherited disorder and does not involve any reaction to formation of antibodies against streptococcus.
After a client who has had a laparoscopic cholecystectomy receives discharge instructions, which of the following client statements would indicate that the teaching has been successful? Select all that apply. 1. I can resume my normal diet when I want. 2. I need to avoid driving for about 4 weeks. 3. I may experience some pain in my right shoulder. 4. I should spend 2 to 3 days in bed before resuming activity. 5. I can take a shower 2 days later. The correct answers are 1. I can resume my normal diet when I want. 3. I may experience some pain in my right shoulder. And 5. I can take a shower 2 days later. Following a laparoscopic cholecystectomy, the client can resume a normal diet as tolerated. The client may experience right shoulder pain from the gas that was used to inflate the abdomen during surgery. The puncture site should be cleansed daily with mild soap and water. If a Band-Aid was applied after surgery, it can be patted dry or removed and replaced. Driving can usually be resumed in 3 to 4 days following surgery, and there is no need for the client to maintain bed rest in the days following surgery. Light exercise such as walking can be resumed immediately. The following clients have a head injury. Which clients should the nurse question administering the medication mannitol? Select all that apply. 1. The 34-year-old client who is HIV positive. 2. The 84-year-old client who has glaucoma. 3. The 68-year-old client who has cor pulmonale. 4. The 16-year-old client who has cystic fibrosis. 5. The 58-year-old client with congestive heart failure. The correct answers are 3. The 68-year-old client who has cor pulmonale, and 5. The 58-year-old client with congestive heart failure. Cor pulmonale is right-sided heart failure, often secondary to chronic obstructive pulmonary disease. Because mannitol pulls fluid off the brain, it may lead to a circulatory overload, which the heart with right-sided failure could not handle. This client would need an order for a loop diuretic to prevent serious cardiac complications. Because the osmotic diuretic mannitol pulls fluid off the brain, it may lead to a circulatory overload, which the client in CHF could not handle. This client would need an order for a loop diuretic to prevent serious cardiac complications. A woman has just arrived at the labor and delivery suite. To report the client's status to her primary healthcare practitioner, which of the following assessments should the nurse perform? Select all that apply. 1. Fetal heart rate. 2. Contraction pattern. 3. Urinalysis. 4. Vital signs. 5. Biophysical profile. The correct answers are 1. Fetal heart rate. 2. Contraction pattern. And 4. Vital signs. The nurse should assess the fetal heart before reporting the client's status to the healthcare provider. The nurse should assess the contraction pattern before reporting the client's status. A complete urinalysis would likely be ordered by the primary healthcare practitioner once the client has been officially admitted, but the test would not be performed during the initial assessment process. The nurse should assess the woman's vital signs before reporting her status. A biophysical profile is performed only if ordered by a healthcare practitioner. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. The client diagnosed with leukemia is scheduled for bone marrow transplantation. Which interventions should be implemented to prepare the client for this procedure? Select all that apply. 1. Administer high-dose chemotherapy. 2. Teach the client about autologous transfusions. 3. Have the family members human leukocyte antigen typed. 4. Monitor the complete blood cell count daily. 5. Provide central line care per protocol. The correct answers are 1. Administer high-dose chemotherapy. 3. Have the family members human leukocyte antigen typed. 4. Monitor the complete blood cell count daily. And 5. Provide central line care per protocol. All of the bone marrow cells must be destroyed prior to implanting the healthy bone marrow. High-dose chemotherapy and full-body irradiation therapy are used to accomplish this. The best bone marrow donor comes from an identical twin. Next best comes from a sibling who matches. The most complications occur from a matched unrelated donor. The client's body recognizes the marrow as foreign and tries to reject it, resulting in graft versus host disease. The CBC must be monitored daily to assess for infections, anemia, and thrombocytopenia. Clients will have at least one multiple-line central venous access. These clients are seriously ill and require multiple transfusions and antibiotics. Autologous transfusions are infusions from the client himself or herself. This client has cancer involving blood tissue. To reinfuse the client's own tissues would be to purposefully give the client cancer cells.
Which should the nurse do to ensure efficiency when managing a daily assignment? 1. Give care to a client in isolation first. 2. Plan activities to promote nursing convenience. 3. Organize care around legally required activities. 4. Perform routine bed baths between breakfast and lunch. The correct answer is 3. Organize care around legally required activities. Rationale: legally required activities must be accomplished because they are dependent functions that support the medical regimen of care. Although legally required activities should be accomplished first, many independent actions by the nurse also must be implemented to maintain a basic standard of care and client safety. Some nursing interventions, which are not essential, can be implemented after the required activities. Client needs are the priority, not the convenience of the nurse. Options 1 and 4 may not be possible, depending on the needs of clients.
A 3-month-old infant arrives at the health center for a scheduled well-child visit. The parents ask the nurse why the infant extends the arms and legs in response to a loud sound. Which response by the nurse is best? 1. Inform the parents that this is a normal reflex that generally disappears by 4 to 6 months of age. 2. Tell the parents if the behavior does not change by 6 months, the infant will need further evaluation. 3. Remind the parents this is a normal response that indicates the infant's hearing is intact. 4. Reassure the parents that the behavior is normal and not an indicator of any problem such as cerebral palsy. The correct answer is 1. Inform the parents that this is a normal reflex that generally disappears by 4 to 6 months of age. The infant's behavior is consistent with the Moro and startle reflexes. The Moro reflex usually disappears by 6 months of age. The startle reflex usually disappears by 4 months of age. A hearing test is not based on response to loud sounds alone. Although it is true that further evaluation may be needed if the reflexes do not disappear, there is no need for the nurse to discuss this with the parents at this time. The infant's behavior is not consistent with cerebral palsy. While caring for a client who has sustained a myocardial infarction, the nurse notes 8 premature ventricular contractions in 1 minute on the cardiac monitor. The client is receiving an IV infusion of 5% dextrose in water and oxygen at 2 liters per minute. The nurse's first course of action should be to 1. Increase the IV infusion rate. 2. Notify the physician promptly. 3. Increase the oxygen concentration. 4. Administer a prescribed analgesic. The correct answer is 2. Notify the physician promptly. PVCs are often a precursor of life-threatening arrhythmias, including ventricular tachycardia and ventricular fibrillation. An occasional PVC is not considered dangerous, but if PVCs occur at a rate greater than 5 or 6 per minute in the post-MI client, the physician should be notified immediately. More than 6 PVCs per minute is considered serious and usually calls for decreasing ventricular irritability by administering medications such as lidocaine hydrochloride. Increasing the IV infusion rate would not decrease the number of PVCs. Increasing the oxygen concentration should not be the nurse's first course of action. Rather, the nurse should notify the physician promptly. Administering a prescribed analgesic would not decrease ventricular irritability. The nurse is instructing the client with hypothyroidism who takes levothyroxine 100 micrograms, digoxin, and simvastatin. Teaching regarding medications is effective if the client will take 1. Synthroid with breakfast and the other medications after breakfast. 2. Synthroid before breakfast and the other medications 4 hours later. 3. All medications together 1 hour after eating breakfast. 4. All medications before going to bed. The correct answer is 2. Synthroid before breakfast and the other medications 4 hours later. Synthroid must be given at the same time each day on an empty stomach, preferably 30 minutes to 1 hour before breakfast. Other medications may impair the action of levothyroxine absorption. The client should separate doses of other medications by 4 to 5 hours.
The rapid response team has been called to manage an unwitnessed cardiac arrest in a client's hospital room. The estimated maximum time a person can be without cardiopulmonary function and still not experience permanent brain damage is 1 to 2 minutes, 2, 4 to 6 minutes, 3, 8 to 10 minutes, 4, 12 to 15 minutes. The correct answer is 2. After a person is without cardiopulmonary function for 4 to 6 minutes, permanent brain damage is almost certain. To prevent permanent brain damage, it is important to begin CPR promptly after a cardiopulmonary arrest. Which of the following outcome criteria would a nurse develop for a child with cystic fibrosis who has ineffective airway clearance related to increased pulmonary secretions and inability to expectorate? 1. Respiratory rate and rhythm within expected range. 2. Absence of chills and fever. 3. Ability to engage in age-related activities. 4. Ability to tolerate usual diet without vomiting. The correct answer is 1. After treatment, the client outcome would be that respiratory status would be within normal limits, as evidenced by a respiratory rate and rhythm within expected range. Absence of chills and fever, although related to an underlying problem causing the respiratory problem, do not specifically relate to the respiratory problem of ineffective airway clearance. The child's ability to engage in age-related activities may provide some evidence of improved respiratory status. However, this outcome criterion is more directly related to activity intolerance. Although the child's ability to tolerate his or her usual diet may indirectly relate to respiratory function, this outcome is more specifically related to an imbalanced nutrition that may or may not be related to the child's respiratory status.
A client has been admitted to the medical surgical unit following an emergency cholecystectomy. There is a Jackson Pratt drain with a portable suction unit attached. After 4 hours, the drainage unit is full. The nurse should do which of the following? 1. Notify the surgeon. 2. Remove the drain and suction unit. 3. Check the dressing for bleeding. 4. Empty the drainage unit. The correct answer is 4. Empty the drainage unit. Portable suction units should be emptied and drained every shift or when full. It is normal for the unit to fill within the first hours after surgery. The nurse does not need to contact the surgeon. There should not be bleeding on the dressing if the drainage system is emptied when full. The drain should not be removed until prescribed by the physician. The client has an open laceration on the right temporal lobe secondary to being hit on the head with a baseball bat. The emergency department's HCP sutures the laceration, and the CT scan is negative. Which instruction should the nurse discuss with the client? 1. Do not put anything on the laceration for 72 hours. 2. Use hydrocortisone cream 0.5% on the laceration. 3. Cleanse the area with alcohol 3 times a day. 4. Apply a topical antibiotic ointment to the sutured area. The correct answer is 4. Apply a topical antibiotic ointment to the sutured area. The sutured area must be cleansed with soap and water and patted dry, and an antibiotic ointment, such as Neosporin, should be applied to prevent infection. While performing Leopold maneuvers on a woman in labor, the nurse palpates a hard round mass in the fundal area, a flat surface on the left side, small objects on the right side, and a soft round mass just above the symphysis. Which of the following is a reasonable conclusion by the nurse? 1. The fetal position is transverse. 2. The fetal presentation is vertex. 3. The fetal lie is vertical. 4. The fetal attitude is flexed. The correct answer is 3. The fetal lie is vertical. With the palpation findings of a hard round mass in the fundal area and soft round mass above the symphysis, the nurse can conclude that the fetal position is not transverse. The nurse can conclude that the fetal lie is vertical. The attitude is difficult to determine when performing Leopold maneuvers. The client is diagnosed with chronic lymphocytic leukemia after routine laboratory tests during a yearly physical. Which is the scientific rationale for the random nature of discovering the illness? 1. CCL is not serious, and clients die from other causes first. 2. There are no symptoms with this form of leukemia. 3. This is a childhood illness and is self-limiting. 4. In the early stages of chronic lymphocytic leukemia, the client may be asymptomatic. The correct answer is 4. In the early stages of chronic lymphocytic leukemia, the client may be asymptomatic. In this form of leukemia, the cells seem to escape apoptosis, which results in many thousands of mature cells clogging the body. Because the cells are mature, the client may be asymptomatic in the early stages. All types of leukemia are serious and can cause death. The chronic types of leukemia are more insidious in the onset of symptoms and can have a slower progression of the disease. Chronic types of leukemia are more common in the adult population. The symptoms may have a slower onset, but anemia causing fatigue and weakness and thrombocytopenia causing bleeding can be present. Organ enlargement from infiltration may be present. Secondary symptoms of fever, night sweats, and weight loss may also be present.
A first-year nursing student in the clinical area is given an appropriate client assignment by the instructor. Which should the student nurse do? 1. Complete the care indicated on the client's plan of care. 2. Accept the role of leader of the client's healthcare team. 3. Assume accountability for the tasks that are assigned by the instructor. 4. Help other students to complete their assigned tasks when never necessary. The correct answer is 3. Assume accountability for the tasks that are assigned by the instructor. Rationale. Students are accountable for the tasks assigned by the instructor or preceptor. As part of accountability, students are obligated to keep the instructor or preceptor informed about the status of the client, how the assignment is progressing, and whether all interventions are implemented as planned. Although students are expected to complete all planned care, the client's condition can change or some unforeseen event may interfere with the plan. The student must keep the instructor or preceptor informed about the client's condition and use the instructor or preceptor as a resource person when the unexpected occurs or guidance is needed. Students are assigned to care for clients for a specific time period and generally are included as members, not leaders of the nursing team, particularly beginning nursing students. Students should not help other students unless specifically assigned to do so by the instructor or preceptor. An exception occurs when assistance is needed to ensure client safety in an emergency.
A 7-month-old infant arrives at the health center for a scheduled well-child visit. When the nurse approaches the infant to obtain vital signs, the infant cries vigorously and clings fearfully to the mother. Which of the following phenomena provides the best explanation for the infant's behavior? 1. Separation anxiety. 2. Dissociation disorder. 3. Stranger anxiety. 4. Autism spectrum. The correct answer is 3. Stranger anxiety. This infant is displaying stranger anxiety, The child becomes anxious when exposed to unfamiliar people. Separation anxiety occurs when the child is separated from the primary caregiver. Anxiety and crying are also common behaviors. Stranger anxiety and separation anxiety are concurrent and generally begin at 7 to 8 months of age. Which of the following is an expected outcome for a client on the second day of hospitalization after a myocardial infarction? The client: 1. Continues to have severe chest pain. 2. Can identify risk factors for MI. 3. Participates in a cardiac rehabilitation walking program. 4. Can perform personal self-care activities without pain. The correct answer is 4. Can perform personal self-care activities without pain. By day 2 of hospitalization after an MI, clients are expected to be able to perform personal care without chest pain. Severe chest pain should not be present on day 2 after an MI. Day 2 of hospitalization may be too soon for clients to be able to identify risk factors for MI or to begin a walking program. However, the client may be sitting up in a chair as part of the cardiac rehabilitation program. The nurse is teaching a diabetic client using an empowerment approach. The nurse should initiate teaching by asking which of the following? 1. How much does your family need to be involved in learning about your condition? 2. What is required for your family to manage your symptoms? 3. What activities are most important for you to be able to maintain control of your diabetes? 4. What do you know about your medications and condition? The correct answer is 3. What activities are most important for you to be able to maintain control of your diabetes? Empowerment is an approach to clinical practice that emphasizes helping people discover and use their innate abilities to gain mastery over their own condition. Empowerment means that individuals with a health problem have the tools, such as knowledge, control, resources, and experience, to implement and evaluate their self-management practices. Involvement of others, such as asking the client about family involvement, implies that the others will provide the direct care needed rather than the client. Asking the client what the client needs to know implies that the nurse will be the one to provide the information. Telling the client what is required does not provide the client with options or lead to empowerment. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
A nurse is helping a suspected choking victim. The nurse should perform the Heimlich maneuver when the victim: 1. Starts to become cyanotic. 2. Cannot speak due to airway obstruction. 3. Can make only minimal vocal noises. 4. Is coughing vigorously. The correct answer is 2. The Heimlich maneuver should be administered only to a victim who cannot make any sounds due to airway obstruction. If the victim can whisper words or cough, some air exchange is occurring, an emergency medical system should be called instead of attempting the Heimlich maneuver. Cyanosis may accompany or follow choking. However, the Heimlich maneuver should only be initiated when the victim cannot speak. A school-age child with cystic fibrosis asks the nurse what sports she can become involved in as she becomes older. Which of the following activities would be appropriate for the nurse to suggest? 1. Swimming. 2. Track. 3. Baseball. 4. Javelin throwing. The correct answer is 1. Swimming would be the most appropriate suggestion because it coordinates breathing and movement of all muscle groups and can be done on an individual basis or as a team sport. Because track events, baseball, and javelin throwing usually are performed outdoors, the child would be breathing in large amounts of dust and dirt, which would be irritating to her mucous membranes and pulmonary system. The strenuous activity and increased energy expenditure associated with track events, in conjunction with the dust and possible heat, would play a role in placing the child at risk for an upper respiratory tract infection and compromising her respiratory function.
The client who has been hospitalized with pancreatitis does not drink alcohol because of her religious convictions. She becomes upset when the physician persists in asking her about alcohol intake. The nurse should explain that the reason for these questions is that 1. There is a strong link between alcohol use and acute pancreatitis. 2. Alcohol intake can interfere with the tests used to diagnose pancreatitis. 3. Alcoholism is a major health problem, and all clients are questioned about alcohol intake. 4. The physician must obtain the pertinent facts, regardless of religious beliefs. The correct answer is 1. There is a strong link between alcohol use and acute pancreatitis. Alcoholism is a major cause of acute pancreatitis in the United States and Canada. Because some clients are reluctant to discuss alcohol use, staff may inquire about it in several ways. Generally, alcohol intake does not interfere with the tests used to diagnose pancreatitis. Recent ingestion of large amounts of alcohol, however, may cause an increased serum amylase level. Large amounts of ethyl and methyl alcohol may produce an elevated urinary amylase concentration. All clients are asked about alcohol and drug use on hospital admission, but this information is especially pertinent for clients with pancreatitis. Physicians do need to seek facts, but this can be done while respecting the client's religious beliefs. Respecting religious beliefs is important in providing holistic client care. The client with a head injury is ordered a CT scan of the head with contrast dye. Which statements by the client warrant immediate intervention? Select all that apply. 1. I take atenolol for my high blood pressure. 2. I am allergic to many types of fish. 3. I get nauseated whenever I take aspirin. 4. I am taking metformin for my diabetes. 5. I had about 3 beers before I fell and hit my head. The correct answers are 2. I am allergic to many types of fish, and 4. I am taking metformin for my diabetes. The contrast dye used in a CT scan is iodine-based, and an allergy to shellfish suggests an allergy to iodine and would warrant the nurse notifying the HCP to cancel the contrast part of the CT scan. Further assessment would be needed. Metformin, a biguanide medication used for control of diabetes, must not be taken because the kidneys remove metformin. Contrast medium can greatly increase the level of metformin in the blood because damaged kidneys are not as effective at removing metformin from the body. When during the latent phase of labor, should the nurse assess the fetal heart pattern of a low-risk woman, G1P0000? Select all that apply. 1. After vaginal examinations. 2. Before administration of analgesics. 3. Periodically at the end of a contraction. 4. Every 10 minutes. 5. Before ambulating. The correct answers are 1. After vaginal examinations. 2. Before administration of analgesics. 3. Periodically at the end of a contraction. And 5. Before ambulating. The nurse should assess the fetal heart after all vaginal examinations. The nurse should assess the fetal heart before giving the mother any analgesics. The fetal heart should be assessed periodically at the end of a contraction. The fetal heart pattern should be assessed every hour during the latent phase of a low-risk labor. It is not standard protocol to assess every 10 minutes. The nurse should assess the fetal heart before the woman ambulates. The client diagnosed with leukemia is being admitted for an induction course of chemotherapy. Which laboratory values indicate a diagnosis of leukemia? 1. A left shift in the white blood cell count differential. 2. A large number of WBCs that decreases after the administration of antibiotics. 3. An abnormally low hemoglobin and hematocrit level. 4. Red blood cells that are larger than normal. The correct answer is 1. A left shift in the white blood cell count differential. A left shift indicates immature white blood cells are being produced and released into the circulating blood volume. This should be investigated for the malignant process of leukemia. Leukocytosis is normal in the presence of an infection, but it should decrease as the infection clears. A low hemoglobin and hematocrit level indicates anemia and can be caused by a number of factors. Anemia does occur in leukemia, but it is not diagnostic for leukemia. Red blood cells larger than normal occur in macrocytic anemias. They are not characteristic of leukemia. You should recognize elevated WBCs resolve with antibiotics as an infection. Option 3 is not specific enough to be the correct answer.
When delegating a specific procedure to a client care aide, the aide refuses to perform the procedure. Which should the nurse do first? 1. Assign the procedure to another client care aide. 2. Explain that it is part of the client care aide's job description. 3. Explore why the client care aide refused to perform the procedure. 4. Send the client care aide to the procedure manual to review the procedure. The correct answer is 3. Explore why the client care aide refused to perform the procedure. Rationale. The nurse must first explore the reason for the nurse aide's refusal to perform the procedure. The employee may have an acceptable reason for refusing to comply. When the reason is identified, then the nurse manager can take an informed action. Assigning the procedure to another staff member is premature. Another option has priority. The employee may be fully aware of the requirements of the job description and not need to have them described. Even though a task is within one's job description, a person can refuse to perform a procedure because of a reason that is considered acceptable.
A 6-year-old child who received chemotherapy and had anorexia is now cheerfully eating peanut butter, yogurt, and applesauce. When the mother arrives, the child refuses to eat and throws the dish on the floor. What is the nurse's best response to this behavior? 1. Remind the child that foods tasted good today and will help her or his body to get strong. 2. Allow the mother and child time alone to review and control the behavior. 3. Ask the mother to leave until the child can finish eating and then invite her back. 4. Explain to the mother that the behavior could be a normal expression of anger. The correct answer is 4. Explain to the mother that the behavior could be a normal expression of anger. Help the mother to understand that the child may be angry about being left in the hospital or about her inability to prevent the illness and protect the child. Reminding the child about the food and the purpose of the food does not address the strong emotions underlying the outburst. Allowing the mother and child time alone is a possibility, but the assumption would be that the mother understands the child's behavior and is prepared to deal with the behavior in a constructive manner. Asking the mother to leave the child suggests that the mother is a source of stress. A nurse is completing the health history for a client who has been taking echinacea for a head cold. The client asks, "Why isn't this helping me feel better?" Which of the following responses by the nurse would be the most accurate? 1. There is limited information as to the effectiveness of herbal products. 2. Antibiotics are the agents needed to treat a head cold. 3. The head cold should be gone within the month. 4. Combining herbal products with prescription antiviral medications is sure to help you. The correct answer is 1. There is limited information as to the effectiveness of herbal products. At this time, there is no strong research evidence to warrant recommendations of herbal products for management of colds. Further study is needed to show evidence of therapeutic effects and indications. Antibiotics are effective against bacteria. The head cold may have a viral cause. An uncomplicated upper respiratory tract infection subsides within 2 to 3 weeks. There may be a drug-drug interaction with herbal products and prescriptions. A client has undergone a cystectomy and an ileal conduit diversion. What should the nurse incorporate into the discharge instructions? Select all that apply. 1. Drink at least 3,000 milliliters of fluid each day. 2. Minimize daily activities. 3. Keep urine alkaline to prevent urinary tract infections. 4. Avoid odor-producing foods, such as onions, fish, eggs, and cheese. 5. Wear snug clothing over the stoma to encourage urine flow into the drainage bag. The correct answers are 1. Drink at least 3,000 milliliters of fluid each day, and 4. Avoid odor-producing foods, such as onions, fish, eggs, and cheese. An adequate fluid intake aids in the prevention of urinary calculi and infection. Odor-producing foods can produce offensive odors that may impact the client's lifestyle and relationships. Lack of activity leads to urinary stasis, which promotes urinary calculi development and infection. Acidic urine helps prevent urinary tract infections. Tight clothing over the stoma obstructs blood circulation and urine flow.
When performing the Heimlich maneuver on a conscious adult victim, the rescuer delivers inward and upward thrusts specifically. 1. Above the umbilicus. 2. At the level of the xiphoid process. 3. Over the victim's mid-abdominal area. 4. Below the xiphoid process and above the umbilicus. The correct answer is 4. The thrust should be delivered below the xiphoid process, but above the umbilicus, to minimize the risk of internal injuries. When explaining to parents how to reduce the risk of sudden infant death syndrome, the nurse should teach about which of the following measures. Select all that apply. 1. Maintain a smoke-free environment. 2. Use a wedge for sideline positions. 3. Breastfeed the baby. 4. Place the baby on his back to sleep. 5. Use bumper pads over the bed rails. 6. Have the baby sleep in the parent's bed. The correct answers are 1, 3, and 4. Exposure to environmental tobacco increases the risk for SIDS. Sleeping on the back and breastfeeding both decrease the risk of SIDS. The sideline position is not recommended for sleep. It is recommended that babies be dressed in sleepers and that cribs are free of blankets, pillows, bumper pads, and stuffed animals. Co-bedding with parents is not recommended as parents may roll on the child.
The nurse monitors the client with pancreatitis for early signs of shock. Which of the following conditions is primarily responsible for making it difficult to manage shock in pancreatitis? 1. Severity of intestinal hemorrhage. 2. Vasodilating effects of kinin peptides. 3. Tendency toward heart failure. 4. Frequent incidence of acute tubular necrosis. The correct answer is 2. Vasodilating effects of kinin peptides. Life-threatening shock is a potential complication of pancreatitis. Kinin peptides activated by the trap trypsin cause vasodilation and increased capillary permeability. These effects exacerbate shock and are not easily reversed with pharmacologic agents such as vasopressors. Hemorrhage may occur into the pancreas, but not in the intestines. Systemic complications include pulmonary complications, but not heart failure or acute tubular necrosis. The nurse is preparing to administer medications to the following clients. Which medication should the nurse question administering? 1. Furosemide to a client with a serum potassium level of 4.2 milliequivalents per liter. 2. Mannitol to a client with a serum osmolality of 280 milliosmol per kilogram. 3. Digoxin to a client with a digoxin level of 2.4 nanograms per milliliter. 4. Phenytoin to a client with a phenytoin level of 14 microgram per milliliter. The correct answer is 3. Digoxin to a client with a digoxin level of 2.4 nanograms per milliliter. The normal digoxin level is 0.8 to 2.0 nanograms per milliliter. A digoxin level of 2.4 nanograms per milliliter would warrant the nurse questioning the administration of this medication. The trade name for digoxin is lanoxin, and the classification is cardiac glycoside. The nurse is assessing the fetal station during a vaginal examination. Which of the following structures should the nurse palpate? 1. Sacral promontory. 2. Ischial spines. 3. Cervix. 4. Symphysis pubis. The correct answer is 2. Ischial spines. Palpating the sacral promontory assesses the obstetric conjugate, not the fetal station. Station is assessed by palpating the ischial spines. Palpating the cervix assesses dilation and effacement, not fetal station. Palpating the symphysis, pubis assesses the obstetric conjugate, not the fetal station. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. Which medication is contraindicated for a client diagnosed with leukemia? 1. Bactrim, a sulfa antibiotic. 2. Morphine, a narcotic analgesic. 3. Epigen, a biologic response modifier. 4. Gleevec, a genetic blocking agent. The correct answer is 3. Epigen, a biologic response modifier. Epigen is a biologic response modifier that stimulates the bone marrow to produce red blood cells. The bone marrow is the area of malignancy in leukemia. Stimulating the bone marrow would be generally ineffective for the desired results and would have the potential to stimulate malignant growth. Because of the ineffective or non-existent WBC's characteristic of leukemia, the body cannot fight infections, and antibiotics are given to treat infections. Leukemic infiltrations into the organs or the central nervous system cause pain. Morphine is the drug of choice for most clients with cancer. Gleevec is a drug that specifically works in leukemic cells to block the expression of the BCR-ABL protein, preventing the cells from growing and dividing. If you were not familiar with the drug mentioned in option 4, then this option would not be a good choice. Options 1 and 2 are common drugs and should not be chosen as the answer unless you know for sure they are contraindicated.
Which is the most important reason why a nursing assistant must fully understand how to implement a delegated procedure. 1. Be capable of completing the procedure safely. 2. Be proficient enough to perform the procedure quickly. 3. Have the knowledge to explain the procedure to a client. 4. Have the correct information when teaching the procedure to another nursing assistant. The correct answer is 1. Be capable of completing the procedure safely. Rationale: safety of the client is the priority. The nursing assistant must perform only the skills that are within the legal role of the nursing assistant and perform correctly on a return demonstration. Nurse aides are trained and supervised by the nurse, not other nurse aides.
A nurse is teaching a client about taking antihistamines. Which of the following instructions should the nurse include in the teaching plan? Select all that apply. 1. Operating machinery and driving may be dangerous while taking antihistamines. 2. Continue taking antihistamines even if nasal infection develops. 3. The effect of antihistamines is not felt until a day later. 4. Do not use alcohol with antihistamines. 5. Increase fluid intake to 2,000 milliliters per day. The correct answers are 1. Operating machinery and driving may be dangerous while taking antihistamines. 4. Do not use alcohol with antihistamines. And 5. Increase fluid intake to 2,000 milliliters per day. Antihistamines have an anticholinergic action and a drying effect and reduce nasal, salivary, and lacrimal gland hypersecretion, runny nose, tearing, and itching eyes. An adverse effect is drowsiness, so operating machinery and driving are not recommended. There is also an additive depressant effect when alcohol is combined with antihistamines, so alcohol should be avoided during antihistamine use. The client should ensure adequate fluid intake of at least 8 glasses per day due to the drying effect of the drug. Antihistamines have no antibacterial action. The effect of antihistamines is prompt, not delayed. A nurse is caring for a client with an ileal conduit. When assessing the stoma, which of the following outcomes are not desirable? Select all that apply. 1. Dermatitis. 2. Bleeding. 3. Fungal infection. 4. Use of adhesive solvent on the skin around the stoma. 5. Placing skin cement on the faceplate of the collection bag. The correct answers are 1. Dermatitis, 2. Bleeding, and 3. Fungal infection. Dermatitis with alkaline encrustations may occur when alkaline urine comes in contact with exposed skin. Yeast infections, or fungal infections, are another common peristomal skin problem. If the stoma is irritated from rubbing, there will be bleeding. The nurse and client should avoid irritating the stoma. Adhesive solvent should be used on a gauze pad to remove old adhesive and should, therefore, not contact the stoma directly. Only a minimal amount of skin cement is applied to the faceplate of the collection bag and skin to secure the appliance over the stoma, so obstruction of the stoma by the cement would not be possible if correct technique is followed.
Which one of the following children is at most risk for sudden infant death syndrome? 1. Infant who is 3 months old. 2. 2-year-old who has apnea lasting up to 5 seconds. 3. Firstborn child whose parents are in their early 40s. 4. 6-month-old who has had 2 bouts of pneumonia. The correct answer is 1. The highest incidence of SIDS occurs in infants between ages 2 and 4 months. About 90% of SIDS occurs before the age of 6 months. Apnea lasting longer than 20 seconds has also been associated with a higher incidence of SIDS. SIDS occurs with higher frequency in families where a child in the family has already died of SIDS, but the age of the parents has not been shown to contribute to SIDS. A respiratory infection such as pneumonia has not been shown to cause a higher incidence of SIDS.
A client with acute pancreatitis has a blood pressure of 88/40, heart rate of 128 beats per minute, respirations of 28 breaths per minute, and Gray-Turner's sign. What action should the nurse perform first? 1. Assess the urine output. 2. Place an intravenous line. 3. Position on the left side. 4. Insert a nasogastric tube. The correct answer is 2. Place an intravenous line. Gray-Turner's sign is a bluish discoloration in the flank area caused by retroperitoneal bleeding. The vital signs are showing hemodynamic instability. IV access should be obtained to provide immediate volume replacement. The urine output will provide information on the fluid status. A nasogastric tube is indicated for clients with uncontrolled nausea and vomiting or gastric distension. Repositioning the client may be considered for pain management once the client's vital signs are stable. An 18-month-old child has oral mucositis secondary to chemotherapy. Which task should the nurse delegate to the assistive personnel? 1. Reporting evidence of severe mucosal ulceration. 2. Assisting the child in swishing and spitting mouthwash. 3. Assessing the child's ability and willingness to drink through a straw. 4. Feeding the child a bland, moist, soft diet. The correct answer is 4. Feeding the child a bland, moist, soft diet. Helping the child to eat is within the scope of responsibilities for an AP. Assessing ability and willingness to drink and checking for extent of mucosal ulceration are the responsibilities of a nurse. An 18-month-old child is not able to swish and spit, which could result in swallowing the mouthwash. Mouthwash is not intended for swallowing because it can contain alcohol and other ingredients not safe for ingestion.
The monitor technician informs the nurse that the client has started having premature ventricular contractions every other beat, which is a priority nursing action. 1. Activate the rapid response team. 2. Assess the client's orientation and vital signs. 3. Call the physician. 4. Administer a bolus of lidocaine. The correct answer is 2. The priority action is to assess the client and determine whether the rhythm is life-threatening. More information, including vital signs, should be obtained, and the physician should be quickly notified. A bolus of lidocaine may be prescribed to treat this arrhythmia. This is not a code-type situation unless the client has been determined to be in a life-threatening situation.
The client with a head injury is admitted into the intensive care unit. Which HCP medication order should the ICU nurse question? Select all that apply. 1. Morphine. 2. Mannitol. 3. Methylprednisolone. 4. Phenytoin. 5. Oxygen. The correct answers are 1. Morphine and 3. Methylprednisolone. Administering narcotics to clients with head injuries may mask signs of increased intracranial pressure, so the nurse questioning this medication would be appropriate. Research supports the finding that clients with head injuries who are treated with anti-inflammatory corticosteroids are 20% more likely to die within 2 weeks after the head injury than those who aren't treated. The nurse should question this medication. The labor and delivery nurse is performing Leopold maneuvers. A soft round mass is felt in the fundal region. A flat object is noted on the left, and small objects are noted on the right of the uterus. A hard round mass is noted above the symphysis. Which of the following positions is consistent with these findings? 1. Left occipital anterior. 2. Left sacral posterior. 3. Right mentum anterior. 4. Right sacral posterior. The correct answer is 1. Left occipital anterior. The nurse's findings upon performing Leopold maneuvers indicate that the fetus is in the left occiput anterior position. That is, the fetal back is felt on the mother's left side, the small parts are felt on her right side, the buttocks are felt in the fundal region, and the head is felt above her symphysis. In the left sacral posterior position, the fetus's buttocks are facing toward the mother's left posterior. A hard round mass is felt in the fundal region, and a soft round mass is felt above the symphysis. In the right mentum anterior position, the fetus's face is facing toward the mother's right anterior, and small objects are felt on the right of the mother's abdomen with a flat area felt on the mother's left side. In the right sacral posterior position, the fetus's sacrum is facing the mother's right posterior, and a hard round mass is felt in the fundal region, while a soft round mass is felt above the symphysis. The laboratory results for a male client diagnosed with leukemia include RBC count 2.1 times 10 to the power of 6 cubic millimeter, WBC count 150 times 10 to the power of 3 cubic millimeter, platelets 22 times 10 to the power of 3 cubic millimeter, potassium 3.8 milliequivalents per liter, and sodium 139 milliequivalents per liter. Based on these results, which intervention should the nurse teach the client? 1. Encourage the client to eat foods high in iron. 2. Instruct the client to use an electric razor when shaving. 3. Discuss the importance of limiting sodium in the diet. 4. Instruct the family to limit visits to once a week. The correct answer is 2. Instruct the client to use an electric razor when shaving. The platelet count of 22 times 10 to the power of 3 cubic millimeter indicates a platelet count of 22,000. The definition of thrombocytopenia is a count less than 100,000. This client is at risk for bleeding. Bleeding precautions include decreasing the risk by using soft bristle toothbrushes and electric razors and holding all venipuncture sites for a minimum of 5 minutes. The anemia that occurs in leukemia is not related to iron deficiency, and eating foods high in iron will not help. The sodium level is within normal limits. The client is encouraged to eat whatever he or she wants to eat, unless some other disease process limits food choices. The client is at risk for infection, but unless the family or significant others are ill, they should be encouraged to visit whenever possible. You could eliminate option 3 on the basis of a normal laboratory value. The RBC, WBC, and platelet values are all not in normal range. The correct answer option must address one of these values.
A nursing team leader delegates a wound irrigation to a licensed practical nurse. It has been a long time since the LPN performed this procedure. Which should the nursing team leader do to ensure client safety? 1. Verbally describe how to perform the procedure to the LPN. 2. Have the LPN demonstrate how to perform the procedure. 3. Assign another LPN to assist with the procedure. 4. Delegate the procedure to another LPN. The correct answer is 2. Have the LPN demonstrate how to perform the procedure. Rationale. Demonstration is the safest way to assess whether a person has the knowledge and skill to perform a procedure safely. A superior delegating care is responsible for ensuring that the person implementing the care is legally qualified and competent. Providing just a verbal description is unsafe. This does not ensure that cognitive information can be converted to a psychomotor skill. A peer should not be held responsible for the care assigned to another team member. The nurse who delegates a procedure to a subordinate is directly responsible for ensuring that the care is safely delivered to clients. Option 4 does not address the original licensed practical nurses need to know how to perform the procedure safely. This procedure is within the legal scope of practice of a licensed practical nurse.
The pediatric unit charge nurse is making patient assignments for the evening shift. Which patient is most appropriate to assign to an experienced LPN/LVN? 1. A 1-year-old patient with severe combined immunodeficiency disease who is scheduled to receive chemotherapy in preparation for a stem cell transplant. 2. A 2-year-old patient with Wiskott-Aldrich syndrome who has orders for a platelet transfusion. 3. A 3-year-old patient who has chronic graft versus host disease and is incontinent of loose stools. 4. A 6-year-old patient who received chemotherapy 1 week ago and is admitted with increasing lethargy and a temperature of 101 degrees Fahrenheit. The correct answer is 3. A 3-year-old patient who has chronic graft versus host disease and is incontinent of loose stools. LPN/LVN scope of practice includes the care of patients with chronic and stable health problems, such as the patient with chronic graft versus host disease. Chemotherapy medications are considered high-alert medications and should be given by RNs who have received additional education in chemotherapy administration. Platelets and other blood products should be given by RNs. The 6-year-old patient has a history and clinical manifestations consistent with neutropenia and sepsis and should be assessed by an RN as quickly as possible. A client with allergic rhinitis is instructed on the correct technique for using an intranasal inhaler. Which of the following statements would demonstrate to the nurse that the client understands the instructions? 1. I should limit the use of the inhaler to early morning and bedtime use. 2. It is important to not shake the canister because that can damage the spray device. 3. I should hold one nostril closed while I insert the spray into the other nostril. 4. The inhaler tip is inserted into the nostril and pointed toward the inside nostril wall. The correct answer is 3. I should hold one nostril closed while I insert the spray into the other nostril. When using an intranasal inhaler, it is important to close off one nostril while inhaling the spray into the other nostril to ensure the best inhalation of the spray. Use of the inhaler is not limited to mornings and bedtime. The canister should be shaken immediately before use. The inhaler tip should be inserted into the nostril and pointed toward the outside nostril wall to maximize inhalation of the medication. A client is admitted to the recovery room after cystoscopy with biopsy. Before the nurse can discharge the client, the nurse should be sure the client 1. Has a bowel movement. 2. Has received the first dose of pain medication. 3. Has voided. 4. Has no blood in the urine. The correct answer is 3. Has voided. The nurse should verify that the client has voided prior to discharge in order to evaluate bladder function. Bowel function is not expected to be affected by this procedure. There may not be a need for pain medication immediately post-procedure and before discharge, but the nurse should assess the client's pain status and inform the client about the use and side effects of the medication. It is normal for the client to have hematuria because of the procedure. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
The nurse is preparing to defibrillate a client on a cardiac monitor who is in ventricular fibrillation. See the photo. The nurse should do which of the following? 1. Move the paddle in the nurse's left hand to the midline. 2. Move the paddle in the nurse's right hand to above the client's nipple. 3. Grasp the handles of the paddles to allow visibility of the black markings on the paddle. 4. After pressing the charge button and calling all clear, push the shock button. The correct answer is 4. The paddles are in the correct position. The nurse can push the shock button to defibrillate the client. Parents bring their child to the emergency department because the child has stopped breathing. A nurse obtains a brief history of events occurring before and after the parents found the infant not breathing. Which of the following questions should the nurse ask the parents first? 1. Was the infant sleeping while wrapped in a blanket? 2. Was the infant lying on his stomach? 3. What did the infant look like when you found him? 4. When had you last checked on the infant? The correct answer is 3. Because this is an especially disturbing and upsetting time for the parents, they must be approached in a sensitive manner. Asking what the infant looked like when found allows the parents to verbalize what they saw and felt, thereby helping to minimize their feelings of guilt without implying any blame, neglect, wrongdoing, or abuse. Asking if the child was wrapped in a blanket or lying on his stomach, or when the parents last checked on the infant, implies that the parents did something wrong or failed in their care of the infant, thus blaming them for the event.
A client is admitted with acute necrotizing pancreatitis. Lab results have been obtained, and a peripheral IV has been inserted. Which of the following prescriptions from a healthcare provider should the nurse question? 1. Infuse a 500 ml normal saline bolus. 2. Calcium gluconate 90 mg in 100 ml normal saline. 3. Total parenteral nutrition at 72 ml per hour. 4. Placement of a Foley catheter. The correct answer is 3. Total parenteral nutrition at 72 ml per hour. Clients with acute necrotizing pancreatitis should remain nothing by mouth with early enteral feeding via the jejunum to maintain bowel integrity and immune function. TPN is considered if enteral feedings are contraindicated. Access is also needed for TPN, preferably via a central line. Hemodynamic instability can result from fluid volume loss and bleeding and requires fluid and electrolyte replacement. Fat necrosis occurring with acute pancreatitis can cause hypocalcemia requiring calcium replacement. A Foley catheter provides accurate output assessment to monitor for prerenal acute renal failure that can occur from hypovolemia. The client with increased intracranial pressure is receiving mannitol. Which intervention should the nurse implement to evaluate the effectiveness of the medication? 1. Monitor the client's vital signs. 2. Maintain strict intake and output. 3. Assess the client's neurological status. 4. Check the client's serum osmolality level. The correct answer is 3. Assess the client's neurological status. Mannitol, an osmotic diuretic, is administered to decrease intracranial pressure. Changes in intracranial pressure affect neurological status. Therefore, the client's neurological status should be evaluated to determine the effectiveness of the medication. A nurse is caring for a laboring woman who is in transition. Which of the following signs, symptoms would indicate that the woman is progressing into the second stage of labor? Select all that apply. 1. Bulging perineum. 2. Increased bloody show. 3. Spontaneous rupture of the membranes. 4. Uncontrollable urge to push. 5. Inability to breathe through contractions. The correct answers are 1. Bulging perineum, 2. Increased bloody show, and 4. Uncontrollable urge to push. A bulging perineum indicates progression to the second stage of labor. The bloody show increases as a woman enters the second stage of labor. The amniotic sac can rupture at any time. With a fully dilated cervix and bulging perineum, laboring women usually feel a strong urge to push. The gravita's ability to work with her labor is more dependent on her level of pain and her preparation for labor than on the phases and or stages of labor. The nurse writes a nursing problem of altered nutrition for a client diagnosed with leukemia who has received a treatment regimen of chemotherapy and radiation. Which nursing intervention should be implemented? 1. Administer an antidiarrheal medication prior to meals. 2. Monitor the client's serum albumin levels. 3. Assess for signs and symptoms of infection. 4. Provide skincare to irradiated areas. The correct answer is 2. Monitor the client's serum albumin levels. Serum albumin is a measure of the protein content in the blood that is derived from the foods eaten. Albumin monitors nutritional status. The nurse should administer an antiemetic prior to meals, not an antidiarrheal medication. Assessment of the nutritional status is indicated for this problem, not assessment of the signs and symptoms of infections. This addresses an altered skin integrity problem.
A nurse manager is informed that a large number of clients will be admitted in response to a terrorist attack. Which type of leadership style is appropriate to use in this situation? 1. Collaborative. 2. Authoritarian. 3. Laissez-faire. 4. Democratic. The correct answer is 2. Authoritarian. Rationale. The authoritarian leadership style is the appropriate style to use in a crisis when urgent decisions are necessary. In a crisis, one person must assume the responsibility for decisions. Autocratic leaders give orders and directions and make decisions for the group. Collaborative is not a classic leadership style. Collaborative refers to the democratic leadership style. Democratic leaders encourage discussion and decision-making within the group, which requires collaboration, coordination, and communication among group members. The laissez-faire leadership style is not the appropriate style to use in a crisis when urgent decisions are necessary. Laissez-faire leaders are non-directive and permissive, which allows for self-regulation, creativity, and autonomy but limits fast-acting efficiency. The democratic leadership style is not the appropriate style to use in a crisis when urgent decisions are necessary. Democratic leaders encourage discussion and decision-making within the group, which takes time.
The nurse is preparing to care for a 6-year-old child who has just undergone allogenic stem cell transplantation. Which nursing tasks should the nurse delegate to the assistive personnel? Select all that apply. 1. Stocking the child's room with standard personal protective equipment items. 2. Teaching the child to perform thorough hand washing after using the bathroom. 3. Reminding the child to wear a face mask outside of the hospital room. 4. Assessing the child's oral cavity for signs and symptoms of infection. 5. Talking to the family members about the ways to reduce risk of infection. 6. Talk to the parents about local community and healthcare resources that will support the family after discharge. The correct answers are 1. Stocking the child's room with standard personal protective equipment items, and 3. Reminding the child to wear a face mask outside of the hospital room. Because all patient care staff members should be familiar with standard personal protective equipment, an AP will be able to stock the room. Reminding the child to wear a face mask is also a task that can be done by an AP, although the nurse is responsible for the initial teaching. Initially, teaching the child a good hand-washing technique, nursing assessments, and family education is within the scope of the nurse and not an AP. Talking to the family about local resources post-discharge should be done by either the nurse or the social services department. Which of the following would be an expected outcome for a client recovering from an upper respiratory tract infection? The client will 1. Maintain a fluid intake of 800 milliliters every 24 hours. 2. Experience chills only once a day. 3. Cough productively without chest discomfort. 4. Experience less nasal obstruction and discharge. The correct answer is 4. Experience less nasal obstruction and discharge. A client recovering from an upper respiratory tract infection should report decreasing or no nasal discharge and obstruction. Daily fluid intake should be increased to more than 1 liter every 24 hours to liquefy secretions. The temperature should be below 100 degrees Fahrenheit or 37.8 degrees Celsius with no chills or diaphoresis. A productive cough with chest pain indicates a pulmonary infection, not an upper respiratory tract infection. The nurse should assess the client with bladder cancer for which of the following? 1. Suprapubic pain. 2. Dysuria. 3. Painless hematuria. 4. Urine retention. The correct answer is 3. Painless hematuria. Painless hematuria is the most common clinical finding in bladder cancer. Other symptoms include urinary frequency, dysuria, and urinary urgency, but these are not as common as hematuria. Suprapubic pain and urine retention do not occur in bladder cancer.
The nurse is caring for a client whose condition has been deteriorating. The client becomes unresponsive. The blood pressure is 80/40, and oxygen saturation is 90% on 50% face mask. The nurse should 1. Begin chest compressions. 2. Call the rapid response team. 3. Remove the family from the room. 4. Ventilate the client with a bag mask device. The correct answer is 2. The rapid response team should be called immediately to evaluate and treat the client. There is no indication at this time for manual ventilations or chest compressions. If the family is not interfering in client care, it can be reassuring to the family to see that all possible care is being provided. When planning a visit to the parents of an infant who died of sudden infant death syndrome at home, the nurse should visit the parents at which of the following times? 1. A few days after the funeral. 2. 2 weeks after the funeral. 3. As soon as the parents are ready to talk. 4. As soon after the infant's death as possible. The correct answer is 4. The community health nurse should visit as soon after the death as possible because the parents may need help to deal with the sudden, unexpected death of their infant. Parents often have a great deal of guilt in these situations and need to express their feelings to someone who can provide counseling.
The nurse is assisting with a bone marrow aspiration and biopsy. In which order, from first to last, should the nurse complete the following tasks? 1. Position the client in a side-lying position. 2. Clean the skin with an antiseptic solution. 3. Verify the client has signed an informed consent. 4. Apply ice to the biopsy site. The correct order is 3. Verify the client has signed an informed consent. 1. Position the client in a side-lying position. 2. Clean the skin with an antiseptic solution. And 4. Apply ice to the biopsy site. First, the nurse must verify that the client has voluntarily signed a consent form before the procedure begins, and check that the client understands the procedure. The nurse then positions the client in a side-lying or lateral decubitus, position with the affected side up. Then the nurse should clean the skin site and surrounding area with an antiseptic solution, such as betadine, before the healthcare provider numbs the site and collects the specimen. When the procedure is finished, the nurse must apply ice to the biopsy site to reduce pain. The client has increased intracranial pressure, and the HCP orders a bolus of 0.5 grams per kilograms IV of 25% osmotic diuretic solution. The client weighs 165 pounds. How much medication should the nurse administer to the client? The correct answer is 37.5 grams. To determine this, first find the client's weight in kilograms. 165 pounds divided by 2.2, which equals to 75 kilograms. Then, multiply 0.5 grams by weight in kilograms. 0.5 multiplied by 75 kilograms, which equals to 37.5 grams. During a vaginal examination, the nurse palpates fetal buttocks that are facing the left posterior and are 1 centimeter above the ischial spines. Which of the following is consistent with this assessment? 1. LOA -1 station. 2. LSP -1 station. 3. LMP +1 station. 4. LSA +1 station. The correct answer is 2. LSP -1 station. The LOA position refers to a fetus whose occiput is facing toward the mother's left anterior, and a presenting part at -1 station is 1 centimeter above the ischial spines. The LSP position is the correct answer. The fetal buttocks are facing toward the mother's left posterior, and buttocks at -1 station are 1 centimeter above the ischial spines. The LMP position refers to a fetus whose face is facing toward the mother's LP, and a presenting part at +1 is 1 centimeter below the ischial spines. The LSA position refers to a fetus whose buttocks are facing toward the mother's LA, and a presenting part at +1 station is 1 centimeter below the ischial spines. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. The charge nurse and the licensed practical nurse are caring for clients on an oncology floor. Which client should not be assigned to the LPN? 1. The client newly diagnosed with chronic lymphocytic leukemia. 2. The client who is 4 hours post-procedure bone marrow biopsy. 3. The client who received 2 units of PRBCs on the previous shift. 4. The client who is receiving multiple intravenous piggyback medications. The correct answer is 1. The client newly diagnosed with chronic lymphocytic leukemia. The newly diagnosed client will need to be taught about the disease and about treatment options. The charge nurse cannot delegate teaching to an LPN. For option 2, this client is post-procedure and could be cared for by the LPN. For option 3, this client has already received the blood products. This client requires routine monitoring, which the LPN could perform. For option 4, the LPN can administer antibiotic medications.
A nurse manager is experiencing staff resistance when implementing change. Which is the most important action by the nurse manager to overcome resistance to change? 1. Identify the reason for the resistance. 2. Restate the purpose of the change concisely. 3. Modify the goals to appeal to more key people. 4. Emphasize the positive consequences of the planned change. The correct answer is 1. Identify the reason for the resistance. Rationale. Option 1 is essential to overcome resistance to change. There are many different reasons people resist change. Each person will respond to different strategies. There are 4 different types of interventions to overcome resistance: providing information, disproving currently held beliefs, maintaining psychological safety, and administrating an order or command. Although it is important to state the purpose of the change clearly and concisely, another option is a more important action that can be implemented by the nurse manager to overcome resistance to change. Modifying a goal compromises the integrity of the planned change. All ramifications associated with the change should be explored before beginning, and all contingencies planned for, so that modifying a goal will be unnecessary. Although emphasizing the positive consequences of the planned change might be done, another option is a more important action that can be implemented by the nurse manager to overcome resistance to change.
A 4-month-old infant boy is brought to the emergency department by his parents. He has been vomiting and fussy for the past 24 hours. On examination, there are circular bruises on his back. What priority assessment does the nurse anticipate? 1. Chest X-ray examination. 2. Ultrasonography of the head. 3. Electroencephalography. 4. Ophthalmologic examination. The correct answer is 4. Ophthalmologic examination. The history and physical examination suggest shaken baby syndrome. An ophthalmologic examination is indicated to determine if the infant has retinal hemorrhages characteristic of shaken baby syndrome. Electroencephalography may be indicated if there is evidence of seizures. Magnetic resonance imaging or computed tomography of the head can detect subdural hematomas. There is no evidence that would support the need for a chest X-ray examination. The nurse teaches the client how to instill nose drops. Which of the following techniques is correct? 1. The client uses sterile technique when handling the dropper. 2. The client blows the nose gently before instilling drops. 3. The client uses a new dropper for each installation. 4. The client sits in a semi-Fowler's position with the head tilted forward after administration of the drops. The correct answer is 2. The client blows the nose gently before instilling drops. The client should blow the nose before instilling nose drops. Instilling nose drops is a clean technique. The dropper should be cleaned after each administration, but it does not need to be changed. The client should assume a position that will allow the medication to reach the desired area. This is usually a supine position. A client is to have a cystoscopy. Which of the following indicate that the client has developed a complication after the cystoscopy? 1. Dizziness. 2. Chills. 3. Pink-tinged urine. 4. Bladder spasms. The correct answer is 2. Chills. Chills could indicate the onset of acute infection that can progress to septic shock. Dizziness would not be an anticipated symptom after a cystoscopy. Pink-tinged urine and bladder spasms are common after cystoscopy.
Which activity would be appropriate? To delegate to an unlicensed personnel. For a client diagnosed with a myocardial infarction, who is stable? 1. Evaluate the lung sounds. 2. Help the client identify risk factors for coronary artery disease. 3. Provide teaching on a 2-gram sodium diet. 4. Record the intake and output. The correct answer is 4. Unlicensed personnel are able to measure and record intake and output. The nurse is responsible for client teaching, physical assessments, and evaluating the information collected on the client. When developing the ongoing plan of care for the parents whose infant died of sudden infant death syndrome, the nurse should plan to accomplish which of the following on the second home visit? 1. Allow the parents to express their feelings. 2. Have the parents gain an understanding of the disease. 3. Assess the impact of the infant's death on their other children. 4. Deal with issues such as having other children. The correct answer is 1. The goal of the second home visit is to help the parents express their feelings more openly. Many parents are reluctant to express their grief and need help. The goal of the first visit is to help the parents understand the disease and what happened. The first visit also provides time to help the parents understand that they are not to blame. Although it is important to assess the impact of SIDS on siblings, this is not the primary goal for the second visit. However, the nurse must be flexible in case problems involving this area arise. Typically, parents are unable to deal with decisions, such as having other children during the second visit, because they are grieving for the child that they lost. This topic may be discussed later in the course of care.
A client with iron deficiency anemia is refusing to take the prescribed oral iron medication because the medication is causing nausea. The nurse should do which of the following? Select all that apply. 1. Suggest that the client use ginger when taking the medication. 2. Ask the client what is causing the nausea. 3. Tell the client to use stool softeners to minimize constipation. 4. Offer to administer the medication by an intramuscular injection. 5. Suggest that the client take the iron with orange juice. The correct answers are 1. Suggest that the client use ginger when taking the medication. 2. Ask the client what is causing the nausea. And 5. Suggest that the client take the iron with orange juice. Nausea and vomiting are common adverse effects of oral iron preparations. The nurse should first ask the client why the client does not want to take the oral medication, and then suggest ways to decrease the nausea and vomiting. Ginger may help minimize the nausea, and the client can try this remedy and evaluate its effectiveness. Iron should be taken on an empty stomach, but can be taken with orange juice. The client can evaluate if this helps the nausea. Stool softeners should not be used in clients with iron deficiency anemia. Instead, constipation can be prevented by following a high-fiber diet. Administering iron intramuscularly is done only if other approaches are not effective. The client with a seizure disorder is prescribed phenytoin. Which statement indicates the client understands the medication teaching? 1. If my urine turns a reddish-brown color, I should call my doctor. 2. I should take my medication on an empty stomach. 3. I will use a soft bristled toothbrush to brush my teeth. 4. I may get a sore throat when taking this medication. The correct answer is 3. I will use a soft bristled toothbrush to brush my teeth. The client should use a soft bristled toothbrush to prevent gum irritation and bleeding. Gingival hyperplasia is a side effect of this medication. The nurse enters a laboring client's room. The client is complaining of intense back pain with each contraction. The nurse concludes that the fetus is likely in which of the following positions? 1. Mentum anterior. 2. Sacrum posterior. 3. Occiput posterior. 4. Scapula anterior. The correct answer is 3. Occiput posterior. A fetus in the mentum anterior position is unlikely to elicit severe back pain in the mother. A fetus in the sacral posterior position is unlikely to elicit severe back pain in the mother. When a fetus is in the occiput posterior position, mothers frequently complain of severe back pain. A fetus in the scapula anterior position is unlikely to elicit severe back pain in the mother. The nurse is completing a care plan for a client diagnosed with leukemia. Which independent problem should be addressed? 1. Infection. 2. Anemia. 3. Nutrition. 4. Grieving. The correct answer is 4. Grieving. Grieving is an independent problem, and the nurse can assess and treat this problem with or without collaboration. Treating infections, which require HCP orders for cultures and antibiotics, is a collaborative problem. The treatment of anemia is a collaborative problem. The provision of adequate nutrition requires collaboration between the nurse, HCP, and dietitian. The stem of the question asks for an independent intervention. If you understand the problem and the treatment needs, options 1, 2, and 3 can be eliminated.
A nurse manager plans to provide feedback to a subordinate who needs a change in behavior. Which is the first intervention by the nurse manager? 1. Be assertive. 2. Explore alternatives. 3. Identify the unacceptable behavior. 4. Document the content of the counseling session. The correct answer is 3. Identify the unacceptable behavior. Rationale. Problem recognition is the first step in the problem-solving process. Once the unacceptable behavior is identified and acknowledged, then the reasons for the problem can be explored, solutions suggested, and expectations reinforced. The nurse manager can provide negative feedback that is firm without being assertive. Not yielding under pressure is less confrontational than being confident in a persistent way. When providing negative feedback, the exploration of alternative solutions is performed later in the counseling session. Although documenting the content of the counseling session should be done, it is not feedback. Feedback is necessary for the subordinate to recognize one's offending behavior. In addition, documentation is the last, not the first, step in the counseling process.
While working in the pediatric clinic, the nurse receives a telephone call from the parent of a 13-year-old child who is receiving chemotherapy for leukemia. The patient's sibling has chickenpox. Which action will the nurse anticipate taking next? 1. Administer varicella-zoster immune globulin to the patient. 2. Teach the parent about the correct use of acyclovir. 3. Educate the parent about contact and airborne precautions. 4. Prepare to admit the patient to a private room in the hospital. The correct answer is 1. Administer varicella-zoster immune globulin to the patient. The administration of varicella-zoster immune globulin can prevent the development of varicella in immunosuppressed patients and will typically be prescribed. Acyclovir therapy and hospitalization may be required if the child develops a varicella-zoster virus infection. Contact and airborne precautions will be implemented to prevent the spread of infection to other children if the child is hospitalized with varicella. The nurse should include which of the following instructions in the teaching plan for a client with chronic sinusitis? 1. Avoid the use of caffeinated beverages. 2. Perform postural drainage every day. 3. Take hot showers twice daily. 4. Report a temperature of 102 degrees Fahrenheit, 38.9 degrees Celsius or higher. The correct answer is 3. Take hot showers twice daily. The client with chronic sinusitis should be instructed to take hot showers in the morning and evening to promote drainage of secretions. There is no need to limit caffeine intake. Performing postural drainage will inhibit removal of secretions, not promote it. Clients should elevate the head of the bed to promote drainage. Clients should report all temperatures higher than 100.4 degrees Fahrenheit or 38 degrees Celsius because a temperature that high can indicate infection. If the client develops lower abdominal pain after a cystoscopy, the nurse should instruct the client to do which of the following? 1. Apply an ice pack to the pubic area. 2. Massage the abdomen gently. 3. Ambulate as much as possible. 4. Sit in a tub of warm water. The correct answer is 4. Sit in a tub of warm water. Lower abdominal pain after a cystoscopy is frequently caused by bladder spasms. Warm water can help relax muscles. Ice is not effective in relieving spasms. Massage and ambulation may increase bladder irritability. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
The nursing assistant reports to the nurse that a client is feeling short of breath. The client's blood pressure was 124/78 2 hours ago, with a heart rate of 82. The nursing assistant reports that blood pressure is now 84/44, with a heart rate of 54, and the client stated, "I just don't feel good." Which of the following interventions should the nurse initiate? Select all that apply. 1. Confirm the client's vital signs and complete a quick assessment. 2. Inform the charge nurse of the change in condition and initiate the hospital's rapid/emergency response team. 3. Make a quick check on other assigned clients before spending the amount of time required to take care of this client. 4. Position client in semi-Fowler's position. 5. Stay with the client and reassure the client. 6. Call the physician and report the situation using SBAR format. The correct answers are 1, 2, 4, 5, and 6. The nurse must have assessment data and verify vital signs if necessary in order to determine the action that is required. If there is a significant change in the client's condition, the charge nurse should be notified in order to help the nurse with both this client and the nurse's other assigned clients if necessary. Most acute care facilities have a rapid response team that can also help assess and intervene with basic standing orders if necessary. Positioning the client in semi-Fowlers is a nursing action that may assist in breathing and relieve shortness of breath. It is important for the nurse to reassure the client by staying calm and remaining with the client. The physician must be notified of the change in client's condition. The nurse must have all information available and present it to the physician in a concise and accurate manner using SBAR format, including a recommendation for treatment if indicated. The nurse should stay with this client and delegate checking on other assigned clients to the charge nurse or nursing assistant. A child has just ingested about 10 adult-strength acetaminophen pills. The mother brings a child to the emergency department. What should the nurse do? Place the interventions in the order of priority from first to last. 1. Administer activated charcoal. 2. Assess the airway. 3. Reassure the mother. 4. Check serum acetaminophen levels. 5. Obtain a history of the incident. 6. Complete a physical examination. The correct order is 2, 1, 3, 6, 5, and 4. Immediate care of the child who has ingested acetaminophen is to ensure airway, breathing, and circulation. Next, the nurse should administer activated charcoal. Acetylcysteine mucimist may also be used as an antidote. When the child is stable, the nurse should reassure the mother. Next, the nurse should perform a physical exam to assess the child for other health problems, and then obtain further information about how the child obtained the aspirin. The serum acetaminophen level should be obtained 4 hours after ingestion.
A client had a mastectomy followed by chemotherapy 6 months ago. She reports that she is now unable to concentrate at her card game, and it seems harder and harder to finish her errands because of exhaustion. Based on this information, the nurse should suggest that the client do which of the following? 1. Take frequent naps. 2. Limit activities. 3. Increase fluid intake. 4. Avoid contact with others. The correct answer is 1. Take frequent naps. This client is likely experiencing fatigue and should increase her periods of rest. The fatigue may be caused by anemia from depletion of red blood cells due to the chemotherapy. Asking the client to limit her activities may cause the client to become withdrawn. The information given does not support limiting activity. Increasing fluid intake will not reduce the fatigue. The information does not indicate that the client is immunosuppressed and should avoid contact with others. The client with a seizure disorder who is taking carbamazepine tells the clinic nurse, "I am taking evening primrose oil for my premenstrual cramps, and it is really working." Which statement is the nurse's best response? 1. You should inform your HCP about taking this herb. 2. It is very dangerous to take both the herb and carbamazepine. 3. Herbs are natural substances, and I am glad it is helping your PMS. 4. Are you sure you should be taking herbs along with carbamazepine? The correct answer is 1. You should inform your HCP about taking this herb. Evening primrose oil may lower the seizure threshold, and the dose of carbamazepine, an anticonvulsant, may need to be modified. Therefore, the client should notify the HCP. When performing Leopold maneuvers, the nurse notes that the fetus is in the left occiput anterior position, which is the best position for the nurse to place a fetoscope to hear the fetal heartbeat. 1. Left upper quadrant. 2. Right upper quadrant. 3. Left lower quadrant. 4. Right lower quadrant. The correct answer is 3. Left lower quadrant. The left upper quadrant would be the appropriate place to place a fetoscope to hear the fetal heartbeat if the baby were in the left sacrum anterior position, not the left occiput anterior position. The right upper quadrant would be appropriate if the baby were in the right sacrum anterior position. The fetoscope should be placed in the left lower quadrant for a fetus positioned in the left occiput anterior position as described in the question. The right lower quadrant would be appropriate if the baby were in the right occiput anterior position. The nurse is caring for a client diagnosed with acute myeloid leukemia. Which assessment data warrant immediate intervention? 1. Temperature 99.0 degrees Fahrenheit, pulse 102, respirations 22, and blood pressure 132/68. 2. Hyperplasia of the gums. 3. Weakness and fatigue. 4. Pain in the left upper quadrant. The correct answer is 4. Pain in the left upper quadrant. Pain is expected, but it is a priority, and pain control measures should be implemented. The vital signs in option 1 are not alarming. The vital signs are slightly elevated and indicate monitoring at intervals, but they do not indicate an immediate need. Hyperplasia of the gums is a symptom of myeloid leukemia, but it is not an emergency. Weakness and fatigue are symptoms of the disease and are expected. If all the answer options contain expected events, you must decide which is priority, and pain is a priority need.
A client is to be discharged from the hospital. Which discharge task can be delegated to a nursing assistant? Select all that apply. 1. Teaching the client how to measure weight using a standing scale. 2. Obtaining the client's temperature, pulse, and respiratory rate. 3. Determining if the client knows how to measure fluid intake. 4. Demonstrating to the client how to safely use a walker. 5. Reviewing foods that are high in vitamin C. The correct answer is 2. Obtaining the client's temperature, pulse, and respiratory rate. Rationale. Teaching a client how to obtain a body weight requires the knowledge and judgment of a nurse. Teaching requires a complex level of interaction with the client, problem solving, and innovation in the form of an individually designed teaching plan of care that addresses the specific learning needs of the client. In addition, the outcome is unpredictable, and it has the potential to cause harm if the skill is taught incorrectly. Obtaining vital signs can be delegated to a nursing assistant because it is not a complex task. It requires simple problem-solving skills and a simple level of interaction with the client. Although this task has the potential to cause harm if the critical elements of the skill are not implemented appropriately, it is within the scope of practice of a nursing assistant. It does not require the more advanced competencies of a nurse. Assessing a client's level of understanding is a complex task that requires knowledge and judgment and is within the scope of practice of a nurse. This task requires a complex level of interaction with the client, problem solving, and innovation in the form of an individually designed teaching plan of care that addresses the specific learning needs of the client. Teaching a client how to use a walker requires the knowledge and judgment of a nurse. Reviewing foods that are high in vitamin C requires the knowledge and judgment of a nurse.
An unimmunized 7-year-old child who attends a local elementary school contracts rubeola. The child has 2 siblings, ages 9 and 11 years, who also attend the elementary school. Which action by the school nurse is a priority? 1. Exclude the child and siblings from attending school for 21 days. 2. Notify all parents of children attending the school of the exposure. 3. Recommend that the siblings receive the measles vaccine. 4. Recommend that the siblings receive measles immunoglobulin. The correct answer is 1. Exclude the child and siblings from attending school for 21 days. Rubeola is a highly contagious infectious disease with severe consequences that include death. The Centers for Disease Control and Prevention reports that 9 of 10 susceptible people with close contact to a person with measles will contract the disease. The incubation period is 7 to 21 days. Excluding the infected and exposed children during this period of time is a priority to prevent exposure of healthy children enrolled in the elementary school. Although it is important to notify the parents of the other children in the school of the exposure, limiting exposure of other children is the priority. Mumps, measles, and rubella vaccine administered within 72 hours of initial measles exposure and immunoglobulin administered within 6 days of exposure may provide some protection or modify the clinical course of the disease in unimmunized children. However, the priority is to prevent an epidemic by limiting exposure. A client with allergic rhinitis asks the nurse what to do to decrease the rhinorrhea. Which of the following instructions would be appropriate for the nurse to give the client? 1. Use your nasal decongestant spray regularly to help clear your nasal passages. 2. Ask the doctor for antibiotics. Antibiotics will help decrease the secretion. 3. It is important to increase your activity. A daily brisk walk will help promote drainage. 4. Keep a diary of when your symptoms occur. This can help you identify what precipitates your attacks. The correct answer is 4. Keep a diary of when your symptoms occur. This can help you identify what precipitates your attacks. It is important for clients with allergic rhinitis to determine the precipitating factors so that they can be avoided. Keeping a diary can help identify these triggers. Nasal decongestant sprays should not be used regularly because they can cause a rebound effect. Antibiotics are not appropriate for allergic rhinitis because an infection is not present. Increasing activity will not control the client's symptoms. In fact, walking outdoors may increase them if the client is allergic to pollen. A client who has been diagnosed with bladder cancer is scheduled for an ileal conduit. Preoperatively, the nurse reinforces the client's understanding of the surgical procedure by explaining that an ileal conduit 1. Is a temporary procedure that can be reversed later. 2. Diverts urine into the sigmoid colon, where it is expelled through the rectum. 3. Conveys urine from the ureters to a stoma opening on the abdomen. 4. Creates an opening in the bladder that allows urine to drain into an external pouch. The correct answer is 3. Conveys urine from the ureters to a stoma opening on the abdomen. An ileal conduit is a permanent urinary diversion in which a portion of the ileum is surgically resected and one end of the segment is closed. The ureters are surgically attached to this segment of the ileum, and the open end of the ileum is brought to the skin surface on the abdomen to form the stoma. The client must wear a pouch to collect the urine that continually flows through the conduit. The bladder is removed during the surgical procedure, and the ileal conduit is not reversible. Diversion of urine to the sigmoid colon is called a ureterosigmoidostomy. An opening in the bladder that allows urine to drain externally is called a cystostomy.
The nurse is assessing a client with heart failure who is receiving home healthcare monitoring using electronic devices, including scales, blood pressure monitoring, and structured questions to which the client responds daily on a touchscreen monitor. The nurse reviews data obtained within the last 3 days. The nurse calls the client to follow up. The nurse should ask the client which of the following first. 1. How are you feeling today? 2. Are you having shortness of breath? 3. Did you calibrate the scales before using them? 4. How much fluid did you drink during the last 24 hours? The correct answer is 2. The client has gained 5 pounds in 3 days with a steady increase in blood pressure. The client is exhibiting signs of heart failure, and if the client is short of breath, this will be another sign. Asking how the client is feeling is too general, and a more focused question will quickly determine the client's current health status. The scale should be calibrated periodically, but a 5 pounds weight gain, along with increased blood pressure, is not likely due to problems with the scale. The weight gain is likely due to fluid retention, not drinking too much fluid. On finding a child who is not breathing, the nurse has someone activate the emergency medical system and then does which of the following first? 1. Clear the airway. 2. Begin mouth-to-mouth resuscitation. 3. Initiate oxygen therapy. 4. Start chest compressions. The correct answer is 4. When breathlessness is determined, the priority nursing action is checking a pulse and beginning compressions. After 30 compressions, the nurse opens the airway and gives 2 breaths. Oxygen therapy would not be initiated at this time because the child is not breathing. Also, administering oxygen therapy would interfere with providing mouth-to-mouth resuscitation.
A client is to have a transfusion of packed red blood cells from a designated donor. The client asks if any diseases can be transmitted by this donor. The nurse should inform the client that which of the following diseases can be transmitted by a designated donor. Select all that apply. 1. Epstein-Barr virus. 2. Human immunodeficiency virus. 3. Cytomegalovirus. 4. Hepatitis A. 5. Malaria. The correct answers are 1. Epstein-Barr virus, 2. Human immunodeficiency virus, and 3. Cytomegalovirus. Using designated donors does not decrease the risk of contracting infectious diseases, such as the Epstein-Barr virus, HIV, or CMV. Hepatitis A is transmitted by the oral fecal route, not the blood route. However, hepatitis B and C can be contracted from a designated donor. Malaria is transmitted by mosquitoes. Which data should the nurse assess for the client with a seizure disorder who is taking Valproate? 1. Creatinine and blood urea nitrogen levels. 2. White blood cell count. 3. Liver enzymes. 4. Red blood cell count. The correct answer is 3. Liver enzymes. Hepatotoxicity is one of the possible adverse reactions to Valproate, an anticonvulsant. Therefore, the liver enzymes should be monitored. On examination of a full-term primipara, a labor nurse notes, active labor, right occiput anterior, 7 centimeters dilated, and plus 3 station. Which of the following should the nurse report to the healthcare provider? 1. Descent is progressing well. 2. Fetal head is not yet engaged. 3. Vaginal delivery is imminent. 4. External rotation is complete. The correct answer is 1. Descent is progressing well. The presenting part is 3 centimeters below the ischial spines. Descent is progressing well. The fetal head is well past engagement. Engagement is defined as 0 station. The woman, a primipara, is only 7 centimeters dilated. Delivery is likely to be many hours away. External rotation does not occur until after delivery of the fetal head. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. The client diagnosed with non-Hodgkin's lymphoma is scheduled for a lymphangiogram. Which information should the nurse teach? 1. The scan will identify any malignancy in the vascular system. 2. Radiopaque dye will be injected between the toes. 3. The test will be done similar to a cardiac angiogram. 4. The test will be completed in about 5 minutes. The correct answer is 2. Radiopaque dye will be injected between the toes. Dye is injected between the toes of both feet, and then scans are performed in a few hours, at 24 hours, and then possibly once a day for several days. In option 1, the scan detects abnormalities in the lymphatic system, not the vascular system. Cardiac angiograms are performed through the femoral or brachial arteries and are completed in one session. The test takes 30 minutes to 1 hour and then is repeated at intervals. Options 1 and 3 could be eliminated because of the words vascular and cardiac. These words pertain to the cardiovascular system, not the lymphatic system.
Place the following steps of the decision-making process in the order in which they should be implemented by a nurse. 1. Identify possible solutions to the problem. 2. Gather relevant information. 3. Identify the problem. 4. Evaluate the result. 5. Test the solution. The correct order is 3. Identify the problem. 2. Gather relevant information. 1. Identify possible solutions to the problem. 5. Test the solution. And 4. Evaluate the result. Rationale. The first step in the decision-making process is defining and describing the problem. The second step in the decision-making process is gathering significant information associated with the problem. The third step of the decision-making process is identifying promising strategies to resolve the problem. The fourth step of the decision-making process is implementing an action to address the problem. The fifth step of the decision-making process is evaluating the results by comparing the actual outcomes to the expected outcomes of the employed solution to the problems.
The school nurse is performing developmental screenings for children who will be entering preschool. A 4-year-old girl excitedly tells the nurse about her recent birthday party. As she relates the details of the event, she frequently stutters. Which action by the nurse is most appropriate at this time? 1. Refer the child to an audiologist. 2. Obtain a detailed birth history from the parents. 3. Document the findings on the child's school record. 4. Refer the child to a speech pathologist. The correct answer is 3. Document the findings on the child's school record. Stuttering during the preschool years is a normal variation, particularly when excited or upset. The cause is attributed to preschool children increased cognitive abilities and imagination such that their speech cannot keep up with their thoughts. Documenting this on the child's record is important for continued observation to determine if it extends beyond the preschool years. Guaifenesin 300 milligrams 4 times a day has been prescribed as an expectorant. The dosage strength of the liquid is 200 milligrams per 5 milliliter. How many milliliters should the nurse administer for each dose? Blank milliliters. The correct answer is 7.5 milliliters. To solve this problem, you set up the formula as 200 milligrams over 5 milliliters equals to 300 milligrams over x. You cross-multiply 200 times x and 300 times 5. You get 200x equals to 1,500. You divide 200 on both sides, and you get x equals to 7.5 milliliters. This is the amount that the nurse should administer for each dose. After surgery for an ileal conduit, the nurse should closely assess the client for the occurrence of which of the following complications related to pelvic surgery? 1. Peritonitis. 2. Thrombophlebitis. 3. Husitis. 4. Inguinal hernia. The correct answer is 2. Thrombophlebitis. After pelvic surgery, there is an increased chance of thrombophlebitis owing to the pelvic manipulation that can interfere with circulation and promote venous stasis. Peritonitis is a potential complication of any abdominal surgery, not just pelvic surgery. Husitis is most frequently an indication of liver disease. Inguinal hernia may be caused by an increase in intra-abdominal pressure or a congenital weakness of the abdominal wall. Ventral hernia occurs at the site of a previous abdominal incision.
The nurse is tracking data on a group of clients with heart failure who have been discharged from the hospital and are being followed at a clinic, which of the following data indicate that nursing interventions of monitoring and teaching have been effective. 1. 90% of clients have not gained weight. 2. 75% of the clients viewed the educational video. 3. 80% of the clients reported that they are taking their medications. 4. 5% of the clients required hospitalization in the last 90 days. The correct answer is 4. The goals of managing clients outside of the hospital are for the clients to maintain health and prevent readmission, thus interventions, such as monitoring and teaching, appear to have contributed to the low readmission rate in this group of clients. Although it is important that clients do not gain weight, view educational material, and continue to take their medication, the primary indicator of effectiveness of the program is the lack of rehospitalization. Which of the following breathing rates should the nurse use when performing rescue breathing during cardiopulmonary resuscitation for a 5-year-old? 1. 10 breaths per minute. 2. 12 breaths per minute. 3. 15 breaths per minute. 4. 20 breaths per minute. The correct answer is 1. Rescue breaths should be delivered slowly at a volume that makes the chest rise and fall. For a 5-year-old child, the rate is 10 breaths per minute. If the nurse is also administering chest compressions, the rate is 2 breaths for every 15 compressions.
A client has been admitted with active rectal bleeding and has been typed and cross-matched for 2 units of packed red blood cells. Within 10 minutes of admission, the client faints when getting up to go to the bedside commode. The nurse notifies the healthcare provider, who prescribes a unit of blood to be administered immediately. the nurse can safely administer which type of blood for immediate transfusion? 1. A negative. 2. B negative. 3. AB negative. 4. O negative. The correct answer is 4. O negative. A routine serology study to confirm compatibility between a blood donor and recipient takes about 1 hour. In an emergency, O negative RBCs can be safely administered to most clients, which is why a person with O negative blood is called a universal donor. The other types of RBCs may cause an adverse reaction. The nurse is preparing to administer the following anticonvulsant medications. Which medication should the nurse question administering? 1. Carbamazepine to the client, who has a carbamazepine serum level of 8 micrograms per milliliter. 2. Clonazepam to the client, who has a clonazepam serum level of 60 nanograms per milliliter. 3. Phenytoin to the client, who has a phenytoin serum level of 26 micrograms per milliliter. 4. Ethosuximide to the client, who has an ethosuximide serum level of 45 micrograms per milliliter. The correct answer is 3. Phenytoin to the client, who has a phenytoin serum level of 26 micrograms per milliliter. The therapeutic serum level of phenytoin, an anticonvulsant, is 10 to 20 micrograms per milliliter. Because the client's level is above that range, the nurse should question administering this medication. 1 hour ago, a multipara was examined with the following results: 8 centimeters, 50% effaced, and plus 1 station. She is now pushing with contractions, and the fetal head is seen at the vaginal introitus. The nurse concludes that the client is now 1. 9 centimeters dilated, 70% effaced, and plus 2 station. 2. 9 centimeters dilated, 80% effaced, and plus 3 station. 3. 10 centimeters dilated, 90% effaced, and plus 4 station. 4. 10 centimeters dilated, 100% effaced, and plus 5 station. The correct answer is 4. 10 centimeters dilated, 100% effaced, and plus 5 station. In option 1 and 2, this client is still in stage 1, which is when the cervix is not fully effaced or fully dilated, and the station is high. In option 3, although this client is fully dilated, the cervix is not fully effaced, and the baby has not descended far enough. In option 4, the cervix is fully dilated and fully effaced, and the baby is low enough to be seen through the vaginal introitus. The client asks the nurse, "They say I have cancer. How can they tell if I have Hodgkin's disease from a biopsy?" The nurse's answer is based on which scientific rationale? 1. Biopsies are nuclear medicine scans that can detect cancer. 2. A biopsy is a laboratory test that detects cancer cells. 3. It determines which kind of cancer the client has. 4. The HCP takes a small piece out of the tumor and looks at the cells. The correct answer is 4. The HCP takes a small piece out of the tumor and looks at the cells. A biopsy is the removal of cells from a mass and examination of the tissue under a microscope to determine if the cells are cancerous. Reed-Sternberg cells are diagnostic for Hodgkin's disease. If these cells are not found in the biopsy, the HCP can rebiopsy to make sure the specimen provided the needed sample, or, depending on involvement of the tissue, diagnose a non-Hodgkin's lymphoma. Biopsies are surgical procedures requiring needle aspiration or excision of the area. They are not nuclear medicine scans. The biopsy specimen is sent to the pathology laboratory for the pathologist to determine the type of cell. Laboratory test refers to tests of body fluids performed by a laboratory technician. A biopsy is used to determine if the client has cancer, and if so, what kind. However, this response does not answer the client's question. Option 1 can be eliminated if you know what the word biopsy means. Option 3 does not answer the question and can be eliminated for this reason.
A nurse and a nursing assistant are working together on a surgical unit. Which activity should the nurse assign to the nursing assistant? Select all that apply. 1. Taking vital signs of clients who are stable. 2. Delivering meal trays to clients who are in isolation. 3. Explaining to a client how to use an incentive spirometer. 4. changing the linens on beds that are occupied by clients who are on bed rest. 5. Emptying a urine collection bag that is attached to continuous bladder irrigation. The correct answers are 1. Taking vital signs of clients who are stable. 2. Delivering meal trays to clients who are in isolation. 4. Changing the linens on beds that are occupied by clients who are on bed rest. And 5. Emptying a urine collection bag that is attached to continuous bladder irrigation. Rationale. Taking vital signs of clients who are stable is within the scope of practice of a nursing assistant. Determining the significance of the results of routine vital signs requires the expertise of a nurse. Delivering meal trays to clients who are in isolation is within the scope of practice of a nursing assistant. Nursing assistants are taught how to use personal protective equipment. Changing the linens on beds that are occupied by clients who are on bed rest is within the scope of practice of a nursing assistant. The activity is simple and repetitive. Emptying and recording the volume of output collected from a urine collection bag is within the legal role of a nursing assistant. The nurse will then calculate the volume of urine by deducting the volume of irrigating solution instilled from the total output. Calculating the actual urine output is an assessment that requires the skill of a nurse. Client teaching is within the legal scope of a nurse, not a nursing assistant. Teaching requires a complex level of interaction with the client, problem solving, and innovation in the form of an individually designed teaching plan of care that addresses the specific learning needs of the client. In addition, the outcome is unpredictable and it has the potential to cause harm if the skill is taught incorrectly.
An adolescent with cystic fibrosis is admitted to the pediatric unit with increased shortness of breath and pneumonia. Which nursing activity is most important to include in the patient's care? 1. Allowing the adolescent to decide if aerosolized medications are needed. 2. Scheduling postural drainage and a chest physiotherapy every 4 hours. 3. Placing the adolescent in a room with another adolescent with CF. 4. Encouraging oral fluid intake of 2,400 milliliters per day. The correct answer is 2. Scheduling postural drainage and a chest physiotherapy every 4 hours. National guidelines indicate that airway clearance techniques are critical for patients with CF. Thus, postural drainage and chest physiotherapy are a priority. National guidelines also indicate that children and adolescents with CF who are hospitalized with respiratory illnesses should be placed on contact precautions. Furthermore, people with CF should be separated from others with CF to reduce droplet transmission of CF pathogens. There is no evidence that increased fluid intake adequately thins respiratory secretions, and chest physiotherapy is the priority. Pseudoephedrine has been prescribed as a nasal decongestant. Which of the following is a possible adverse effect of this drug? 1. Constipation. 2. Bradycardia. 3. Diplopia. 4. Restlessness. The correct answer is 4. Restlessness. Adverse effects of pseudoephedrine are experienced primarily in the cardiovascular system and through sympathetic effects on the central nervous system. The most common CNS adverse effects include restlessness, dizziness, tension, anxiety, insomnia, and weakness. Common cardiovascular adverse effects include tachycardia, hypertension, palpitations, and arrhythmias. Constipation and diplopia are not adverse effects of pseudoephedrine. Tachycardia, not bradycardia, is an adverse effect of pseudoephedrine. The nurse is assessing the urine of a client who has had an ileal conduit and notes that the urine is yellow with a moderate amount of mucus. Based on these data, the nurse should 1. Change the appliance bag. 2. Notify the physician. 3. Obtain a urine specimen for culture. 4. Encourage a high fluid intake. The correct answer is 4. Encourage a high fluid intake. Mucus is secreted by the intestinal segment used to create the conduit and is a normal occurrence. The client should be encouraged to maintain a large fluid intake to help flush the mucus out of the conduit. Because mucus in the urine is expected, it is not necessary to change the appliance bag or to notify the physician. The mucus is not an indication of an infection, so a urine culture is not necessary. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
The nurse in the intensive care unit is giving a report to the nurse in a cardiac step-down unit about a client who had coronary artery bypass surgery. Which of the following is the most effective way to assure essential information about the client is reported? 1. Give the report face-to-face with both nurses in a quiet room. 2. Audio tape the report for future reference and documentation. 3. Use a printed checklist with information individualized for the client. 4. Document essential transfer information in the client's electronic health record. The correct answer is 3. Using an individualized, printed checklist ensures that all key information is reported. The checklist can then serve as a record to which nurses can refer later. Giving a verbal report leaves room for error in memory. Using an audio tape or an electronic health record requires nurses to spend unnecessary time retrieving information. The nurse begins CPR on a 5-year-old unresponsive client. When the emergency response team arrives, the child continues to have no respiratory effort, but has a heart rate of 50 with cyanotic legs. The team should next: 1. Discontinue compressions but continue administering breaths with a bag mask device. 2. Establish an intravenous line with a large bore needle while preparing the defibrillator. 3. Begin 2-person CPR at a ratio of 2 breaths to 15 compressions. 4. Begin 2-person CPR at a ratio of 2 breaths to 30 compressions. The correct answer is 3. CPR is done on children for a heart rate of less than 60 with signs of poor perfusion. Rescuers should use a 15 to 2 compression to ventilation ratio for 2 rescuer CPR for a child. Breaths without compressions are indicated only for respiratory arrest where the heart rate remains above 60. The AED/defibrillator should be used as soon as it is ready, but rescuers should not discontinue compressions until the device is ready for use. The ratio for 2-person CPR in adults is 30 to 2.
The nurse is preparing to teach a client with microcytic hypochromic anemia about the diet to follow after discharge. Which of the following foods should be included in the diet? 1. Eggs. 2. Lettuce. 3. Citrus fruits. 4. Cheese. The correct answer is 1. Eggs. One of the microcytic hypochromic anemias is iron deficiency anemia. A rich source of iron is needed in the diet, and eggs are high in iron. Other foods high in iron include organ and muscle meats, shellfish, shrimp, and tuna. Enriched, whole grain, and fortified cereals and breads, legumes, nuts, dried fruits and beans, oatmeal, and sweet potatoes. Dark green, leafy vegetables and citrus fruits are good sources of vitamin C. Cheese is a good source of calcium. The client with a seizure disorder is prescribed fosphenytoin. Which interventions should the nurse discuss with the client? Select all that apply. 1. Instruct the client to wear a medic alert bracelet and carry identification. 2. Tell the client to not self-medicate with over-the-counter medications. 3. Encourage the client to decrease drinking of any type of alcohol. 4. Discuss the importance of maintaining good oral hygiene. 5. Explain the importance of maintaining adequate nutritional intake. The correct answers are 1. Instruct the client to wear a medic alert bracelet and carry identification. 2. Tell the client to not self-medicate with over-the-counter medications. And 5. Explain the importance of maintaining adequate nutritional intake. The client should wear a medic alert bracelet and carry identification so that an HCP and others possibly providing care know that the client has a seizure disorder. The client should not take any OTC medications without first consulting with the HCP or pharmacist because many medications interact with fosphenytoin, an anticonvulsant. The medication may cause anorexia, nausea, and vomiting. Therefore, the client should maintain an adequate nutritional intake. The nurse is caring for a nulliparous client who attended Lamaze childbirth education classes. Which of the following techniques should the nurse include in her plan of care? Select all that apply. 1. Hypnotic suggestion. 2. Rhythmic chanting. 3. muscle relaxation. 4. Pelvic rocking. 5. Abdominal massage. The correct answers are 3. Muscle relaxation, 4. Pelvic rocking, and 5. Abdominal massage. Hypnotic suggestion is usually not included in childbirth education based on the Lamaze method. Rhythmic chanting is usually not included in childbirth education based on the Lamaze method. Muscle relaxation is an integral part of Lamaze childbirth education. Pelvic rocking is taught in Lamaze classes as a way of easing back pain during pregnancy and labor. Abdominal massage, called effleurage, is also an integral part of Lamaze childbirth education. The nurse is admitting a client with a diagnosis of rule-out Hodgkin's lymphoma. Which assessment data support this diagnosis? 1. Night sweats and fever without chills. 2. Edematous lymph nodes in the groin. 3. Malaise and complaints of an upset stomach. 4. Pain in the neck area after a fatty meal. The correct answer is 1. Night sweats and fever without chills. Clients with Hodgkin's disease experience drenching diaphoresis, especially at night, fever without chills, and unintentional weight loss. Early-stage disease is indicated by a painless enlargement of a lymph node on one side of the neck. Pruritus is also a common symptom. Malaise and stomach complaints are not associated with Hodgkin's disease. Pain in the neck area at the site of the cancer occurs in some clients after the ingestion of alcohol. The cause for this is unknown.
The nursing team consists of a nurse in charge, a licensed nurse, and a nursing assistant. Which task should be delegated to a licensed nurse rather than the nursing assistant? Select all that apply. 1. Obtaining routine vital signs. 2. Providing discharge teaching. 3. Ambulating a stable client in the hall. 4. Transporting a client to another location for an X-ray examination. The correct answer is 2. Providing discharge teaching. Rationale. Discharge teaching requires the knowledge and judgment of a licensed nurse. It requires synthesizing and summarizing information, as well as coordinating a variety of community healthcare services to meet client needs. Taking routine vital signs is not complex, has little potential for harm, requires only simple problem-solving skills, involve a simple level of interaction with the client, and is within the scope of practice of a nursing assistant. Taking vital signs requires the more advanced competencies of a licensed nurse when previous vital signs have been outside the expected range, the client is unstable, or the client is transferred from one service/unit to another. Ambulating a stable client in the hall is within the scope of practice of a nursing assistant and does not require the educational skill of a nurse. Transporting a client is not a complex task. It requires simple problem-solving skills and involves a predictable outcome and a simple level of interaction with the client. It does not require the more advanced competencies of a nurse.
The nurse has obtained this assessment information about a 3-year-old patient who has just returned to the pediatric unit after having a tonsillectomy. Which finding requires the most immediate follow-up? 1. Frequent swallowing. 2. Hypotonic bowel sounds. 3. Reports of a sore throat. 4. Heart rate of 112 beats per minute. The correct answer is 1. Frequent swallowing. Frequent swallowing after a tonsillectomy may indicate bleeding. The nurse should inspect the back of the throat for evidence of bleeding. The other assessment results are expected in a 3-year-old child after surgery. A healthcare provider has just inserted nasal packing for a client with epistaxis. The client is taking ramipril for hypertension. What should the nurse instruct the client to do? 1. Use 81 milligrams of aspirin daily for relief of discomfort. 2. Omit the next dose of ramipril. 3. Remove the packing if there is difficulty swallowing. 4. Avoid rigorous aerobic exercise. The correct answer is 4. Avoid rigorous aerobic exercise. Epistaxis, or nosebleed, is a common, sudden emergency. Commonly, no apparent explanation for the bleeding is known. With significant blood loss, systemic symptoms such as vertigo, increased pulse, shortness of breath, decreased blood pressure, and pallor will occur. Because aerobic exercise may increase blood pressure, and increased blood pressure can cause epistaxis, the client with hypertension should avoid it. Aspirin inhibits platelet aggregation, reducing the ability of the blood to clot. The client should continue to take his anti-hypertension medication, Ramipril. Posterior nasal packing should be left in place for 1 to 3 days. When teaching the client to care for an ileal conduit, the nurse instructs the client to empty the appliance frequently. Which of the following indicates that the client is following instructions? 1. The skin around the stoma is red. 2. The urine is deep yellow. 3. There is no odor present. 4. The seal around the stoma is intact. The correct answer is 4. The seal around the stoma is intact. If the appliance becomes too full, it is likely to pull away from the skin completely or to leak urine onto the skin. Thus, if the seal is intact, the client is emptying the appliance regularly. The skin around the seal should not be red or irritated, which could indicate a leak. There will likely be an odor from the urine. Deep yellow urine indicates that the client should be increasing fluid intake.
The nurse is planning care for elderly clients who are affected by orthostatic hypotension. The nurse should do which of the following? Select all that apply. 1. Assist the clients to stand to help prevent falls. 2. Teach clients how to gradually change their position. 3. Request a prescription for antihypertensive medications for clients at high risk. 4. Conduct fall risk assessments. 5. Consider the use of sequential compression devices for high-risk clients. 6. Place clients on bed rest. The correct answers are 1, 2, 4, and 5. Orthostatic hypotension is a drop in blood pressure that occurs when changing position, usually to a more upright position. Orthostatic hypotension often occurs in elderly clients, and it is a common cause of falls. Nurses must assess clients for orthostatic hypotension and assist all clients with orthostatic hypotension in standing to help prevent falls. Lower limb compression devices aid in prevention of decreased orthostatic systolic blood pressure and reduce symptoms in elderly clients with progressive orthostatic hypotension. Nurses must teach clients how to gradually change their position, and they must conduct fall risk assessments. Sequential compression devices may be helpful to high-risk clients and should be considered when developing the care plan. Antihypertensive medications are not necessary for clients with orthostatic hypertension and may precipitate dangerous drops in blood pressure. The client should be encouraged to be ambulatory. As part of a health education program, the nurse teaches a group of parents CPR. The nurse determines that the teaching had been effective when a parent states, 1. If I am by myself, I should call for help before starting CPR. 2. I should compress the chest using 2 to 3 fingers. 3. I should deliver chest compression at a rate of 100 per minute. 4. If I can't get the breaths to make the chest rise, I should administer abdominal thrusts. The correct answer is 3. To maintain the best perfusion, it is recommended that compressions be given at a rate of 100 per minute in a ratio of 30 compressions to 2 breaths for 1 rescue CPR. Children still are more likely to have had a respiratory arrest than a cardiac arrest and are more likely to respond to opening the airway and rescue breaths. Therefore, it is recommended that unless the collapse was witnessed, a sole rescuer should attempt 5 cycles of CPR before leaving a call for help. Using 2 to 3 fingers for chest compressions is recommended for infant CPR only. Abdominal thrusts are no longer recommended for unconscious victims.
The nurse should instruct the client to eat which of the following foods to obtain the best supply of vitamin B12? 1. Whole grains. 2. Green leafy vegetables. 3. Meats and dairy products. 4. Broccoli and Brussels sprouts. The correct answer is 3. Meats and dairy products. Good sources of vitamin B12 include meats and dairy products. Whole grains are a good source of thiamine. Green leafy vegetables are good sources of niacin, folate, and carotenoids, which are precursors of vitamin A. Broccoli and Brussels sprouts are good sources of ascorbic acid, which is vitamin C. An antenatal client is informing the nurse of her prenatal signs and symptoms. Which of the following findings would the nurse determine are presumptive signs of pregnancy? Select all that apply. 1. Amenorrhea. 2. Breast tenderness. 3. Quickening. 4. Frequent urination. 5. Uterine growth. The correct answers are 1. Amenorrhea. 2. Breast tenderness. 3. Quickening. And 4. Frequent urination. There are 3 classifications of signs of pregnancy: presumptive, probable, and positive. Signs that are totally subjective or presumptive include amenorrhea, breast tenderness, quickening, and frequent urination. Signs that are objective but not totally absolute are termed probable and include alterations in uterine shape and size and softening of the cervix. Signs that are absolute or positive include hearing the fetal heartbeat, detecting fetal movement by a healthcare provider, and seeing ultrasound images of the fetal outline. The nurse reviews the record of a child who was just seen by a healthcare provider. The HCP has documented a diagnosis of suspected aortic stenosis. Which specific sign-symptom of aortic stenosis should the nurse anticipate? 1. Pallor. 2. Hyperactivity. 3. Exercise intolerance. 4. Gastrointestinal disturbances. The correct answer is 3. Exercise intolerance. The child with aortic stenosis shows signs of exercise intolerance, chest pain, and dizziness when standing for long periods. Pallor may be noted, but it is not specific to this type of disorder alone. Options 2 and 4 are not related to this disorder. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. The client is diagnosed with low back pain and is prescribed cyclobenzaprine. Which instructions should the clinic nurse teach the client? Select all that apply. 1. Take the medication just before leaving home for work each day. 2. Drink a full glass of water with each dose of medication. 3. The medication can cause drowsiness that will make driving unsafe. 4. Divide the dose of medication between early morning and bedtime. 5. Suck on hard candy if you experience a dry mouth. The correct answers are 3. The medication can cause drowsiness that will make driving unsafe, and 5. Suck on hard candy if you experience a dry mouth. Cyclobenzaprine is a muscle relaxant. The medication acts on the central nervous system and can cause drowsiness. The client should be warned not to drive until the client understands the effects on his or her body. Driving could be dangerous for the client and others. Taking the medication before leaving the house could be a danger to the client and others because this medication can cause drowsiness. The client should not be driving or operating equipment until the client has determined the effect of the medication on his or her body. There is no need to drink a full glass of water when taking cyclobenzaprine. A side effect of cyclobenzaprine is a dry mouth, so using hard candy is an appropriate intervention.
Which of the following statements by a client taking trazodone deserel, as prescribed by the primary healthcare provider, indicates to the nurse that further teaching about the medication is needed? 1. I will continue to take my medication after a light snack. 2. Taking deserel at night will help me to sleep. 3. My depression will be gone in about 5 to 7 days. 4. I won't drink alcohol while taking deserel. The correct answer is 3. My depression will be gone in about 5 to 7 days. Rationale. Symptom relief can occur during the first week of therapy, with optimal effects possible within 2 weeks. For some clients, 2 to 4 weeks is needed for optimal effects. The client statement that the depression will be gone in 5 to 7 days indicates to the nurse that clarification and further teaching is needed. Trazodone should be taken after a meal or light snack to enhance its absorption. Trazodone can cause drowsiness, and therefore the major portion of the drug should be taken at bedtime. The depressant effects of central nervous system depressants and alcohol may be potentiated by this drug.
The nurse is providing nursing care for a newborn infant with respiratory distress syndrome who is receiving nasal continuous positive airway pressure ventilation. Which assessment finding is most important to report to the healthcare provider? 1. Apical pulse rate of 156 beats per minute. 2. Crackles audible in both lungs. 3. Tracheal deviation to the right. 4. Oxygen saturation of 93%. The correct answer is 3. Tracheal deviation to the right. Tracheal deviation suggests tension pneumothorax, a possible complication of positive pressure ventilation. The nurse will need to communicate rapidly with the HCP and assist with actions such as chest tube insertion. The heart rate, crackles, and oxygen saturation will be reported to the HCP but are expected in RDS and do not require immediate intervention. A client has had surgery for a deviated nasal septum. Which of the following would indicate that bleeding was occurring even if the nasal drip pad remained dry and intact? 1. Nausea. 2. Repeated swallowing. 3. Increased respiratory rate. 4. Increased pain. The correct answer is 2. Repeated swallowing. Because of the dense nasal packing, bleeding may not be apparent through the nasal drip pad. Instead, the blood may run down the throat, causing the client to swallow frequently. The back of the throat, where the blood will be apparent, can be assessed with a flashlight. An accumulation of blood in the stomach can cause nausea and vomiting, but nausea would not be the initial indicator of bleeding. An increased respiratory rate occurs in shock, but is not an early sign of bleeding in a client who has undergone nasal surgery. Increased pain warrants further assessment, but is not an indicator of bleeding. The nurse should teach the client with an ileal conduit to prevent urine leakage when changing the appliance by using which of the following procedures? 1. Insert a gauze wick into the stoma. 2. Close the opening temporarily with a cellophane seal. 3. Suction the stoma before changing the appliance. 4. Avoid oral fluids for several hours before changing the appliance. The correct answer is 1. Insert a gauze wick into the stoma. Inserting a gauze wick into the stoma helps prevent urine leakage when changing the appliance. The stoma should not be sealed or suctioned. Oral fluids do not need to be avoided.
A client with peripheral vascular disease has chronic, severe pretibial and ankle edema bilaterally. Because the client is on complete bed rest and circulation is compromised, one goal is to maintain tissue integrity. Which of the following interventions will help achieve this outcome? 1. Administering pain medication. 2. Encouraging fluids. 3. Turning the client every 1 to 2 hours. 4. Maintaining hygiene. The correct answer is 3. The client is at greater risk for skin breakdown in the lower extremities related to the edema and to remaining in one position, which increases capillary pressure. Turning the client every 1 to 2 hours promotes vasodilation and prevents vascular compression. Administering pain medication will not have an effect on skin integrity. Encouraging fluids is not a direct intervention for maintaining skin integrity, although being well hydrated is a goal for most clients. Maintaining hygiene does influence skin integrity, but is secondary in this situation. When performing cardiopulmonary resuscitation, CPR, which of the following indicates that external chest compressions are effective? 1. Mottling of the skin. 2. Pupillary dilation. 3. Palpable pulse. 4. Cool, dry skin. The correct answer is 3. With CPR, effectiveness of external chest compressions is indicated by palpable peripheral pulses, the disappearance of mottling and cyanosis, the return of pupils to normal size, and warm, dry skin. To determine whether the victim of cardiopulmonary arrest has resumed spontaneous breathing and circulation, chest compressions must be stopped for 5 seconds at the end of the first minute and every few minutes thereafter.
The nurse has just admitted a 35-year-old female client who has a serum vitamin B12 concentration of 800 picograms per milliliter. Which of the following laboratory findings should alert the nurse to focus the health history to obtain specific information about drug or alcohol use? 1. Total bilirubin, 0.3 milligrams per deciliter. 2. Serum creatinine, 0.5 milligrams per deciliter. 3. Hemoglobin, 16 grams per deciliter. 4. Folate, 1.5 nanograms per milliliter. The correct answer is 4. Folate, 1.5 nanograms per milliliter. Normal range of folic acid is 1.8 to 9 nanograms per milliliter, and normal range of vitamin B12 is 200 to 900 picograms per milliliter. A low folic acid level in the presence of a normal vitamin B12 level is indicative of a primary folic acid deficiency anemia. Factors that affect the absorption of folic acid are drugs such as methotrexate, oral contraceptives, anti-seizure drugs, and alcohol. The total bilirubin, serum creatinine, and hemoglobin values are within normal limits. The nurse is assessing the laboratory report of a 40-week gestation client. Which of the following values would the nurse expect to find elevated above pre-pregnancy levels? Select all that apply. 1. Glucose. 2. Fibrinogen. 3. Hematocrit. 4. Bilirubin. 5. White blood cells. The correct answers are 2. Fibrinogen and 5. White blood cells. Fibrinogen levels will be elevated slightly in a 40-week pregnant woman because coagulation factors like fibrinogen increase to help prevent excessive blood loss during delivery. A 40-week pregnant woman's white blood cell count will be elevated above normal as a means of protecting her body from infection. The nurse has reinforced home care instructions to the mother of a child who is being discharged after cardiac surgery. Which statement by the mother indicates the need for further teaching? 1. A balance of rest and exercise is important. 2. I can apply lotion or powder to the incision if it is itchy. 3. Activities during which the child could fall need to be avoided for 2 to 4 weeks. 4. Large crowds of people need to be avoided for at least 2 weeks after the surgery. The correct answer is 2. I can apply lotion or powder to the incision if it is itchy. The mother should be instructed that lotions and powders should not be applied to the incision site because these items can affect the skin integrity and the healing process. Options 1, 3, and 4 are accurate instructions regarding home care after cardiac surgery. The charge nurse on an orthopedic unit is transcribing orders for a client diagnosed with back pain. Which HCP order should the charge nurse question? 1. Physical therapy for hot packs and massage. 2. Complete blood count and complete metabolic panel. 3. Hydrocodone PRN. 4. Carisoprodol POBID. The correct answer is 3. Hydrocodone PRN. Hydrocodone is an opioid analgesic. This medication order is incomplete. The nurse should contact the HCP for a time limitation. Physical therapy for heat and massage is standard therapy for back pain. There is no reason to question this order. For option 2, many medications can affect the kidneys or the liver and the blood counts. Baseline data should be obtained. There is no reason to question this order. Carisoprodol is a muscle relaxant and comes in 1 strength, so this order is complete. There is no reason to question this order.
A 62-year-old female client with severe depression and psychotic symptoms is scheduled for electroconvulsive therapy tomorrow morning. The client's daughter asked the nurse, "How painful will the treatment be for mom?" The nurse should respond by saying which of the following? 1. Your mother will be given something for pain before the treatment. 2. The primary healthcare provider will make sure your mother doesn't suffer needlessly. 3. Your mother will be asleep during the treatment and will not be in pain. 4. Your mother will be able to talk to us and tell us if she's in pain. The correct answer is 3. Your mother will be asleep during the treatment and will not be in pain. Rationale. The nurse should explain that ECT is a safe treatment and that the client is given an ultra-short-acting anesthetic to induce sleep before ECT and a muscle relaxant to prevent musculoskeletal complications during the convulsion, which typically lasts 30 to 60 seconds to be therapeutic. Atropine is given before ECT to inhibit salivation and respiratory tract secretions and thereby minimize the risk of aspiration. Medication for pain is not necessary and is not given before or during the treatment. Some clients experience a headache after the treatment and may request and be given an analgesic such as acetaminophen. Telling the daughter that the primary healthcare provider will ensure that the client does not suffer needlessly would not provide accurate information about ECT. This statement also implies that the client will have pain during the treatment, which is untrue.
The nurse is assisting with the delivery of a 31-week gestational age premature newborn who requires intubation for respiratory distress syndrome. Which medication does the nurse anticipate will be needed first for this infant? 1. Theophylline. 2. Surfactant. 3. Dexamethasone. 4. Albuterol. The correct answer is 2. Surfactant. Research indicates that the administration of synthetic surfactant improves respiratory status and decreases the incidence of pneumothorax in premature infants with RDS. The other medications may be used if respiratory distress persists, but the first medication administered will be the surfactant. A client who has undergone outpatient nasal surgery is ready for discharge and has nasal packing in place. Which of the following discharge instructions would be appropriate for the client? 1. Avoid activities that elicit the Valsalva maneuver. 2. Take aspirin to control nasal discomfort. 3. Avoid brushing the teeth until the nasal packing is removed. 4. Apply heat to the nasal area to control swelling. The correct answer is 1. Avoid activities that elicit the Valsalva maneuver. The client should be instructed to avoid any activities that cause Valsalva's maneuver, such as constipation, vigorous coughing, exercise, in order to reduce bleeding and stress on suture lines. The client should not take aspirin because of its antiplatelet properties, which may cause bleeding. Oral hygiene is important to rid the mouth of old dried blood and to enhance the client's appetite. Cool compresses, not heat, should be applied to decrease swelling and control discoloration of the area. The client with an ileal conduit will be using a reusable appliance at home. The nurse should teach the client to clean the appliance routinely with which product? 1. Baking soda. 2. Soap. 3. Hydrogen peroxide. 4. Alcohol. The correct answer is 2. Soap. A reusable appliance should be routinely cleaned with soap and water. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
A client who has been diagnosed with peripheral vascular disease is being discharged. The client needs further instruction, as she says she will 1. Avoid heating pads. 2. Not cross the legs. 3. Wear leather shoes. 4. Use iodine on an injured site. The correct answer is 4. The client should avoid using iodine or over-the-counter medications. Iodine is a highly toxic solution. An individual who has known PVD should be seen by a physician for treatment to avoid infection. The client with PVD should avoid heating pads and crossing the legs and should wear leather shoes. A heating pad can cause injury, which, because of the decreased blood supply, can be difficult to heal. Crossing the legs can further impede blood flow. Leather shoes provide better protection. A nurse walks into the room just as a 10-month-old infant places an object in his mouth and starts to choke. After opening the infant's mouth, which of the following should the nurse do next to clear the airway? 1. Use blind finger sweeps. 2. Deliver back slaps and chest thrusts. 3. Apply for subdiaphragmatic abdominal thrusts. 4. Attempt to visualize the object. The correct answer is 2. The nurse should use mechanical force, back slaps and chest thrusts, in an attempt to dislodge the object. Blind finger sweeps are not appropriate in infants and children because the foreign body may be pushed back into the airway. Subdiaphragmatic abdominal thrusts are not used for infants age 1 year or younger because of the risk of injury to abdominal organs. If the object is not visible when opening the mouth, time is wasted in looking for it. Action is required to dislodge the object as quickly as possible.
Which of the following lab values should the nurse report to the healthcare provider when the client has anemia? 1. Schilling test result, elevated. 2. Intrinsic factor, absent. 3. Sedimentation rate, 16 millimeters per hour. 4. Red blood cells within normal range. The correct answer is 2. Intrinsic factor, absent. The defining characteristic of pernicious anemia, a megaloblastic anemia, is lack of the intrinsic factor, which results from atrophy of the stomach wall. Without the intrinsic factor, vitamin B12 cannot be absorbed in the small intestine, and folic acid needs vitamin B12 for deoxyribonucleic acid synthesis of RBCs. The gastric analysis is done to determine the primary cause of the anemia. An elevated excretion of the injected radioactive vitamin B12, which is protocol for the first and second stages of the Schilling test, indicates that the client has the intrinsic factor and can absorb vitamin B12 in the intestinal tract. A sedimentation rate of 16 millimeters per hour is normal for both men and women and is a non-specific test to detect the presence of inflammation. It is not specific to anemias. An RBC value within the normal range does not indicate an anemia. When analyzing the need for health teaching of a prenatal multigravida, the nurse should ask which of the following questions. 1. What are the ages of your children? 2. What is your marital status? 3. Do you ever drink alcohol? 4. Do you have any allergies? The correct answer is 3. Do you ever drink alcohol? All of the possible responses are questions that should be asked of a pregnant multigravida, but only one is related to the client's needs for health teaching. The nurse is told that a child with rheumatic fever will be arriving to the nursing unit for admission. Which question should the nurse ask the family to elicit information specific to the development of RF? 1. Has the child complained of back pain? 2. Has the child complained of headaches? 3. Has the child had any nausea or vomiting? 4. Did the child have a sore throat or a fever within the past 2 months? The correct answer is 4. Did the child have a sore throat or a fever within the past 2 months? Rheumatic fever characteristically presents 2 to 6 weeks after an untreated or partially treated group A beta hemolytic streptococcal infection of the upper respiratory tract. Initially, the nurse determines if the child has had a sore throat or an unexplained fever within the past 2 months. Options 1, 2, and 3 are unrelated to RF. The nurse is administering medications to clients on an orthopedic unit. Which medication should the nurse question? 1. Ibuprofen to a client diagnosed with back pain and a history of ulcers. 2. Morphine to a client diagnosed with back pain rated as 6. 3. Methocarbamol to a client diagnosed with chronic back pain. 4. Acetaminophen with codeine 3 to a client diagnosed with mild back pain. The correct answer is 1. Ibuprofen to a client diagnosed with back pain and a history of ulcers. Ibuprofen is an NSAID. NSAIDs decrease prostaglandin production in the stomach, increasing the client's risk of developing ulcers. This client has a known risk of peptic ulcer disease. The nurse should question the medication and discuss this with the HCP. Morphine sulfate is an opioid analgesic. Opioid analgesics are administered for pain. The client is in the moderate to severe pain range. The nurse would administer this medication. Methocarbamol is a muscle relaxant. Muscle relaxant medications are administered to clients with back pain to relax the muscles and decrease the pain. The nurse would administer this medication. Acetaminophen is a non-narcotic analgesic, and when combined with codeine, a narcotic analgesic, the potency of medication for pain relief is increased. The nurse would administer this medication.
During a group session, a client who is depressed tells the group that he lost his job. Which of the following responses by the nurse is best? 1. It must have been very upsetting for you. 2. Would you tell us about your job? 3. You'll find another job when you're better. 4. You were probably too depressed to work. The correct answer is 1. It must have been very upsetting for you. Rationale. By stating, it must have been very upsetting for you, the nurse conveys empathy to the client by recognizing the underlying meaning of a painful occurrence. The nurse's statement invites the client to verbalize feelings and thoughts and lets the client know that the nurse is listening to and respects the client. Telling the client to talk about the job disregards the client's feelings and is non-therapeutic for the depressed client because of underlying feelings of worthlessness and guilt that are commonly present. Telling the client that he will find another job when he is better or that he was probably too depressed to work is inappropriate because it disregards the client's feelings and may promote additional feelings of failure and inadequacy in the client.
The nurse obtains this information when assessing a 3-year-old patient with uncorrected tetralogy of Fallot who is crying. Which finding requires immediate action? 1. The apical pulse rate is 118 beats per minute. 2. A loud systolic murmur is heard in the pulmonic area. 3. There is marked clubbing of the child's nail beds. 4. The lips and oral mucosa are dusky in color. The correct answer is 4. The lips and oral mucosa are dusky in color. Circumoral cyanosis indicates a drop in the partial pressure of oxygen that may precipitate seizures and loss of consciousness. The nurse should rapidly place the child in a knee chest position, administer oxygen, and take steps to calm the child. The other assessment data are expected in a child with congenital heart defects, such as tetralogy of Fallot. Which of the following statements should indicate to the nurse that a client has understood the discharge instructions provided after nasal surgery? 1. I should not shower until my packing is removed. 2. I will take stool softeners and modify my diet to prevent constipation. 3. Coughing every 2 hours is important to prevent respiratory complications. 4. It is important to blow my nose each day to remove the dried secretions. The correct answer is 2. I will take stool softeners and modify my diet to prevent constipation. Constipation can cause straining during defecation, which can induce bleeding. Showering is not contraindicated. The client should take measures to prevent coughing, which can cause bleeding. The client should avoid blowing the nose for 48 hours after the packing is removed. Thereafter, the client should blow the nose gently, using the open mouth technique to minimize bleeding in the surgical area. The nurse is evaluating the discharge teaching for a client who has an allele conduit. Which of the following statements indicates that the client has correctly understood the teaching? Select all that apply. 1. If I limit my fluid intake, I will not have to empty my ostomy pouch as often. 2. I can place an aspirin tablet in my pouch to decrease odor. 3. I can usually keep my ostomy pouch on for 3 to 7 days before changing it. 4. I must use a skin barrier to protect my skin from urine. 5. I should empty my ostomy pouch of urine when it is full. The correct answers are 3. I can usually keep my ostomy pouch on for 3 to 7 days before changing it. And 4. I must use a skin barrier to protect my skin from urine. The client with an ileal conduit must learn self-care activities related to care of the stoma and ostomy appliances. The client should be taught to increase fluid intake to about 3,000 milliliters per day and should not limit intake. Adequate fluid intake helps to flush mucus from the ileal conduit. The ostomy appliance should be changed approximately every 3 to 7 days and whenever a leak develops. A skin barrier is essential to protecting the skin from the irritation of the urine. Aspirin should not be used as a method of odor control because it can be an irritant to the stoma and lead to ulceration. The ostomy pouch should be emptied when it is 1/3 to 1/2 full to prevent the weight of the urine from pulling the appliance away from the skin.
A client with peripheral vascular disease has bypass surgery. The primary goal of the plan of care after surgery is to 1. Maintain circulation. 2. Prevent infection. 3. Relieve pain. 4. Provide education. The correct answer is 1. Maintaining circulation in the affected extremity after surgery is the focus of care. The graft can become occluded, and the client must be assessed frequently to determine whether the graft is patent. Preventing infection and relieving pain are important, but are secondary to maintaining graft patency. Education should have taken place in the preoperative phase, and then continued during the recovery phase. When preparing to deliver back slaps to an infant who is choking on a foreign body, in which of the following positions should the nurse position the infant? 1. Head down and lower than the trunk. 2. Head up and raise above the trunk. 3. Head to one side and even with the trunk lower than the head. 4. Head parallel to the nurse and supported at the buttocks. The correct answer is 1. To deliver back slaps, the nurse should place the infant face down, straddled over the nurse's arm, with the head lowered in the trunk and the head supported. This position, together with the back slaps, facilitates dislodgement and removal of a foreign object and minimizes aspiration if vomiting occurs. Placing the infant with the head up and raised above the trunk would not aid in dislodging and removing the foreign object. In addition, this position places the infant at risk for aspiration should vomiting occur. Placing the head to one side may minimize the risk of aspiration. However, it would not help with removal of an object that is dislodged by the back slaps. Placing the infant with the head parallel to the nurse and supported at the buttocks is more appropriate for burping the infant.
The nurse devises a teaching plan for the client with aplastic anemia. Which of the following is the most important concept to teach for health promotion and maintenance? 1. Eat animal protein and dark green, leafy vegetables every day. 2. Avoid exposure to others with acute infections. 3. Practice yoga and meditation to decrease stress and anxiety. 4. Get 8 hours of sleep at night and take naps during the day. The correct answer is 2. Avoid exposure to others with acute infections. Clients with aplastic anemia are severely immunocompromised and at risk for infection and possible death related to bone marrow suppression and pancytopenia. Strict aseptic technique and reverse isolation are important measures to prevent infection. Although diet, reduced stress, and rest are valued in supporting health, the potentially fatal consequence of an acute infection places it as a priority for teaching the client about health maintenance. Animal meat and dark green leafy vegetables, good sources of vitamin B12 and folic acid, should be included in the daily diet. Yoga and meditation are good complementary therapies to reduce stress. 8 hours of rest and naps are good for spacing and pacing activity and rest. A woman whose prenatal weight was 105 pounds, weighs 109 pounds, at her 12-week visit. Which of the following comments by the nurse is appropriate at this time? 1. We expect you to gain about 1 pound per week, so your weight is a little low at this time. 2. Most women gain no weight during the first trimester, so I would suggest you eat fewer desserts for the next few weeks. 3. You entered the pregnancy well underweight, so we should check your diet to make sure you are getting the nutrients you need. 4. Your weight gain is exactly what we would expect it to be at this time. The correct answer is 4. Your weight gain is exactly what we would expect it to be at this time. For women who enter the pregnancy with a normal weight for height, the expected weight gain is 3 to 5 pounds for the entire first trimester and approximately 0.8 to 1 pound per week from weeks 13 to 40. Acetyl salicylic acid is prescribed for a child with rheumatic fever. The nurse should question this prescription if the child had documented evidence of which condition? 1. Arthralgia. 2. Joint pain. 3. Facial edema. 4. A viral infection. The correct answer is 4. A viral infection. Anti-inflammatory agents, including aspirin, may be prescribed by the healthcare provider for the child with RF. Aspirin should not be given to a child who has chickenpox or other viral infections, such as influenza, because of the risk of Reyes syndrome. Options 1 and 2 are clinical manifestations of RF. Facial edema may be associated with the development of a cardiac complication. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. The client diagnosed with low back pain is prescribed morphine sulfate. Which interventions should the nurse implement? Select all that apply. 1. Discuss with the HCP starting the client on a stool softener. 2. Teach the client about rating the pain on a numeric pain scale. 3. Inform the client to rise quickly from a supine position. 4. Administer anticonvulsant medications around the clock. 5. Tell the client to call for assistance when getting out of bed. The correct answers are 1. Discuss with the HCP, starting the client on a stool softener. 2. Teach the client about rating the pain on a numeric pain scale. And 5. Tell the client to call for assistance when getting out of bed. Narcotic pain medications slow peristalsis in the small and large intestines, increasing the risk for constipation and fecal impaction. The nurse should discuss a bowel regimen with the HCP. The nurse should attempt to have the client quantify the pain so that the effectiveness of interventions can be evaluated. The numeric pain scale is one method of objectifying the pain. Rising quickly from a flat-on-the-back position could increase the client's pain. Some of the medications administered for back pain can cause orthostatic hypotension. The nurse should teach the client to turn on the side and push up on the elbow slowly when getting out of bed. The client may be taking antispasmodic and pain medications, but there is no reason for anticonvulsant medications. For option 5, tell the client to call for assistance when getting out of bed.
A male client who is very depressed exhibits psychomotor retardation, a flat affect, and apathy. The nurse observes the client to be in need of grooming and hygiene. Which of the following nursing actions is most appropriate? 1. Explaining the importance of hygiene to the client. 2. Asking the client if he is ready to shower. 3. Waiting until the client's family can participate in the client's care. 4. Stating to the client that it's time for him to take a shower. The correct answer is 4. Stating to the client that it's time for him to take a shower. Rationale: the client with depression is preoccupied, has decreased energy, and cannot make decisions, even simple ones. Therefore, the nurse presents the situation, it's time for a shower, and assists the client with personal hygiene to preserve his dignity and self-esteem. Explaining the importance of good hygiene to the client is inappropriate because the client may know the benefits of hygiene, but is too fatigued and preoccupied to pay attention to self-care. Asking the client if he is ready for a shower is not helpful because the client with depression commonly cannot make even simple decisions. This action also reinforces the client's feeling about not caring about showering. Waiting for the family to visit to help with the client's hygiene is inappropriate and irresponsible on the part of the nurse. The nurse is responsible for making basic decisions for the client until the client can make decisions for himself.
The nurse is observing a preschool classroom of children between the ages of 3 to 4 years of age. When planning actions to ensure that each child meets normal developmental goals, which child will require the most immediate intervention? 1. A 3-year-old boy who needs help dressing. 2. A 4-year-old girl who has an imaginary friend. 3. A 4-year-old girl who engages only in parallel play. 4. A 3-year-old boy who draws stick figures. The correct answer is 3. A 4-year-old girl who engages only in parallel play. At 4 years of age, children engage in pretend play. Parallel play is seen in younger children between the ages of 2 and 3 years when they play side by side with limited interaction. The other behaviors are developmentally appropriate. The nurse will plan interventions to ensure that all the children meet developmental goals, but the 4-year-old child engaging only in parallel play will require the most immediate intervention. The nurse is planning to give preoperative instructions to a client who will be undergoing rhinoplasty. Which of the following instructions should be included? 1. After surgery, nasal packing will be in place for 7 to 10 days. 2. Normal saline nose drops will need to be administered preoperatively. 3. The results of the surgery will be immediately obvious post-operatively. 4. Aspirin-containing medications should not be taken for 2 weeks before surgery. The correct answer is 4. Aspirin-containing medications should not be taken for 2 weeks before surgery. Aspirin-containing medications should be discontinued for 2 weeks before surgery to decrease the risk of bleeding. Nasal packing is usually removed the day after surgery. Normal saline nose drops are not routinely administered preoperatively. The results of the surgery will not be obvious immediately after surgery because of edema and ecchymosis. A client has an ileal conduit. Which of the following solutions will be useful to help control odor in the urine collecting bag after it has been cleaned? 1. Salt water. 2. Vinegar. 3. Ammonia. 4. Bleach. The correct answer is 2. Vinegar. A distilled vinegar solution acts as a good deodorizing agent after an appliance has been cleaned well with soap and water. If the client prefers, a commercial deodorizer may be used. Salt solution does not deodorize. Ammonia and bleaching agents may damage the appliance.
The nurse is instructing a client who is at risk for peripheral vascular disease how to use knee-length elastic stockings. The teaching plan should include which of the following? Select all that apply. 1. Apply the elastic stockings in the morning. 2. Remove the stockings if swelling occurs. 3. Apply the stockings while in bed. 4. Once the stockings have been pulled over the calf, roll the remaining stocking down to make a cuff. 5. Keep the stockings in place for 48 hours and reapply using a clean pair of stockings. The correct answers are 1 and 3. Elastic stockings are used to promote circulation by preventing pooling of blood in the feet and legs. The stocking should be applied in the morning. Before the client gets out of bed, the stocking should be applied smoothly to avoid wrinkles, but the top should not be rolled down to avoid constriction of circulation. The stocking should be removed every 8 hours, and the client should elevate the legs for 15 minutes and reapply the stockings. Clean stockings should be applied daily or as needed. A 6-month-old infant has had a cardiac arrest, and the rapid response team has been paged. The charge nurse arrives in the client's room and observes a licensed practical nurse administering CPR to an infant. See the figure below. To assist the LPN with CPR, the charge nurse should 1. Take over rescue breaths with a rate of 1 breath per 5 compressions using a bag mask device while the LPN continues compressions. 2. Take over compressions using one hand while the LPN uses a mask device to administer rescue breaths. 3. Take over rescue breaths using a rate of 2 breaths per 15 compressions using a bag mask device while the LPN delivers compressions. 4. Take over compressions at 80 compressions a minute while the LPN uses a bag mask device to administer rescue breaths. The correct answer is 2. The charge nurse should first obtain a bag mask device and assist with CPR by giving breaths at 2 breaths per 15 compressions. The LPN is using correct technique by using 2 to 3 fingers on the chest to administer chest compressions. The encircling hand technique may also be used during 2-person infant CPR. The heel of both hands is used for older children and adolescents. The compression rate is at least 100 per minute.
A client had a resection of the terminal ileum 3 years ago. While obtaining a health history and physical assessment, the nurse finds that the client has weakness, shortness of breath, and a sore tongue. Which additional information from the client indicates a need for intervention and client teaching? 1. I have been drinking plenty of fluids. 2. I have been gargling with warm salt water for my sore tongue. 3. I have 3 to 4 loose stools per day. 4. I take a vitamin B12 tablet every day. The correct answer is 4. I take a vitamin B12 tablet every day. Vitamin B12 combines with intrinsic factor in the stomach and is then carried to the ileum, where it is absorbed into the bloodstream. In this situation, vitamin B12 cannot be absorbed regardless of the amount of oral intake of sources of vitamin B12, such as animal protein or vitamin B12 tablets. Vitamin B12 needs to be injected every month because the ileum has been surgically removed. Replacement of fluids and electrolytes is important when the client has continuous multiple loose stools on a daily basis. Warm salt water is used to soothe sore mucous membranes. Crohn's disease and a small bowel resection may cause several loose stools a day. Because nausea and vomiting are such common complaints of pregnant women, the nurse provides anticipatory guidance to a 6-week gestation client by telling her to do which of the following? 1. Avoid eating greasy foods. 2. Drink orange juice before rising. 3. Consume 1 teaspoon of nutmeg each morning. 4. Eat 3 large meals plus a bedtime snack. The correct answer is 1. Avoid eating greasy foods. The stomach is extra sensitive during pregnancy, so the pregnant woman should try to avoid foods that will aggravate it even more. Most fatty, greasy, fried, or other generally unhealthy foods are not going to help settle the stomach. These make morning sickness worse. Saltine crackers should be eaten before rising. Drinking orange juice has not been recommended. Although consuming ginger may help to alleviate the nausea and vomiting of pregnancy, neither cinnamon nor nutmeg has been shown to alleviate the symptoms. It is recommended that mothers eat small, frequent meals throughout the day. The nurse assists with admitting a child with a diagnosis of acute stage Kawasaki disease. When obtaining the child's medical history, which manifestation is likely to be noted? 1. Cracked lips. 2. A normal appearance. 3. Conjunctival hyperemia. 4. Desquamation of the skin. The correct answer is 3. Conjunctival hyperemia. During the acute stage of Kawasaki disease, the child presents with fever, conjunctival hyperemia, a red throat, swollen hands, a rash, and enlargement of the cervical lymph nodes. During the subacute stage, cracking lips and fissures, desquamation of the skin on the tips of the fingers and toes, joint pain, cardiac manifestations, and thrombocytosis occur. During the convalescent stage, the child appears normal, but signs of inflammation may be present. The client diagnosed with low back pain is scheduled to have a steroid injection into the intrathecal space. Which statement by the client indicates the client understands the procedure? 1. I will have to curl up like a Halloween cat. 2. This procedure will cure my back pain. 3. I will have an injection in each of my hips. 4. There is no risk with this procedure. The correct answer is 1. I will have to curl up like a Halloween cat. Intrathecal indicates into the central nervous system via a lumbar puncture. The client will be positioned with the back arched, much like a Halloween cat, for the HCP to be able to insert the needle between the vertebrae. The procedure provides temporary relief of inflammation of affected nerves. The injections are into the intravertebral space, not into the hips. An injection in the hips indicates an intramuscular injection. There is risk with any procedure. In this procedure, nerve damage is the greatest risk.
When developing the teaching plan for the family of a client with severe depression who is to receive electroconvulsive therapy, ECT, which of the following information should the nurse include? 1. Some temporary confusion and disorientation immediately after treatment is common. 2. During an ECT treatment session, the client is at risk for aspiration. 3. Clients with severe depression usually do not respond to ECT. 4. The client will not be able to breathe independently during a treatment. The correct answer is 1. Some temporary confusion and disorientation immediately after a treatment is common. Rationale. The family needs to be informed that some confusion and disorientation will occur as the client emerges from anesthesia immediately after ECT to lessen their fear and anxiety about the procedure. The nurse will assist the client with reorientation and will give clear, simple instructions. The client may need to lie down after ECT because of the effects of the anesthesia. Informing the family that there is a danger of aspiration during ECT is inappropriate and unnecessary. The risk of aspiration occurring during ECT is minimal because food and fluids are withheld for 6 to 8 hours before the treatment. In addition, the client receives atropine to inhibit salivation and respiratory tract secretions. Telling the family that the client will not be able to breathe independently during ECT may frighten them unnecessarily. If asked, the nurse should inform the family that the anesthesiologist mechanically ventilates the client with 100% oxygen immediately before the treatment. The client with severe depression responds to ECT. Usually, ECT is used for those who are severely depressed and not responding to pharmacotherapy.
After receiving the change of shift report, which patient should the nurse assess first? 1. An 18-month-old patient with coarctation of the aorta who has decreased pedal pulses. 2. A 3-year-old patient with rheumatic fever who reports severe knee pain. 3. A 5-year-old patient with endocarditis who has crackles audible throughout both lungs. 4. An 8-year-old patient with Kawasaki disease who has a temperature of 102.2 degrees Fahrenheit. The correct answer is 3. a 5-year-old patient with endocarditis who has crackles audible throughout both lungs. Crackles throughout both lungs indicate that the child has severe left ventricular failure as a complication of endocarditis. Hypoxemia is likely, so the child needs rapid assessment of oxygen saturation, initiation of supplemental oxygen delivery, and administration of medications such as diuretics. The other children should also be assessed as quickly as possible, but they are not experiencing life-threatening complications of their medical diagnoses. Which of the following assessments is a priority immediately after nasal surgery? 1. Assessing the client's pain. 2. Inspecting for periorbital ecchymosis. 3. Assessing respiratory status. 4. Measuring intake and output. The correct answer is 3. Assessing respiratory status. Immediately after nasal surgery, ineffective breathing patterns may develop as a result of the nasal packing and nasal edema. Nasal packing may dislodge, leading to obstruction. Assessing for airway obstruction is a priority. Assessing for pain is important, but it is not as high a priority as assessment of the airways. It is too early to detect ecchymosis. Measuring intake and output is not typically a priority nursing assessment after nasal surgery. A female client who has a urinary diversion tells the nurse, "This urinary pouch is embarrassing. Everyone will know that I'm not normal. I don't see how I can go out in public anymore." The most appropriate nursing goal for this client is to 1. Manage her anxiety about her health. 2. Learn how to care for the urinary diversion. 3. Overcome feelings of worthlessness. 4. Express fears about the urinary diversion. The correct answer is 4. Express fears about the urinary diversion. It is normal for clients to express fears and concerns about the body changes associated with a urinary diversion. Allowing the client time to verbalize concerns in a supportive environment and suggesting that she discuss these concerns with people who have successfully adjusted to ostomy surgery can help her begin coping with these changes in a positive manner. Although the client may be anxious about the situation and may be feeling worthless, the underlying problem is a disturbance in body image. There are no data to indicate that the client does not know how to care for the urinary diversion. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
A client is scheduled to undergo right axillary to axillary artery bypass surgery. Which of the following interventions is most important for the nurse to implement in the preoperative period? 1. Assess the temperature in the affected arm. 2. Monitor the radial pulse in the affected arm. 3. Protect the extremity from cold. 4. Avoid using the arm for a venipuncture. The correct answer is 4. If surgery is scheduled, the nurse should avoid venipunctures in the affected extremity. The goal should be to prevent unnecessary trauma and possible infection in the affected arm. Disruptions in skin integrity and even minor skin irritations can cause the surgery to be canceled. The nurse can continue to monitor the temperature and radial pulse in the affected arm. However, doing so is not the priority. Keeping the client warm is important, but is not the priority at this time. When teaching the parents of an infant how to perform back slaps to dislodge a foreign body, which of the following should the nurse tell the parents to use to deliver the blows? 1. Palm of the hand. 2. Heel of the hand. 3. Fingertips. 4. Entire hand. The correct answer is 2. Back slaps are delivered rapidly and forcefully with the heel of the hand between the infant's shoulder blades. Slowly delivered back slaps are less likely to dislodge the object. Using the heel of the hand allows more force to be applied than when using the palm or the whole hand, increasing the likelihood of loosening the object. The fingertips would be used to deliver chest compressions to an infant younger than 1 year of age.
A client who follows a vegetarian diet was referred to a dietitian for nutritional counseling for anemia. Which client outcome indicates that the client does not understand nutritional counseling? The client: 1. Adds dried fruit to cereal and baked goods. 2. Cooks tomato-based foods in iron pots. 3. Drinks coffee or tea with meals. 4. Adds vitamin C to all meals. The correct answer is 3. Drinks coffee or tea with meals. Coffee and tea increase gastrointestinal motility and inhibit the absorption of non-heme iron. Clients are instructed to add dried fruits to dishes at every meal because dried fruits are a non-heme or non-animal iron source. Cooking in iron cookware, especially acid-based foods such as tomatoes, adds iron to the diet. Clients are instructed to add a rich supply of vitamin C to every meal because the absorption of iron is increased when food with vitamin C or ascorbic acid is consumed. A client enters the prenatal clinic. She states that she missed her period yesterday and used a home pregnancy test this morning. She states that the results were negative, but I still think I am pregnant. Which of the following statements would be appropriate for the nurse to make at this time? 1. Your period is probably just irregular. 2. We could do a blood test to check. 3. Home pregnancy test results are very accurate. 4. You should repeat the test in 1 week. The correct answer is 2. We could do a blood test to check. Because quantitative pregnancy tests measure the exact quantity of human chorionic gonadotropin in the bloodstream, they are more accurate than urine tests that simply measure whether or not the hormone is present in the urine. Similar to the urine tests on the market, qualitative serum tests detect whether or not the hormone is present, but they are still considered to be more accurate than urine tests. The nurse caring for an infant with congenital heart disease is monitoring the infant closely for signs of heart failure. The nurse should observe for which early sign of heart failure? 1. Pallor. 2. Cough. 3. Tachycardia. 4. Slow and shallow breathing. The correct answer is 3. Tachycardia. The early signs of rheumatic fever include tachycardia, tachypnea, profuse scalp sweating, fatigue, irritability, sudden weight gain, and respiratory distress. A cough may occur with HF as a result of mucosal swelling and irritation, but it is not an early sign. Pallor may be noted in the infant with heart failure, but it is also not an early sign. The nurse is completing the preoperative checklist for a client diagnosed with a herniated disc. Which information is a priority for the nurse to notify the operating room staff? 1. The client is reporting a headache. 2. The client is allergic to iodine and aspirin. 3. The client has not had anything to drink. 4. The client's hematocrit is 43%. The correct answer is 2. The client is allergic to iodine and aspirin. The standard surgical scrub is a povidone iodine antiseptic skin preparation. This should be brought to the attention of the surgical nurse who will be preparing the surgical site so that a substitute can be used. The client's report of a headache occurs frequently when clients have not been able to eat or drink, especially caffeine drinks. This is not a priority at this time. Clients going to surgery should be NPO for several hours to prevent aspiration during anesthesia. Option 4 is a normal hematocrit level.
The client with recurring depression will be discharged from the psychiatric unit. Which suggestion to the family is best to help them prepare for the client's return home? 1. Discourage visitors while the client is at home. 2. Provide for a schedule of activities outside the home. 3. Involve the client in usual at-home activities. 4. Encourage the client to sleep as much as possible. The correct answer is 3. Involve the client in usual at-home activities. Rationale. It is best to involve the client in usual at-home activities as much as the client can tolerate them. Discouraging visitors may not be in the client's best interest because visits with supportive significant others will help reinforce supportive relationships, which are important to the client's self-worth and self-esteem. Providing for a schedule of activities outside the home may be overwhelming for the client initially. Involving the client in planning for outside activities would be appropriate. Encouraging the client to sleep as much as possible is non-therapeutic and promotes withdrawal from others.
The nurse is obtaining the history and physical information for a child who is recovering from Kawasaki disease and receives aspirin therapy. Which information concerns the nurse the most? 1. The child attends a daycare center 5 days a week. 2. The child's fingers have areas of peeling skin. 3. The child is very irritable and cries frequently. 4. The child has not received any immunizations. The correct answer is 4. The child has not received any immunizations. Children who receive aspirin therapy are at risk for the development of Reyes syndrome if they contract viral illnesses such as varicella or influenza, so the lack of immunization is the greatest concern for this child. Peeling skin on the fingers and toes and irritability are consistent with Kawasaki disease, but do not require any change in therapy. Because Kawasaki disease is not a communicable disease, there is no risk for transmission to other children in the daycare. After nasal surgery, the client expresses concern about how to decrease facial pain and swelling while recovering at home. Which of the following discharge instructions would be most effective for decreasing pain and edema? 1. Take analgesics every 4 hours around the clock. 2. Use corticosteroid nasal spray as needed to control symptoms. 3. Use a bedside humidifier while sleeping. 4. Apply cold compresses to the area. The correct answer is 4. Apply cold compresses to the area. Applying cold compresses helps to decrease facial swelling and pain from edema. Analgesics may decrease pain, but they do not decrease edema. A corticosteroid nasal spray would not be administered post-operatively because it can impair healing. Use of a bedside humidifier promotes comfort by providing moisture for nasal mucosa, but it does not decrease edema. The nurse teaches the client with urinary diversion to attach the appliance to a standard urine collection bag at night. The most important reason for doing this is to prevent 1. Urine reflux into the stoma. 2. Appliance separation. 3. Urine leakage. 4. The need to restrict fluids. The correct answer is 1. Urine reflux into the stoma. The most important reason for attaching the appliance to a standard urine collection bag at night is to prevent urine reflux into the stoma and ureters, which can result in infection. Use of a standard collection bag also keeps the appliance from separating from the skin and helps prevent urine leakage from an overly full bag, but the primary purpose is to prevent reflux of urine. A client with urinary diversion should drink 2,000 to 3,000 milliliters of fluid each day. It would be inappropriate to suggest decreasing fluid intake.
One goal in caring for a client with arterial occlusive disease is to promote vasodilation in the affected extremity. To achieve this goal, the nurse should encourage the client to 1. Avoid eating low-fat foods. 2. Elevate the legs above the heart. 3. Stop smoking. 4. Begin a jogging program. The correct answer is 3. Nicotine causes vasospasm and impedes blood flow. Stopping smoking is the most significant lifestyle change a client can make. The client should eat low-fat foods as part of a balanced diet. The legs should not be elevated above the heart because this will impede arterial flow. The legs should be in a slightly dependent position. Jogging is not necessary and probably is not possible for many clients with arterial occlusive disease. A rehabilitation program that includes daily walking is suggested. While the nurse is delivering abdominal thrust to a 6-year-old who is choking on a foreign body, the child begins to cry. Which of the following should the nurse do next? 1. Tap or gently shake the shoulders. 2. Deliver back slaps. 3. Perform a blind finger sweep of the mouth. 4. Observe the child closely. The correct answer is 4. Crying indicates that the airway obstruction has been relieved. No additional thrusts are needed. However, the child needs to be observed closely for complications, including respiratory distress. Tapping or shaking the shoulders is used initially to determine unresponsiveness in someone who appears unconscious. Delivering chest or back slaps could jeopardize the child's now patent airway. Because the obstruction has been relieved, there is no need to sweep the child's mouth. Additionally, blind finger sweeps are contraindicated because the object may be pushed further back, possibly causing complete airway obstruction.
A client was admitted to the hospital with iron deficiency anemia and blood-streaked emesis. Which question is most appropriate for the nurse to ask in determining the extent of the client's activity intolerance? 1. What daily activities were you able to do 6 months ago compared with the present? 2. How long have you had this problem? 3. Have you been able to keep up with all your usual activities? 4. Are you more tired now than you used to be? The correct answer is 1. What daily activities were you able to do 6 months ago compared with the present? It is difficult to determine activity intolerance without objectively comparing activities from one time frame to another. Because iron deficiency anemia can occur gradually and individual endurance varies, the nurse can best assess the client's activity tolerance by asking the client to compare activities 6 months ago and at present. Asking a client how long a problem has existed is a very open-ended question that allows for too much subjectivity for any definition of the client's activity tolerance. Also, the client may not even identify that a problem exists. Asking the client whether he is staying abreast of usual activities addresses whether the tasks were completed, not the tolerance of the client while the tasks were being completed, or the resulting condition of the client after the tasks were completed. Asking the client if he is more tired now than usual does not address his activity tolerance. Tiredness is a subjective evaluation and again can be distorted by factors such as the gradual onset of the anemia or the endurance of the individual. Agravida G1 P0000 is having her first prenatal physical examination. Which of the following assessments should the nurse inform the client that she will have that day? Select all that apply. 1. Pap smear. 2. Mammogram. 3. Glucose tolerance test. 4. Biophysical profile. 5. Complete blood count. The correct answers are 1. Pap smear and 5. Complete blood count. At the first prenatal visit, pregnant clients will undergo complete obstetrical and medical physical assessments. The assessments are performed to provide the healthcare practitioner with baseline data regarding the health and well-being of the woman, as well as to inform the healthcare practitioner of any medical problems that the mother has that might affect the pregnancy. A breast examination will be performed by the practitioner to assess for abnormalities, but since mammograms are potentially harm-producing X-rays, they are ordered only in emergent cases. A glucose assessment will likely be performed at the end of the second trimester. A biophysical profile may be done, but not until the third trimester. The nurse monitors the daily weight of an infant with heart failure. Which finding alerts the nurse to suspect fluid accumulation and thus the need to notify the charge nurse? 1. Bradypnea. 2. Diaphoresis. 3. Decreased blood pressure. 4. A weight gain of 1 pound in 1 day. The correct answer is 4. A weight gain of 1 pound in 1 day. A weight gain of 0.5 kilogram or 1 pound in 1 day is a result of the accumulation of fluid. The nurse should monitor the urine output, monitor for evidence of facial or peripheral edema, check the lung sounds, and report the weight gain. Tachypnea and an increased blood pressure would occur with fluid accumulation. Diaphoresis is a sign of HF, but it is not specific to fluid accumulation, and it usually occurs with exertional activities. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. The client presents to the outpatient clinic reporting back pain. Which assessment question should the nurse ask first? 1. What activity did you do to hurt your back? 2. Which over-the-counter medications have you taken? 3. Have you used illegal drugs to treat the back pain? 4. Did you miss any work time because of this pain? The correct answer is 2. Which over-the-counter medications have you taken? The priority at this time is to determine what medications have been tried in order to assess the full extent of the injury. This is the first intervention. Adult clients will frequently only seek the HCP's advice and treatment when remedies have failed. Option 1 is important, but it is not a priority during the initial assessment. The nurse should determine how the client has been treating the injury. This would be the second query, not the first. Option 3 is an accusatory statement and most likely will make the client mistrust the nurse's objectives. This should not be asked at this time. Option 4 is the third query the nurse could ask. Missed work time is important, but to treat the client, the HCP must be aware of the attempted treatments.
A client with major depression is to be discharged home tomorrow. When preparing the client's discharge plan, which of the following areas is most important for the nurse to review with the client? 1. Future plans for going back to work. 2. A conflict encountered with another client. 3. Results of psychological testing. 4. Medication management with outpatient follow-up. The correct answer is for medication management with outpatient follow-up. Rationale: medication management with outpatient follow-up is of vital importance to discuss with the client before discharge. The nurse teaches and clarifies any questions related to medication and outpatient treatment. The client also has the opportunity to voice feelings related to medication and treatment. The goal is to assist the client in making a successful transition from hospital to home with optimal functioning outside the hospital for as long as possible. The nurse may also need to assist with decreasing any anxiety the client may have related to discharge. Discussing future plans for returning to work or employment is not as immediate a concern as assisting with medication and treatment compliance. Noncompliance with medication is a primary cause of relapse in a client with a psychiatric disorder. Reviewing a conflict the client had encountered with another client is not appropriate or therapeutic at this time unless the client brings it to the nurse's attention. The conflict should have been dealt with and resolved when it occurred. Reviewing the results of psychological testing is the responsibility of the primary healthcare provider if he chooses.
The staff nurse is working with a student nurse to provide care for a 10-year-old patient with severe abdominal, hip, and knee pain caused by a sickle cell crisis. Which action taken by the student requires the staff nurse to intervene immediately? 1. Administering oral pain medication as needed. 2. Positioning cold packs on the child's knees. 3. Encouraging increased fluid intake. 4. Monitoring vital signs every 2 hours. The correct answer is 2. Positioning cold packs on the child's knees. Sickle cell crisis may include vaso-occlusive crisis, splenic sequestration, and aplastic crisis. The symptoms experienced by this child are indicative of both vaso-occlusive crisis and splenic sequestration. Placing cold packs on the knees of a child with vaso-occlusive crisis results in vasoconstriction, placing the child at risk for thrombosis formation. Encouraging increased fluid intake is advised to prevent thrombosis formation. Monitoring vital signs is a method to assess for life-threatening complications associated with both vaso-occlusive crisis and splenic sequestration. Vaso-occlusive crisis is associated with severe pain, and pain medication is recommended. A client is being discharged with nasal packing in place. The nurse should instruct the client to 1. Perform frequent mouth care. 2. Use normal saline nose drops daily. 3. Sneeze and cough with mouth closed. 4. Gargle every 4 hours with salt water. The correct answer is 1. Perform frequent mouth care. Frequent mouth care is important to provide comfort and encourage eating. Mouth care promotes moist mucous membranes. Nose drops cannot be used with nasal packing in place. When sneezing and coughing, the client should do so with the mouth open to decrease the chance of dislodging the packing. Gargling should not be attempted with packing in place. The nurse is teaching the client with an ileal conduit how to prevent a urinary tract infection. Which of the following measures would be most effective? 1. Avoid people with respiratory tract infections. 2. Maintain a daily fluid intake of 2,000 to 3,000 milliliters. 3. Use sterile technique to change the appliance. 4. Irrigate the stoma daily. The correct answer is 2. Maintain a daily fluid intake of 2,000 to 3,000 milliliters. Maintaining a fluid intake of 2,000 to 3,000 milliliters per day is likely to be most effective in preventing urinary tract infection. A high fluid intake results in high urine output, which prevents urinary stasis and bacterial growth. Avoiding people with respiratory tract infections will not prevent urinary tract infections. Clean, not sterile, technique is used to change the appliance. An ileal conduit stoma is not irrigated.
The client has aching, weakness, and a cramping sensation in both of the lower extremities while walking. To promote health and maintain the client's level of activity, the nurse should suggest that the client try 1. Cross-country skiing, 2. Jogging, 3. Golfing, 4. Riding a stationary bike. The correct answer is 4. In this case, the exercise prescription needs to be individualized because walking causes discomfort. To maintain the level of activity and decrease venous congestion, riding a stationary bike is another appropriate exercise behavior. Use of a stationary bike provides a non-weight-bearing exercise modality, which allows a longer duration of activity. Jogging and cross-country skiing are weight-bearing activities. In addition, cross-country skiing involves a cold environment, and maintaining warmth is essential in promoting arterial blood flow and preventing vasoconstriction. Golfing is a good activity, but it is not typically considered an exercise that causes aerobic changes in the body. A 3-year-old is brought into the emergency department in her mother's arms. The child's mouth is open and she is drooling and lethargic. Her mother states that she became ill suddenly within the past 2 hours. What should the nurse do first? 1. Draw blood cultures for a complete blood count. 2. Start an intravenous line. 3. Inspect the child's throat with a tongue blade. 4. Maintain the child in an undisturbed upright position. The correct answer is 4. This child is in severe respiratory distress with potential for complete airway obstruction. The nurse should refrain from disturbing the child at this time to avoid irritating the epiglottis and causing it to completely obstruct the child's airway. The child may be intubated or undergo a tracheotomy. However, initially, the child should be kept as calm as possible with as little disruption as possible. Any attempt to restrain the child, draw blood, insert an IV, or examine her throat could result in total airway obstruction.
A physician prescribes vitamin B12 for a client with pernicious anemia. Which sites are appropriate for the nurse to administer vitamin B12? Select all that apply. 1. Median cutaneous. 2. Greater femur trochanter. 3. Acromion muscle. 4. Ventrogluteal. 5. Upper back. 6. Dorsogluteal. The correct answers are 4. Ventrogluteal and 6. Dorsogluteal. A client with pernicious anemia has lost the ability to absorb vitamin B12 either because of the lack of an acidic gastric environment or the lack of the intrinsic factor. Vitamin B12 must be administered by a deep intramuscular route. The ventrogluteal and dorsogluteal locations are the most acceptable sites for a deep intramuscular injection. The other sites are not acceptable. The nurse plans to provide anticipatory guidance to a 10 weeks pregnant client who is being seen in the prenatal clinic. Which of the following information should be a priority for the nurse to provide? 1. Pain management during labor. 2. Methods to relieve backaches. 3. Breastfeeding positions. 4. Characteristics of the newborn. The correct answer is 2. Methods to relieve backaches. This 10-week pregnant client will be entering the second trimester in a couple of weeks. As the uterine body grows, the client is likely to experience backaches. It is appropriate for the nurse to provide information about this possibility and ways to relieve them. The nurse provides home care instructions to the parents of a child with heart failure regarding the procedure for the administration of digoxin. Which statement by a parent indicates the need for further teaching? 1. I will not mix the medication with food. 2. If more than one dose is missed, I will call the healthcare provider. 3. I will take my child's pulse before administering the medication. 4. If my child vomits after medication administration, I will repeat the dose. The correct answer is 4. If my child vomits after medication administration, I will repeat the dose. The parents need to be instructed that if the child vomits after the digoxin is administered, they are not to repeat the dose. Options 1, 2, and 3 are accurate instructions regarding the administration of this medication. Additionally, the parents should be instructed that if a dose is missed and it is not noticed until 4 hours later, the dose should not be administered. The client diagnosed with chronic low back pain has been taking baclofen. Which instruction should the nurse review with the client? 1. The medication can cause gastric ulcer formation. 2. The client may consume no more than 1 glass of wine per day. 3. The medication must be tapered off when discontinued. 4. The client should not take the medication before bedtime. The correct answer is 3. The medication must be tapered off when discontinued. Baclofen must be tapered off when being discontinued. Abrupt withdrawal after prolonged use can cause anxiety, agitated behavior, hallucinations, severe tachycardia, acute spasticity, and seizures. This medication is not known to increase the risk of ulcers. The client should be warned not to consume any alcohol while taking baclofen. Baclofen is a central nervous system depressant, as is alcohol. The combination of alcohol and baclofen could intensify the depressant effects. The medication can cause drowsiness, which might assist the client to rest. Administration at bedtime is preferred if this is the case.
The client who has been taking venlafaxine Effexor 25 milligrams PO 3 times a day for the past 2 days states, "This medicine isn't doing me any good. I'm still so depressed." Which of the following responses by the nurse is most appropriate? 1. Perhaps we'll need to increase your dose. 2. Let's wait a few days and see how you feel. 3. It takes about 2 to 4 weeks to receive the full effects. 4. It's too soon to tell if your medication will help you. The correct answer is 3. It takes about 2 to 4 weeks to receive the full effects. Rationale: the client needs to be informed of the time lag involved with antidepressant therapy. Although improvement in the client's symptoms will occur gradually over the course of 1 to 2 weeks, typically it takes 2 to 4 weeks to get the full effects of the medication. This information will help the client be compliant with medication and will also help in decreasing any anxiety the client has about not feeling better. The client's dose may not need to be increased. It is too early to determine the full effectiveness of the drug. Additionally, such a statement may increase the client's anxiety and diminish self-worth. Telling the client to wait a few days discounts the client's feelings and is inappropriate. Although it is too soon to tell whether the medication will be effective, telling this to the client may cause the client undue distress. This statement is somewhat negative because it is possible that the medication will not be effective, possibly further compounding the client's anxiety about not feeling better.
The nurse has just received a change of shift report about these pediatric patients. Which patient will the nurse assess first? 1. A 1-year-old patient with hemophilia B who was admitted because of decreased responsiveness. 2. A 3-year-old patient with von Willebrand disease who has a dose of desmopressin scheduled. 3. A 7-year-old patient with acute lymphocytic leukemia who has chemotherapy-induced thrombocytopenia. 4. A 16-year-old patient with sickle cell disease who reports acute right lower quadrant abdominal pain. The correct answer is 1. A 1-year-old patient with hemophilia B who was admitted because of decreased responsiveness. Because decreased responsiveness in a 1-year-old patient with a clotting disorder may indicate intracerebral bleeding, this patient should be assessed immediately. The other patients also require assessments or interventions, but are not at immediate risk for life-threatening or disabling complications. Which of the following activities should the nurse teach the client to implement after the removal of nasal packing on the second post-operative day? 1. Avoid cleaning the nares until swelling has subsided. 2. Apply water-soluble jelly to lubricate the nares. 3. Keep a nasal drip pad in place to absorb secretions. 4. Use a bulb syringe to gently irrigate nares. The correct answer is 2. Apply water-soluble jelly to lubricate the nares. After removal of nasal packing, the client should be instructed to apply water-soluble jelly to the nares to lubricate the nares and promote comfort. Swelling gradually subsides over several weeks. The client can gently clean the nares as soon as packing is removed. A nasal drip pad is not needed after removal of packing. Irrigation with a bulb syringe may interfere with healing and introduce infection. The nurse evaluates the effectiveness of the client's post-operative plan of care. Which of the following would be an expected outcome for a client with an ileal conduit? 1. The client verbalizes the understanding that physical activity must be curtailed. 2. The client will place an aspirin in the drainage pouch to help control odor. 3. The client demonstrates how to catheterize the stoma. 4. The client will empty the drainage pouch frequently throughout the day. The correct answer is 4. The client will empty the drainage pouch frequently throughout the day. It is important that the client empty the drainage pouch throughout the day to decrease the risk of leakage. The client does not normally need to curtail physical activity. Aspirin should never be placed in a pouch because aspirin can irritate or ulcerate the stoma. The client does not catheterize an ileal conduit stoma. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
The client with peripheral vascular disease has been prescribed diltiazem. The nurse should determine the effectiveness of this medication by assessing the client for 1. Relief of anxiety, 2. Sedation, 3. Vasoconstriction, 4. Vasodilation. The correct answer is 4. Diltiazem is a calcium channel blocker that blocks the influx of calcium into the cell. In this situation, the primary use of diltiazem is to promote vasodilation and prevent spasms of the arteries. As a result of the vasodilation, blood, oxygen, and nutrients can reach the muscle and tissues. Diltiazem is not an anti-anxiety agent and does not promote sedation. It also does not cause vasoconstriction, which would be contraindicated for a client with peripheral vascular disease. The father of a 16-month-old child calls the clinic because the child has a low-grade fever, cold symptoms, and a hoarse cough. Which of the following should the nurse suggest that the father do? 1. Offer extra fluids frequently. 2. Bring the child to the clinic immediately. 3. Count the child's respiratory rate. 4. Use a hot air vaporizer. The correct answer is 1. The toddler is exhibiting cold symptoms. A hoarse cough may be part of the upper respiratory tract infection. The best suggestion is to have the father offer the child additional fluids at frequent intervals to help keep secretions loose and membranes moist. There is no evidence presented to suggest that the child needs to be brought to the clinic immediately. Although having the father count the child's respiratory rate may provide some additional information, it may lead the father to suspect that something is seriously wrong, possibly leading to undue anxiety. A hot air vaporizer is not recommended. However, a cool mist vaporizer would cause vasoconstriction of the respiratory passages, making it easier for the child to breathe and loosening secretions.
Which position would most help to decrease a client's discomfort when the client's spouse injects vitamin B12 using the ventrogluteal site? 1. Lying on the side with legs extended. 2. Lying on the abdomen with toes pointed inward. 3. Leaning over the edge of a low table with hips flexed. 4. Standing upright with the feet one shoulder width apart. The correct answer is 2. Lying on the abdomen with toes pointed inward. To promote comfort when injecting at the ventrogluteal site, the position of choice is with the client lying on the abdomen with toes pointed inward. This positioning promotes muscle relaxation, which decreases the discomfort of making an injection into a tense muscle. Lying on the side with legs extended will not provide the greatest muscle relaxation. Leaning over the edge of a table with the hips flexed and standing upright with the feet apart will increase muscular tension. A client asks the nurse what was meant when the physician told her she had a positive Chadwick sign. Which of the following information about the finding would be appropriate for the nurse to convey at this time? 1. It is a purplish stretch mark on your abdomen. 2. It means that you are having heart palpitations. 3. It is a bluish coloration of your cervix and vagina. 4. It means the doctor heard abnormal sounds when you breathed in. The correct answer is 3. It is a bluish coloration of your cervix and vagina. Chadwick sign is a probable sign of pregnancy. The bluish coloration is a result of the increase in vascularization of the area in response to the high levels of circulating estrogen in the pregnant woman's system. A healthcare provider has prescribed oxygen as needed for a 10-month-old infant with heart failure. In which situation should the nurse administer the oxygen to the child? 1. When the child is sleeping. 2. When changing the child's diapers. 3. When the mother is holding the child. 4. When drawing blood for electrolyte levels. The correct answer is 4. When drawing blood for electrolyte levels. Oxygen administration may be prescribed for the infant with HF for stressful periods, especially during bouts of crying or invasive procedures. Drawing blood is an invasive procedure that would likely cause the child to cry. The nurse is administering 9 o'clock medications to clients on a medical unit. Which medication should be administered first? 1. Morphine sulfate extended release to a client with low back pain. 2. Chlorzoxazone to a client on bed rest. 3. Acetaminophen to a client with a headache. 4. Diazepam to a client with muscle spasms. The correct answer is 4. Diazepam to a client with muscle spasms. Diazepam is a benzodiazepine. A client having muscle spasms is a priority for the nurse. Muscle spasms can be extremely painful. This medication should be administered first. Morphine sulfate extended release is an opioid analgesic and is a sustained-release tablet. This medication is to provide relief of chronic pain over the course of the day. It does not need to be the first medication administered. Chlorzoxazone is a muscle relaxant. The client prescribed bed rest usually takes a muscle relaxant as a routine medication. It does not need to be administered first. Acetaminophen is an analgesic. A headache that is to be treated with acetaminophen would not be the first medication for the nurse to administer.
The client states to the nurse, I take citalopram, Celexa, 40 milligrams every day as my primary healthcare provider prescribed. I have also been taking St. John's wort 750 milligrams daily for the past 2 weeks. Which of the following indicate that the client is developing serotonin syndrome? Select all that apply. 1. Confusion. 2. Restlessness. 3. Constipation. 4. Diaphoresis. 5. Ataxia. The correct answers are 1. Confusion. 2. Restlessness. 4. Diaphoresis. And 5. Ataxia. Rationale. Serotonin syndrome can occur if a selective serotonin reuptake inhibitor is combined with a monoamine oxidase inhibitor, a tryptophan serotonin precursor, or St. John's wort. Signs and symptoms of serotonin syndrome include mental status changes, such as confusion, restlessness or agitation, headache, diaphoresis, ataxia, myoclonus, shivering, tremor, diarrhea, nausea, abdominal cramps, and hyperreflexia. Constipation is not associated with serotonin syndrome.
According to evidence-based guidelines from the American Optometric Association, which modifiable risk factor is the most important to emphasize during patient teaching to reduce the risk for age-related macular degeneration? 1. Initiate smoking cessation. 2. Take vitamin D and E supplements. 3. Eat dark green, leafy vegetables. 4. Wear protective eyewear as needed. The correct answer is 1. Initiate smoking cessation. According to the American Optometric Association, smoking cessation is the most important modifiable factor for decreasing risk for age-related macular degeneration. Consumption of dark green vegetables and use of vitamin supplements are recommended, but the evidence is less compelling. Use of protective eyewear is recommended to prevent eye injuries during active sports or hazardous occupations, but this preventative measure is not related to age-related macular degeneration. The nurse is teaching a client how to manage a nosebleed. Which of the following instructions would be appropriate to give the client? 1. Tilt your head backward and pinch your nose. 2. Lie down flat and place an ice compress over the bridge of the nose. 3. Blow your nose gently with your neck flexed. 4. Sit down, lean forward, and pinch the soft portion of your nose. The correct answer is 4. Sit down, lean forward, and pinch the soft portion of your nose. The client should assume a sitting position and lean forward. Firm pressure should be applied to the soft portion of the nose for approximately 10 minutes. Tilting the head backward can cause the client to swallow blood, which can obscure the amount of bleeding and also can lead to nausea. Ice compresses may be applied, but the client should not lie flat. Blowing the nose is to be avoided because it can increase bleeding. A client is scheduled to undergo weekly intravesical chemotherapy for bladder cancer for the next 8 weeks. Which of the following indicates that the client understands how to manage the urine as a biohazard? The client will 1. Void into a bedpan and then empty the urine into the toilet. 2. Disinfect the urine and toilet with bleach for 6 hours following a treatment. 3. Clean the bathroom daily with disinfectant wipes. 4. Use a separate bathroom from the rest of the family for the next 8 weeks. The correct answer is 2. Disinfect the urine and toilet with bleach for 6 hours following a treatment. After intravesical chemotherapy, the client must treat the urine as a biohazard. This involves disinfecting the urine and the toilet with household bleach for 6 hours following a treatment. It is not necessary to use a bedpan and then empty the urine in the toilet. The client can use the toilet, but must disinfect the urine with bleach. The bathroom does not need to be cleaned daily with disinfectant wipes. The client does not need to use a separate bathroom as long as the client's urine is disinfected with bleach.
A client is receiving pentoxifylline for intermittent claudication. The nurse should determine the effectiveness of the drug by asking if the client 1. Has improved circulation in the legs. 2. Can wiggle the toes. 3. Is urinating more frequently. 4. Is less dizzy. The correct answer is 1. Although pentoxifylline's precise mechanism of action is unknown, its therapeutic effect is to increase blood flow, and the client should have improved circulation in the legs. The client does not have nerve impairment and should be able to wiggle the toes. Urination is not improved by taking pentoxifylline. Dizziness is a side effect of the drug, not an intended outcome. A 21-month-old child admitted with a diagnosis of croup now has a respiratory rate of 48 breaths per minute, a heart rate of 120 beats per minute, and a temperature of 100.8 degrees Fahrenheit rectally. The nurse is having difficulty calming the child. Which of the following should the nurse do next? 1. Administer acetaminophen. 2. Notify the primary care provider immediately. 3. Allow the toddler to continue to cry. 4. Offer clear fluids every few minutes. The correct answer is 2. The nurse may be having difficulty calming the child because the child is experiencing increasing respiratory distress. The normal respiratory rate for a 21-month-old is 25 to 30 breaths per minute. The child's respiratory rate is 48 breaths per minute. Therefore, the primary care provider needs to be notified immediately. Typically, acetaminophen is not given to a child unless the temperature is 101 degrees Fahrenheit or higher. Letting the toddler cry is inappropriate with croup because crying increases respiratory distress. Offering fluids every few minutes to a toddler experiencing increasing respiratory distress would do little, if anything, to calm the child. Also, the child would have difficulty coordinating breathing and swallowing, possibly increasing the risk of aspiration.
A client is admitted from the emergency department after falling down a flight of stairs at home. The client's vital signs are stable, and the history states that the client had a gastric stapling 2 years ago. The client jokes about being clumsy lately and tripping over things. The nurse should ask the client which of the following questions? Select all that apply. 1. Are you experiencing numbness in your extremities? 2. How much vitamin B12 are you getting? 3. Are you feeling depressed? 4. Do you feel safe at home? 5. Are you getting sufficient iron in your diet? The correct answers are 1. Are you experiencing numbness in your extremities? 2. How much vitamin B12 are you getting? 3. Are you feeling depressed? And 4. Do you feel safe at home? The nurse should ask the client about symptoms related to pernicious anemia because the client had the stomach stapled 2 years ago and shows no history of supplemental vitamin B12. numbness and tingling relate to a loss of intrinsic factor from the gastric stapling. Intrinsic factor is necessary for absorption of vitamin B12. The nurse should suspect pernicious anemia if the client is not taking supplemental vitamin B12. Other signs and symptoms of pernicious anemia include cognitive problems and depression. The nurse also should ask about the client's support at home in case the fall was not an accident. Pernicious anemia is not related to dietary intake of iron. A client enters the prenatal clinic. She states that she believes she is pregnant. Which of the following hormone elevations will indicate a high probability that the client is pregnant? 1. Chorionic gonadotropin. 2. Oxytocin. 3. Prolactin. 4. Luteinizing hormone. The correct answer is 1. Chorionic gonadotropin. Human chorionic gonadotropin is produced by the fertilized egg. Its presence in the bloodstream signals the body to keep the corpus luteum alive. Until the placenta takes over the function of producing progesterone and estrogen, the corpus luteum produces the hormones that are essential to the maintenance of the pregnancy. Oxytocin is the hormone of labor. It is not measured as a sign of pregnancy. Prolactin is the hormone that stimulates lactogenesis immediately after delivery. It is not measured as a sign of pregnancy. Luteinizing hormone is the hormone that stimulates ovulation. It is not measured as a sign of pregnancy. The nurse is preparing to administer digoxin to an infant with heart failure. Before administering the medication, the nurse double-checks the dose, counts the apical heart rate for 1 full minute, and obtains a rate of 88 beats per minute. Based on this finding, which is the appropriate nursing action? 1. Withhold the medication. 2. Administer the medication. 3. Double-check the apical heart rate and administer the medication. 4. Check the blood pressure and respiration and administer the medication. The correct answer is 1. Withhold the medication. Digoxin is effective within a narrow therapeutic range. Safety in dosing is achieved by double-checking the dose and counting the apical heart rate for 1 full minute. If the heart rate is less than 100 beats per minute in an infant, the nurse should withhold the dose and notify the healthcare provider. The remaining options are incorrect actions. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. The client is admitted with severe low back pain and prescribed methocarbamol IV piggyback every 8 hours. Which nursing intervention has priority when administering this medication? 1. Ask the client to lie flat for 15 minutes following the IV infusion. 2. Infuse at a rapid rate of 200 to 250 milliliter per hour via an infusion pump. 3. Assess the IV site for extravasation after the infusion is complete. 4. Monitor liver function laboratory tests daily. The correct answer is 1. Ask the client to lie flat for 15 minutes following the IV infusion. Methocarbamol is a muscle relaxant. The client should be kept recumbent during and for at least 15 minutes following the administration of methocarbamol IV to reduce the risk of orthostatic hypotension. The medication must be administered slowly at a rate of no greater than 300 milligrams per minute, not by rapid infusion. The IV site should be assessed prior to the initiation of the medication to prevent complications from extravasation of the medication into the tissues. Methocarbamol is detoxified by the kidneys, not the liver.
When teaching the client with atypical depression about foods to avoid while taking phenelzine, which of the following should the nurse include? 1. Roasted chicken. 2. Salami. 3. Fresh fish. 4. Hamburger. The correct answer is 2. Salami. Rationale. Phenelzine is a monoamine oxidase inhibitor. MAOIs block the enzyme monoamine oxidase, which is involved in the decomposition and inactivation of norepinephrine, serotonin, dopamine, and tyramine. Foods high in tyramine. Those that are fermented, pickled, aged, or smoked must be avoided because when they are ingested in combination with MAOIs, a hypertensive crisis occurs. Some examples include salami, bologna, dried fish, sour cream, yogurt, aged cheese, bananas, pickled herring, caffeinated beverages, chocolate, licorice, beer, red wine, and alcohol-free beer.
The nurse is reviewing prescriptions for several patients who have disorders of the eye. Which medication prescription is the most important to discuss with the healthcare provider? 1. Timolol for open-angle glaucoma. 2. Cromolyn sodium for allergic conjunctivitis. 3. Atropine for acute angle closure glaucoma. 4. Ranibizumab for wet age-related macular degeneration. The correct answer is 3. Atropine for acute angle closure glaucoma. Atropine should not be used for acute angle closure glaucoma. Atropine causes dilation of the pupil, which impedes outflow of aqueous humor and increases intraocular pressure. This action could precipitate or worsen the condition. An elderly client had posterior packing inserted to control a severe nosebleed. After insertion of the packing, the client should be closely monitored for which of the following complications? 1. Vertigo. 2. Bell's palsy. 3. Hypoventilation. 4. Loss of gag reflex. The correct answer is 3. Hypoventilation. Posterior packing may alter the respiratory status of the client, especially in elderly clients, causing hypoventilation. Clients should be observed carefully for changes in level of consciousness, respiratory rate, and heart rate and rhythm after the insertion of the packing. Vertigo does not occur as a result of the insertion of posterior packing. Bell's palsy, a disorder of the seventh cranial nerve, is not associated with epistaxis or nasal packing. Loss of gag reflex does not occur as a result of the insertion of posterior packing. A nurse is planning care for a client who underwent a percutaneous needle biopsy of the kidney. What should the nurse plan to do immediately after the biopsy? Select all that apply. 1. Assess the biopsy site. 2. Take vital signs every hour. 3. Assess urine for hematuria. 4. Place the client in a prone position. 5. Assess the client for chest pain. The correct answers are 1. Assess the biopsy site. 3. Assess urine for hematuria. And 4. Place the client in a prone position. The nurse should assess the biopsy site for bleeding and hematoma formation. The client should remain prone for 8 to 24 hours after the biopsy. A pressure dressing will aid in blood coagulation. Vital signs assessment should be taken every 5 to 15 minutes for the first hour, and then less often if the client is stable. The urine does not need to be collected and kept on ice. The nurse should collect serial urine specimens to assess for hematuria. A renal biopsy does not put the client at increased risk for chest pain.
A client with peripheral vascular disease, coronary artery disease, and chronic obstructive pulmonary disease takes theophylline 200 milligrams twice daily every day and digoxin 0.5 milligrams once a day. The physician now prescribes pentoxifylline. To prevent problematic adverse effects, the nurse should monitor the clients. 1. Digoxin level. 2. Partial thromboplastin time. 3. Serum cholesterol level. 4. Theophylline level. The correct answer is 4. Pentoxifylline can potentiate the effects of theophylline and increase the risk of theophylline toxicity. Therefore, the nurse should monitor the client's theophylline level. Pentoxifylline does not interact with digoxin. Pentoxifylline can interact with heparin, and the client's PTT would need to be monitored closely if the client were taking heparin. It does not affect cholesterol levels. A child has viral pharyngitis. The nurse should advise the parents to do which of the following? Select all that apply. 1. Use a cool mist vaporizer. 2. Offer a soft to liquid diet. 3. Administer amoxicillin. 4. Administer acetaminophen. 5. Place the child on secretion precautions. The correct answers are 1, 2, and 4. Viral pharyngitis is treated with symptomatic supportive therapy. Treatment includes use of a cool mist vaporizer. feeding a soft or liquid diet, and administration of acetaminophen for comfort. Viral infections do not respond to antibiotic administration. The child does not need to be on secretion precautions because viral pharyngitis is not contagious.
A client has fatigue, temperature of 37.5 degrees Celsius, dark bronze skin, and dark urine. Hemoglobin is 9 grams per deciliter, hematocrit is 49, and red blood cells are 2.75 million per microliter. What should the nurse do first? 1. Initiate an intake and output record. 2. Place the client on bed rest. 3. Place the client on contact isolation. 4. Keep the client out of sunlight. The correct answer is 1. Initiate an intake and output record. The nurse should prepare to start an intake and output record because the client is exhibiting clinical manifestations of anemia with jaundice and is demonstrating a fluid imbalance. The client does not need to be on bed rest at this point. The client is not contagious and does not need to be placed in contact isolation. The changes in the color of the skin and urine are related to the jaundice and will not be affected by sunlight. A 16-year-old G1P0000 is being seen at her 10-week gestation visit. She tells the nurse that she felt the baby move that morning. Which of the following responses by the nurse is appropriate? 1. That is very exciting. The baby must be very healthy. 2. Would you please describe what you felt for me? 3. That is impossible. The baby is not big enough yet. 4. Would you please let me see if I can feel the baby? The correct answer is 2. Would you please describe what you felt for me? Quickening, or subjective fetal movement, occurs between 16 and 20 weeks gestation. At 10 weeks gestation, it would be impossible for the young woman to feel fetal movement. The nurse, therefore, should elicit more information from the teen to determine what she had felt. The nurse is assigned to care for an infant with a diagnosis of tricuspid atresia. The nurse plans care, knowing which is true regarding this diagnosis. 1. A single vessel overrides both ventricles. 2. Frequent episodes of hypercyanotic spells occur. 3. There is no communication from the right atrium to the right ventricle. 4. There is no communication from the systemic and pulmonary circulations. The correct answer is 3. There is no communication from the right atrium to the right ventricle. In tricuspid atresia, there is no communication from the right atrium to the right ventricle. Option 1 describes truncus arteriosus. Option 4 describes transposition of the great arteries. In Option 2, frequent episodes of hypercyanotic spells occur in tetralogy of Fallot. The client diagnosed with osteoarthritis is prescribed celecoxib. Which statement by the client warrants intervention by the nurse? 1. I take aspirin daily to help prevent heart disease. 2. I am allergic to penicillin and aminoglycosides. 3. I know I am overweight and need to lose 50 pounds. 4. I walk 30 minutes at least 3 times a week. The correct answer is 1. I take aspirin daily to help prevent heart disease. Celecoxib is an NSAID. The client should not take aspirin with an NSAID because it can increase the risk of gastrointestinal upset and possible gastrointestinal bleeding. Allergies to antibiotics are not a contraindication to the use of NSAID. Obesity is not contraindicated in clients taking NSAIDs. Exercising is recommended for clients with osteoarthritis unless it causes pain. Therefore, this activity would not warrant the client not taking celecoxib.
A client is taking phenelzine, Nardil, 15 milligrams PO, 3 times a day. The nurse is about to administer the 1 p.m. dose when the client tells the nurse about having a throbbing headache. Which of the following should the nurse do first? 1. Give the client an analgesic, prescribed PRN. 2. Call the primary healthcare provider to report the symptom. 3. Administer the client's next dose of phenelzine. 4. Obtain the client's vital signs. The correct answer is 4. Obtain the client's vital signs. Rationale. The nurse should first take the client's vital signs because the client could be experiencing a hypertensive crisis. which requires prompt intervention. Signs and symptoms of a hypertensive crisis include occipital headache, a stiff or sore neck, nausea, vomiting, sweating, dilated pupils and photophobia, nosebleed, tachycardia, bradycardia, and constricting chest pain. Giving this client an analgesic without taking his vital signs first is inappropriate. After the client's vital signs have been obtained, then the nurse would call the primary healthcare provider to report the client's problems and vital signs. Administering the client's next dose of phenelzine for taking his vital signs could result in a dangerous situation if the client is experiencing a hypertensive crisis.
A patient calls the clinic and reports redness of the sclera, itching of the eyes, and increased lacrimation for several hours. What should the nurse direct the caller to do first? 1. Please call your healthcare provider. 2. Apply a cool compress to your eyes. 3. If you are wearing contact lenses, remove them. 4. Take an over-the-counter antihistamine. The correct answer is 3. If you are wearing contact lenses, remove them. If the patient is wearing contact lenses, the lenses may be causing the symptoms, and removing them will prevent further eye irritation or damage. Policies on giving telephone advice vary among institutions, and knowledge of the facility policy is essential. The other options may be appropriate, but additional information is needed before suggesting anything else. The nurse is assessing a 48-year-old client with a history of smoking during a routine clinic visit. The client, who exercises regularly, reports having pain in the calf during exercise that disappears at rest. Which of the following findings requires further evaluation? 1. Heart rate 57 beats per minute. 2. Oxygen saturation of 94% on room air. 3. Blood pressure 134/82. 4. Ankle brachial index of 0.65. The correct answer is 4. Ankle brachial index of 0.65. An ankle brachial index of 0.65 suggests moderate arterial vascular disease in a client who is experiencing intermittent claudication. A Doppler ultrasound is indicated for further evaluation. The bradycardic heart rate is acceptable in an athletic client with a normal blood pressure. The oxygen saturation is acceptable. The client has a smoking history. A nurse is reviewing a client's chart and notes the Papa-Nicolau smear laboratory report indicates visualization of clue cells and a vaginal pH of 3.8. What should the nurse teach this client? Select all that apply. 1. Seek care if the vaginal discharge has a fishy odor. 2. Seek care if experiencing thick, white, adherent vaginal discharge. 3. All vaginal infections are sexually transmitted infections. 4. Do not douche unless instructed by a healthcare provider. 5. Usually vaginal infections can be treated with over-the-counter preparations. The correct answers are 1. Seek care if the vaginal discharge has a fishy odor. 2. Seek care if experiencing thick, white, adherent vaginal discharge. And 4. Do not douche unless instructed by a healthcare provider. Bacterial vaginosis is a clinical syndrome resulting from the replacement of the normal vaginal lactobacillus species with overgrowth of anaerobic bacteria that cause a cluster of symptoms. Presence of a thick, white, adherent vaginal discharge with a fishy odor is evidence for bacterial vaginosis, and the client should seek treatment. The client should not douche unless under medical prescriptions, because douching can cause bacteria to ascend into the uterus. Bacterial vaginosis is not sexually transmitted, and it does not require treatment of the partner. Vaginal infections commonly require an examination and diagnostic assessment. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
A client with a history of coronary artery disease has been diagnosed with peripheral vascular disease. The physician started the client on pentoxifylline once daily. Approximately 1 hour after receiving the initial dose of pentoxifylline, the client reports having chest pain. The nurse should first 1. Initiate the rapid response team. 2. Contact the physician. 3. Encourage the client to relax. 4. Document the episode in the chart. The correct answer is 2. Angina is an adverse reaction to pentoxavalene, which should be used cautiously in clients with CAD. The nurse should report the client's symptoms to the physician, who may prescribe nitroglycerin and possibly discontinue the pentoxavalene. The client should rest until the chest pain subsides, and documentation is essential when a client experiences an adverse reaction with medications that have been prescribed. However, the nurse's top priority is to call the physician, report the problem, and obtain a prescription for nitroglycerin. The client's reports of symptoms should never be dismissed. A father brings his 3-month-old infant to the clinic, reporting that the infant has a cold, is having trouble breathing, and just doesn't seem to be acting right. Which of the following actions should the nurse do first? 1. Check the infant's heart rate. 2. Weigh the infant. 3. Assess the infant's oxygen saturation. 4. Obtain more information from the father. The correct answer is 3. In an infant with these symptoms, the first action by the nurse would be to obtain an oxygen saturation reading to determine how well the infant is oxygenating, which is valuable information for an infant having trouble breathing. Because the father probably could provide no other information, checking the heart rate would be the second action done by the nurse. Then the nurse would obtain the infant's weight.
When a client is receiving a cephalosporin, the nurse must monitor the client for which of the following? 1. Drug-induced hemolytic anemia. 2. Purpura. 3. Infectious emboli. 4. Ecchymosis. The correct answer is 1. Drug-induced hemolytic anemia. Drug-induced hemolytic anemia is acquired, antibody-mediated, RBC destruction precipitated by medications, such as cephalosporins, sulfa drugs, rifampin, methyldopa, procainamide, quinidine, and thiazide. Purpura is a condition with various manifestations characterized by hemorrhages into the skin, mucous membranes, internal organs, and other tissues. Infectious emboli are clumps of bacteria present in blood or lymph. Ecchymoses are skin discolorations due to extravasations of blood into the skin or mucous membranes. A 20-year-old client states that the at-home pregnancy test that she took this morning was positive. Which of the following comments by the nurse is appropriate at this time? 1. Congratulations, you and your family must be so happy. 2. Have you told the baby's father yet? 3. How do you feel about the results? 4. Please tell me when your last menstrual period was. The correct answer is 3. How do you feel about the results? Some pregnant women are happy about their pregnancy, some are sad, and still others are frightened. At the initial interview, it is essential that the nurse not assume that the woman will respond in any particular way. The nurse must ask open-ended questions to elicit the woman's feelings about the pregnancy. Prostaglandin E1 is prescribed for a child with transposition of the great arteries. The mother of the child asks the nurse why the child needs the medication. The nurse correctly responds that which is the purpose of this medication. 1. Maintains an adequate hormone level. 2. Prevents hypercyanotic spells. 3. Maintains the position of the great arteries. 4. Provides adequate oxygen saturation and maintains cardiac output. The correct answer is 4. Provides adequate oxygen saturation and maintains cardiac output. A child with transposition of the great arteries may receive prostaglandin E1 temporarily to increase blood mixing if systemic and pulmonary mixing are inadequate to maintain adequate cardiac output. Options 1, 2, and 3 are incorrect. In addition, hypercyanotic spells occur in tetralogy of Fallot. The client diagnosed with severe osteoarthritis of the left knee is receiving sodium hyaluronate injected directly into the left knee. Which information should be discussed with the client? 1. Explain that this medication will cause some bleeding into the joint. 2. Instruct the client to avoid any strenuous activity for 48 hours after injection. 3. Discuss that the medication will be injected daily for 7 days. 4. Tell the client that strict bed rest is required for 24 hours after the injection. The correct answer is 2. Instruct the client to avoid any strenuous activity for 48 hours after injection. Sodium hyaluronate is a synovial joint lubricant used for relief of osteoarthritis pain unrelieved by NSAIDs. After the injection, the client can walk and perform routine daily activities, but running, bicycling, or strenuous activity should be avoided. Sodium hyaluronate is a preparation of a chemical normally found in high amounts in the synovial fluid. The injection replaces or supplements the body's natural hyaluronic acid that deteriorates as a result of the inflammation of osteoarthritis. Any bleeding into the joint is a complication. Bleeding into a joint would not be the expected benefit of any type of medication. The treatment includes 3 to 5 injections, with the client receiving 1 injection every week. This injection is done in an HCP's office. The client will be able to walk out of the clinic after the injection.
A female client with severe depression and weight loss has not eaten since admission to the hospital 2 days ago. Which of the following approaches should the nurse include when developing this client's plan of care to ensure that she eats? 1. Serving the client her meal trays in her room. 2. Sitting with the client and spoon feeding if required. 3. Calling the family to bring the client food from home. 4. Explaining the importance of nutrition in recovery. The correct answer is 2. Sitting with the client and spoon feeding if required. Rationale. A depressed client commonly is not interested in eating because of the psychopathology of the disorder. Therefore, the nurse must take responsibility to ensure that the client eats, including spoon feeding the client if necessary. Serving the client her tray in her room does not ensure that she will eat. Calling the family to bring the client food from home usually is allowed, but it is still the nurse's responsibility to ensure that the client eats. Explaining the importance of nutrition in recovery is not helpful. The client may intellectually know that eating is important, but may not be interested in eating or want to eat.
The clinic nurse is preparing to test the visual acuity of a client using a Snellen chart. Which of the following identifies the accurate procedure for this visual acuity test? 1. Both eyes are assessed together, followed by the assessment of the right and then the left eye. 2. The right eye is tested, followed by the left eye, and then both eyes are tested. 3. The client is asked to stand at 40 feet from the chart and is asked to read the largest line on the chart. 4. The client is asked to stand at 40 feet from the chart and to read the line that can be read 200 feet away by an individual with unimpaired vision. The correct answer is 2. The right eye is tested, followed by the left eye, and then both eyes are tested. Visual acuity is assessed in one eye at a time, and then in both eyes together, with the client comfortably standing or sitting. The right eye is tested with the left eye covered, then the left eye is tested with the right eye covered. Both eyes then are tested together. Visual acuity is measured with or without corrective lenses, and the client stands at a distance of 20 feet from the chart. A visual acuity test is only one part of a comprehensive ophthalmologic examination. The goal of the visual acuity test is to determine clarity or sharpness of vision. A client with peripheral vascular disease has undergone a right femoral popliteal bypass graft. The blood pressure has decreased from 124/80 to 94/62. What should the nurse assess first? 1. IV fluid solution. 2. Pedal pulses. 3. Nasal cannula flow rate. 4. Capillary refill. The correct answer is 2. Pedal pulses. With each set of vital signs, the nurse should assess the dorsalis pedis and posterior tibial pulses. The nurse needs to ensure adequate perfusion to the lower extremity with the drop in blood pressure. IV fluids, nasal cannula setting, and capillary refill are important to assess. However, priority is to determine the cause of drop in blood pressure and that adequate perfusion through the new graft is maintained. A nurse is discussing daily activities with a client. Which of the following activities puts the client at risk for altering the normal pH of her vagina? 1. Consuming over 4 cups of coffee per day. 2. Having sexual intercourse during the menstrual cycle. 3. douching unless instructed to do so by the healthcare provider. 4. Using tampons during the menstrual cycle. The correct answer is 3. Douching unless instructed to do so by the healthcare provider. Douching may disrupt the normal flora of the vaginal lactobacilli and change the pH, which could result in overgrowth of other bacteria. Coffee, intercourse during menses, and tampons are not related to changes in vaginal pH or the incidence of bacterial vaginosis.
A client with peripheral vascular disease is recovering from an aortofemoral popliteal bypass graft. When developing a postoperative education plan, which question by the nurse will provide the most helpful information? 1. How did you manage your health before admission? 2. How far could you walk without pain before surgery? 3. What is your home environment like? 4. Do you have problems with your retention? The correct answer is 1. Assessing the individual's health behavior before surgery will help the nurse and client develop strategies to manage the postoperative course. Asking open-ended questions will elicit the most helpful information. The client's ability to walk after surgery will be improved after surgery. The nurse can ask direct questions after obtaining general information. While the nurse is working in a homeless shelter, assessment of a 6-month-old infant reveals a respiratory rate of 52 breaths per minute retractions and wheezing. The mother states that her infant was doing fine until yesterday. Which of the following actions would be most appropriate? 1. Administer a nebulizer treatment. 2. Send the infant for a chest radiograph. 3. Refer the infant to the emergency department. 4. Provide teaching about cold care to the mother. The correct answer is 3. Based on the assessment findings of increased respiratory rate, retractions, and wheezing, this infant needs further evaluation, which could be obtained in an emergency department. Without a definitive diagnosis, administering a nebulizer treatment would be outside the nurse's scope of practice unless there was a prescription for such a treatment. Sending the infant for a radiograph may not be in the nurse's scope of practice. The findings need to be reported to a primary care provider who can then determine whether or not a chest radiograph is warranted. The infant is exhibiting signs and symptoms of respiratory distress and is too ill to send out with just instructions on cold care for the mother.
A client is to have a Schilling test. The nurse should 1. Administer methylcellulose. 2. Start a 24 to 48-hour urine specimen collection. 3. Maintain nothing by mouth status. 4. Start a 72-hour stool specimen collection. The correct answer is 2. Start a 24 to 48-hour urine specimen collection. Urinary vitamin B12 levels are measured after the ingestion of radioactive vitamin B12. A 24 to 48-hour urine specimen is collected after administration of an oral dose of radioactively tagged vitamin B12 and an injection of non-radioactive vitamin B12. In a healthy state of absorption, excess vitamin B12 is excreted in the urine. In a malabsorptive state, or when the intrinsic factor is missing, vitamin B12 is excreted in the feces. Methylcellulose is a bulk-forming agent. Laxatives interfere with the absorption of vitamin B12. The client is NPO 8 to 12 hours before the test, but is not NPO during the test. A stool collection is not a part of the Schilling test. If stool contaminates the urine collection, the results will be altered. A client is in the 10th week of her pregnancy. Which of the following symptoms would the nurse expect the client to exhibit? Select all that apply. 1. Backache. 2. Urinary frequency. 3. Dyspnea on exertion. 4. Fatigue. 5. Diarrhea. The correct answers are 2. Urinary frequency, and 4. Fatigue. During the first trimester, the body undergoes a number of important changes. The embryo is developing, the hormones of the body are increasing, and the maternal blood supply is increasing. To accomplish each of the tasks, the body uses energy. The mother is fatigued not only because the body is undergoing great change, but also because the thyroid gland has not caught up with the increasing energy demands. In addition, because the organs are confined within the bony pelvis, the enlarging uterus prevents the bladder from expanding with large quantities of urine. As a result, the woman needs to urinate much more frequently than she did prior to becoming pregnant. The nurse is caring for a child with a suspected diagnosis of rheumatic fever. The nurse reviews the laboratory results. Which laboratory study should assist in confirming the diagnosis of rheumatic fever? 1. Immunoglobulin. 2. Red blood cell count. 3. Anti-streptolysin O titer. 4. White blood cell count. The correct answer is 3. Anti-streptolysin O titer. A diagnosis of rheumatic fever is confirmed by the presence of 2 major manifestations, or 1 major and 2 minor manifestations from the Jones criteria. In addition, evidence of a recent streptococcal infection is confirmed by a positive anti-streptolysin O titer streptozyme or an anti-DNase B assay. Options 1, 2, and 4 will not assist in confirming the diagnosis of rheumatic fever. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. The nurse is preparing to administer the following medications. Which medication should the nurse question administering? 1. Ibuprofen to a client receiving furosemide. 2. Nabumetone to a client receiving digoxin. 3. Acetyl salicylic acid to a client receiving warfarin. 4. Ketorolac intramuscularly to a client on morphine. The correct answer is 3. Acetyl salicylic acid to a client receiving warfarin. Acetyl salicylic acid is a mild analgesic, but it is also an antiplatelet. Acetyl salicylic acid displaces warfarin from protein-binding sites and will increase the client's bleeding. Therefore, the nurse should question administering the acetyl salicylic acid. Ibuprofen is an NSAID. NSAIDs do not interfere with the effectiveness of loop diuretics. Therefore, the nurse would not question administering the ibuprofen. Nabumetone is a cyclooxygenase 2 inhibitor. Cyclooxygenase 2 inhibitors do not interfere with the effectiveness of cardiac glycosides. Therefore, the nurse would not question administering the nabumetone. Ketorolac is an NSAIDs. Ketorolac is often administered around the clock to a client in pain, along with a narcotic analgesic. Ketorolac decreases the inflammation to help decrease the pain.
After administering a prescribed medication to a client who becomes restless at night and has difficulty falling asleep, which of the following nursing actions is most appropriate? 1. Sitting quietly with the client at the bedside until the medication takes effect. 2. Engaging the client in interaction until the client falls asleep. 3. Reading to the client with the lights turned down low. 4. Encouraging the client to watch television until the client feels sleepy. The correct answer is 1. Sitting quietly with the client at the bedside until the medication takes effect. Rationale: to promote adequate rest, 6 to 8 hours per night, and to eliminate hypersomnia, the nurse should sit with the client at the bedside until the medication takes effect. The presence of a caring nurse provides the client with comfort and security and helps to decrease the client's anxiety. Engaging the client in interaction until the client falls asleep, reading to the client, or encouraging the client to watch television may be too stimulating for the client, consequently increasing rather than decreasing the client's restlessness.
Which findings should be immediately reported to the healthcare provider? 1. A change in color vision. 2. Crusty yellow drainage on the eyelashes. 3. Increased lacrimation. 4. A curtain-like shadow across the visual field. The correct answer is 4. A curtain-like shadow across the visual field. A curtain-like shadow is a symptom of retinal detachment, which is an emergency situation. A change in color vision is a symptom of a cataract. Crusty drainage is associated with conjunctivitis. Increased lacrimation is associated with many eye irritants, such as allergies, contact lenses, or foreign bodies. An overweight client taking warfarin has dry skin due to decreased arterial blood flow. What should the nurse instruct the client to do? Select all that apply. 1. Apply lanolin or petroleum jelly to intact skin. 2. Follow a reduced calorie, reduced fat diet. 3. Inspect the involved areas daily for new ulcerations. 4. Instruct the client to limit activities of daily living. 5. Use an electric razor to shave. The correct answers are 1. Apply lanolin or petroleum jelly to intact skin. 2. Follow a reduced calorie, reduced fat diet. 3. Inspect the involved areas daily for new ulcerations. And 5. Use an electric razor to shave. Maintaining skin integrity is important in preventing chronic ulcers and infections. The client should be taught to inspect the skin on a daily basis. The client should reduce weight to promote circulation. A diet lower in calories and fat is appropriate. Because the client is receiving Coumadin, the client is at risk for bleeding from cuts. To decrease the risk of cuts, the nurse should suggest that the client use an electric razor. The client with decreased arterial blood flow should be encouraged to participate in ADLs. In fact, the client should be encouraged to consult an exercise physiologist for an exercise program that enhances the aerobic capacity of the body. A client is prescribed oral metronidazole for treatment of bacterial vaginosis. What should the nurse instruct the client to avoid during treatment and for 24 hours thereafter? 1. Douching. 2. Sexual intercourse. 3. Hot tub baths. 4. Alcohol consumption. The correct answer is 4. Alcohol consumption. Metronidazole interacts with alcohol and can cause a serious disulfiram-type reaction with severe, prolonged vomiting. The client should not douche unless following a medical prescription, but douching does not interact with metronidazole. Sexual intercourse and hot tub baths are not known to affect the incidence or treatment of bacterial vaginosis.
The client with peripheral vascular disease and a history of hypertension is to be discharged on a low-fat, low-cholesterol, low-sodium diet, which should be the nurse's first step in planning the dietary instructions. 1. Determine the client's knowledge level about cholesterol. 2. Ask the client to name foods high in fat, cholesterol, and salt. 3. Explain the importance of complying with the diet. 4. Assess the family's food preferences. The correct answer is 4. Before beginning dietary interventions, the nurse must assess the client's pattern of food intake, lifestyle, food preferences, and ethnic, cultural, and financial influences. An infant is being treated at home for bronchiolitis. Which of the following should the nurse teach the parent about home care? Select all that apply. 1. Offering small amounts of fluids frequently. 2. Allowing the infant to sleep prone. 3. Calling the clinic if the infant vomits. 4. Writing down how much the infant drinks. 5. Performing chest physiotherapy every 4 hours. 6. Watching for difficulty breathing. The correct answers are 1 and 6. An infant with bronchiolitis will have increased respirations and will tire more quickly, so it is best and easiest for the infant to take fluids more often in smaller amounts. The parents also would be instructed to watch for signs of increased difficulty breathing, which signal possible complications. Healthy infants, and even those with bronchiolitis, should sleep in the supine position. Calling the clinic for an episode of vomiting would not be necessary. However, the parents would be instructed to call if the infant cannot keep down any fluids for a period of more than 4 hours. Parents would not need to record how much the infant drinks. Chest physiotherapy is not indicated because it does not help and further irritates the infant.
A client from a Mediterranean country is admitted with thalassemia, jaundice, splenomegaly, and hepatomegaly. Which of the following should be the primary focus of nursing care for this client? 1. Providing activities of daily living on the time schedule of the client's homeland. 2. Offering foods that the client enjoys in order to increase the intake of calories. 3. Decreasing cardiac demands by promoting rest. 4. Listening to concerns about the hospitalization. The correct answer is 3. Decreasing cardiac demands by promoting rest. This client has clinical manifestations of thalassemia major, a disease found in descendants from the Mediterranean Sea area whose mother and father both possess a gene for thalassemia. The severe hemolytic anemia causes sequestration of red blood cells in the spleen and liver, which leads to engorgement of the organs and chronic bone marrow hyperplasia. Rest will decrease the demands on the heart due to the diminished hemoglobin level, a physiologic concern. The nurse should follow the time schedule of the area in which the client is now living. The nurse can help the client prescribe preferred foods and listen to concerns, but the main priority is to decrease oxygen demands. The midwife has just palpated the fundal height at the location noted on the picture below. It is likely that the client is how many weeks pregnant? 1. 12 weeks. 2. 20 weeks. 3. 28 weeks. 4. 36 weeks. The correct answer is 1. 12 weeks. The client is likely 12 weeks pregnant. At 12 weeks, the fundal height is at the top of the symphysis. The fundal height is assessed at every prenatal visit. It is an easy, non-invasive means of assessing fetal growth. The nurse should know that the top of the fundus is at the level of the symphysis at the end of the first trimester. The nurse is caring for a child with a diagnosis of Kawasaki disease. The mother of the child asks the nurse about the disorder. Which statement most accurately describes Kawasaki disease? 1. It is an acquired cell-mediated immunodeficiency disorder. 2. It is a chronic multisystem autoimmune disease characterized by the inflammation of connective tissue. 3. It is also called mucocutaneous lymph node syndrome and is a febrile generalized vasculitis of unknown cause. 4. It is an inflammatory autoimmune disease that affects the connective tissue of the heart, joints, and subcutaneous tissues. The correct answer is 3. It is also called mucocutaneous lymph node syndrome and is a febrile generalized vasculitis of unknown cause. Kawasaki disease, also called mucocutaneous lymph node syndrome, is a febrile generalized vasculitis of unknown etiology. Option 1 describes human immunodeficiency virus infection. Option 2 describes systemic lupus erythematosus. Option 4 describes rheumatic fever. The client is taking acetyl-salicylic acid 4 to 5 times a day for severe osteoarthritic pain. Which teaching interventions should the nurse discuss with the client? Select all that apply. 1. Do not drink any type of alcoholic beverages. 2. Keep the acetyl-salicylic acid bottle out of the reach of children. 3. Inform the dentist about taking high doses of acetyl-salicylic acid. 4. Maintain a serum salicylate level between 15 and 30 milligrams per deciliter. 5. Explain that ringing in the ears is a common side effect. The correct answers are 1. Do not drink any type of alcoholic beverages. 2. Keep the acetyl-salicylic acid bottle out of the reach of children. 3. Inform the dentist about taking high doses of acetyl-salicylic acid. And 4. Maintain a serum salicylate level between 15 and 30 milligrams per deciliter. Alcohol displaces warfarin from protein-binding sites and will increase the client's bleeding. Therefore, the nurse should instruct the client not to drink alcohol. Acetyl-salicylic acid poisoning can kill children, and all medications, prescription or non-prescription, should be kept out of the reach of children. High doses of acetyl-salicylic acid can cause bleeding. Therefore, the dentist should be made aware of the client's medication use. Aspirin toxicity can occur when the client is taking acetyl-salicylic acid 4 to 5 times a day. Therefore, the serum level should be kept within normal limits. Mild toxicity occurs with serum levels above 30 milligrams per deciliter, and severe toxicity occurs above 50 milligrams per deciliter. Tinnitus is a sign of aspirin toxicity and should be reported to the HCP.
Which of the following behaviors exhibited by a client with depression should lead the nurse to determine that the client is ready for discharge? 1. Interactions with staff and peers. 2. Sleeping for 4 hours in the afternoon and 4 hours at night. 3. Verbalization of feeling in control of self and situations. 4. Statements of dissatisfaction over not being able to perform at work. The correct answer is 3. Verbalization of feeling in control of self and situations. Rationale. The client who verbalizes feeling in control of self and situations no longer feels powerless to affect an outcome, but realizes that one's actions can have an impact on self and situations. It is common for the client with depression to feel powerless to affect an outcome and to feel a lack of control over a situation. Although interacting with staff and peers is a positive action, the client could be conversing in a negative or non-therapeutic manner. Sleeping 4 hours in the afternoon and 4 hours at night is evidence of symptomatology and does not indicate improvement or recovery. Verbalizing dissatisfaction over not being able to perform at work indicates that the client is most likely focusing on shortcomings and powerlessness.
A patient has a hordeolum on the right upper eyelid. Which intervention would the nurse recommend first? 1. Apply warm compresses 4 times per day. 2. Gently perform hygienic eyelid scrubs. 3. Obtain a prescription for antibiotic drops. 4. Contact the ophthalmologist. The correct answer is 1. Apply warm compresses 4 times per day. Warm compresses usually provide relief. If the problem persists, eyelid scrubs and antibiotic drops would be appropriate. The ophthalmologist could be consulted, but other providers such as the family physician or the nurse practitioner could give a prescription for antibiotics. The nurse is caring for a client with peripheral artery disease who has recently been prescribed clopidogrel. The nurse understands that more teaching is necessary when the client states which of the following. 1. I should not be surprised if I bruise easier or if my gums bleed a little when brushing my teeth. 2. It doesn't really matter if I take this medicine with or without food, whatever works best for my stomach. 3. I should stop taking Plavix if it makes me feel weak and dizzy. 4. The doctor prescribed this medicine to make my platelets less likely to stick together and help prevent clots from forming. The correct answer is 3. I should stop taking Plavix if it makes me feel weak and dizzy. Weakness, dizziness, and headache are common adverse effects of Plavix, and the client should report these to the physician if they are problematic. In order to decrease risk of clot formation, Plavix must be taken regularly and should not be stopped or taken intermittently. The main adverse effect of Plavix is bleeding, which often occurs as increased bruising or bleeding when brushing teeth. Plavix is well absorbed, and while food may help decrease potential gastrointestinal upset, Plavix may be taken with or without food. Plavix is an antiplatelet agent used to prevent clot formation in clients who have experienced or are at risk for myocardial infarction, ischemic stroke, peripheral artery disease, or acute coronary syndrome. A nurse is assessing a client with vaginal discharge. Which of the following diseases are commonly associated with vaginal discharge? Select all that apply. 1. Candidiasis. 2. Bacterial vaginosis. 3. Gonorrhea. 4. Trichomoniasis. 5. Syphilis. The correct answers are 1. Candidiasis, 2. Bacterial vaginosis, and 4. Trichomoniasis. Candidiasis causes a white discharge that results in redness and itching. Bacterial vaginosis causes a thick, white, adherent discharge. Trichomoniasis causes a diffuse yellow-green discharge and is a sexually transmitted infection. Gonorrhea and syphilis usually do not change vaginal discharge. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
While the nurse is providing preoperative teaching for a client with peripheral vascular disease who is to have a below-the-knee amputation, the client says, I hate the idea of being an invalid after they cut off my leg. The nurse's most therapeutic response should be, 1. You'll still have one good leg to use. 2. Tell me more about how you're feeling. 3. Let's finish the preoperative teaching. 4. You're fortunate to have a wife who can take care of you. The correct answer is 2. Encouraging the client who is undergoing amputation to verbalize feelings is the most therapeutic nursing intervention. By eliciting concerns, the nurse may be able to provide information to help the client cope. The nurse should avoid value-laden responses, such as, you'll still have one good leg, that may make the client feel guilty or hostile and block further communication. The nurse should not ignore the client's expressed concerns, nor should the nurse reinforce the client's concern about invalidism and dependency, or assume that his wife is willing to care for him. In preparation for discharge, the nurse teaches a mother of an infant diagnosed with bronchiolitis about the condition and its treatment. Which of the following statements by the mother indicates successful teaching? 1. I need be sure to take my child's temperature every day. 2. I hope I don't get a cold from my child. 3. Next time my child gets a cold, I need to listen to the chest. 4. I need to wash my hands more often. The correct answer is 4. Hand washing is the best way to prevent respiratory illnesses and the spread of disease. Bronchiolitis, a viral infection primarily affecting the bronchioles, causes swelling and mucus accumulation of the lumina and subsequent hyperinflation of the lung with air trapping. It is transmitted primarily by direct contact with respiratory secretions as a result of eye-to-hand or nose-to-hand contact, or from contaminated fomites. Therefore, hand washing minimizes the risk for transmission. Taking the child's temperature is not appropriate in most cases, as long as the child is getting better. Taking the temperature will not be helpful. The mother's statement that she hopes she doesn't get a cold from her child does not indicate understanding of what to do after discharge. For most parents, listening to the child's chest would not be helpful because the parents would not know what they were listening for. Rather, watching for an increased respiratory rate, fever, or evidence of poor eating or drinking will be more helpful in alerting the parent to potential illness. The nurse is assisting with a student assessment screening of 6th graders at the local grade school. A student presents with a back and spine, as in the following illustration. What is the nurse's best interpretation of this finding? 1. Dupuytren contracture. 2. Cole's fracture. 3. Scoliosis. 4. Lordosis. The correct answer is 3. Scoliosis. Rationale. Scoliosis occurs when the vertebrae rotate and begin to compress. The spinal column moves into a lateral curve. On assessment, findings include asymmetry at hip and shoulder height, with prominent thoracic ribs and scapula on one side. Dupuytren contracture is a hand deformity with slow progressive thickening of the palmar fascia, leading to flexion contracture of the 4th and 5th fingers. Cole's fracture occurs in the distal radius. Lordosis is a loss of lumbar curvature, sometimes called flat back, which may also be present with scoliosis.
When assessing the psychological adjustment of an 8-week gravida, which of the following would the nurse expect to see signs of? 1. Ambivalence. 2. Depression. 3. Anxiety. 4. Ecstasy. The correct answer is 1. Ambivalence. It is common for women to be ambivalent about their pregnancy during the first trimester. Even women who stop taking birth control pills to become pregnant are often startled and ambivalent when they actually get pregnant. This is not pathological. The women usually slowly accept the pregnancy, and by 20 weeks gestation are happy and enthusiastic about the prospect of becoming a mother. An infant with heart failure is receiving diuretic therapy, and the nurse is closely monitoring the intake and output. Which is the best method for the nurse to use to monitor the urine output? 1. Weighing the diapers. 2. Inserting a Foley catheter. 3. Comparing intake with output. 4. Measuring the amount of water added to formula. The correct answer is 1. Weighing the diapers. The best method to monitor urine output in an infant on diuretic therapy is to weigh the diapers. The weight of dry diapers is subtracted from the weight of wet diapers to determine the amount of urine excreted. 1 gram is equivalent to 1 milliliter of urine. Comparing intake with output would not provide an accurate measure of urine output. Measuring the amount of water added to formula is unrelated to the amount of output. Although Foley catheter drainage is most accurate in determining output, it is not the best method and places the infant at risk for infection. At 9 o'clock, the charge nurse observes the primary nurse crushing an enteric-coated aspirin in the medication room. Which action should the charge nurse implement? 1. Take no action because this is an acceptable standard of practice. 2. Correct the primary nurse's behavior in the medication room. 3. Explain that enteric-coated medication should not be crushed. 4. Complete an adverse occurrence report on the primary nurse. The correct answer is 3. Explain that enteric-coated medication should not be crushed. The charge nurse should explain to the primary nurse that enteric-coated aspirin should not be crushed because the coating ensures the aspirin will dissolve only in the small intestine where the coating dissolves. The aspirin will be absorbed in the stomach if the coating is crushed. Enteric-coated aspirin should not be crushed. The charge nurse should not correct the primary nurse in front of other staff, and, at 9 o'clock, there would be other nurses in the medication room. Because the client did not receive the crushed enteric-coated aspirin, no adverse occurrence report needs to be completed. This form is completed if the client's condition has been compromised in some way.
Which of the following outcomes should the nurse include in the initial plan of care for a client who is exhibiting psychomotor retardation, withdrawal, minimal eye contact, and unresponsiveness to the nurse's questions? 1. The client will initiate interactions with peers. 2. The client will participate in milieu activities. 3. The client will discuss adaptive coping techniques. 4. The client will interact with the nurse. The correct answer is 4. The client will interact with the nurse. Rationale. In the initial plan of care, the most appropriate outcome would be that the client will interact with the nurse. First, the client would begin interacting with one individual, the nurse. The nurse would gradually assist the client to engage in interactions with other clients in one-on-one contacts, progressing toward informal group gatherings and eventually taking part in structured group activities. The client needs to experience success according to the client's level of tolerance. Initiating interactions with peers occurs when the client can gain a measure of confidence and self-esteem instead of feeling intimidated or unduly anxious. Discussing adaptive coping techniques is an outcome the client may be able to reach when symptoms are not as severe and the client can concentrate on improving coping skills.
After cataract surgery, which symptom needs to be immediately reported to the healthcare provider? 1. A scratchy sensation in the operative eye. 2. Loss of depth perception with the patch in place. 3. Poor vision 6 to 8 hours after patch removal. 4. Pain not relieved by prescribed medication. The correct answer is 4. Pain not relieved by prescribed medication. Pain may signal hemorrhage, infection, or increased ocular pressure. A scratchy sensation and loss of depth perception with the patch in place are common. Adequate vision may not return for 24 hours. A client is receiving salostazole for peripheral arterial disease causing intermittent claudication. The nurse determines this medication is effective when the client reports which of the following? 1. I am having fewer aches and pains. 2. I do not have headaches anymore. 3. I am able to walk further without leg pain. 4. My toes are turning grayish-black in color. The correct answer is 3. I am able to walk further without leg pain. Salostazole is indicated for management of intermittent claudication. Symptoms usually improve within 2 to 4 weeks of therapy. Intermittent claudication prevents clients from walking for long periods of time. Salostazole inhibits platelet aggregation induced by various stimuli and improving blood flow to the muscles and allowing the client to walk long distances without pain. Peripheral arterial disease causes pain mainly of the leg muscles. Aches and pains does not specify exactly where the pain is occurring. Headaches may occur as a side effect of this drug, and the client should report this information to the healthcare provider. Peripheral arterial disease causes decreased blood supply to the peripheral tissues and may cause gangrene of the toes. The drug is effective when the toes are warm to the touch and the color of the toes is similar to the color of the body. A female client with which condition would be at increased risk for vulvovaginal candidiasis? Select all that apply. 1. Uncontrolled diabetes. 2. Immunosuppression due to cancer. 3. Human immunodeficiency virus infection. 4. Hypertension. 5. Asthma. The correct answers are 1. Uncontrolled diabetes, 2. Immunosuppression due to cancer, and 3. Human immunodeficiency virus infection. Women with underlying medical conditions, such as uncontrolled diabetes, and HIV infection or cancer-causing immunosuppression, correlate with an increasing severity of candidiasis. Hypertension and asthma are not related to immunosuppression or complicated candidiasis.
The client asks the nurse, "Why can't the doctor tell me exactly how much of my leg they're going to take off? Don't you think I should know that?" The nurse responds, knowing that the final decision on the level of the amputation will depend primarily on 1. The need to remove as much of the leg as possible. 2. The adequacy of the blood supply to the tissues. 3. The ease with which a prosthesis can be fitted. 4. The client's ability to walk with a prosthesis. The correct answer is 2. The level of amputation commonly cannot be accurately determined until surgery, when the surgeon can directly assess the adequacy of the circulation of the residual limb. A longer residual limb facilitates prosthesis fitting and will make it easier for the client to walk. However, although these aspects will be considered in the final decision, they are not the primary factors influencing the decision. The nurse observes an 18-month-old who has been admitted with a respiratory tract infection. See the figure below. The nurse should first: 1. Position the child supine. 2. Call the rapid response team. 3. Offer the child a carbonated drink. 4. Place the child in a croup tent. The correct answer is 4. The child is in respiratory distress and is sitting in a position to relieve the airway obstruction. The nurse should provide a humidified environment with a croup tent with cool mist to facilitate breathing and liquefy secretions. The child should remain sitting to facilitate breathing. The nurse should allow the child to determine the most comfortable position. After the child is breathing normally, the nurse can offer fluids. The primary care provider also may prescribe intravenous fluids. The nurse can call the rapid response team if the respiratory distress is not relieved by using a croup tent or changes in other vital signs indicate further distress. The nurse is caring for a patient who had a dual energy X-ray absorptiometry scan and is now prescribed calcium with vitamin D twice a day. The patient asks the nurse the purpose of this drug. What is the nurse's best response? Select all that apply. 1. When your calcium and vitamin D levels are low, your risk for osteoporosis and osteomalacia increases. 2. When your vitamin D level is high, your bones release calcium to keep your blood calcium level in the normal range. 3. When your blood calcium is low, calcium is released from your bones, increasing your risk for fractures. 4. When blood calcium is normal, long bones are formed, increasing a person's height. 5. The extra calcium and vitamin D will help protect your bones from damage, such as fractures. 6. You can also get extra vitamin D by increasing your intake of beef and pork sources. The correct answers are 1. When your calcium and vitamin D levels are low, your risk for osteoporosis and osteomalacia increases. 3. When your blood calcium is low, calcium is released from your bones, increasing your risk for fractures. And 5. The extra calcium and vitamin D will help protect your bones from damage, such as fractures. Rationale: vitamin D and its metabolites are produced in the body and transported in the blood to promote the absorption of calcium and phosphorus from the small intestine. There is a relationship between calcium and phosphorus, so that if a patient's phosphorus level is higher than normal, the calcium level will drop and vice versa. A decrease in the body's vitamin D level can result in osteomalacia, softening a bone, in an adult. When serum calcium levels are lowered, parathyroid hormone secretion increases and stimulates bone to promote osteoclastic activity and release calcium to the blood. PTH reduces the renal excretion of calcium and facilitates its absorption from the intestine. Sources of vitamin D include sunlight, fatty fish, and vitamin D in rich foods.
How does the nurse interpret the laboratory analysis of a stool sample containing excessive amounts of azoturia and steatorrhea in a child with cystic fibrosis? The values indicate the child is 1. Not compliant with taking her vitamins. 2. Not compliant with taking her enzymes. 3. Eating too many foods high in fat. 4. Eating too many foods high in fiber. The correct answer is 2. Not compliant with taking her enzymes. If the child were not taking enzymes, the result would be a large amount of undigested food, azoturia, and steatorrhea in the stool. Pancreatic ducts in CF clients become clogged with thick mucus that blocks the flow of digestive enzymes from the pancreas to the duodenum. Therefore, clients must take digestive enzymes with all meals and snacks to aid in absorption of nutrients. Often, teens are non-compliant with their medication regimen because they want to be like their peers. When a nurse is administering a medication to a confused patient, the patient says, "This pill looks different from the one I had before." Which should the nurse do? 1. Ask what the other pill looked like. 2. Explain the purpose of the medication. 3. Check the original medication prescription. 4. Encourage the patient to take the medication. The correct answer is 3. Check the original medication prescription. Option 3 is the safest intervention because it goes to the original source of the prescription. Option 2 ignores the patient's concern. Option 1 is unsafe because the patient is confused and the information obtained may be inaccurate. Option 4 ignores the patient's statement and is unsafe without first obtaining additional information. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. The client diagnosed with a partial thickness burn is prescribed mafenide acetate. Which intervention should the emergency department nurse implement when applying this medication? 1. Do not administer if the serum sodium level is decreased. 2. Assess the client's urine for any increased concentration. 3. Determine the amount of burned skin using the rule of 9. 4. Pre-medicate the client prior to administering the medication. The correct answer is 4. Pre-medicate the client prior to administering the medication. Mafenide acetate is a topical antimicrobial. The medication causes pain or a burning sensation following its application. Therefore, the client should be pre-medicated. The serum sodium level is not affected by mafenide acetate, a topical antimicrobial. It is affected when administering silver nitrate, a topical antimicrobial that is also used to treat burns. Urine concentration may be affected by silver sulfadiazine, a topical antimicrobial that is used to treat burns, but mafenide acetate does not affect urine concentration. This should have been done prior to the emergency department's physician prescribing this medication. Therefore, this would not be an appropriate intervention.
When preparing a teaching plan for a client about imipramine tofranil, which of the following substances should the nurse tell the client to avoid while taking the medication? 1. Caffeinated coffee. 2. Sunscreen. 3. Alcohol. 4. Artificial tears. The correct answer is 3. Alcohol. Rationale. Imipramine, a tricyclic antidepressant in combination with alcohol, will produce additive central nervous system depression. Although caffeinated coffee is safe to use when the client is taking imipramine, it is not recommended for a client with depression who may be experiencing sleep disturbances. Imipramine may cause photosensitivity, so the client would be instructed to use sunscreen and protective clothing when exposed to the sun. Reduced lacrimation may occur as a side effect of imipramine. Therefore, the use of artificial tears may be recommended.
For a patient who has multiple risk factors for primary open-angle glaucoma, which sign or symptom should be investigated as an early sign of POAG? 1. Loss of central visual field. 2. Seeing halos around lights. 3. Mild eye aching. 4. Loss of peripheral vision. The correct answer is 3. Mild eye aching. POAG develops slowly, and irreversible damage to the optic nerve can occur before any signs or symptoms are manifested. However, mild eye aching or headaches should be investigated as possible early signs of POAG. Loss of peripheral vision, seeing halos, and loss of central vision are late signs. The client admitted with peripheral vascular disease asks the nurse why her legs hurt when she walks. The nurse bases a response on the knowledge that the main characteristic of PVD is 1. Decreased blood flow. 2. Increased blood flow. 3. Slow blood flow. 4. Thrombus formation. The correct answer is 1. Decreased blood flow. Decreased blood flow is a common characteristic of all PVD. When the demand for oxygen to the working muscles becomes greater than the supply, pain is the outcome. Slow blood flow throughout the circulatory system may suggest pump failure. Thrombus formation can result from stasis or damage to the intima of the vessels. A client taking oral contraceptives is placed on a 10-day course of antibiotics for an infection. Which of the following instructions should the nurse include in the teaching plan? 1. Use a barrier method of birth control for the rest of your cycle. 2. You should stop taking the oral contraceptives while taking the antibiotic. 3. Call your healthcare provider for increased hunger or fluid retention. 4. Take the antibiotics 2 hours after the oral contraceptive. The correct answer is 1. Use a barrier method of birth control for the rest of your cycle. Antibiotics may decrease the effectiveness of oral contraceptives. The client should be instructed to continue the contraceptives and use a barrier method as a backup method of birth control until the next menstrual cycle. The client should not stop taking her oral contraceptives, and there is no indication for or benefit to taking the antibiotic 2 hours after the contraceptive. There is no incidence of the adverse effects of increased hunger and fluid retention with the interaction of antibiotic therapy and oral contraceptives.
A client has undergone an amputation of 3 toes and a femoropopliteal bypass. The nurse should teach the client that after surgery, which of the following leg positions is contraindicated while sitting in a chair? 1. Crossing the legs. 2. Elevating the legs. 3. Flexing the ankles. 4. Extending the knees. The correct answer is 1. Leg crossing is contraindicated because it causes adduction of the hips and decreases the flow of blood into the lower extremities. This may result in increased pressure in the graft in the affected leg. Elevating the legs, flexing the ankles, and extending the knees are not necessarily contraindicated. A teaching care plan to prevent the transmission of respiratory syncytial virus should include which of the following? Select all that apply. 1. The virus can be spread by direct contact. 2. The virus can be spread by indirect contact. 3. Palivizumab is recommended to prevent RSV for all toddlers in daycare. 4. The virus is typically contagious for 3 weeks. 5. Older children seldom spread RSV. 6. Frequent hand washing helps reduce the spread of RSV. The correct answers are 1, 2, and 6. RSV can be spread through direct contact, such as kissing the face of an infected person, and it can be spread through indirect contact by touching surfaces covered with infected secretions. Hand washing is one of the best ways to reduce the risk of disease transmission. Palivizumab can prevent severe RSV infections, but is only recommended for the most at-risk infants and children. RSV is typically contagious for 3 to 8 days. RSV frequently manifests in older children as cold-like symptoms. Infected school-aged children frequently spread the virus to other family members. The nurse is preparing a discussion of musculoskeletal health maintenance for a group of older adults. Which key points would the nurse be sure to include? Select all that apply. 1. Be aware of and consume foods rich in calcium and vitamin D. 2. Wear hats and long sleeves to avoid sun exposure at all times. 3. Consider exercise with low impact to avoid risk for injury. 4. If you smoke, consider a smoking cessation program. 5. Excessive alcohol intake can interfere with vitamins and nutrients for bone growth. 6. Weight-bearing activities decrease the risk for osteoporosis. The correct answers are 1. Be aware of and consume foods rich in calcium and vitamin D. 3. Consider exercise with low impact to avoid risk for injury. 4. If you smoke, consider a smoking cessation program. 5. Excessive alcohol intake can interfere with vitamins and nutrients for bone growth. And 6. Weight-bearing activities decrease the risk for osteoporosis. Rationale. Many health problems of the musculoskeletal system can be prevented through health promotion strategies and avoidance of risky lifestyle behaviors. Weight-bearing activities, such as walking, can reduce risk factors for osteoporosis and maintain muscle strength. Young men are at the greatest risk for trauma related to motor vehicle crashes. Older adults are at the greatest risk for falls that result in fractures and soft tissue injury. High-impact sports, such as excessive jogging or running, can cause musculoskeletal injury to soft tissues and bone. Tobacco use slows the healing of musculoskeletal injuries. Excessive alcohol intake can decrease vitamins and nutrients a person needs for bone and muscle tissue growth. Hats and long sleeves are recommended to prevent sunburn, but the nurse would recommend 20 minutes of sun exposure several times a week for vitamin D, which contributes to bone health.
Which would the nurse explain to parents about the inheritance of cystic fibrosis? 1. CF is an autosomal dominant trait passed on from the child's mother. 2. CF is an autosomal dominant trait passed on from the child's father. 3. The child of parents who are both carriers of the gene for CF has a 50% chance of acquiring CF. 4. The child of a mother who has CF and a father who is a carrier of the gene for CF has a 50% chance of acquiring CF. The correct answer is 4. The child of a mother who has CF and a father who is a carrier of the gene for CF has a 50% chance of acquiring CF. If the child is born to a parent with CF and the other parent is a carrier, the child has a 50% chance of acquiring the disease and a 50% chance of being a carrier of the disease. A nurse administers an incorrect dose of medication to a patient. Which is the primary purpose of documenting this event in an incident report? 1. Record the event for future litigation. 2. Provide a basis for designing new policies. 3. Prevent similar situations from happening again. 4. Ensure accountability for the cause of the accident. The correct answer is 3. Prevent similar situations from happening again. Risk management committees use statistical data about accidents and incidents to identify patterns of risk and prevent future accidents and incidents. Providing a basis for designing new policies is not the primary reason for incident reports. Although documentation of an incident may be used in a court of law, it is not the primary reason for an incident report. Although nurses are always accountable for their actions, accountability for the cause of an incident is the role of the courts. The nurse is discussing the application of silver nitrate to a client diagnosed with a partial thickness burn to the left leg. Which information should the nurse teach the client when discussing how to apply this medication after discharge? 1. Administer the silver nitrate ointment directly to the burned area twice a day. 2. Notify the HCP if a black discoloration occurs on the burned area. 3. Apply the silver nitrate solution to the wound dressing every 2 hours. 4. Do not allow anyone except the HCP to change the wound dressing. The correct answer is 3. Apply the silver nitrate solution to the wound dressing every 2 hours. Silver nitrate is a topical antimicrobial. Silver nitrate is used as a 0.5% solution in distilled water and should be applied to the bulky gauze dressing every 2 hours, and the dressing should be changed twice a day. Option 1 is the incorrect way to apply silver nitrate. Silver nitrate solution causes a black discoloration on all skin surfaces and dressings with which it comes into contact. Therefore, the client would not need to notify the HCP. The bulky wound dressing must be changed twice a day. Therefore, the nurse must teach the client to change the dressing. A dressing change does not have to be done only by the HCP.
The client with depression who is taking imipramine, tofranil, states to the nurse, "My doctor wants me to have an electrocardiogram in 2 weeks, but my heart is fine." Which response by the nurse is most appropriate? 1. It's routine practice to have ECGs periodically because there is a slight chance that the drug may affect the heart. 2. It's probably a precautionary measure because I'm not aware that you have a cardiac condition. 3. Try not to worry too much about this. Your doctor is just being very thorough in monitoring your condition. 4. You had an ECG before you were prescribed imipramine, and the procedure will be the same. The correct answer is 1. It's routine practice to have ECGs periodically because there is a slight chance that the drug may affect the heart. Rationale. Telling the client that ECGs are done routinely for all clients taking imipramine, a tricyclic antidepressant, is an honest and direct response. Additionally, it provides some reassurance for the client. Commonly, a client with depression will ruminate, leading to needless increased anxiety. Tricyclic antidepressants may cause tachycardia, ECG changes, and cardiotoxicity. Telling the client that it's probably a precautionary measure because the nurse is not aware of a cardiac condition instills doubt and may cause undue anxiety for the client. Telling the client not to worry because the doctor is very thorough dismisses the client's concern and does not give the client adequate information. Explaining that the client had an ECG before initiating therapy with imipramine and that the procedure will be the same does not answer the client's question.
According to evidence-based guidelines from the American Optometric Association, which patient needs to have an annual eye examination? 1. 18-year-old who is asymptomatic and has low risk. 2. 40-year-old who is asymptomatic and has low risk. 3. 55-year-old who is asymptomatic and has low risk. 4. 67-year-old who is asymptomatic and has low risk. The correct answer is 4. 67-year-old who is asymptomatic and has low risk. People 65 years or older are advised to have eye examinations annually or even more frequently, even if they have low risk. People who are 18 to 64 years old with low risk are advised to have eye examinations at least every 2 years. Examples of risk factors include family history for eye disease, systemic health conditions that affect the eyes, such as diabetes, racial or ethnic backgrounds with increased risk, such as African Americans, occupations that are eye hazardous, prescription or non-prescription drugs with ocular side effects, contact lenses, previous eye surgery or eye injury, and having functional vision in only one eye. The nurse is planning care for a client who is diagnosed with peripheral vascular disease and has a history of heart failure. The nurse should develop a plan of care that is based on the fact that the client may have a low tolerance for exercise related to 1. Decreased blood flow. 2. Increased blood flow. 3. Decreased pain. 4. Increased blood viscosity. The correct answer is 1. Decreased blood flow. A client with PVD and heart failure will experience decreased blood flow. In this situation, low exercise tolerance may be related to less blood being ejected from the left ventricle into the systemic circulation. Decreased blood supply to the tissues results in pain. Increased blood viscosity may be a component, but it is of much less importance than the disease processes. A client is asking for information about using an intrauterine device. Which of the following questions asked by the nurse would provide pertinent information on whether or not a client is a candidate for an IUD? 1. Do you smoke? 2. Do you have hypertension? 3. How often do you have sex? 4. Are you in a monogamous relationship? The correct answer is 4. Are you in a monogamous relationship? Due to the increased risk of pelvic inflammatory disease, candidates for the IUD should be in a monogamous relationship. Smoking and hypertension are not contraindications for an IUD. The frequency of sexual relations will not affect IUD use. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
The nurse is monitoring the client after and above the knee amputation and notes that blood has saturated. Through the distal part of the dressing, the nurse should immediately 1. Apply a tourniquet. 2. Assess vital signs. 3. Call the physician. 4. Elevate the surgical extremity with a large pillow. The correct answer is 2. The client should be evaluated for hemodynamic stability and extent of bleeding prior to calling the physician. Direct pressure can be used prior to applying a tourniquet if there is significant bleeding. To avoid flexion contractures, which can delay rehabilitation, elevation of the surgical limb is contraindicated. A charge nurse is making assignments for a group of children on a pediatric unit. The nurse should most avoid assigning the same nurse to care for a 2-year-old with respiratory syncytial virus and 1. An 18-month-old with RSV. 2. A 9-year-old 8 hours post-appendectomy. 3. A 1-year-old with a heart defect. 4. A 6-year-old with sickle cell crisis. The correct answer is 3. RSV may be spread through both direct and indirect contact. While contact and standard precautions should be employed, a measure to further decrease the risk of nosocomial infections is to avoid assigning the same nurse caring for an RSV client to a client at risk for infection. A private room is preferred, but if this is not an option, the nurse should understand that children 2 years of age and younger are most at risk for RSV, especially if they have other chronic problems, such as a heart defect. From an infection control perspective, pairing 2 clients with RSV is ideal. RSV infections are less likely to pose a serious problem in older children. The nurse is caring for a patient with osteoporosis who is at an increased risk for falls. Which intervention should the nurse delegate to the assistive personnel? 1. Identifying environmental factors that increase the risk for falls. 2. Monitoring gait, balance, and fatigue level with ambulation. 3. Collaborating with the physical therapist to provide the patient with a walker. 4. Assisting the patient with ambulation to the bathroom and in the halls. The correct answer is 4. Assisting the patient with ambulation to the bathroom and in the halls. Rationale. Assisting with activities of daily living, including assisting with ambulation to the bathroom and in the halls, is within the scope of the AP's practice. The other 3 interventions require additional educational preparation and are within the scope of practice of licensed nurses.
The parent of a 4-month-old with cystic fibrosis asks the nurse what time to begin the child's first chest physiotherapy each day. Which is the nurse's best response? 1. 30 minutes before feeding the child breakfast. 2. After deep suctioning the child each morning. 3. 30 minutes after feeding the child breakfast. 4. Only when the child has congestion or coughing. The correct answer is 1. 30 minutes before feeding the child breakfast. CPT should be done in the morning prior to feeding to avoid the risk of the child vomiting. When preparing to administer a medication, the nurse identifies that the dose is larger than the standard dose recommended by the manufacturer. Which should the nurse do? 1. Inform the supervisor. 2. Give the drug as prescribed. 3. Give the average dose of the medication. 4. Discuss the prescription with the primary healthcare provider. The correct answer is 4. Discuss the prescription with the primary healthcare provider. Nurses have a professional responsibility to know or investigate the standard dose for medications being administered. Nurses are also responsible for their own actions, regardless of whether there is a written prescription. The nurse has a responsibility to question and/or refuse to administer a prescription that appears unreasonable. Giving the drug as prescribed may be unsafe for the patient and may result in malpractice. Changing a medication prescription is not within the scope of nursing practice. The client diagnosed with a full-thickness burn over 38% of the body is admitted to the burn unit 4 hours after the fire. The HCP writes an order for Ringer's lactate 450 milliliter per hour. Which interventions should the nurse implement? Select all that apply. 1. Question the HCP's orders. 2. Administer the IV fluid as prescribed. 3. Infuse the IV fluid via a pump. 4. Do not administer more than 200 milliliter an hour. 5. Verify the order with another nurse in the burn unit. The correct answers are 2. Administer the IV fluid as prescribed, and 3. Infuse the IV fluid via a pump. There are formulas that are used to determine the client's fluid volume resuscitation. The formulas specify the total amount of fluid that must be infused in 24 hours, 50% in the first 8 hours, followed by the other 50% over the next 16 hours. This is a large amount of fluid, but its administration is not uncommon in clients diagnosed with full thickness, burns over more than 20% of their total body surface. The IV fluids must be infused on a pump to ensure the client receives the correct amount for fluid resuscitation. For option 1, the nurse should administer this IV fluid as ordered. For option 4, this is not an unusual amount of fluid to be infused. There is no absolute amount of fluid that a client may require during fluid resuscitation. For option 5, there is no reason to verify this order with another nurse in the burn unit.
When assessing a client who is receiving tricyclic antidepressant therapy, which of the following should alert the nurse to the possibility that the client is experiencing anticholinergic effects? 1. tremors and cardiac arrhythmias. 2. Sedation and delirium. 3. Respiratory depression and convulsions. 4. Urine retention and blurred vision. The correct answer is 4. Urine retention and blurred vision. Rationale. Anticholinergic effects, which result from blockage of the parasympathetic nervous system, include urine retention, blurred vision, dry mouth, and constipation. Tremors and cardiac arrhythmias are possible side effects, but they are caused by increased norepinephrine availability. Sedation and delirium are not anticholinergic effects. Sedation may be a therapeutic effect because many clients with depression experience agitation and insomnia. Delirium, typically not a side effect, would indicate toxicity, especially in elderly clients. Respiratory depression, convulsions, ataxia, agitation, stupor, and coma indicate tricyclic antidepressant toxicity.
The nurse is assigned to care for a client with a detached retina. Which finding should the nurse expect to be documented in the client's record? 1. Blurred vision. 2. Pain in the affected eye. 3. A yellow discoloration of the sclera. 4. A sense of a curtain falling across the field of vision. The correct answer is 4. A sense of a curtain falling across the field of vision. A characteristic clinical manifestation of retinal detachment described by clients is the feeling that a shadow or curtain is falling across the field of vision. There is no pain associated with detachment of the retina. A retinal detachment is an ophthalmic emergency, and even more so if visual acuity is still normal. Options 1 and 3 are not specifically associated with a detached retina. When assessing the lower extremities of a client with peripheral vascular disease, the nurse notes bilateral ankle edema. The edema is related to 1. Competent venous valves. 2. Decreased blood volume. 3. Increase in muscular activity. 4. Increased venous pressure. The correct answer is 4. Increased venous pressure. In PVD, decreased blood flow can result in increased venous pressure. The increase in venous pressure results in an increase in capillary hydrostatic pressure, which causes a net filtration of fluid out of the capillaries into the interstitial space, resulting in edema. Valves often become incompetent with PVD. Blood volume is not decreased in this condition. Decreased muscular action would contribute to the formation of edema in the lower extremities. A nurse is caring for a hospitalized 22-year-old female client with type 1 diabetes mellitus and toxic shock syndrome. Which of the following should the nurse perform first? 1. Administer 5% dextrose in half-normal saline solution at 150 milliliters per hour IV. 2. Administer 50 milligrams of meperidine IM every 4 hours as needed for pain. 3. Teach the client to use pads at night instead of tampons during her menstrual period. 4. Administer 400 milligrams of ciprofloxacin IV every 12 hours infused over 1 hour. The correct answer is 1. Administer 5% dextrose in half-normal saline solution at 150 milliliters per hour IV. Fluid losses can occur from vomiting, diarrhea, and fever and can lead to hypovolemic shock. The first nursing action is to treat the hypovolemic shock that accompanies toxic shock, so the IV fluids must be administered immediately. The fluid replacement is critical to avoid circulatory collapse. Pain medication and teaching can be implemented later. Antibiotics will be given because toxic shock syndrome is caused by a staphylococcal infection. However, fluid replacement is initiated first to treat life-threatening hypovolemic shock.
The client has had a below-the-knee amputation, secondary to arterial occlusive disease. The nurse is instructing the client in residual limb care. Which of the following statements by the client indicates that the client understands how to implement the plan of care? 1. I should inspect the incision carefully when I change the dressing every other day. 2. I should wash the incision, dry it, and apply moisturizing lotion daily. 3. I should rewrap the stump as often as needed. 4. I should elevate the stump on pillows to decrease swelling. The correct answer is 3. The purpose of wrapping the residual limb is to shape the residual limb to accept a prosthesis and bear weight. The compression bandaging should be worn at all times for many weeks after surgery and should be reapplied as needed to keep it free of wrinkles and snug. The dressing should be changed daily to allow for inspection of the stump incision. No lotion should be applied to the stump unless specifically prescribed by the physician. The stump should not be elevated on pillows because this will contribute to the formation of flexion contractures. Contractures will prevent the client from wearing a prosthesis and ambulating. The nurse is preparing to administer the last dose of ceftriaxone before discharge to a 1-year-old, but finds the IV has occluded. The nurse should 1. Restart the IV. 2. Administer the medication intramuscularly. 3. Arrange for early discharge. 4. Contact the prescriber to request a prescription change. The correct answer is 4. Restarting an IV for 1 dose of a medication may not be in the infant's best interest when the medication can be given in an alternate form. The prescriber should be contacted to determine IM or PO options. Rocephin may be given IM, but changing the route of medication administration requires a prescription. Failing to complete an entire course of antibiotics contributes to the emergence of antibiotic resistance and would rarely be the best option.
The parent of an infant with cystic fibrosis asks the nurse how to meet the child's increased nutritional needs. Which is the nurse's best suggestion? 1. You may need to increase the number of fresh fruits and vegetables you give your infant. 2. You may need to advance your infant's diet to whole cow's milk because it is higher in fat than formula. 3. You may need to change your infant to a higher calorie formula. 4. You may need to increase your infant's carbohydrate intake. The correct answer is 3. You may need to change your infant to a higher calorie formula. Often, infants with CF need to have a higher calorie formula to meet their nutritional needs. Infants may also be placed on hydrolysate formulas that contain medium-chain triglycerides. When a nurse attempts to administer a medication to a patient, the patient refuses to take the medication because it causes diarrhea. The nurse provides teaching about the medication, but the patient continues adamantly to refuse the medication. Which should the nurse do first? 1. Document the patient's refusal to take the medication. 2. Discuss with a family member the need for the patient to take the medication. 3. Explain again to the patient the consequences of refusing to take the medication. 4. Notify the primary healthcare provider of the patient's refusal to take the medication. The correct answer is 1. Document the patient's refusal to take the medication. Withholding the medication and documenting the patient's refusal are the appropriate interventions. Patients have a right to refuse care. Discussing the situation with a family member without the patient's consent is a violation of confidentiality. The patient has been taught about the medication and adamantly refuses the medication. Further teaching at this time may be viewed by the patient as badgering. Notifying the primary healthcare provider eventually should be done, but it is not the priority at this time. The client experienced an electrical burn that resulted in full thickness burns to the right and left hand. The HCP ordered the fluid resuscitation rates. Which data indicates the fluid resuscitation is effective? 1. The client's urine output is less than 30 milliliter per hour. 2. The client's urine output is at least 50 milliliter per hour. 3. The client's urine output is 75 to 100 milliliter per hour. 4. The client's urine output is greater than 200 milliliter per hour. The correct answer is 3. The client's urine output is 75 to 100 milliliter per hour. The client diagnosed with an electrical burn should have a urine output of 75 to 100 milliliter per hour for the fluid resuscitation to be effective. An output of greater than 100 milliliter per hour would indicate the client is losing too much fluid and that the fluid resuscitation is not effective. Urine output of less than 30 milliliter per hour would not indicate the fluid resuscitation is effective. For option 2, this would indicate effective fluid resuscitation for a client diagnosed with a thermal burn, but not for a client diagnosed with an electrical burn. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
A client with depression who is taking doxepin, Sinequin, 100 milligrams PO, at bedtime has dizziness on arising. Which of the following suggestions is most appropriate? 1. Try taking a hot shower. 2. Get up slowly and dangle your feet before standing. 3. Stay in bed until you are feeling better. 4. You need to limit the fluids you drink. The correct answer is 2. Get up slowly and dangle your feet before standing. Rationale. Doxepin and other tricyclic antidepressants may cause postural hypotension, especially in the morning. Postural hypotension occurs because the tricyclic antidepressant inhibits the body's natural vasoconstrictive reaction when a person stands. The nurse regularly monitors the client's vital signs, both lying and standing. The nurse should instruct the client to rise slowly and dangle his feet before standing. Advising the client to take a hot shower is detrimental to the client's safety. Heat causes vasodilation, which could further exacerbate the dizziness, placing the client at risk for falls and subsequent injury. Telling the client to stay in bed until he is feeling better is not helpful and is impractical. The client with depression would rather stay in bed and withdraw from others. Placing the client on fluid restriction is detrimental to the client with depression whose fluid and food intake may be inadequate.
The nurse is on a camping trip. A man who is chopping wood gets struck in the eye with a piece of debris. On examination, a wood splinter is protruding from his eyeball. What should the nurse do first? 1. Have the man lie in the back seat of the car and drive him to the emergency department. 2. Gently remove the piece of wood and place a sterile dressing over the eye. 3. Carefully rest a plastic cup on the orbital rim and tape it in place. 4. Flush the eye with copious amounts of clean tepid water, then check visual acuity. The correct answer is 3. Carefully rest a plastic cup on the orbital rim and tape it in place. Penetrating objects should not be removed or disturbed by anyone except an eye specialist because the object may be creating a tamponade effect. Removing or disrupting the object could result in additional damage to the eye. The man needs to have emergency care, and 911 should be called. But if there are no emergency services available, the man should sit in the back seat of the car with a seatbelt in place for transport to the nearest facility. If an eye has been cut or punctured, the bottom of a paper cup taped to the bones surrounding the eye can serve as a shield until you get medical attention. After a penetrating eye injury has been assessed and treated by an ophthalmologist, there is a possibility that based on the ophthalmologist's recommendations, foreign body removal, flushing, and dressing application could be accomplished in the emergency department. However, penetrating objects frequently require surgical removal. Antibiotics and a tetanus immunization are administered before the patient is transferred to the operating room. The nurse is obtaining the pulse of a client who had a femoral popliteal bypass surgery 6 hours ago. Which assessment provides the most accurate information about the client's post-operative status? 1, 2, 3, 4. The correct answer is option 4. The presence of a strong dorsalis pedis pulse indicates that there is circulation to the extremity distal to the surgery, indicating that the graft between the femoral and popliteal artery is allowing blood to circulate effectively. Option 1 shows the nurse obtaining the radial pulse. Option 2 shows the femoral pulse, which is proximal to the surgery site and will not indicate circulation distal to the surgery site. Option 3 shows the nurse obtaining an apical pulse. A 39-year-old female client has been experiencing intermittent vaginal bleeding for several months. Her physician tells her that she has uterine fibroids and recommends an abdominal hysterectomy. When the client expresses fear about the surgery, the nurse should 1. Reassure the client of her physician's competence. 2. Give the client opportunities to express her fears. 3. Teach the client that fear impedes recovery. 4. Change the topic of conversation. The correct answer is 2. Give the client opportunities to express her fears. The best approach for a client who is fearful about having surgery is to allow the client opportunities to express her fears. Open-ended questions should elicit the client's individual and specific fears. This then gives the nurse the opportunity to provide clarification, information, and support, and possibly to offer other resources. The other actions are not supportive and deny the client the opportunity to express her feelings.
The nurse is preparing to teach a patient with a new diagnosis of osteoporosis about strategies to prevent falls. Which teaching points should the nurse be sure to include? Select all that apply. 1. Wear a hip protector when ambulating. 2. Remove throw rugs and other obstacles at home. 3. Exercise to help build your strength. 4. Expect a few bumps and bruises when you go home. 5. Rest when you are tired. 6. Avoid consuming 3 or more alcoholic drinks per day. The correct answers are 1. Wear a hip protector when ambulating. 2. Remove throw rugs and other obstacles at home. 3. Exercise to help build your strength. And 5. Rest when you are tired. Rationale. The purpose of this teaching is to help the patient prevent falls. The hip protector can prevent hip fractures if the patient falls. Throw rugs and obstacles in the home increase the risk of falls. Patients who are tired are also more likely to fall. Exercise helps to strengthen muscles and improve coordination. Women should not consume more than 1 drink per day, and men should not consume more than 2 drinks per day. Which of the following clients is at greatest risk for Buerger's disease? 1. A 29-year-old male with a 14-year history of cigarette smoking. 2. A 38-year-old female who is taking birth control pills. 3. A 54-year-old female with adult-onset diabetes. 4. A 65-year-old male with atherosclerosis. The correct answer is 1. Buerger's disease is a non-atherosclerotic, inflammatory vaso-occlusive disorder. The disorder occurs predominantly in younger men, less than 40 years of age, and there is a very strong relationship with tobacco use. Diagnosis is based on age of onset, history of tobacco use, symptoms, and exclusion of diabetes mellitus. A nurse administers cefazolin instead of ceftriaxone to an 8-year-old with pneumonia. The client has suffered no adverse effects. The nurse tells the charge nurse of the incident, but fears disciplinary action from reporting the error. The charge nurse should tell the nurse, 1. If you do not report the error, I will have to. 2. Reporting the error helps to identify system problems to improve client safety. 3. Notify the client's primary care provider to see if she wants this reported. 4. This is not a serious mistake, so reporting it will not affect your position. The correct answer is 2. Client safety is enhanced when the emphasis on medication errors is to determine the root cause. All errors should be reported so systems can identify patterns that contribute to errors. Here, the similar names probably contributed to the error. The nurse who commits the error knows all the relevant information and is in the best position to report it. While the primary care provider should be notified, it is a nursing responsibility to report errors, not a primary care provider choice. Relating mistakes to a nurse's position focuses on personal blame. The nurse's assessment reveals all of these data when a patient with Paget disease is admitted to the acute care unit. Which findings should the nurse notify the healthcare provider about first? 1. There is a bowing of both legs, and the knees are asymmetrical. 2. The base of the skull is invaginated platyphagia. 3. The patient is only 5 feet tall and weighs 120 pounds. 4. The skull is soft, thick, and larger than normal. The correct answer is 2. The base of the skull is invaginated platyphagia. Rationale. Platyphagia, basilar skull invagination, causes brainstem manifestations that threaten life. Patients with Paget disease are usually short and often have bowing of the long bones that results in asymmetrical knees or elbow deformities. The skull is typically soft, thick, and enlarged.
The parent of a child with cystic fibrosis is excited about the possibility of the child receiving a double lung transplant. What should the parent understand? 1. The transplant will cure the child of CF and allow the child to lead a long and healthy life. 2. The transplant will not cure the child of CF, but will allow the child to have a longer life. 3. The transplant will help to reverse the multisystem damage that has been caused by CF. 4. The transplant will be the child's only chance at surviving long enough to graduate from college. The correct answer is 2. The transplant will not cure the child of CF, but will allow the child to have a longer life. If the child were not taking enzymes, the result would be a large amount of undigested food, azoturia, and steatorrhea in the stool. Pancreatic ducts in CF clients become clogged with thick mucus that blocks the flow of digestive enzymes from the pancreas to the duodenum. Therefore, clients must take digestive enzymes with all meals and snacks to aid in absorption of nutrients. Often, teens are non-compliant with their medication regimen because they want to be like their peers. When caring for a terminally ill patient, a family member says, "I need your help to hasten my mother's so that she is no longer suffering." Which should the nurse do, based on the position of the American Nurses Association in relation to assisted? 1. Not participate in active euthanasia. 2. Participate based on personal values and beliefs. 3. Participate when the patient is experiencing severe pain. 4. Not participate unless 2 primary healthcare providers are consulted and the patient has had counseling. The correct answer is 1. Not participate in active euthanasia. Nursing actions must comply with the law, and the law states that euthanasia is legally wrong. Euthanasia can lead to criminal charges of homicide or civil lawsuits for providing an unacceptable standard of care. A nurse's beliefs, values, or moral convictions should not be imposed on patients. Compassion and good intentions are not an acceptable basis for actions beyond the scope of nursing practice. Nurses, as well as other healthcare providers, cannot legally be involved with euthanasia. In some states in the United States, a primary healthcare provider can prescribe a medication that can be taken by a patient to cause death. The American Nurses Association, according to its Code for Nurses with Interpretive Statement, indicates that nurses should not participate in active euthanasia. The client is admitted to the emergency department diagnosed with a partial and full thickness burn to the left leg. Which question is most important for the nurse to ask the client? 1. When was your last tetanus shot? 2. Can you tell me how this burn happened? 3. Will you need any help when you go home? 4. Have you taken any antibiotics in the last week? The correct answer is 1. When was your last tetanus shot? A tetanus toxoid is administered intramuscularly early in the acute phase of burn care to prevent Clostridium tetani infection. If the client has not had a tetanus shot within the last 10 years, or if the time is in doubt, a booster of tetanus toxoid should be administered.
The primary healthcare provider prescribes mirtazapine, Remeron, 30 milligrams PO at bedtime for a client diagnosed with depression. The nurse should 1. Give the medication as prescribed. 2. Question the primary healthcare provider's prescription. 3. Request to give the medication in the morning. 4. Give the medication in 3 divided doses. The correct answer is 1. Give the medication as prescribed. Rationale. The nurse should give the medication as prescribed. Mirtazapine is given once daily, preferably at bedtime, to minimize the risk of injury resulting from postural hypotension and sedative effects. The usual dosage ranges from 15 to 45 milligrams. There is no reason to question the primary healthcare provider's prescriptions. The nurse should administer the medication as prescribed. Requesting to give the medication in 3 divided doses is inappropriate and demonstrates the nurse's lack of knowledge about the drug.
The home health nurse discovers that an older patient has been taking her glaucoma eye drops by mouth for the past week. What should the nurse do first? 1. Obtain a prescription for tonometry so that her intraocular pressure can be checked. 2. Try to determine the frequency and the amount that she has been ingesting. 3. Ask her how she decided to take the drops orally instead of instilling them as eye drops. 4. Call the Poison Control Center and be prepared to describe untoward side effects. The correct answer is 2. Try to determine the frequency and the amount that she has been ingesting. Try to find out the amount and frequency that she has been taking the drops by mouth. This information will be needed when calling the ophthalmologist or poison control. A good follow-up question is to try to find out why she is taking the drops by mouth. She may be very confused, or there may have been an error of omission in patient education by all healthcare team members who were involved in the initial prescription. The nurse is teaching a client about risk factors associated with atherosclerosis and how to reduce the risk. Which of the following is a risk factor that the client is not able to modify? 1. Diabetes. 2. Age. 3. Exercise level. 4. Dietary preferences. The correct answer is 2. Age. Age is a non-modifiable risk factor for atherosclerosis. The nurse instructs the client to manage modifiable risk factors such as comorbid diseases, such as diabetes, activity level, and diet. Controlling serum blood glucose levels, engaging in regular aerobic activity, and choosing a diet low in saturated fats can reduce the risk of developing atherosclerosis. A female with uterine fibroids has dysmenorrhea and menorrhagia. After reviewing the laboratory reports, the nurse should report which results to the healthcare provider. Select all that apply. 1. Hemoglobin 9.0 grams per deciliter. 2. Hematocrit 27.1%. 3. White blood cell count 10,000 cells per cubic milliliter. 4. Potassium 4.0 milliequivalents per liter. 5. Normocytic red blood cells. The correct answers are 1. Hemoglobin 9.0 grams per deciliter and 2. Hematocrit 27.1%. A woman with uterine fibroids and dysmenorrhea is at risk for iron deficiency anemia. The hemoglobin and hematocrit indicate the likelihood that the fibroids causing heavy menstrual blood loss have resulted in anemia. A hemoglobin of less than 12 grams per deciliter in women is considered low. The white blood cell count and potassium levels are within normal parameters, and normocytic red blood cells are normal. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
The primary goal for the client with Berger's disease is to prevent 1. Embolus formation, 2. Fat embolus formation, 3. Thrombus formation, 4. Thrombophlebitis. The correct answer is 3. Because of the inflammation, a common complication of Berger's disease is thrombus formation and potential occlusion of the vessel. Inflammation of the immediate and small arteries and veins is involved in the disease process. Embolus is a potential risk if a thrombus has developed. Fat embolus is associated with fractures of the bones. Thrombophlebitis occurs after thrombus formation. A 12-year-old with cystic fibrosis is being treated in the hospital for pneumonia. The primary care provider is calling in a telephone prescription for ampicillin. The nurse should do which of the following? Select all that apply. 1. Ask the unit clerk to listen on the speakerphone with the nurse and write down the prescription. 2. Ask the primary care provider to come to the hospital and write the prescription on the chart. 3. Repeat the prescription to the primary care provider. 4. Ask the primary care provider to confirm that the prescription is correct as understood by the nurse. 5. Ask the nursing supervisor to co-sign the telephone prescription as transcribed by the nurse. The correct answers are 3 and 4. To ensure client safety in obtaining telephone prescriptions, the prescription must be received by a licensed nurse. The nurse should write the prescription, read the prescription back to the primary care provider, and receive confirmation from the primary care provider that the prescription is correct. It is not necessary to ask the unit clerk to listen to prescription, to require the primary care provider to come to the hospital to write the prescription on the chart, or to have the nursing supervisor co-sign the telephone prescription. The charge nurse observes an LPN/LVN assigned to provide all of these interventions for a patient with Paget disease. Which action requires that the charge nurse intervene? 1. Administering 600 milligrams of ibuprofen to the patient. 2. Encouraging the patient to perform exercises recommended by a physical therapist. 3. Applying ice and gentle massage to the patient's lower extremities. 4. Reminding the patient to drink milk and eat cottage cheese. The correct answer is 3. Applying ice and gentle massage to the patient's lower extremities. Rationale. Applying heat, not ice, is the appropriate measure to help reduce the patient's pain. Ibuprofen is useful to manage mild to moderate pain. Exercise prescribed by a physical therapist would be non-impact in nature and provide strengthening for the patient. A diet rich in calcium promotes bone health.
A 2-year-old has just been diagnosed with cystic fibrosis. The parents ask the nurse what early respiratory symptoms they should expect to see in their child. Which is the nurse's best response? 1. You can expect your child to develop a barrel-shaped chest. 2. You can expect your child to develop a chronic productive cough. 3. You can expect your child to develop bronchiectasis. 4. You can expect your child to develop wheezing respirations. The correct answer is 4. You can expect your child to develop wheezing respirations. Wheezing respirations and a dry, non-productive cough are common early symptoms in CF. Answer 2 can be eliminated because of the word chronic. Chronic implies that the disease process is advanced rather than in the initial stages. Answers 1 and 3 can be eliminated if you know of the signs and symptoms of advanced lung disease. Which organization is responsible for ensuring that nurses are minimally qualified to practice nursing? 1. State Boards of Nursing. 2. American Nurses Association. 3. Sigma Theta Tau International. 4. Constituent Leagues of the National League for Nursing. The correct answer is 1. State Boards of Nursing. The National Council of State Boards of Nursing is responsible for the NCLEX examinations. However, the licensing authority in the jurisdiction in which the graduate takes the examination verifies the acceptable score on the examination. The client diagnosed with a partial thickness, burn to the entire right leg, who is being treated with silver sulfadiazine, develops leukopenia. Which medication should the nurse expect the HCP to prescribe? 1. Discontinue the silver sulfadiazine ointment immediately. 2. Continue administering the silver sulfadiazine ointment. 3. Administer aminoglycoside antibiotics intravenously. 4. Administer hydrocortisone cream to the burned area. The correct answer is 2. Continue administering the silver sulfadiazine ointment. Silver sulfadiazine is a sulfonamide antibacterial agent. Many clients develop marked leukopenia in response to silver sulfadiazine. The leukopenia will improve spontaneously over the course of treatment. Leukopenia does not contraindicate use of this medication. Leukopenia improves over the course of the treatment with silver sulfadiazine and does not warrant discontinuing the medication. Leukopenia, secondary to silver sulfadiazine therapy, does not warrant the administration of aminoglycoside antibiotics. Hydrocortisone cream does not treat leukopenia secondary to silver sulfadiazine.
A client taking mirtazapine is disheartened about a 20 pounds, 9 kilograms, weight gain over the past 3 months. The client tells the nurse, I stopped taking my mirtazapine 15 days ago. I don't want to get depressed again, but I feel awful about my weight. Which response by the nurse is most appropriate? 1. Focusing on diet and exercise alone should control your weight. 2. Your depression is much better now, so your medication is helping you. 3. Look at all the positive things that have happened to you since you started mirtazapine. 4. I hear how difficult this is for you and will help you approach the doctor about it. The correct answer is 4. I hear how difficult this is for you and will help you approach the doctor about it. Rationale. The nurse should express concern for the client and offer to help the client speak with the primary healthcare provider, which will lend support to the client's concerns. The client who has stopped the medication must be taken seriously because medication noncompliance could result in a recurrence of symptoms of depression. Telling the client to focus on diet and exercise ignores the client's feelings and subtly implies the weight gain is the client's fault. Pointing out that the medication has helped and that positive things have happened since the depression lifted may be true, but it does not address the client's current feelings or needs.
A nursing student is assisting an older patient who has decreased vision related to macular degeneration. The patient is alert, conversant, and cognitively intact. When would the supervising nurse intervene? 1. Student puts the call bell and personal items within reach and locates each item by guiding the patient's hand. 2. Student closes the curtains and turns off all of the lights at the end of the shift to encourage rest and sleep. 3. Student talks to the patient about family and asks, "So, when was the last time that you saw your uncle?" 4. Student assists during mealtime by opening packages and describing location of foods by using clock coordinates. The correct answer is 2. Student closes the curtains and turns off all of the lights at the end of the shift to encourage rest and sleep. For patients who retain some vision, the room should be well lit. Even at night, there should be a nightlight. Other options are correct actions. Words such as see, look, or view are parts of normal speech, and it's acceptable and natural to use these terms. The nurse is assessing the lower extremities of the client with peripheral vascular disease. During the assessment, the nurse should expect to find which of the following clinical manifestations of PVD? Select all that apply. 1. Hairy legs. 2. Mottled skin. 3. Pink skin. 4. Coolness. 5. Moist skin. The correct answers are 2. Mottled skin and 4. Coolness. Reduction of blood flow to a specific area results in decreased oxygen and nutrients. As a result, the skin may appear mottled. The skin will also be cool to the touch. Loss of hair and dry skin are other signs that the nurse may observe in a client with PVD of the lower extremities. The client will have an abdominal hysterectomy tomorrow. Which of the following information will be most important for the nurse to give to the client prior to admission to the hospital? 1. What to wear to the hospital. 2. What she can eat and drink before admission. 3. The type of pain medication that will be prescribed post-operatively. 4. The amount of activity she can have after surgery. The correct answer is 2. What she can eat and drink before admission. It is a priority that the client knows she will not be able to eat or drink for 8 hours before admission. A client who consumes food and fluid before receiving a general anesthetic is at risk for aspiration, which can lead to aspiration pneumonia, respiratory arrest, and even death. The clothing she should wear to the hospital and the type of medication she will receive are important, but not the priority. Information on exercise and resumption of normal activities can be included in the discharge teaching.
A client with Berger's disease smokes 2 packs of cigarettes a day. When helping a client change smoking behavior, it is important to know the clients. 1. Ability to attend support groups. 2. Goals for the treatment. 3. Perception of the negative behavior. 4. Motivation. The correct answer is 3. When helping a client change detrimental health behavior, it is critical to learn how the client perceives a situation or problem. The client is more likely to change detrimental health behaviors if he realizes that there's a problem and that these behaviors lead to the problem. While understanding the client's ability to attend group meetings, his goals for treatment, and his motivation may help facilitate change, the nurse should first understand the client's perception of the problem and then determine what strategies might work from his perspective. The triage nurse in the emergency room must prioritize the children waiting to be seen. Which of the following children is in the greatest need of emergency medical treatment? 1. A 6-year-old with fever 104 degrees Fahrenheit, a muffled voice, no spontaneous cough, and drooling. 2. A 3-year-old with fever 100 degrees Fahrenheit, a barky cough, and mild intercostal retractions. 3. A 4-year-old with fever 101 degrees Fahrenheit, a hoarse cough, inspiratory stridor, and restlessness. 4. A 13-year-old with fever 104 degrees Fahrenheit, chills, and a cough with thick yellow secretions. The correct answer is 1. This child is exhibiting signs and symptoms of epiglottitis, which is a medical emergency due to the risk of complete airway obstruction. The 3 and 4-year-olds are exhibiting signs and symptoms of croup. Symptoms often diminish after the child has been taken out in the cool night air. If symptoms do not improve, the child may need a single dose of dexamethasone. Fever should also be treated with antipyretics. The 13-year-old is exhibiting signs and symptoms of bronchitis. Treatment includes rest, antipyretics, and hydration. The charge nurse is making assignments for the day shift. Which patient should be assigned to the nurse who was floated from the post-anesthesia care unit for the day? 1. A 35-year-old patient with osteomyelitis who needs teaching before hyperbaric oxygen therapy. 2. A 62-year-old patient with osteomalacia who is being discharged to a long-term care facility. 3. A 68-year-old patient with osteoporosis given a new orthotic device whose knowledge of its use must be assessed. 4. A 72-year-old patient with Paget disease who has just returned from surgery for total knee replacement. The correct answer is 4. A 72-year-old patient with Paget disease who has just returned from surgery for total knee replacement. Rationale. The post-anesthesia care unit nurse is very familiar with the assessment skills necessary to monitor a patient who just underwent surgery. For the other patients, nurse is familiar with musculoskeletal system. Related nursing care are needed to provide teaching and assessment and prepare a report to the long-term care facility.
The parent of a child with cystic fibrosis asks the nurse what will be done to relieve the child's constipation. Which is the nurse's best response? 1. Your child likely has an obstruction and will require surgery. 2. Your child will likely be given IV fluids. 3. Your child will likely be given Miralax. 4. Your child will be placed on a clear liquid diet. The correct answer is 3. Your child will likely be given Miralax. CF clients with constipation commonly receive a stool softener or an osmotic solution such as Miralax orally to relieve their constipation. Answers 1 and 2 can be eliminated because surgery and IV fluids are not indicated for constipation. For which primary reason is a nurse expert called to testify in a lawsuit regarding professional nursing malpractice? 1. To strengthen the defense. 2. To support the prosecution. 3. To present standards of nursing care as they apply to the facts in the case. 4. To make judgments associated with laws governing the practice of nursing. The correct answer is 3. To present standards of nursing care as they apply to the facts in the case. The American Nurses Association Standards of Clinical Nursing Practice are authoritative statements by which the National Organization for Nursing describes the responsibilities for which nurses are accountable. An expert nurse is capable of explaining these standards as they apply to the situation under litigation. These professional standards are criteria that help a judge or jury determine if a nurse committed malpractice or negligence. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. Which client should the nurse use caution with when applying mafenide acetate to a burned area? 1. A client with a creatinine level of 0.8 mg per deciliter. 2. A client diagnosed with chronic obstructive pulmonary disease. 3. A client with a pulse oximeter reading of 95%. 4. A client diagnosed with type 2 diabetes who is taking insulin. The correct answer is 2. A client diagnosed with chronic obstructive pulmonary disease. Mafenide acetate is a topical antimicrobial. Mafenide acetate impairs the renal mechanism involved in the buffering of the blood, thereby increasing the excretion of bicarbonate in the urine. When this occurs, the pulmonary system effects a compensatory hyperventilatory status to maintain normal acid-base balance. If this compensation cannot take place as a result of pulmonary disease, the client develops metabolic acidosis. Mafenide acetate affects the acid-base balance in the body and should not be administered to clients diagnosed with renal disease. A 0.8 mg per deciliter serum creatinine level is within normal range of 0.5 to 1.5 mg per deciliter. Therefore, the nurse would not need to use caution with this client. This client has adequate respiratory status. Therefore, the nurse would not need to use caution with this client. There is no reason a client diagnosed with diabetes could not be prescribed mafenide acetate.
When developing a teaching plan for a client about the medications prescribed for depression, which of the following components is most important for the nurse to include? 1. Pharmacokinetics of the medication. 2. Current research related to the medication. 3. Management of common adverse effects. 4. Dosage regulation and adjustment. The correct answer is 3. Management of common adverse effects. Rationale. Compliance with medication therapy is crucial for the client with depression. Medication noncompliance is the primary cause of relapse among psychiatric clients. Therefore, the nurse needs to teach the client about managing common adverse effects to promote compliance with medication. Teaching the client about the medication's pharmacokinetics may help the client to understand the reason for the drug. However, teaching about how to manage common adverse effects to promote compliance is crucial. Current research about the medication is more important to the nurse than to the client. Teaching about dosage regulation and adjustment of medication may be helpful, but typically the primary healthcare provider, not the client, is the person in charge of this aspect.
In the care of a patient who recently sustained blindness, which tasks would be delegated to assistive personnel? Select all that apply. 1. Counseling the patient to express grief or loss. 2. Assisting the patient with ambulating in the hall. 3. Orienting the patient to the surroundings. 4. Encouraging independence. 5. Obtaining supplies for hygienic care. 6. Storing personal items to reduce clutter. The correct answers are 2. Assisting the patient with ambulating in the hall, and 5. Obtaining supplies for hygienic care. Assisting the patient with ambulating in the hall and obtaining supplies are within the scope of practice of the AP. Counseling for emotional problems, orienting the patient to the room, and encouraging independence require formative evaluation to gauge readiness, and these activities should be the responsibility of the nurse. Storing items and rearranging furniture are inappropriate actions because the patient needs be able to consistently locate objects in the immediate environment. The nurse is unable to palpate the client's left pedal pulses. Which of the following actions should the nurse take next? 1. Auscultate the pulses with a stethoscope. 2. Call the physician. 3. Use a Doppler ultrasound device. 4. Inspect the lower left extremity. The correct answer is 3. Use a Doppler ultrasound device. When pedal pulses are not palpable, the nurse should obtain a Doppler ultrasound device. Auscultation is not likely to be helpful if the pulse isn't palpable. Inspection of the lower extremity can be done simultaneously when palpating, but the nurse should first try to locate a pulse by Doppler. Calling the physician may be necessary if there is a change in the client's condition. The nurse is witnessing the client's signature on the informed surgical consent for an abdominal hysterectomy. It is important to ascertain that the client understands that with this surgical procedure she will have 1. Decreased libido. 2. Infertility. 3. Depression. 4. Weight gain. The correct answer is 2. Infertility. The client needs to understand that with removal of the uterus, she will no longer be able to bear children or have menstrual periods. The surgical procedure should not change her libido or sexual functioning. Research does not support the idea that hysterectomy contributes to depression or weight gain. Research demonstrates that women who have managed health problems for some time before the hysterectomy may actually have a more positive effect, with less worry about their health condition, contraception, or pregnancy.
A client with Berger's disease has established a goal to stop smoking. Which medication would be the most helpful in attaining this goal? 1. Bupropion. 2. Nicotine. 3. Nitroglycerin. 4. Ibuprofen. The correct answer is 1. Bupropion is used to promote smoking cessation. All types of nicotine should be avoided to prevent vasoconstriction. Nitroglycerin, used for angina, and ibuprofen, an anti-inflammatory medication, have no role in smoking cessation. A 6-month-old on the pediatric floor has a respiratory rate of 68, mild intercostal retractions, and oxygen saturation of 89%. The infant has not been feeding well for the last 24 hours and is restless. Using the SBAR Situation Background Assessment Recommendation technique for communication, the nurse calls the primary healthcare provider with the recommendation for 1. Starting oxygen, 2. Providing sedation, 3. Transferring to PICU, 4. Prescribing a chest CT scan. The correct answer is 1. The infant is experiencing signs and symptoms of respiratory distress, indicating the need for oxygen therapy. Sedation will not improve the infant's respiratory distress and would likely cause further respiratory depression. If the infant's respiratory status continues to decline, she may need to be transferred to the PICU. Oxygen should be the priority as it may improve the infant's respiratory status. A chest CT is not indicated. However, a chest X-ray will be another appropriate recommendation for this infant. The nurse delegates the measurement of vital signs to an experienced assistive personnel. Osteomyelitis has been diagnosed in a patient. Which vital sign value would the nurse instruct the AP to report immediately for this patient? 1. Temperature of 101 degrees Fahrenheit. 2. Blood pressure of 136/80. 3. Heart rate of 96 beats per minute. 4. Respiratory rate of 24 breaths per minute. The correct answer is 1. Temperature of 101 degrees Fahrenheit. Rationale: an elevated temperature indicates infection and inflammation. This patient needs IV antibiotic therapy. The other vital sign values are normal or high normal.
The parents of a 5-week-old have just been told that their child has cystic fibrosis. The mother had a sister who died of CF when she was 19 years of age. The parents are sad and ask the nurse about their child's projected life expectancy. What is the nurse's best response? 1. The life expectancy for CF patients has improved significantly in recent years. 2. Your child might not follow the same course that the mother's sister did. 3. The healthcare provider will come to speak to you about treatment options. 4. The nurse answers their questions briefly, listens to their concerns, and is available later after they've processed the information. The correct answer is 4. The nurse answers their questions briefly, listens to their concerns, and is available later after they've processed the information. The nurse's best intervention is to listen as the parents express their concerns and fears. The nurse's answers should be brief, knowing that the parents are not able to process information right now. The nurse should be available later if the parents have any other concerns or questions, or if they just need someone with whom to talk. A nurse initiates a visit from a member of the clergy for a patient. How is the nurse functioning when initiating this visit? 1. Interdependently. 2. Independently. 3. Dependently. 4. Collegially. The correct answer is 2. Independently. A nurse does not need a primary healthcare provider's order to make a referral to a member of the clergy. An interdependent intervention requires a primary healthcare provider's order associated with a parameter. When a nurse initiates a referral to a member of the clergy, the nurse is working independently. A nurse can make a referral to a member of the clergy. This action is within the scope of nursing practice. The nurse can make a referral to a member of the clergy without collaborating with another professional healthcare team member. The client diagnosed with partial and full thickness burns to 35% of the body is admitted to the burn department. The HCP has prescribed famotidine. Which statement best describes the scientific rationale for administering this medication? 1. Famotidine acts on the cell wall to prevent bacterial growth. 2. Famotidine will help control the client's pain. 3. Famotidine will help decrease the client's nausea and vomiting. 4. Famotidine will help decrease gastric acid production. The correct answer is 4. Famotidine will help decrease gastric acid production. Curling's ulcer is an acute ulceration of the stomach or duodenum that forms following a burn injury. Histamine 2 antagonists like famotidine are administered to decrease gastric acid secretion in the acute phase of burn care. Silver sulfadiazine, a topical antimicrobial, not famotidine, acts on the cell membrane and cell wall of susceptible bacteria and binds to cellular DNA. IV opioid medications, not famotidine, will help decrease the client's pain. Antiemetics, not famotidine, will help prevent the client's nausea and vomiting.
A client taking paroxetine, Paxil, 40 milligrams PO every morning tells the nurse that her mouth feels like cotton. Which of the following statements by the client necessitates further assessment by the nurse? 1. I'm sucking on ice chips. 2. I'm using sugarless gum. 3. I'm sucking on sugarless candy. 4. I'm drinking 12 glasses of water every day. The correct answer is 4. I'm drinking 12 glasses of water every day. Rationale. Dry mouth is a common, temporary side effect of paroxetine. The nurse needs to further assess the client's water intake when the client states she is drinking lots of water. Excessive intake of water could be harmful to the client and could lead to electrolyte imbalance. Dry mouth is caused by the medication, and drinking a lot of water will not eliminate it. Sucking on ice chips or using sugarless gum or candy is appropriate to ease the discomfort of dry mouth associated with paroxetine.
Which patients would be best to assign to the most experienced nurse in an ambulatory care center that specializes in vision problems and eye surgery? Select all that apply. 1. Patient who requires post-operative instructions after cataract surgery. 2. Patient who needs an iPad and a metal shield applied. 3. Patient who requests a home health referral for dressing changes and eye drop installation. 4. Patient who needs teaching about self-administration of eye drop. 5. Patient who requires an assessment for recent and sudden loss of sight. 6. Patient who requires preoperative teaching for laser trabeculoplasty. The correct answers are 1. Patient who requires post-operative instructions after cataract surgery. 3. Patient who requests a home health referral for dressing changes and eye drop installation. 5. Patient who requires an assessment for recent and sudden loss of sight. And 6. Patient who requires preoperative teaching for laser trabeculoplasty. Providing post-operative and preoperative instructions, making home health referrals, and assessing for needs related to loss of vision should be done by an experienced nurse who can give specific details and specialized information about follow-up eye care and adjustment to loss. The principles of applying an iPad and shield and teaching the administration of eye drops are basic procedures that should be familiar to all nurses. Which of the following lipid abnormalities is a risk factor for the development of atherosclerosis and peripheral vascular disease? 1. Low concentration of triglycerides. 2. High levels of high-density lipid cholesterol. 3. High levels of low-density lipid cholesterol. 4. Low levels of LDL cholesterol. The correct answer is 3. High levels of low-density lipid cholesterol. An increased LDL cholesterol concentration has been documented as a risk factor for the development of atherosclerosis. LDL cholesterol is not broken down in the liver, but is deposited into the intima of the blood vessels. Low triglyceride levels are desirable. High HDL and low LDL levels are beneficial and are known to be protective for the cardiovascular system. Which is the correct order from first to last for proper placement of a urinary catheter? 1. Lubricate the catheter adequately with a water-soluble lubricant. 2. Ensure free flow of urine. 3. Insert the catheter far enough into the bladder to prevent trauma to the urethral tissue. 4. Prepare a sterile field. The correct order is 4. Prepare a sterile field. 1. Lubricate the catheter adequately with a water-soluble lubricant. 3. Insert the catheter far enough into the bladder to prevent trauma to the urethral tissue. And 2. Ensure free flow of urine. After gathering appropriate supplies, the nurse should prepare a sterile field. After lubricating the catheter adequately with a water-soluble lubricant to minimize trauma to the urethra, the nurse should insert the catheter far enough into the bladder so the retention balloon does not traumatize urethral tissues. Ensuring a free flow of urine prevents infection. Improper drainage occurs when tubing is kinked or twisted. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
The nurse is assessing a client with Buerger's disease. The nurse should determine if the client is experiencing 1. Thickening of the intima and media of the artery. 2. Inflammation and fibrosis of arteries, veins, and nerves. 3. Vasospasm lasting several minutes. 4. Pain, pallor, and pulselessness. The correct answer is 2. Buerger's disease is characterized by inflammation and fibrosis of arteries, veins, and nerves. White blood cells infiltrate the area and become fibrotic, which results in occlusion of the vessels. Signs and symptoms include slowly developing claudication, cyanosis, coldness, and pain at rest. Thickening of the intima and media of the artery is characteristic of atherosclerosis. Vasospasm lasting several minutes is characteristic of Raynaud's disease. Pain, pallor, and pulselessness are symptoms of acute occlusion of an artery by an embolus or other cause such as compartment syndrome. The nurse is working with an assistive personnel to provide care for 6 patients. At the beginning of the shift, the nurse carefully tells the AP what patient interventions and tasks he or she is expected to perform. Which 4 C's guide the nurse's communication with the AP? Select all that apply. 1. Clear. 2. Comprehensive. 3. Concise. 4. Credible. 5. Correct. 6. Complete. The correct answers are 1. Clear, 3. Concise, 5. Correct, and 6. Complete. Rationale. Clear, concise, correct, and complete are the 4 C's of communication. Implementing the 4 C's of communication helps the nurse ensure that the AP understands what is being said, that the AP does not confuse the nurse's directions, that the directions comply with policies, procedures, job descriptions, and the law, and that the AP has all the information necessary to complete the tasks assigned.
A 7-month-old has a low-grade fever, nasal congestion, and a mild cough. What should the nursing care management of this child include? Select all that apply. 1. Maintaining strict bed rest. 2. Avoiding contact with family members. 3. Instilling saline nose drops and bulb suctioning. 4. Keeping the head of the bed flat. 5. Providing humidity and propping the head of the bed up. The correct answers are 3. Instilling saline nose drops and bulb suctioning, and 5. Providing humidity and propping the head of the bed up. Infants are nose breathers and often have increased difficulty when they are congested. Nasal saline drops and gentle suctioning with a bulb syringe are often recommended. Other helpful suggestions for infants with colds are to provide humidity with a cool mist humidifier or take them into a steamy bathroom. In addition, raising the head of the bed helps with drainage of secretions. You can eliminate answer 4 given a basic understanding of interventions to improve respiratory function. A patient is asked to participate in a medical research study. Which document should the nurse explain to the patient because it protects the patient's rights? 1. Code of Ethics. 2. Informed Consent. 3. Nurse Practice Act. 4. Constitution of the United States. The correct answer is 2. Informed Consent. Informed consent is an agreement by a person to accept a course of treatment or a procedure after receiving complete information necessary to make a knowledgeable decision. Nurse Practice Acts define the scope of nursing practice. They are unrelated to participation in research studies. The HCP prescribed morphine 2 to 5 milligrams intramuscular every 2 hours for the client diagnosed with full thickness, burns to the chest and abdominal area. The client reports pain of 10 on a pain scale from 1 through 10. Which intervention should the nurse implement? 1. Administer 5 milligrams of morphine IM to the client immediately. 2. Contact the HCP to request an increase in the medication. 3. Request a patient-controlled analgesia pump for the client. 4. Assess the client for complications and then administer the medication. The correct answer is 3. Request a patient-controlled analgesia pump for the client. The client should have IV pain medication until hemodynamic stability and unimpaired tissue perfusion return. The PCA pump provides an IV route, and the client can control the amount of medication administered with the PCA, ensuring safe limits of pain medication. The client should receive IV medication, not IM medication. Therefore, the nurse should not administer this medication after assessing the client. The nurse should be a client advocate and notify the HCP for a change in the route of the morphine.
The client with depression has been consistent with taking 12.5 milligrams of paroxetine, Paxil, extended release daily. The nurse judges the client to be benefiting from this drug therapy when the client demonstrates which of the following behaviors? Select all that apply. 1. Takes 2-hour evening naps daily. 2. Completes homework assignments. 3. Decreases pacing. 4. Increases somatization. 5. Verbalizes feelings. The correct answers are 2. Completes homework assignments. 3. Decreases pacing. And 5. Verbalizes feelings. Rationale. Symptoms of depression include depressed mood, appetite disturbance, sleep disturbance, psychomotor disturbance, fatigue, feelings of worthlessness, excessive or inappropriate guilt, and decreased concentration. Paroxetine is a selective serotonin reuptake inhibitor antidepressant that also can be used to treat anxiety. Improved concentration, verbalization of feelings, and decreased agitation or pacing are signs of improvement. Taking 2-hour evening naps daily is still a sign of fatigue or lack of energy, and the increased use of somatization could be signs of continued symptoms of depression.
The nurse is preparing to administer a beta-adrenergic blocking glaucoma agent. Which statement made by the patient warrants additional assessment and a notification to the healthcare provider? 1. My blood pressure runs a little high if I gain too much weight. 2. Occasionally, I have palpitations, but they pass very quickly. 3. My joints feel stiff today, but that's just my arthritis. 4. My pulse rate is a little low today because I take digoxin. The correct answer is 4. My pulse rate is a little low today because I take digoxin. All beta-adrenergic blockers are contraindicated in bradycardia. Alpha-adrenergic agents can cause tachycardia and hypertension. Carbonic anhydrase inhibitors should not be given to patients with rheumatoid arthritis who are taking high dosages of aspirin. When assessing an individual with peripheral vascular disease, which clinical manifestation would indicate complete arterial obstruction in the lower left leg? 1. Aching pain in the left calf. 2. Burning pain in the left calf. 3. Numbness and tingling in the left leg. 4. Coldness of the left foot and ankle. The correct answer is 4. Coldness of the left foot and ankle. Coldness in the left foot and ankle is consistent with complete arterial obstruction. Other expected findings would include paralysis and pallor. Aching pain, a burning sensation, or numbness and tingling are earlier signs of tissue hypoxia and ischemia, and are commonly associated with incomplete obstruction. Which of the following physical sensations will the client who has had an abdominal hysterectomy most likely experience if she hyperventilates while performing deep breathing exercises? 1. Dyspnea. 2. Dizziness. 3. Blurred vision. 4. Mental confusion. The correct answer is 2. Dizziness. Hyperventilation occurs when the client breathes so rapidly and deeply that she exhales excessive amounts of carbon dioxide. A characteristic symptom of hyperventilation is dizziness. To avoid hyperventilation, the nurse should assist the client in the practice of slow, deep breathing in a regular breathing pattern. Dyspnea, blurred vision, and mental confusion are not associated with hyperventilation.
When instructing a client who has been newly diagnosed with vasospastic disorder, Raynaud's phenomenon, about management of care, the nurse should discuss which of the following topics? 1. Scheduling a sympathectomy procedure for the next visit. 2. Using a beta blocker medication. 3. Follow-up monitoring for development of connective tissue disease. 4. Benefit of an angioplasty to the affected extremities. The correct answer is 3. Clients with Raynaud's phenomenon should receive routine follow-up to monitor symptoms and to assess the development of connective tissue or autoimmune diseases associated with Raynaud's. Beta blockers are not considered first-line drug therapy. A sympathectomy is considered only in advanced cases. There is no benefit to an angioplasty, which is used for atherosclerotic vascular disease. The nurse is caring for a patient with carpal tunnel syndrome who has been admitted for surgery. Which intervention should be delegated to the assistive personnel? 1. Initiating placement of a splint for immobilization during the day. 2. Assessing the patient's wrist and hand for discoloration and brittle nails. 3. Assisting the patient with daily self-care measures, such as bathing and eating. 4. Testing the patient for painful tingling in the 5 digits of the hand. The correct answer is 3. Assisting the patient with daily self-care measures, such as bathing and eating. Rationale. Helping with activities of daily living is within the scope of practice of APs. Placing a splint for the first time is appropriate to the scope of practice of physical therapists. Assessing and testing for paresthesia are not within the scope of practice of APs and are appropriate for professional nurses.
A school-aged child has been diagnosed with nasopharyngitis. The parent is concerned because the child has had little or no appetite for the last 24 hours. Which is the nurse's best response? 1. Do not be concerned. It is common for children to have a decreased appetite during a respiratory illness. 2. Be sure your child is taking an adequate amount of fluids. The appetite should return soon. 3. Try offering the child some favorite foods. Maybe that will improve the appetite. 4. You need to force your child to eat whatever you can. Adequate nutrition is essential. The correct answer is 2. Be sure your child is taking an adequate amount of fluids. The appetite should return soon. It is common for children to have a decreased appetite when they have a respiratory illness. The nurse is appropriately instructing the parent that the child will be fine by taking in an adequate amount of fluid, which will keep the child hydrated. Answer 4 can be eliminated because one should not force the child to eat. If the word encourage had been used, answer 4 would have been a better choice, although still not the best answer. Answer 1 can be eliminated because the nurse did not inform the parent of the importance of maintaining adequate fluid intake. Which element of ethical practice is associated with fair policies and procedures guiding allocation of organs for transplantation? 1. Justice. 2. Fidelity. 3. Veracity. 4. Non-maleficence. The correct answer is 1. Justice. Justice refers to fairness and that all patients should be treated equally, impartially, and without prejudice regardless of individual factors. Fidelity refers to making only promises or commitments that can be kept. Veracity refers to being truthful, which is essential to a trusting nurse-patient relationship. Non-maleficence refers to preventing harm, avoiding actions that can cause harm, or removing a patient from harm. The client is prescribed silver sulfadiazine for a partial thickness burn to the back. Which information should the nurse discuss concerning this medication? 1. Encourage the client to drink 3,000 milliliters of water. 2. Discuss the need to eat foods high in protein. 3. Teach the client how to test the urine for ketones. 4. Instruct the client to change the dressing twice a day. The correct answer is 1. Encourage the client to drink 3,000 milliliters of water. Silver sulfadiazine is a sulfonamide antibacterial agent. The client should drink large amounts of fluids to prevent sulfa crystals from forming in the urine. The client should eat foods high in protein for healing purposes, but this does not specifically concern this medication. Ketones are a byproduct of fat breakdown and would not be specific for teaching about silver sulfadiazine. The client should change the dressing twice a day, but this is not part of teaching about the medication silver sulfadiazine.
A client diagnosed with major depression has sleep and appetite disturbances and a flat affect and is withdrawn. The client has been taking fluvoxamine Luvox, 50 milligrams twice daily for 5 days. Which client behavior is most important to report to the next shift? 1. Client's flat affect. 2. Clients interacting with a visitor. 3. Client sleeping from 11 p.m. to 6 a.m. 4. Client spending the entire evening in her room. The correct answer is 3. Client sleeping from 11 p.m. to 6 a.m. Rationale. The most important behavior to report to the next shift is that the client was able to sleep from 11 p.m. to 6 a.m. This indicates that improvement in the symptoms of depression is occurring as a result of pharmacologic therapy. The nurse would expect to observe improvement in sleep, appetite, and psychomotor behavior first before improvement in cognitive symptoms. The client's flat affect is still a symptom of depression. The fact that the client had a visitor is not as important as changes in the client's behavior. Spending the evening in her room is a continuation of the client's withdrawn behavior and is important to report, but not as important as the improvement in sleep.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. The nurse is supervising a new nurse who has just finished assessing a patient for redness and discomfort to the right eye. The new nurse documents Visual Acuity NA. Which action would the supervising nurse take? 1. Do nothing. The documentation is minimal but acceptable. 2. Ask her to explain the rationale for the documentation. 3. Reassess the patient's eye and vision to validate findings. 4. Suggest contacting the clinical educator for documentation tips. The correct answer is 2. Ask her to explain the rationale for the documentation. Asking the nurse to explain the documentation is a way of assessing her knowledge of documentation, her understanding of how the patient's report guides the focused assessment, and her understanding of the use of abbreviations. The nurse may have a good reason for charting NA, but a reader could misunderstand. For example, Visual Acuity NA could be interpreted as the nurse making a clinical judgment that assessing vision was not applicable for this patient. The documentation is not acceptable because the patient's report indicates that vision should be tested if at all possible. Redoing the assessment does not help the nurse to correct mistakes. Contacting the educator for assistance is an option that is based on assessment of her rationale. A client with peripheral vascular disease returns to the surgical care unit after having femoral popliteal bypass grafting. Indicate in which order the nurse should conduct assessment of this client. 1. Post-operative pain. 2. Peripheral pulses. 3. Urine output. 4. Incision site. The correct order is 2. Peripheral pulses. 4. Incision site. 3. Urine output. And 1. Post-operative pain. Because assessment of the presence and quality of the pedal pulses in the affected extremity is essential after surgery to make sure that the bypass graft is functioning, this step should be done first. The nurse should next ensure that the dressing is intact, and then that the client has adequate urine output. Lastly, the nurse should determine the client's level of pain. Which nursing measure would most likely relieve post-operative gas pains after abdominal hysterectomy? 1. Offering the client a hot beverage. 2. Providing extra warmth. 3. Applying a snugly fitting abdominal binder. 4. Helping the client walk. The correct answer is 4. Helping the client walk. The discomfort associated with gas pains is likely to be relieved when the client ambulates. The gas will be more easily expelled with exercise. The anesthesia, analgesics, and immobility have altered normal peristalsis. Peristalsis will be stimulated by exercise. Offering a hot beverage, providing extra warmth, and applying an abdominal binder are not recommended and could aggravate the discomfort of post-operative gas pains.
A client has been diagnosed with vasospastic disorder, Raynaud's phenomenon, on the tip of the nose and fingertips. The physician has prescribed reserpine to determine if the client will obtain relief. The client often works outside in cold weather and also smokes 2 packs of cigarettes per day. Which of the following should be included in the discharge plan for this client? Select all that apply. 1. Stopping smoking. 2. Wearing a face covering and gloves in the winter. 3. Placing fingertips in cool water to rewarm them. 4. Finding employment that can be done in a warm environment. 5. reporting signs of orthostatic hypotension. The correct answers are 1, 2, and 5. Vasospastic disorder, Raynaud's disease, is a form of intermittent arteriolar vasoconstriction that results in coldness, pain, and pallor of the fingertips, toes, or tip of the nose, and a rebound circulation with redness and pain. The nurse should instruct the client to stop smoking because nicotine is a vasoconstrictor. An adverse effect of reserpine is orthostatic hypotension. The client should report dizziness and low blood pressure, as it may be necessary to consider stopping the drug. The client should prevent vasoconstriction by covering affected parts when in cold environments. The nurse can teach the client to rewarm exposed extremities by using warm water or placing them next to the body, such as under the axilla. It is not realistic to ask this client to change jobs at this time. The nurse observes the assistive personnel performing all of these interventions for a patient with carpal tunnel syndrome, which action requires that the nurse intervene immediately. 1. Arranging the patient's lunch tray and cutting his meat. 2. Providing warm water and assisting the patient with his bath. 3. Replacing the patient's splint in hyperextension position. 4. Reminding the patient not to lift very heavy objects. The correct answer is 3, replacing the patient's splint in hyperextension position. Rationale. When a patient with CTS has a splint to immobilize the wrist is placed either in the neutral position or in slight extension, not hyperextension. The other interventions are correct and are within the scope of practice of an AP. APs may remind patients about elements of their care plans that have already been taught, such as avoiding heavy lifting.
A child's parent asks the nurse what treatment the child will need for the diagnosis of strep throat. Which is the nurse's best response? 1. Your child will be sent home on bed rest and should recover in a few days without any intervention. 2. Your child will need to have the tonsils removed to prevent future strep infections. 3. Your child will need oral penicillin for 10 days and should feel better in a few days. 4. Your child will need to be admitted to the hospital for 5 days of intravenous antibiotics. The correct answer is 3. Your child will need oral penicillin for 10 days and should feel better in a few days. The child will need a 10-day course of penicillin amoxicillin to treat the strep infection. It is essential that the nurse always tell the family that, although the child will feel better in a few days, the entire course of antibiotics must be completed. Answer 2 can be eliminated because it is a treatment for recurrent tonsillitis, not strep throat. Answer 1 can be eliminated if the test taker understands that bacterial infections need to be treated with antibiotics. A primary healthcare provider orders out of bed to a chair as the activity level for a patient. How is the nurse functioning when moving this patient out of bed to a chair? 1. Interdependently. 2. Collaboratively. 3. Independently. 4. Dependently. The correct answer is 4. Dependently. Determining the extent of activity desirable for a patient is within the primary healthcare provider's, not a nurse's, scope of practice. Following activity orders is a dependent function of the nurse. The nurse is using the antimicrobial binding dressing, Actisorb Silver 220, for a stage 3 pressure ulcer on the left hip area. The dressing is a combination of silver and activated charcoal. Which intervention should the nurse implement? 1. Perform the sterile dressing change twice a day. 2. Avoid cutting the dressing when applying it to the wound. 3. Pre-medicate the client with a narcotic analgesic. 4. Do not use tape to hold the secondary dressing in place. The correct answer is 2. Avoid cutting the dressing when applying it to the wound. The nurse should avoid cutting the dressing because particles of activated charcoal may get into the wound and cause discoloration. The dressing may be left in place for up to 7 days or may be changed every 24 hours, but it would not be changed twice a day. This does not allow the dressing adequate time to increase healing of the wound. The dressing change does not warrant administering a narcotic analgesic to the client. Tape should be used to hold the secondary dressing in place, or the antimicrobial binding dressing will not remain in the pressure ulcer.
A client with major depressive disorder has independently showered, dressed, and washed her hair for the first time since her admission to the inpatient unit 4 days ago. In an interaction with the nurse, she still stresses her faults. She states, "I'm just no good. I can't do anything right." The nurse's best response would be 1. You look very nice today. 2. You were able to shower, wash your hair, and dress today. 3. I'll get out the craft project that you wanted to complete. 4. What is your goal for today? The correct answer is 2. You were able to shower, wash your hair, and dress today. Rationale. An objective reflection by the nurse based on actual behavior is the best affirmation for the client to help boost self-esteem. Depressed persons tend to reject positive opinions from others. Picking a project for such a client is also likely to bring a negative response and/or foster dependence. Antipsychotics are sometimes prescribed for clients with bipolar disorder and would not pose a special concern.
Phenylephrine, an adrenergic agonist, has been prescribed as a topical application for a patient who had intraocular surgery. Although systemic toxicity is unlikely, which adverse physiologic response is the concern? 1. Cardiovascular response, such as hypertension or ventricular dysrhythmias. 2. Renal response, such as urinary retention or urinary incontinence. 3. Respiratory response, such as bronchospasm or mucus plugs. 4. Musculoskeletal response, such as bone pain or joint stiffness. The correct answer is 1. Cardiovascular response, such as hypertension or ventricular dysrhythmias. Topical phenylephrine usually does not cause systemic reactions because the amount of absorption is very small. Cardiac responses are the concern. Other possible reactions may include sweating, tremors, agitation, or confusion. A client with heart failure has bilateral +4 edema of the right ankle that extends up to the midcalf. The client is sitting in a chair with the legs in a dependent position. Which of the following goals is the priority? 1. Decrease venous congestion. 2. Maintain normal respirations. 3. Maintain body temperature. 4. Prevent injury to lower extremities. The correct answer is 1. Decrease venous congestion. Decreasing venous congestion in the extremities is a desired outcome for clients with heart failure. The nurse should elevate the client's legs above the level of the heart to achieve this goal. The client is not demonstrating difficulty breathing or being cold. The nurse should prevent injury to the swollen extremity. However, this is not the priority. On the second post-operative day after an abdominal hysterectomy, the client develops a temperature of 100.4 degrees Fahrenheit. The nurse's first action should be to 1. Increase the number of wound changes to minimize infection. 2. Obtain a culture and sensitivity study of the urine to determine the source of infection. 3. Ensure that the client takes at least 10 deep breaths every hour. 4. Change the site of the client's IV fluid catheter to reduce the risk of infection. The correct answer is 3. Ensure that the client takes at least 10 deep breaths every hour. Elevated temperature on the second post-operative day is suggestive of a respiratory tract infection. Respiratory infections most often occur during the first 48 hours after surgery. The client's vital signs should be monitored closely, and abnormalities should be reported to the surgeon. Signs of infection, if present in the wound or urinary tract, are likely to occur later in the post-operative period. There is no indication that the IV catheter is the source of infection.
A nurse assesses a 40-year-old female client with vasospastic disorder, Raynaud's phenomenon, involving her right hand. The nurse notes the information in the progress notes. The notes say, the client has a palpable but faint right radial pulse. Capillary refill on 5 digits is less than 8 seconds. No observable swelling. The client is reporting numbness in the tips of all digits. The skin is warm, dry, and red. From these findings, the nurse should develop a plan with the client to first manage. 1. Acute pain. 2. Numbness. 3. Lack of circulation. 4. Potential for skin breakdown. The correct answer is 2. The client has numbness in the fingertips, and the nurse should first help the client regain sensory perception and discuss strategies for prevention of injury. The client does not have acute pain. The client does have adequate circulation and is not at risk for skin breakdown at this time. A patient is scheduled for endoscopic carpal tunnel release surgery in the morning. What would the nurse be sure to teach the patient? 1. Pain and numbness are expected to be experienced for several days to weeks. 2. Immediately after surgery, the patient will no longer need assistance. 3. After surgery, the dressing will be large and there will be lots of drainage. 4. The patient's pain and paresthesia will no longer be present. The correct answer is 1. Pain and numbness are expected to be experienced for several days to weeks. Rationale. Postoperative pain and numbness occur for a longer period of time with endoscopic carpal tunnel release than with an open procedure. Patients often need assistance post-operatively, even after they are discharged. The dressing from the endoscopic procedure is usually very small, and there should not be a lot of drainage.
A child is complaining of throat pain. Which statement by the mother indicates that she needs more education regarding the care and treatment of her child's pharyngitis? 1. I will have my child gargle with salt water 3 times a day. 2. I will offer my child ice chips several times a day. 3. I will give my child Tylenol every 4 to 6 hours as needed. 4. I will ask the nurse practitioner for some amoxicillin. The correct answer is 4. I will ask the nurse practitioner for some amoxicillin. Pharyngitis is a self-limiting viral illness that does not require antibiotic therapy. Pharyngitis should be treated with rest and comfort measures, including Tylenol, throat sprays, cold liquids, and popsicles. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. A nurse witnesses an accident and assists the victim who has a life-threatening injury. Which should the nurse do to meet an important standard of care when acting as a good Samaritan at the scene of an accident? 1. Seek consent from the injured party before rendering assistance. 2. Implement every critical care intervention necessary to sustain life. 3. Stay on the scene until another qualified person takes over responsibility. 4. Insist on helping because a nurse is the best qualified person to provide care. The correct answer is 3. Stay on the scene until another qualified person takes over responsibility. When a nurse renders emergency care, the nurse has an ethical responsibility not to abandon the injured person. The nurse should not leave the scene until the injured person leaves or another qualified person assumes responsibility. Depending on the injured person's physical and emotional status, the person may or may not be able to consent to care. The nurse should not attempt interventions that are beyond the scope of nursing practice. The male client diagnosed with a stage 4 pressure ulcer on the coccyx area is being treated with an autolytic medication for debridement and an occlusive dressing. The wife of the client asks the nurse, "Why isn't someone doing something about that foul odor my husband has?" Which statement is the nurse's best response? 1. I will contact your husband's doctor when he makes rounds. 2. The odor is secondary to an infection, and he is taking antibiotics. 3. The odor is an expected reaction to the pressure dressing. 4. I am sorry the odor bothers you. We will bathe your husband. The correct answer is 3. The odor is an expected reaction to the pressure dressing. Option 3 is an expected reaction to the pressure dressing. The foul odor is produced by the breakdown of cellular debris and does not indicate that the wound is infected. In option 1, there is no reason to contact the HCP because this is an expected reaction to the pressure dressing. In option 2, the client may have an infection and is taking antibiotics, but this is not causing the foul odor. In option 4, bathing the husband will not help the odor. Therefore, this response is not appropriate.
A nurse is educating a client who has been diagnosed with dysthymia about possible treatment for the disorder. Which response by the nurse is most appropriate? 1. Antidepressants, particularly the selective serotonin reuptake inhibitor, SSRI, group, offer you the best treatment for your dysphonia. 2. Doctors recommend that clients experiencing dysphonia receive electroconvulsive therapy, ECT, to treat their disorder. 3. Because you have a mild, though long-lasting dysthymic mood, psychotherapy can usually bring improvement with less likelihood of the need for medication. 4. Since your dysthymia indicates a long-lasting mild depression, long-term psychoanalysis would be the best treatment for you. The correct answer is 3. Because you have a mild, though long-lasting dysthymic mood, psychotherapy can usually bring improvement with less likelihood of the need for medication. Rationale. Dysthymia is a milder, persistent type of depression in which sufferers are able to minimally carry on their work. Antidepressant and ECT are treatments used for occurrences of major depression, with ECT being used as a last resort when several medications fail. Psychoanalysis is a very involved, long-term treatment rarely used now due to its cost and the long period of treatment required for results.
An older patient had ranibizumab injected into his eye for treatment of wet age-related macular degeneration several days ago. He is now experiencing redness, light sensitivity, and pain. Which advice would the nurse give to the patient? 1. These are common side effects that should pass after a few more days. 2. Contact the healthcare provider immediately for possible eye infection. 3. Rest eyes as much as possible and wear sunglasses if lights are too bright. 4. Inform the HCP before the next treatment so that the dosage can be adjusted. The correct answer is 2. Contact the healthcare provider immediately for possible eye infection. Ranibizumab is an angiogenesis inhibitor that is directly injected into the vitreous humor of the eye. The purpose of the medication injection is to inhibit the growth of new blood vessels in patients who have neovascular age-related macular degeneration. The biggest concern about adverse effects of the treatment is endophthalmitis. This can be caused by bacteria, virus, or fungus. Redness, light sensitivity, or pain are signs of possible endophthalmitis that should be immediately reported to the provider. The nurse is assessing an older Caucasian male who has a history of peripheral vascular disease. The nurse observes that the man's left great toe is black. The discoloration is probably a result of 1. Atrophy, 2. Contraction, 3. Gangrene, 4. Rubor. The correct answer is 3. Gangrene. The term gangrene refers to blackened, decomposing tissue that is devoid of circulation. Chronic ischemia and death of the tissue can lead to gangrene in the affected extremity. Injury, edema, and decreased circulation lead to infection, gangrene, and tissue death. Atrophy is the shrinking of tissue, and contraction is joint stiffening secondary to disuse. The term rubor denotes a reddish color of the skin. The nurse is changing the dressing of a client after an abdominal hysterectomy. Which of the following nursing measures would be most appropriate if the dressing adheres to the client's incisional area? 1. Pull off the dressing quickly and then apply slight pressure over the area. 2. Lift an easily moved portion of the dressing and then remove it slowly. 3. Moisten the dressing with sterile normal saline solution and then remove it. 4. Remove part of the dressing and then remove the remainder gradually over a period of several minutes. The correct answer is 3. Moisten the dressing with sterile normal saline solution and then remove it. When a dressing sticks to a wound, it is best to moisten the dressing with sterile normal saline solution and then remove it carefully. Trying to remove a dry dressing is likely to irritate the skin and wound. This may contribute to tension or tearing along the suture line.
Which of the following clients is at greatest risk for vasospastic disorder, Raynaud's phenomenon? 1. Young women. 2. Old women. 3. Old men. 4. Young men. The correct answer is 1. Vasospastic disorder, Raynaud's disease, is more common in young women and is associated with collagen diseases such as rheumatoid arthritis and lupus. The charge nurse assigns the nursing care of a patient who has just returned from open carpal tunnel release surgery to an experienced LPN/LVN. Which instructions would the charge nurse provide for the LPN/LVN? Select all that apply. 1. Check the patient's vital signs every 15 minutes in the first hour. 2. Check the dressing for drainage and tightness. 3. Elevate the patient's hand above the heart. 4. The patient will no longer need pain medication. 5. Check the neurovascular status of the fingers every hour. 6. Instruct the patient to perform range of motion on the affected wrist. The correct answers are 1. Check the patient's vital signs every 15 minutes in the first hour. 2. Check the dressing for drainage and tightness. 3. Elevate the patient's hand above the heart. And 5. Check the neurovascular status of the fingers every hour. Rationale. Post-operatively, patients undergoing open carpal tunnel release surgery experience pain and numbness, and their discomfort may last for weeks to months. Hand movements may be restricted for 4 to 6 weeks after surgery. All of the other directions are appropriate for the postoperative care of this patient. It is important to monitor for drainage, tightness, and neurovascular changes. Raising the hand and wrist above the heart reduces the swelling from surgery, and this is often done for several days.
A school-aged child has been diagnosed with strep throat. The parent asks the nurse when the child can return to school. Which is the nurse's best response? 1. 48 hours after the first documented normal temperature. 2. 24 hours after the first dose of antibiotics. 3. 48 hours after the first dose of antibiotics. 4. 24 hours after the first documented normal temperature. The correct answer is 2. 24 hours after the first dose of antibiotics. Children with strep throat are no longer contagious 24 hours after initiation of antibiotic therapy. A faculty member of a nursing program is conducting an informational session for potential nursing students. Which information about licensure to practice nursing upon completion of a nursing program should the faculty member include in the session? 1. It is a responsibility of the American Nurses Association. 2. It is granted on graduation from a nursing program. 3. It is approved by the National League for Nursing. 4. It is required by law in each individual state. The correct answer is 4. It is required by law in each individual state. The American Nurses Association standards of clinical nursing practice do not address licensure. When a person graduates from a school of nursing, the individual receives a diploma that indicates completion of a course of study. The diploma is not a license to practice nursing. The National League for Nursing promotes nursing service and nursing education. It is not involved with licensure. The Nurse Practice Act in a state stipulates the requirements for licensure within the state. The nurse is changing a hydrocolloid antimicrobial barrier, dressing with silver, for a client diagnosed with a stage 4 pressure ulcer. Which intervention should the nurse implement first? 1. Rinse the wound with physiologically normal saline. 2. Remove the old dressing and assess the pressure ulcer. 3. Hold the dressing in place for 5 seconds after applying. 4. Apply sterile gloves when performing the procedure. The correct answer is 2. Remove the old dressing and assess the pressure ulcer. Removing the old dressing and assessing the pressure ulcer for healing is the first intervention. The nurse should rinse the wound with physiologically normal saline, but this is not the first intervention. This dressing must be held in place for 5 seconds after applying it to the pressure ulcer. The dressing change is performed with non-sterile gloves using aseptic technique. Therefore, this is not an appropriate intervention.
A client comes to the mental health clinic for a follow-up visit for a diagnosis of major depressive disorder. He says that he has been taking his escitalopram oxalate as prescribed since his second hospitalization 3 months ago. He tells the nurse that he is feeling like my old self again. Now he wants to stop taking medication. I don't want to be dependent on meds like my father. What is the nurse's best initial response to him? 1. After another 3 months of stability, it might be safe for you to go off the escitalopram. 2. After 2 significant episodes, you will need to take an antidepressant indefinitely. 3. Research indicates that individuals who have had 2 major depressive episodes have a 70% chance of having a third episode. 4. It is likely that you can learn to manage your depression with a regular exercise regime and a healthy diet. The correct answer is 3. Research indicates that individuals who have had 2 major depressive episodes have a 70% chance of having a third episode. Rationale. After 2 episodes of a major depressive disorder, the likelihood of a third episode increases to 70%. This information would be useful to convey prior to discussing the importance of continuing his medication. This client also has a family history of depression. A healthy diet and exercise are very significant adjuncts to the therapeutic plan, but may not be sufficient as standalone therapy.
A client sustains a chemical eye injury from a splash of battery acid. The nurse should prepare the client for which immediate measure? 1. Checking visual acuity. 2. Covering the eye with a pressure patch. 3. Swabbing the eye with antibiotic ointment. 4. Irrigating the eye with sterile normal saline. The correct answer is 4. Irrigating the eye with sterile normal saline. Emergency care after a chemical burn to the eye includes irrigating the eye immediately with sterile normal saline or ocular irrigating solution. The irrigation should be maintained for at least 10 minutes. After this emergency treatment, visual acuity is assessed. Options 2 and 3 are not immediate measures. A client has peripheral vascular disease of the lower extremities. The client tells the nurse, "I've really tried to manage my condition well." Which of the following routines should the nurse evaluate as having been appropriate for this client? 1. Resting with the legs elevated above the level of the heart. 2. Walking slowly but steadily for 30 minutes twice a day. 3. Minimizing activity. 4. Wearing anti-embolism stockings at all times when out of bed. The correct answer is 2. Walking slowly but steadily for 30 minutes twice a day. Slow, steady walking is a recommended activity for clients with peripheral vascular disease because it stimulates the development of collateral circulation. The client with PVD should not remain inactive. Elevating the legs above the heart or wearing anti-embolism stockings is a strategy for alleviating venous congestion and may worsen peripheral arterial disease. The client with an abdominal hysterectomy is being prepared for discharge in the morning. The client has a mentally retarded adult son whom she cares for at home. The nurse should discuss with the physician the need for referral to which of the following departments? 1. Home health care. 2. Social work. 3. Pastoral care. 4. Volunteer services. The correct answer is 2. Social work. The social worker will be able to coordinate respite care for the son and other community resources for this family. Home health care would provide care for the client herself, but respite care for the son is the priority need for this family. Pastoral care provides spiritual care. The volunteer department would not be responsible for coordination of care at the client's home. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
The client with vasospastic disorder, Raynaud's phenomenon, has coldness and numbness in the fingers. The nurse assesses the client for effects of vasoconstriction. Which of the following is an early sign of vasoconstriction? 1. Cyanosis. 2. Gangrene. 3. Pallor. 4. Rubor. The correct answer is 3. Initially, the vasoconstriction effect produces pallor or a whitish coloring, followed by cyanosis and finally rubor. Gangrene is the end result of complete arterial occlusion. The skin is blackened and without a blood supply. The nurse is preparing a patient who had carpal tunnel release surgery for discharge. Which information is important to provide for this patient? 1. The surgical procedure is a cure for carpal tunnel syndrome. 2. Do not lift any heavy objects. 3. Frequent doses of pain medication will no longer be necessary. 4. The healthcare provider should be notified immediately if there is any pain or discomfort. The correct answer is 2. Do not lift any heavy objects. Rationale: hand movements, including heavy lifting, may be restricted for 4 to 6 weeks after surgery. Patients experience discomfort for weeks to months after surgery. The surgery is not always a cure. In some cases, CTS may recur months to years after surgery.
A school-age child is admitted to the hospital for a tonsillectomy. During the nurse's post-operative assessment, the child's parent tells the nurse that the child is in pain. Which of the following observations would be of most concern to the nurse? 1. The child's heart rate and blood pressure are elevated. 2. The child complains of having a sore throat. 3. The child is refusing to eat solid foods. 4. The child is swallowing excessively. The correct answer is 4. The child is swallowing excessively. Excessive swallowing is a sign that the child is swallowing blood. This should be considered a medical emergency, and the healthcare provider should be contacted immediately. The child is likely bleeding and will need to return to surgery. Which is a recommended guideline for safe computerized charting? 1. Passwords to the computer system should only be changed if lost. 2. Computer terminals may be left unattended during client care activities. 3. Accidental deletions from the computerized file need to be reported to the nursing manager or supervisor. 4. Copies of printouts from computerized files should be kept on a clipboard at the nurse's station for other nurses to access. The correct answer is 3. Accidental deletions from the computerized file need to be reported to the nursing manager or supervisor. After any inadvertent deletions of permanent computerized records, the nurse should type an explanation into the computer file with the date, time, and his or her initials. The nurse should also contact the nursing manager or supervisor with a written explanation of the situation. Options 1, 2, and 4 represent unsafe charting actions. Only option 3 follows the guidelines for safe computer charting. The nurse is caring for a client diagnosed with a stage 3 pressure ulcer. The client has a Combiderm non-adhesive, sterile, hydrocolloidal dressing. Which data indicates the dressing is ready to be removed? 1. The exudate begins to pool on the wound surface. 2. The color of the drainage changes from brown to a yellow-gray. 3. The HCP must write an order to remove the dressing. 4. The softened area is approaching the edge of the dressing. The correct answer is 4. The softened area is approaching the edge of the dressing. This dressing is an absorbent hydrocolloidal dressing that provides a moist environment, absorbs exudates, and is non-damaging to the skin. When the softened area approaches the edge of the dressing, it must be removed, and a new one must be applied. Option 1 would indicate when an alginate dressing, not a hydrocolloidal dressing, is ready to be removed. The iodosorb gel, not the Combiderm dressing, should be changed when the color changes from brown to a yellow-gray. The nurse does not need a written order from the HCP to change the dressing.
The intake nurse is making an assessment of a client who has just arrived at the emergency department. Which of the following comments from this client who is taking phenelzine, a monoamine oxidase inhibitor, for treatment-resistant depression should be given top priority? 1. My bowels haven't moved in the last 2 days. 2. What was my temperature? I'm feeling warm. 3. My legs feel stiff after I sit in the chair for a while. 4. I have a throbbing headache. The correct answer is 4. I have a throbbing headache. Rationale. A serious, life-threatening reaction to MAO inhibitors is hypertensive crisis. Although this medication is inclined to reduce blood pressure, in combination with too much tyramine, blood pressure can rise to a dangerous level. A throbbing headache could be a significant indicator of an impending crisis.
The nurse is preparing to have a patient who has acute leukemia sign the permit for a bone marrow aspiration. The patient states that the oncologist has explained the procedure and the complications, and she has no further questions. What assessment is most important for the nurse to complete before the procedure is carried out? 1. Review the patient's do not resuscitate status. 2. Review the platelet count. 3. Review the leukocyte count. 4. Ask when the patient ate last. The correct answer is 2. Review the platelet count. The most important assessment to carry out before the procedure is to review the platelet count to ensure that the platelets are within normal limits. A complication of a bone marrow aspiration is bleeding, and platelets are necessary for normal clotting to take place. The nurse should also review the prothrombin time, partial thromboplastin time, and international normalized ratio for the same reason. A patient's DNR status should be reviewed in case of an emergency on all ill patients as a general rule. The leukocyte count in leukemia is expected to be altered and is not important when considering the bleeding complication. Usually, it is not necessary for a patient to be NPO before the procedure. A client is scheduled for an arteriogram. The nurse should explain to the client that the arteriogram will confirm the diagnosis of occlusive arterial disease by 1. Showing the location of the obstruction and the collateral circulation. 2. Scanning the affected extremity and identifying the areas of volume changes. 3. Using ultrasound to estimate the velocity changes in the blood vessels. 4. Determining how long the client can walk. The correct answer is 1. Showing the location of the obstruction and the collateral circulation. An arteriogram involves injecting a radiopaque contrast agent directly into the vascular system to visualize the vessels. It usually involves computed tomographic scanning. The velocity of the blood flow can be estimated by duplex ultrasound. The client's ankle brachial index is determined, and then the client is requested to walk. The normal response is little or no drop in ankle systolic pressure after exercise. When preparing discharge instructions for a client after an abdominal hysterectomy, the nurse should first 1. Have the client watch an educational video. 2. Assess the client's available social supports. 3. Call the social worker to evaluate the client. 4. Read the discharge instructions to the client. The correct answer is 2. Assess the client's available social supports. Assessment is the first step in planning client education. Assessing social support resources is a key aspect of discharge planning that begins when the client is admitted to the hospital. It is imperative to know what assistance and support the client has at home. Assessment includes obtaining data about any family or home responsibilities the client is concerned with during the recovery period. It is within the scope of nursing practice to provide discharge instructions. A social worker is not needed at this time. The nurse should assess the client's needs before determining whether using a video or reading instructions to the client is appropriate.
During an initial assessment of a client diagnosed with vasospastic disorder, Raynaud's phenomenon, the nurse notes a sudden color change from pink to white in the fingers. The nurse should first assess 1. Appearance of cyanosis. 2. Radial pulse. 3. Oxygen saturation of the affected fingers. 4. Blood pressure. The correct answer is 2. Decreased perfusion from vasospasm induces color changes in the extremity. The degree of decreased perfusion should be assessed by taking the radial pulse. Color changes progressively to blue with cyanosis and then red when reperfusion occurs. The oxygen saturation requires adequate perfusion for accuracy. A blood pressure will cause further constriction and reduction of perfusion in the extremity. The nurse is providing care for a patient with a rotator cuff tear. What treatment does the nurse expect a healthcare provider will prescribe first for this patient? 1. Arthroscopic repair of the rotator cuff tear. 2. Elimination of movements in the affected shoulder. 3. Conservative therapies, such as nonsteroidal anti-inflammatory drugs and physical therapy. 4. Pendulum exercises that start slow and progress over 2 weeks. The correct answer is 3. Conservative therapies, such as nonsteroidal anti-inflammatory drugs and physical therapy. Rationale. For the patient with a torn rotator cuff, the HCP usually treats the patient conservatively with NSAIDs, intermittent steroid injections, physical therapy, and activity limitations while the tear heals. Physical therapy treatments may include ultrasound, electrical stimulation, ice, and heat.
The nurse is reviewing discharge instructions with the parents of a child who had a tonsillectomy a few hours ago. The parents tell the nurse that the child is a big eater and they want to know what foods to give the child for the next 24 hours. What is the nurse's best response? 1. The child's diet should not be restricted at all. 2. The child's diet should be restricted to clear liquids. 3. The child's diet should be restricted to ice cream and cold liquids. 4. The child's diet should be restricted to soft foods. The correct answer is 4. The child's diet should be restricted to soft foods. Soft foods are recommended to limit the child's pain and to decrease the risk for bleeding. You can eliminate answer 1 by knowing there are usually some dietary restrictions following any surgical procedure. An anxious patient repeatedly uses the call bell to get the nurse to come to the room. Finally, the nurse says to the patient, "If you keep ringing, there will come a time I won't answer your bell." Which legal term is related to this statement? 1. Slander. 2. Battery. 3. Assault. 4. Libel. The correct answer is 3. Assault. This scenario is an example of assault. Assault is a verbal attack or unlawful threat causing a fear of harm. No actual contact is necessary for a threat to be an assault. Slander is a falsely spoken statement resulting in damage to a person's character or reputation. Battery is the unlawful touching of a person's body without consent. Libel is a false printed statement resulting in damage to a person's character or reputation. The client diagnosed with a stage 2 pressure ulcer is prescribed a hydrogel dressing. Which statement indicates the client understands the teaching about the hydrogel dressing? 1. The hydrogel dressing is soothing and reduces pain. 2. It must be used because my pressure ulcer drains a lot. 3. This dressing can only be used if my wound is not infected. 4. This dressing is very difficult to apply and remove from the wound. The correct answer is 1. The hydrogel dressing is soothing and reduces pain. Hydrogels help maintain a moist healing environment, granulation, and epithelialization, and they facilitate autolytic debridement. One advantage of a hydrogel dressing is that it is soothing and reduces pain. One of the disadvantages of hydrogel dressings is that they are not recommended for wounds with heavy exudate. An advantage of using hydrogel dressings is that they can be used when infection is present. An advantage of using hydrogel dressings is that they are easily applied and removed from the wound.
Which of the following statements made by an adolescent who has just begun taking an antidepressant would indicate the need for further teaching about the action of antidepressants in treating depression? 1. Now that I've been taking my antidepressant for a week, I'm going to feel better about myself. 2. A week ago when I started my antidepressant, I didn't care about eating, but now I want to eat a bit more. 3. After a week of taking my antidepressant, I can sleep a little better, 6 hours or so each night. 4. Now that I've had a week of my antidepressant, it is a little easier to get up in the morning. The correct answer is 1. Now that I have been taking my antidepressant for a week, I'm going to feel better about myself. Rationale. In the first week or so of taking an antidepressant, the vegetative symptoms of depression such as poor sleep, appetite, and energy level improve. However, it takes 3 to 4 weeks for improvement in self-concept/self-esteem to take place.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. A patient who has sickle cell disease is admitted with vaso-occlusive crisis and reports severe abdominal and flank pain. Which of the analgesic medications on the pain treatment protocol will be best for the nurse to administer initially? 1. Ibuprofen 800 mg PO. 2. Morphine sulfate 4 mg IV. 3. Hydromorphone liquid 5 mg PO. 4. Fentanyl 25 micrograms per hour transdermal patch. The correct answer is 2. Morphine sulfate 4 mg IV. Guidelines for the management of vaso-occlusive crisis suggest the rapid use of parenteral opioids for patients who have moderate to severe pain. The other medications may also be appropriate for the patient as the crisis resolves, but are not the best choice for rapid treatment of severe pain. A client is scheduled to have an arteriogram. During the arteriogram, the client reports having nausea, tingling, and dyspnea. The nurse's immediate action should be to 1. Administer epinephrine. 2. Inform the physician. 3. Administer oxygen. 4. Inform the client that the procedure is almost over. The correct answer is 2. Inform the physician. Clients may have an immediate or a delayed reaction to the radiopaque dye. The physician should be notified immediately because the symptoms suggest an allergic reaction. Treatment may involve administering oxygen and epinephrine. Explaining that the procedure is over does not address the current symptoms. Which should the nurse include when teaching a 55-year-old woman in the beginning of menopause? Select all that apply. 1. The average age of onset for menopause is 50 to 52 years. 2. Follicle-stimulating hormone and luteinizing hormone levels elevate. 3. Depression is very common as a result of menopause. 4. Hot flashes, especially at night, can occur in about 80% of women. 5. When periods become irregular, contraception is unnecessary. The correct answers are 1. The average age of onset for menopause is 50 to 52 years. 2. Follicle-stimulating hormone and luteinizing hormone levels elevate. And 4. Hot flashes, especially at night, can occur in about 80% of women. The average age of menopause is 50 to 52 years, although some variation exists. With menopause, follicle-stimulating hormone and luteinizing hormone levels increase dramatically. Hot flashes occur in about 80% of women. They can range from mild to very debilitating with disruption of sleep patterns. Depression is not usual during menopause. If symptoms of depression do occur, the nurse should refer the woman to her healthcare provider. Contraception should be used until menses has ceased for a full year.
The nurse should instruct a client who has been diagnosed with vasospastic disorder, Raynaud's phenomenon, to 1. Immerse the hands in cold water during an episode. 2. Wear light garments when the temperature gets below 50 degrees Fahrenheit. 3. Wear gloves when handling ice or frozen foods. 4. Live in a cold climate. The correct answer is 3. Extreme changes in temperature can precipitate a vasospastic episode and should be avoided by clients with vasospastic disorder, Raynaud's disease. The client should be encouraged to wear gloves when handling frozen foods or ice. The client should immerse the involved extremity in warm water during an episode to promote vasodilation and relaxation of the small arteries that are in spasm. The client can help prevent vasospasm brought on by temperature changes by wearing warm clothes. Living in a cold climate will exacerbate the symptoms. The emergency department nurse receives a call about a patient with a traumatic finger amputation. What instructions will the nurse provide to the patient's wife? Select all that apply. 1. Wrap the completely severed finger in dry sterile gauze or a clean cloth. 2. Put the finger in a watertight, sealed plastic bag. 3. Place the bag directly on ice. 4. Elevate the affected extremity above the patient's heart. 5. Examine the amputation site and apply direct pressure with layers of dry gauze. 6. After performing these steps, call 911 and check the patient for breathing. The correct answers are 1. Wrap the completely severed finger in dry sterile gauze or a clean cloth. 2. Put the finger in a watertight, sealed plastic bag. 4. Elevate the affected extremity above the patient's heart. And 5. Examine the amputation site and apply direct pressure with layers of dry gauze. Rationale. For a person who has a traumatic amputation in the community, first call 911 and then assess the patient for airway or breathing problems. Examine the amputation site and apply direct pressure with layers of dry gauze or cloth. Elevate the extremity above the patient's heart to decrease the bleeding. Do not remove the dressing to prevent dislodging the clot. Wrap the completely severed finger in dry sterile gauze or a clean cloth. Put the finger in a watertight, sealed plastic bag. Place the bag in ice water, never directly on ice, with 1 part ice and 3 parts water. Avoid contact between the finger and the water to prevent tissue damage. Do not remove any semi-detached parts of the digit. Be sure that the part goes with the patient to the hospital.
The nurse is teaching the client diagnosed with angina about sublingual nitroglycerin. Which statement indicates the client needs more medication teaching? 1. I will always carry my nitroglycerin in a dark-colored bottle. 2. If I have chest pain, I will put a tablet underneath my tongue. 3. If my pain is not relieved with one tablet, I will get medical help. 4. I should expect to get a headache after taking my nitroglycerin. The correct answer is 3. If my pain is not relieved with one tablet, I will get medical help. The client should put one tablet under the tongue every 5 minutes, and if the chest pain is not relieved after taking 3 tablets, the client should seek medical attention. This statement indicates the client needs more teaching about the medication. Which medication categories are contraindicated in clients who are pregnant? Select all that apply. 1. Pregnancy category A. 2. Pregnancy category B. 3. Pregnancy category C. 4. Pregnancy category D. 5. Pregnancy category X. The correct answers are 4. Pregnancy category D and 5. Pregnancy category X. Category D medications have a proven risk of fetal harm and are not prescribed for clients who are pregnant unless the mother's life is in danger. Category X medications have a definite risk of fetal abnormality or abortion. Category A medications have a remote risk of causing fetal harm and are prescribed for clients who are pregnant. Category B medications have a slightly higher risk of causing fetal abnormalities than do Category A medications, but they are often prescribed for clients who are pregnant. Category C medications pose a greater risk than Category B medications and are cautiously prescribed for clients who are pregnant. Medications in this category have either not yet been the subject of research or may show a risk in animal studies. The home healthcare nurse is talking on the telephone to a male client diagnosed with hypertension and hears the client sneezing. The client tells the nurse he has been blowing his nose frequently. Which question should the nurse ask the client? 1. Have you had the flu shot in the last 2 weeks? 2. Are there any small children in the home? 3. Are you taking over-the-counter medicine for these symptoms? 4. Do you have any cold sores associated with your sneezing? The correct answer is 3. Are you taking over-the-counter medicine for these symptoms? A client diagnosed with hypertension should not take many of the over-the-counter medications because they work by causing vasoconstriction, which will increase the hypertension. Influenza is a viral illness that might cause these symptoms. However, an immunization should not give the client the illness. Coming into contact with small children increases the risk of contracting colds and the flu, but the client has a problem, not just a potential one. Cold sores are actually an infection by the herpes simplex virus. Colds and cold-like symptoms are caused by the rhinovirus or influenza virus. The term cold sore is a common term that still persists in the populace. The keys to answering this question are the words hypertension and cold. Anytime a client has a chronic illness, the client should discuss over-the-counter medications with the healthcare provider or a pharmacist. Many of the routine medications for chronic illnesses interact with over-the-counter medications.
Which of the following is an expected outcome when a client is receiving an IV administration of furosemide? 1. Increased blood pressure. 2. Increased urine output. 3. Decreased pain. 4. Decreased premature ventricular contractions. The correct answer is 2. Increased urine output. Rationale. Furosemide is a loop diuretic that acts to increase urine output. Furosemide does not increase blood pressure, decrease pain, or decrease arrhythmias.
A patient with sickle cell disease is admitted with splenic sequestration. The blood pressure is 86/40 and heart rate is 124 beats per minute. Which of these actions will the nurse take first? 1. Complete a head-to-toe assessment. 2. Draw blood for type and cross-match. 3. Infuse normal saline at 250 ml per hour. 4. Ask the patient about vaccination history. The correct answer is 3. Infuse normal saline at 250 ml per hour. Because the patient is severely hypotensive, correction of hypovolemia caused by the splenic sequestration is the most urgent action. Nevertheless, the other actions are appropriate because a complete assessment will be needed to plan care, a transfusion is likely to be needed, and vaccination history is pertinent for patients with sickle cell disease. Infusion of saline, however, is the priority need. A nurse is caring for a client who has just returned from surgery to treat a fractured mandible. Which of the following items should always be available at this client's bedside? Select all that apply. 1. Nasogastric tube. 2. Wire cutters. 3. Oxygen cannula. 4. Suction equipment. 5. Code cart. The correct answers are 2. Wire cutters and 4. Suction equipment. Following surgery for a fractured mandible, the client's jaws will be wired. The nurse should be prepared to intervene quickly in case the client develops respiratory distress or begins to choke or vomit. Wire cutters or scissors should always be available in case the wires need to be cut in a medical emergency. Suction equipment should be available to help clear the client's airway if necessary. It is not necessary to keep a nasogastric tube or oxygen cannula at the client's bedside. Cardiopulmonary arrest is unlikely, so a code cart is not needed at the bedside. Which of the following guidelines reflects the current American and Canadian Cancer Society's recommendations for screening for colon cancer in individuals who are not at high risk? 1. Annual digital rectal examination should begin at age 40. 2. Annual fecal testing for occult blood should begin at age 50. 3. Individuals should obtain a baseline barium enema at age 40. 4. Individuals should obtain a baseline colonoscopy at age 45. The correct answer is 2. Annual fecal testing for occult blood should begin at age 50. Annual fecal testing for occult blood should begin at age 50. Annual digital rectal examinations are recommended in men beginning at age 50 to screen for prostate cancer. Baseline barium enemas or colonoscopies are recommended at age 50. Baseline barium enemas and colonoscopies are not performed on individuals in their 40s unless they experience signs or symptoms that indicate the need for such diagnostic testing or are considered to be at high risk.
In order to prevent recurrent vasospastic episodes with Raynaud's phenomenon, the nurse should instruct the client to 1. Keep the hands and feet elevated as much as possible. 2. Use a vibrating massage device on the hands. 3. Wear gloves when obtaining food from the refrigerator. 4. Increase coffee intake to 2 cups per day. The correct answer is 3. Loose, warm clothing should be worn to protect from the cold. Wearing gloves when handling cold objects will help prevent vasospasms. Vibrating equipment and typing contribute to vasospasm. Tobacco and caffeine should be avoided. Elevation will decrease arterial perfusion during vasospasms. When receiving discharge instructions, a patient with osteoporosis makes all of these statements. Which statement indicates to the nurse that the patient needs additional teaching? 1. I take my ibuprofen every morning as soon as I get up. 2. My daughter removed all of the throw rugs in my home. 3. My husband helps me every afternoon with range of motion exercises. 4. I rest in my reclining chair every day for at least an hour. The correct answer is 1. I take my ibuprofen every morning as soon as I get up. Rationale. Ibuprofen can cause abdominal discomfort or pain and ulceration of the gastrointestinal tract. In such cases, it should be taken with meals or milk. Removal of throw rugs helps prevent falls. Range of motion exercises and rest are important strategies for coping with osteoporosis.
The nurse is preparing to administer a nitroglycerin transdermal patch to the client diagnosed with a myocardial infarction. Which intervention should the nurse implement? 1. Question applying the patch if the client's blood pressure is less than 110/70. 2. Use bare hands when applying the transdermal patch. 3. Date and time the transdermal patch prior to applying to client's skin. 4. Place the transdermal patch on the site where the old patch was removed. The correct answer is 3. Date and time the transdermal patch prior to applying to client's skin. The nurse should remove the old patch, wash the client's skin, note the date and time the new patch is applied, and apply it in a new area that is not hairy. The transdermal patch must be rotated so that skin irritation will not occur. Nitroglycerin, a coronary vasodilator, causes hypotension, and the nurse should question administering a transdermal patch if the client's blood pressure is less than 90/60, but not if it is less than 110/70. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. The client who is pregnant is prescribed ferrous sulfate. Which statement indicates to the nurse the client needs more teaching? 1. I should increase my fluid intake and fiber when taking this medication. 2. I will take a daily stool softener to prevent becoming constipated. 3. If I notice that my stool becomes black or dark, I will call my obstetrician. 4. I should take my iron tablet 2 hours after I eat. The correct answer is 3. If I notice that my stool becomes black or dark, I will call my obstetrician. Ferrous sulfate, an iron product, causes the stool to become black and tarry. Therefore, the client would not need to notify the obstetrician. The client should increase fluid and fiber to help decrease the possibility of becoming constipated. The client is instructed to take a daily stool softener to prevent constipation. Iron should be taken between meals, 2 hours after a meal, because food decreases absorption of the medication by 50% to 70%. The school nurse is presenting a class to students at a primary school on how to prevent the transmission of the common cold virus. Which information should the nurse discuss? 1. Instruct the children to always keep a tissue or handkerchief with them. 2. Explain that children current with immunizations will not get a cold. 3. Tell the children they should go to the doctor if they get a cold. 4. Demonstrate to the students how to wash hands correctly. The correct answer is 4. Demonstrate to the students how to wash hands correctly. Hand washing is the single most useful technique for prevention of disease. Colds are caused by a virus, and antibiotics do not treat a virus. Therefore, there is no need to go to a healthcare provider. There is no immunization for the common cold. Colds are actually caused by at least 200 separate viruses, and the viruses mutate frequently. It is not feasible for a child to always have a tissue or handkerchief available. Option 1 contains the word always, an absolute word, and in most questions, absolutes such as always, never, and only make that answer option incorrect.
A client has had a pulmonary artery catheter inserted. In performing hemodynamic monitoring with a catheter, the nurse will wedge the catheter to gain information about which of the following? 1. Cardiac output. 2. Right atrial blood flow. 3. Left end diastolic pressure. 4. Cardiac index. The correct answer is 3. Left end diastolic pressure. Rationale. When wedged, the catheter is pointing indirectly at the left end diastolic pressure. The pulmonary artery wedge pressure is measured when the tip of the catheter is slowing inflated and allowed to wedge into a branch of the pulmonary artery. Once the balloon is wedged, the catheter reads the pressure in front of the balloon. During diastole, the mitral valve is open, reflecting left ventricular end diastolic pressure. Cardiac output is the amount of blood ejected by the heart in 1 minute and is determined through thermodilution and not wedge pressure. Cardiac index is calculated by dividing the client's cardiac output by the client's body surface area and is considered a more accurate reflection of the individual client's cardiac output. Right atrial blood pressure is not measured with the pulmonary artery catheter.
When administering a blood transfusion to a patient, which action can the nurse delegate to the assistive personnel? 1. Take the patient's vital signs before the transfusion is started. 2. Ensure that the blood is infused within no more than 4 hours. 3. Ask the patient at frequent intervals about the presence of chills or dyspnea. 4. Assist with double-checking the patient's identification and blood bag number. The correct answer is 1. Take the patient's vital signs before the transfusion is started. AP education and role includes obtaining vital signs, which will be reported to the nurse before the initiation of the transfusion. Monitoring for transfusion reactions, adjusting the transfusion rate, and ensuring that the blood type and number are correct require critical thinking and should be done by the nurse. Which of the following interventions is most appropriate for a client who has stomatitis? 1. Drinking hot tea at frequent intervals. 2. Gargling with antiseptic mouthwash. 3. Using an electric toothbrush. 4. Eating a soft, bland diet. The correct answer is 4. Eating a soft, bland diet. Clients with stomatitis, inflammation of the mouth, have significant discomfort, which impacts their ability to eat and drink. They will be most comfortable eating soft, bland foods and avoiding temperature extremes in their food and liquids. Gargling with an antiseptic mouthwash will be irritating to the mucosa. Mouth care should include gentle brushing with a soft toothbrush and flossing. A client refuses to look at or care for her colostomy. Which of the following statements by the nurse would be most appropriate? 1. It has been 4 days since your surgery, and you will soon be discharged. You have to learn to care for your colostomy before you leave the hospital. 2. I think we will need to teach your husband to care for your colostomy if you are not going to be able to do it. 3. I understand how you are feeling. It is important for you to feel attractive, and you think having a colostomy changes your attractiveness. 4. I can see that you are upset. Would you like to share your concerns with me? The correct answer is 4. I can see that you are upset. Would you like to share your concerns with me? It is important for the nurse to recognize that individuals go through a grieving process when adjusting to a colostomy. The nurse should be accepting and provide the client with opportunities to share her concerns and feelings when she is ready. Lecturing the client about the need to learn how to care for the colostomy is not productive, nor is attempting to shame her into caring for the colostomy by implying her husband will have to provide the care if she does not. It is not possible for the nurse to understand what the client is feeling.
A client with Raynaud's phenomenon is prescribed diltiazem. An expected outcome is 1. Decreased heart rate. 2. Conversion to normal sinus rhythm. 3. Reduced episodes of finger numbness. 4. Increased SpO2. The correct answer is 3. Calcium channel blockers are first-line drug therapy for the treatment of vasospasms with Raynaud's phenomenon when other therapies are ineffective. Cardizem relaxes smooth muscles and improves peripheral perfusion, therefore reducing finger numbness. Cardizem decreases heart rate and is used to treat atrial fibrillation, but these are not associated with Raynaud's. When vasospasms are prevented, an accurate SpO2 can be measured in the affected extremity. However, SpO2 is a measurement of systemic oxygenation not influenced by cardizem. A patient has a fractured femur, which finding would the nurse instruct the assistive personnel to report immediately? 1. The patient reports pain. 2. The patient appears confused. 3. The patient's blood pressure is 136/88. 4. The patient voided using the bedpan. The correct answer is 2. The patient appears confused. Rationale. Fat embolism syndrome is a serious complication that often results from fractures of long bones. Its earliest manifestation is altered mental status caused by a low arterial oxygen level. The nurse would want to know about and treat the pain, but it is not life-threatening. The nurse would also want to know about the blood pressure in the patient's voiding. However, this information is not urgent to report.
The client is reporting severe chest pain radiating down the left arm and is nauseated and diaphoretic. The HCP suspects the client is having an MI and has ordered morphine sulfate for the pain. Which interventions should the nurse implement? Select all that apply. 1. Instruct the client not to get out of the bed without notifying the nurse. 2. Administer the morphine sulfate intramuscularly in the ventral gluteal muscle. 3. Dilute the morphine sulfate to a 10 milliliters bolus with normal saline. 4. Administer the morphine sulfate slowly over 5 minutes. 5. Question the order because morphine sulfate should not be administered to a client with an MI. The correct answers are 1. Instruct the client not to get out of the bed without notifying the nurse. 3. Dilute the morphine sulfate to a 10 milliliters bolus with normal saline. And 4. Administer the morphine sulfate slowly over 5 minutes. The client should not get out of the bed without assistance due to the drowsiness the client will experience after receiving morphine sulfate, a narcotic analgesic. Also, the client is having chest pain and should not get out of bed without assistance. Morphine sulfate, a narcotic analgesic, is the drug of choice for chest pain, and it is administered intravenously so that it acts as soon as possible, within 10 to 15 minutes. IVP medications should be diluted to help decrease the pain when it is administered and to prevent irritation to the vein. Morphine sulfate may be administered intravenously when a rapid onset of action is desired. The dose is usually in the range of 2.5 to 15 milligrams, given slowly over 4 to 5 minutes. At a preconception visit, the nurse instructs the client on the importance of folic acid in the prevention of serious birth defects. Which statement to the nurse indicates the client needs more teaching? 1. I will increase my intake of spinach, orange juice, and almonds. 2. I will increase my intake of milk, yogurt, and fish. 3. I will take my prenatal vitamin with folic acid daily. 4. I will avoid overcooking my food to prevent vitamin loss. The correct answer is 2. I will increase my intake of milk, yogurt, and fish. Milk, yogurt, and fish are not a source of dietary folic acid. Green leafy vegetables, citrus foods, and nuts, such as peanuts and almonds, are rich in folic acid. A prenatal vitamin with 400 micrograms of folic acid is recommended for a client preparing for pregnancy or a client who is pregnant or lactating. Folic acid can prevent neural tube defects, cardiac defects, and cleft lip or palate. Folic acid can be lost when overcooking foods. Which information should the nurse teach the client diagnosed with acute sinusitis? 1. Instruct the client to complete all the ordered antibiotics. 2. Teach the client how to irrigate the nasal passages. 3. Have the client demonstrate how to blow the nose. 4. Give the client samples of a narcotic analgesic for the headache. The correct answer is 1. Instruct the client to complete all the ordered antibiotics. The client should be taught to take all antibiotics as ordered. Discontinuing antibiotics prior to the full dose results in the development of antibiotic-resistant bacteria. Sinus infections are difficult to treat and may become chronic and will then require several weeks of therapy or possibly surgery to control. If the sinuses are irrigated, it is done under anesthesia by a healthcare provider. Blowing the nose will increase pressure in the sinus cavities and will cause the client increased pain. The nurse is not licensed to prescribe medications, so this is not in the nurse's scope of practice. Also, narcotic analgesic medications are controlled substances and require written documentation of being prescribed by the healthcare provider. Samples are not generally available. Note in this situation, an all is in the correct answer. There are very few cases in which absolute adjectives will describe the correct answer. You must be aware that general rules will not always apply.
After a myocardial infarction, the hospitalized client is taught to move the legs while resting in bed. The expected outcome of this exercise is to 1. Prepare the client for ambulation. 2. Promote urinary and intestinal elimination. 3. Prevent thrombophlebitis and blood clot formation. 4. Decrease the likelihood of pressure ulcer formation. The correct answer is 3. Prevent thrombophlebitis and blood clot formation. Rationale. Encouraging the client to move the legs while in bed is a preventive strategy taught to all clients who are hospitalized and on bed rest to promote venous return. The muscular action aids in venous return and prevents venous stasis in the lower extremities. These exercises are not intended to prepare the client for ambulation. These exercises are not associated with promoting urinary and intestinal elimination. These exercises are not performed to decrease the risk of pressure ulcer formation.
Which of these patients who have just arrived at the emergency department should the nurse assess first? 1. Patient who reports several dark, tarry stools and a history of peptic ulcer disease. 2. Patient with hemophilia A who is experiencing thigh swelling after a fall. 3. patient who has pernicious anemia and reports paresthesia of the hands and feet. 4. Patient with thalassemia major who needs a scheduled blood transfusion. The correct answer is 2. Patient with hemophilia A who is experiencing thigh swelling after a fall. Thigh swelling after an injury in a patient with hemophilia likely indicates acute bleeding, which can compromise blood flow and nerve function in the leg, and should be treated immediately with the administration of factor replacement. The other patients also need assessment, treatment, or both, but the data do not indicate any immediate threat to life or function. A client who has a history of mitral valve prolapse is scheduled to get her teeth cleaned. Which of the following replies by the nurse is most appropriate? 1. The physician will need to reevaluate the status of your heart condition before your dental appointment. 2. Be sure to remind your dentist that you have a heart condition. 3. It is important for you to care for your teeth because your heart condition makes you more susceptible to developing oral infections. 4. We will prescribe a prophylactic antibiotic for you to take before getting your teeth cleaned. The correct answer is 4. We will prescribe a prophylactic antibiotic for you to take before getting your teeth cleaned. Clients who are at risk for developing infective endocarditis due to cardiac conditions such as mitral valve prolapse must take prophylactic antibiotics before any dental procedure that may cause bleeding. The client is not more susceptible to developing oral infections. Rather, the client is more susceptible to developing endocarditis that results from oral bacteria that enter the circulation during the dental procedure. The physician does not necessarily need to reevaluate the heart condition of a client who is stable, but antibiotics must be prescribed. It is not enough to simply remind the dentist about the heart condition. Which of the following is a potential risk factor for the development of colon cancer? 1. Chronic constipation. 2. Long-term use of laxatives. 3. History of smoking. 4. History of inflammatory bowel disease. The correct answer is 4. History of inflammatory bowel disease. A history of inflammatory bowel disease is a risk factor for colon cancer. Other risk factors include age, history of familial polyposis, colorectal polyps, and high-fat or low-fiber diet. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
When giving discharge instructions to the client with vasospastic disorder, Raynaud's phenomenon, the nurse should explain that the expected outcome of taking a beta-adrenergic blocking medication is to control the symptoms by 1. Decreasing the influence of the sympathetic nervous system on the tissues in the hands and feet. 2. Decreasing the pain by producing analgesia. 3. Increasing the blood supply to the affected area. 4. Increasing monoamine oxidase. The correct answer is 1. Beta-adrenergic medications block the beta-adrenergic receptors. Therefore, the expected outcome of the medication is to decrease the influence of the sympathetic nervous system on the blood vessels in the hands. Beta-adrenergic blockers have no analgesic effects. Increasing blood supply to the affected area is an indirect effect of beta-adrenergic blockers. They do not increase monoamine oxidase, which does not play a role in Raynaud's disease. After the nurse receives the change of shift report, which patients should be assessed first? 1. A 42-year-old patient with carpal tunnel syndrome who reports pain. 2. A 64-year-old patient with osteoporosis awaiting discharge. 3. A 28-year-old patient with a fracture who reports that the cast is tight. 4. A 56-year-old patient with a left leg amputation who reports phantom pain. The correct answer is 3. A 28-year-old patient with a fracture who reports that the cast is tight. Rationale: the patient with a tight cast is at risk for circulation impairment and peripheral nerve damage. Although all of the other patient's concerns are important, and the nurse will want to see them as soon as possible, none of their complaints is urgent. The patient with the tight cast may have risk for injury to a limb, which is more urgent.
The nurse is administering 9 o'clock medications to the following clients. Which client should the nurse question administering the medication? 1. The client receiving a calcium channel blocker who drank a glass of grapefruit juice. 2. The client receiving a beta blocker who has an apical pulse of 62 beats per minute. 3. The client receiving a nitroglycerin patch who has a blood pressure of 148/92. 4. The client receiving an antiplatelet medication who has a platelet count of 150,000. The correct answer is 1. The client receiving a calcium channel blocker who drank a glass of grapefruit juice. The client receiving a calcium channel blocker should avoid grapefruit juice because it can cause the calcium channel blocker to rise to toxic levels. Grapefruit juice can inhibit the metabolism of certain medications. Specifically, grapefruit juice inhibits cytochrome P450, 3A4 found in the liver and the intestinal wall. The nurse should investigate any medications the client is taking if the client drinks grapefruit juice. The pregnant client is prescribed metoclopramide to treat hyperemesis gravidarum. Which information should the nurse discuss with the client? Select all that apply. 1. Chew the tablet thoroughly before swallowing. 2. Take the medication 30 minutes prior to mealtime. 3. Do not drink any type of alcoholic beverages. 4. Muscle spasms are a common side effect. 5. The medication can cause drowsiness that will make driving unsafe. The correct answers are 2. Take the medication 30 minutes prior to mealtime. 3. Do not drink any type of alcoholic beverages. And 5. The medication can cause drowsiness that will make driving unsafe. The medication should be taken on an empty stomach at least 30 minutes before eating. Alcohol can increase central nervous system depressive symptoms of the medication and should be avoided. Metoclopramide can cause drowsiness. The client should avoid driving until the response to medication is known. The client should swallow the medication. The client should not crush, chew, or suck on the medication. Muscle spasms and rigidity are extrapyramidal side effects and should be reported to the HCP. The client has been diagnosed with chronic sinusitis. Which sign symptom alerts the nurse to a potentially life-threatening complication? 1. Muscle weakness. 2. Purulent sputum. 3. Nuchal rigidity. 4. Intermittent loss of muscle control. The correct answer is 3. Nuchal rigidity. Nuchal rigidity is a sign symptom of meningitis, which is a life-threatening potential complication of sinusitis resulting from the close proximity of the sinus cavities to the meninges. Intermittent loss of muscle control can be a symptom of multiple sclerosis, but it would not be a life-threatening complication of sinusitis. Muscle weakness is a sign symptom of myalgia, but it is not a life-threatening complication of sinusitis. Purulent sputum would be a sign symptom of a lung infection, but it is not a life-threatening complication of sinusitis. A basic knowledge of anatomy and physiology would help to answer this question. The sinuses lie in the head and surround the orbital cavity. Options 1 and 4 refer to muscle problems, so both could be ruled out as wrong.
Which of the following is the most appropriate diet for a client during the acute phase of myocardial infarction? 1. Liquids as desired. 2. Small, easily digested meals. 3. 3 regular meals per day. 4. Nothing by mouth. The correct answer is 2. Small, easily digested meals. Rationale. Recommended dietary principles in the acute phase of MI include avoiding large meals because small, easily digested foods are better tolerated. Fluids are given according to the client's needs, and sodium restrictions may be prescribed, especially for clients with manifestations of heart failure. Cholesterol restrictions may be prescribed as well. Clients are not prescribed diets of liquids only or restricted to nothing by mouth unless their condition is very unstable.
A patient with chemotherapy-related neutropenia is receiving filgrastim injections. Which finding by the nurse is most important to report to the healthcare provider? 1. The patient says, "My bones are aching." 2. The patient's platelet count is 110,000 cubic milliliters. 3. The patient's white blood cell count is 39,000 cubic milliliters. 4. The patient reports that the medication stings when it is injected. The correct answer is 3. The patient's white blood cell count is 39,000 cubic milliliters. Leukocytosis is an adverse effect of filgrastim and indicates a need to stop the medication or decrease dosage. Bone pain is a common adverse effect as the bone marrow starts to produce more neutrophils. The patient should receive analgesics, but the medication will be continued. Stinging with injection may occur. The nurse should administer the medication more slowly. The patient's platelet count is low and should be reported, but the level of 110,000 cubic milliliters does not increase risk for spontaneous bleeding. Amoxicillin trihydrate 300 mg PO has been prescribed for a client with an oral infection. The medication is available in a liquid suspension that is available as 250 mg per 5 milliliters. How many milliliters should the nurse administer? Blank milliliters. The correct answer is 6 milliliters. To solve this problem, you set up the formula as 250 milligrams over 5 milliliters equals to 300 milligrams over x. You cross-multiply 250 times x and 300 times 5. You get 250x equals to 1,500. You divide 200 on both sides, and you get x equals to 6 milliliters. This is the amount that the nurse should administer for each dose. The nurse is conducting a community presentation on the early detection of colon cancer. Which of the following should the nurse encourage members of the audience to report to their healthcare providers? Select all that apply. 1. Fatigue. 2. Unexplained weight loss with adequate nutritional intake. 3. Rectal bleeding. 4. Bowel changes. 5. Positive fecal occult blood testing. The correct answers are 1. Fatigue. 2. Unexplained weight loss with adequate nutritional intake. 3. Rectal bleeding. 4. Bowel changes. And 5. Positive fecal occult blood testing. Colorectal cancer may be asymptomatic, or symptoms vary according to the location of the tumor and the extent of involvement. Fatigue, weight loss, and iron deficiency anemia, even without rectal bleeding or bowel changes, should prompt investigation for colorectal cancer. Fecal occult blood testing commonly reveals evidence of carcinoma when the client is otherwise asymptomatic.
A client with vasospastic disorder, Raynaud's phenomenon, is considering having a sympathectomy. This nurse should tell the client that the surgery is performed 1. In the early stages of the disease to prevent further circulatory disturbances. 2. When the disease is controlled by medication. 3. When the client is unable to control stress-related vasospasm. 4. When all other treatment alternatives have failed. The correct answer is 4. Sympathectomy is scheduled only after other treatment alternatives have been explored and have failed. Medication and stress management are beneficial strategies to prevent advancement of the disease process. If the disease is controlled by medication, there is no reason for surgery. A patient with a fractured fibula is receiving skeletal traction and has skeletal pins in place. What would the nurse instruct the assistive personnel to report immediately? 1. The patient wants to change position in bed. 2. There is a small amount of clear fluid at the pin sites. 3. The traction weights are resting on the floor. 4. The patient reports pain and muscle spasm. The correct answer is 3. The traction weights are resting on the floor. Rationale. When the weights are resting on the floor, they are not exerting pulling force to provide reduction and alignment or to prevent muscle spasm. The weights should always hang freely. Attending the weights may reduce the patient's pain and spasms. With skeletal pins, a small amount of clear fluid drainage is expected. It is important to inspect the traction system after a patient changes position because position changes may alter the traction.
The client diagnosed with angina who is prescribed nitroglycerin tells the nurse, "I don't understand why I can't take my sildenafil. I need to take it so that I can make love to my wife." Which statement is the nurse's best response? 1. If you take the medications together, they may cause you to have very low blood pressure. 2. You are worried your wife will be concerned if you cannot make love. 3. If you wait at least 8 hours after taking your nitroglycerin, you can take your sildenafil. 4. you should get clarification with your HCP about taking sildenafil. The correct answer is 1. If you take the medications together, they may cause you to have very low blood pressure. Life-threatening hypotension can result with concurrent use of NTG and sildenafil, a peripheral vasodilator erectile agent. The nurse is teaching the pregnant client diagnosed with HIV about methods to prevent transmission to the infant. Which information should the nurse discuss with the client? Select all that apply. 1. The client will take zidovudine PO, regularly beginning at 12 to 14 weeks gestation. 2. The client's newborn should receive oral zidovudine 8 to 12 hours after birth. 3. Breastfeeding should be encouraged to provide the infant passive immunity to HIV. 4. If treated in early pregnancy, the risk of transmission of HIV to the infant is 1% or less. 5. All clients diagnosed with HIV must have a cesarean delivery at 38 weeks gestation. The correct answers are 1. The client will take zidovudine PO regularly beginning at 12 to 14 weeks gestation. 2. The client's newborn should receive oral zidovudine 8 to 12 hours after birth. And 4. If treated in early pregnancy, the risk of transmission of HIV to the infant is 1% or less. Zidovudine is given orally, as directed, around the clock. The newborn should receive oral zidovudine syrup beginning 8 to 12 hours after birth until 6 weeks old. The Centers for Disease Control states that if the client is treated beginning in early pregnancy, the risk of transmission of HIV to the infant can be reduced to 1% or less. Breastfeeding is not recommended because HIV is present in breast milk. The choice of delivery method, vaginal or cesarean, is dependent on the concentration of the virus in maternal plasma. Cesarean delivery before the onset of labor and rupture of membranes can reduce the transmission of the HIV virus. However, the method of delivery needs to be individualized to each client. The client diagnosed with tonsillitis is scheduled to have surgery in the morning. Which assessment data should the nurse notify the healthcare provider about prior to surgery? 1. The client has a hemoglobin of 12.2 grams per deciliter and hematocrit of 36.5%. 2. The client has an oral temperature of 100.2 degrees Fahrenheit and a dry cough. 3. There are 1 to 2 white blood cells in the urinalysis. 4. The client's current international normalized ratio is 1.0. The correct answer is 2. The client has an oral temperature of 100.2 degrees Fahrenheit and a dry cough. A low-grade temperature and a cough could indicate the presence of an infection, in which case the healthcare provider would not want to subject the client to anesthesia and the possibility of further complications. The surgery would be postponed. The hemoglobin and hematocrit given are within normal range. This would not warrant notifying the healthcare provider. 1 to 2 WBCs in a urinalysis is not uncommon because of the normal flora in the bladder. The INR indicates that the client's bleeding time is within normal range. In this question, all the answer options contain normal data except for one. The nurse would not call the healthcare provider to notify him or her of normal values.
The nurse is caring for a client who recently experienced a myocardial infarction and has been started on clopidogrel, Plavix. The nurse should develop a teaching plan that includes which of the following points? Select all that apply. 1. The client should report unexpected bleeding or bleeding that lasts a long time. 2. The client should take Plavix with food. 3. The client may bruise more easily and may experience bleeding gums. 4. Plavix works by preventing platelets from sticking together and forming a clot. 5. The client should drink a glass of water after taking Plavix. The correct answers are 1. The client should report unexpected bleeding or bleeding that lasts a long time. 3. The client may bruise more easily and may experience bleeding gums. And 4. Plavix works by preventing platelets from sticking together and forming a clot. Rationale. Plavix is generally well absorbed and may be taken with or without food. It should be taken at the same time every day, and while food may help prevent potential GI upset, food has no effect on absorption of the drug. Bleeding is the most common adverse effect of Plavix. The client must understand the importance of reporting any unexpected, prolonged, or excessive bleeding, including blood in urine or stool. Increased bruising and bleeding gums are possible side effects of Plavix. The client should be aware of this possibility. Plavix is an antiplatelet agent used to prevent clot formation in clients that have experienced or are at risk for myocardial infarction, ischemic stroke, peripheral artery disease, or acute coronary syndrome. It is not necessary to drink a glass of water after taking Plavix.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. The nurse is reviewing the complete blood count for a patient who has been admitted for knee arthroscopy. Which value is most important to report to the healthcare provider before surgery? 1. Hematocrit of 33%. 2. Hemoglobin level of 10.9 grams per deciliter. 3. Platelet count of 426,000 cubic milliliters. 4. White blood cell count of 16,000 cubic milliliters. The correct answer is 4. White blood cell count of 16,000 cubic milliliters. Centers for Disease Control and Prevention guidelines for the prevention of surgical site infections indicate that surgery should be postponed when there is evidence of a pre-existing infection, such as an elevation in white blood cell count. The other values are slightly abnormal, but would not be likely to cause post-operative problems for knee arthroscopy. During the assessment of a client's mouth, the nurse notes the absence of saliva. The client reports having pain behind the ear. The client has been nothing by mouth for several days, but now can have liquids. Based on these findings, the nurse should do which of the following? 1. Request a prescription for an antifungal mouthwash. 2. Instruct the client to brush the gums as well as the teeth. 3. Encourage the client to suck on hard candy. 4. Give the client a hydrogen peroxide-based mouthwash. The correct answer is 3. Encourage the client to suck on hard candy. The lack of saliva, pain near the area of the ear, and the prolonged NPO status of the client are indications that the client may be developing parotitis or inflammation of the parotid gland. Parotitis usually develops with dehydration combined with poor oral hygiene, or when clients have been NPO for an extended period. Preventive measures include the use of sugarless hard candy or gum to stimulate saliva production, adequate hydration, and frequent mouth care. The client does not have indications of stomatitis, inflammation of the mouth, which produces excessive salivation and a sore mouth. The client does not have indications of oral candidiasis, which causes bluish-white mouth lesions, and the nurse does not need to request a prescription for an antifungal mouthwash. There are no indications that the client has gingivitis, which can be recognized by the inflamed gingiva and bleeding that occur during toothbrushing, and while the client should brush the teeth and gums, increasing salivation to prevent parotitis is the priority at this time. A client with colon cancer is having a barium enema. The nurse should instruct the client to take which of the following after the procedure is completed? 1. Laxative. 2. Anticholinergic. 3. Antacid. 4. Demulcent. The correct answer is 1. Laxative. After a barium enema, a laxative is ordinarily prescribed. This is done to promote elimination of the barium. Retained barium predisposes the client to constipation and fecal impaction. Anticholinergic drugs decrease gastrointestinal motility. Antacids decrease gastric acid secretion. Demulcents soothe mucous membranes of the gastrointestinal tract and are used to treat diarrhea.
A client with pernicious anemia asks why it is necessary to take vitamin B12 injections forever. Which is the nurse's best response? 1. The reason for your vitamin deficiency is an inability to absorb the vitamin because the stomach is not producing sufficient acid. 2. The reason for your vitamin deficiency is an inability to absorb the vitamin because the stomach is not producing sufficient intrinsic factor. 3. The reason for your vitamin deficiency is an excessive excretion of the vitamin because of kidney dysfunction. 4. The reason for your vitamin deficiency is an increased requirement for the vitamin because of rapid red blood cell production. The correct answer is 2. Most clients with pernicious anemia have deficient production of intrinsic factor in the stomach. Intrinsic factor attaches to the vitamin in the stomach and forms a complex that allows the vitamin to be absorbed in the small intestine. The stomach is producing enough acid. There is not an excessive excretion of the vitamin, and there is not a rapid production of red blood cells in this condition. The nurse is supervising a newly graduated nurse caring for a patient with a fracture of the right ankle who is at risk for complications of immobility. For which action should the supervising nurse intervene? 1. Encouraging the patient to go from a lying to a standing position. 2. Administering pain medication before the patient begins exercises. 3. Explaining to the patient and family the purpose of the exercise program. 4. Reminding the patient about the correct use of crutches. The correct answer is 1. Encouraging the patient to go from a lying to a standing position. Rationale. Moving directly from a lying to a standing position does not allow the patient to establish balance. The supervising nurse should instruct the newly graduated nurse about moving the patient from a lying position first, then to a sitting position, and finally to a standing position, which will allow the patient to establish balance before standing. Administering pain medication before the patient begins exercising decreases pain with exercise. Explanations about the purpose of the exercise program and proper use of crutches are appropriate interventions for this patient.
The client diagnosed with a myocardial infarction is receiving thrombolytic therapy. Which data warrants immediate intervention by the nurse? 1. The client's telemetry has reperfusion dysrhythmias. 2. The client is oozing blood from the IV site. 3. The client is alert and oriented to date, time, and place. 4. The client has no signs of infiltration at the insertion site. The correct answer is 2. The client is oozing blood from the IV site. Any bleeding from the IV site, gums, rectum, or vagina should be reported to the HCP. The HCP may not be able to take intervention to prevent the bleeding during therapy, but it warrants notifying the HCP. The client who is 32 weeks pregnant and in preterm labor is prescribed terbutaline. Which data warrants intervention by the nurse? 1. The client's respiratory rate is 34 breaths per minute. 2. The fetal heart rate is 150 beats per minute. 3. The client's apical heart rate is 104 beats per minute. 4. The client reports no contractions. The correct answer is 1. The client's respiratory rate is 34 breaths per minute. Terbutaline, a beta-adrenergic agonist, causes bronchodilation, and if the client's respiratory rate is abnormally high, or if there is a change in quality of lung sounds such as wheezing, rales, or coughing, the HCP should be notified. The normal fetal heart rate is 110 to 160 beats per minute. Therefore, a fetal heart rate of 150 beats per minute is within normal limits and would not warrant intervention by the nurse. The client's apical heart rate is just above normal and would not warrant intervention by the nurse. Terbutaline is administered to prevent contractions. Therefore, the medication is effective. The influenza vaccine is in short supply. Which group of clients would the public health nurse consider priority when administering the vaccine? 1. Elderly and chronically ill clients. 2. Childcare workers and children less than 4 years of age. 3. Hospital chaplains and healthcare workers. 4. School teachers and students living in a dormitory. The correct answer is 1. Elderly and chronically ill clients. The elderly and chronically ill are at greatest risk for developing serious complications if they contract the influenza virus. It is recommended people in contact with children receive the flu vaccine whenever possible, but these clients should be able to withstand a bout with the flu if their immune systems are functioning normally. It is probable these clients will be exposed to the virus, but they are not as likely to develop severe complications with intact functioning immune systems. During flu season, the more people the individual comes into contact with, the greater the risk the client will be exposed to the influenza virus, but this group of people would not receive the vaccine before the elderly and chronically ill. Sometimes, you may think the answer is too easy and obvious, but you should not try to second-guess the question. Test writers are not trying to trick you. They are trying to evaluate knowledge.
Which client is at greatest risk for coronary artery disease? 1. A 32-year-old female with mitral valve prolapse who quit smoking 10 years ago. 2. A 43-year-old male with a family history of CAD and cholesterol level of 158. 3. A 56-year-old male with an HDL of 60 who takes atorvastatin. 4. A 65-year-old female who is obese with an LDL of 188. The correct answer is for a 65-year-old female who is obese with an LDL of 188. Rationale: the woman who is 65 years old, overweight, and has an elevated LDL is at greatest risk. The combination of postmenopausal obesity and high LDL places this client at greatest risk.
The nurse is providing orientation for a new nurse who is preparing to administer packed red blood cells to a patient who had blood loss during surgery. Which action by the new nurse requires that the nurse intervene immediately? 1. Waiting 20 minutes after obtaining the PRBCs before starting the infusion. 2. Starting an IV line for the transfusion using a 22-gauge catheter. 3. Priming the transfusion set using 5% dextrose in lactated Ringer's solution. 4. Telling the patient that the PRBCs may cause a serious transfusion reaction. The correct answer is 3. Priming the transfusion set using 5% dextrose in lactated Ringer's solution. Normal saline, an isotonic solution, should be used when priming the IV line to avoid causing hemolysis of red blood cells. Ideally, blood products should be infused as soon as possible after they are obtained. However, a 20-minute delay would not be unsafe. Large-bore IV catheters are preferable for blood administration. If a smaller catheter must be used, normal saline may be used to dilute the RBCs. Although the new nurse should avoid increasing patient anxiety by indicating that a serious transfusion reaction may occur, this action is not as high a concern as using an inappropriate fluid for priming the IV tubing. The nurse is preparing a community presentation on oral cancer. Which of the following is a primary risk factor for oral cancer that the nurse should include in the presentation? 1. Use of alcohol. 2. Frequent use of mouthwash. 3. Lack of vitamin B12. 4. Lack of regular teeth cleaning by a dentist. The correct answer is 1. Use of alcohol. Chronic and excessive use of alcohol can lead to oral cancer. Smoking and use of smokeless tobacco are other significant risk factors. Additional risk factors include chronic irritation, such as a broken tooth or ill-fitting dentures, poor dental hygiene, overexposure to sun, lip cancer, and syphilis. Use of mouthwash, lack of vitamin B12, and lack of regular teeth cleaning appointments have not been implicated as primary risk factors for oral cancer. A client has a nasogastric tube inserted at the time of abdominal perineal resection with permanent colostomy for colon cancer. This tube will most likely be removed when the client demonstrates 1. Absence of nausea and vomiting. 2. Passage of mucus from the rectum. 3. Passage of flatus and feces from the colostomy. 4. Absence of stomach drainage for 24 hours. The correct answer is 3. Passage of flatus and feces from the colostomy. A sign indicating that a client's colostomy is open and ready to function is passage of feces and flatus. When this occurs, gastric suction is ordinarily discontinued, and the client is allowed to start taking fluids and food orally. Absence of bowel sounds would indicate that the tube should remain in place because peristalsis has not yet returned.
A woman of African descent had experienced severe palpitations, weakness, and shortness of breath after taking bacitracin. As a part of the discharge planning, the nurse should evaluate the client's knowledge about 1. Increased folic acid needs. 2. Congenital enzyme deficiency. 3. Restricted activity in hot weather. 4. Need for blood transfusions. The correct answer is 2. This client presented with the typical signs of glucose 6-phosphate dehydrogenase, aka G6PD, deficiency anemia. 10% of blacks inherit an X-linked recessive disorder of the G6PD enzyme in the red blood cell. When cells with decreased levels of G6PD are exposed to certain drugs, such as sulfonamides, acetylsalicylic acid, thiazide diuretics, and vitamin K, the RBC may hemolyze and anemia and jaundice may occur. The reaction is self-limited as soon as the causative agent is withheld. No further treatment is necessary except counseling to prevent acute incidents by avoiding exposure to specific drugs. There is no need for increased folic acid, restricted activity in hot weather, or blood transfusions. The charge nurse is assigning the nursing care of a patient who had a left below the knee amputation 1 day ago to an experienced nurse who will function under the lead nurse's supervision. What will the lead nurse tell the experienced nurse is a major focus of the patient's care today? 1. To attain pain control over phantom pain. 2. To monitor for signs of sufficient tissue perfusion. 3. To assist the patient to ambulate as soon as possible. 4. To elevate the residual limb when the patient is supine. The correct answer is 2. To monitor for signs of sufficient tissue perfusion. Rationale. Monitoring for sufficient tissue perfusion is a priority at this time. Phantom pain is a concern, but is more common in patients with above-the-knee amputations. Early ambulation is a goal, but at this time, the patient is more likely to be engaged in muscle-strengthening exercises. Elevating the residual limb on a pillow is controversial because it may promote knee flexion contracture.
The nurse is completing AM care with a client diagnosed with angina when the client reports chest pain. The client has a saline lock in the right forearm. Which intervention should the nurse at the bedside implement first? 1. Assess the client's vital signs. 2. Administer sublingual nitroglycerin. 3. Administer IV morphine sulfate via saline lock. 4. Administer oxygen via nasal cannula. The correct answer is 4. Administer oxygen via nasal cannula. The nurse would have oxygen at the bedside, and applying it would be the first intervention the nurse could implement at the bedside. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. The nurse is preparing to administer medications in the antepartum unit. Which medication should the nurse question administering? 1. Terbutaline to a client preparing for an external cephalic version. 2. Hydralazine to a client diagnosed with preeclampsia. 3. Methotrexate to a client with an ectopic pregnancy. 4. Prochlorperazine to a client diagnosed with hyperemesis gravidarum. The correct answer is 4. Prochlorperazine to a client diagnosed with hyperemesis gravidarum. Prochlorperazine is contraindicated in pregnancy. Ondansetron and promethazine are more common medications for nausea and vomiting in pregnancy. Terbutaline can be administered to the client preparing for an external version to relax the uterine muscle for manipulation of the fetus. Hydralazine is commonly used for elevated blood pressure in pregnancy. Methotrexate, a folic acid antagonist, is used for medical management of an early ectopic pregnancy with an intact fallopian tube. The client diagnosed with chronic sinusitis who has undergone a Caldwell-Luke procedure is complaining of pain. Which intervention should the nurse implement first? 1. Administer the narcotic analgesic IVP. 2. Perform gentle oral hygiene. 3. Place the client in semi-Fowler's position. 4. Assess the client's pain. The correct answer is 4. Assess the client's pain. Prior to intervening, the nurse must assess to determine the amount of pain and possible complications occurring that could be masked if narcotic medication is administered. The client has complained of pain, and the nurse, after determining the severity of the pain and barring any complications in the client, will administer pain medication after completion of the assessment. Oral hygiene helps to prevent the development of infections and promotes comfort, but it will not relieve the pain. Placing the client in the semi-Fowler's position will reduce edema of inflamed sinus tissue, but it will not immediately affect the client's perception of pain. Whenever there is an assessment answer among the answer options, you should look carefully at what is being assessed. If the option says to assess the problem identified in the question, it will usually be the correct answer. Remember, the first step in the nursing process is assessment.
A middle-aged adult with a family history of CAD has the following: total cholesterol 198, LDL cholesterol 120, HDL cholesterol 58, triglycerides 148, blood sugar 102, and C-reactive protein 4.2. The healthcare provider prescribes a statin medication and aspirin. The client asks the nurse why these medications are needed. Which is the best response by the nurse? 1. The labs indicate severe hyperlipidemia and the medications will lower your LDL along with a low-fat diet. 2. The triglycerides are elevated and will not return to normal without these medications. 3. The CRP is elevated, indicating inflammation seen in cardiovascular disease, which can be lowered by the medications prescribed. 4. These medications will reduce the risk of type 2 diabetes. The correct answer is 3. The CRP is elevated, indicating inflammation seen in cardiovascular disease, which can be lowered by the medications prescribed. Rationale: CRP is a marker of inflammation and is elevated in the presence of cardiovascular disease. The high-sensitivity CRP is the blood test for greater accuracy in measuring the CRP to evaluate cardiovascular risk. The family history, postmenopausal age, LDL above optimum levels, and elevated CRP place the client at risk of CAD. Statin medications can decrease LDL, whereas statins and aspirin can reduce CRP and decrease the risk of MI and stroke. The blood sugar is within normal limits.
A 32-year-old patient with sickle cell anemia is admitted to the hospital during a sickle cell crisis. Blood pressure is 104/62, oxygen saturation is 85%, and the patient reports pain at a level 8. Which action prescribed by the healthcare provider will the nurse implement first? 1. Administer morphine sulfate 4 to 8 milligrams IV. 2. Give oxygen at 4 liters per minute via nasal cannula. 3. Start an infusion of normal saline at 200 ml per hour. 4. Apply warm packs to painful joints. The correct answer is 2. Give oxygen at 4 liters per minute via nasal cannula. National guidelines for sickle cell crisis indicate that oxygen should be administered if the oxygen saturation is less than 95%. Hypoxia and deoxygenation of the blood cells are the most common cause of sickling, so administration of oxygen is the priority intervention here. Pain control and hydration are also important interventions for this patient and should be accomplished rapidly. A client has entered a smoking cessation program to quit a 2-pack-a-day cigarette habit. The client has not smoked a cigarette for 3 weeks and tells the nurse about fears of starting smoking again because of current job pressures. What would be the most appropriate reply for the nurse to make in response to the client's comments? 1. Don't worry about it. Everybody has difficulty quitting smoking, and you should expect to as well. 2. If you increase your self-control, I am sure you will be able to avoid smoking. 3. Try taking a couple of days of vacation to relieve the stress of your job. 4. It is good that you can talk about your concerns. Try calling a friend when you want to smoke. The correct answer is 4. It is good that you can talk about your concerns. Try calling a friend when you want to smoke. It is important for individuals who are engaged in smoking cessation efforts to feel comfortable with sharing their fears of failure with others and seeking support. Although fewer than 5% of smokers successfully quit on their first attempt, it is not helpful to tell a client to anticipate failure. Telling the client to exercise more self-control does not provide support. Taking a vacation to avoid job pressures does not address the issue of how to manage the desire to smoke when in a stressful situation. The client with colon cancer has an abdominal perineal resection with a colostomy. Which of the following nursing interventions is most appropriate for this client in the post-operative period? 1. Maintain the client in a semi-Fowler's position. 2. Assist the client with warm sitz baths. 3. Administer 30 milliliters of milk of magnesia to stimulate peristalsis. 4. remove the ostomy pouch as needed so the stoma can be assessed. The correct answer is 2. Assist the client with warm sitz baths. Appropriate nursing interventions after an abdominal perineal resection with a colostomy include assisting the client with warm sitz baths 3 to 4 times a day to clean the perineal incision. The client will be more comfortable assuming a side-lying position because of the perineal incision. It would be inappropriate to administer milk of magnesia to stimulate colostomy activity. Stool passage will begin as peristalsis returns. It is not necessary or desirable to change the ostomy pouch daily to assess the stoma. The ostomy pouch should be transparent to allow easy observation of the stoma and drainage.
The nurse is assessing a client activity tolerance by having the client walk on a treadmill for 5 minutes. Which of the following indicates an abnormal response? 1. Pulse rate increased by 20 beats per minute immediately after the activity. 2. Respiratory rate decreased by 5 breaths per minute. 3. Diastolic blood pressure increased by 7. 4. Pulse rate within 6 beats per minute of resting pulse after 3 minutes of rest. The correct answer is 2. The normal physiologic response activity is an increased metabolic rate over the resting basal rate. The decrease in respiratory rate indicates that the client is not strong enough to complete the mechanical cycle of respiration needed for gas exchange. The post-activity pulse is expected to increase immediately after activity, but by no more than 50 beats per minute if it is strenuous activity. The diastolic blood pressure is expected to rise, but by no more than 15. The pulse returns to within 6 beats per minute of the resting pulse after 3 minutes of rest. A patient with a right above the knee amputation asks the nurse why he has phantom limb pain. What is the nurse's best response? 1. Phantom limb pain is not explained or predicted by any one theory. 2. Phantom limb pain occurs because your body thinks your leg is still present. 3. Phantom limb pain will not interfere with your activities of daily living. 4. Phantom limb pain is not real pain but is remembered pain. The correct answer is 1. Phantom limb pain is not explained or predicted by any one theory. Rationale. 3 theories are being researched with regard to phantom limb pain. The peripheral nervous system theory suggests that sensations remain as a result of the severing of peripheral nerves during the amputation. The central nervous system theory states that phantom limb pain results from a loss of inhibitory signals that were generated through afferent impulses from the amputated limb. The psychological theory helps predict and explain phantom limb pain because stress, anxiety, and depression often trigger or worsen a pain episode.
The client being discharged after sustaining an acute MI is prescribed lisinopril. Which instruction should the nurse include when teaching about this medication? 1. Instruct the client to monitor the blood pressure weekly. 2. Encourage the client to take medication on an empty stomach. 3. Discuss the need to rise slowly from lying to a standing position. 4. Teach the client to take the medication at night only. The correct answer is 3. Discuss the need to rise slowly from lying to a standing position. This medication causes orthostatic hypotension, and the client should be instructed to rise slowly from lying to sitting to standing position to prevent falls and injury. The nurse is preparing to administer medication in a labor and delivery unit. Which medication should the nurse question administering? 1. Magnesium sulfate to a client diagnosed with preeclampsia. 2. Dinoprostone to a client diagnosed with asthma. 3. Betamethasone to a client who is 27 weeks pregnant. 4. Oxytocin to a client diagnosed with an incomplete abortion. The correct answer is 2. Dinoprostone to a client diagnosed with asthma. The synthetic prostaglandin dinoprostone is used cautiously in clients who have asthma because it can initiate an asthmatic attack. Therefore, the nurse should question administering this medication. The client with preeclampsia would be receiving the anticonvulsant magnesium sulfate to help prevent seizures. Therefore, the nurse would not question administering this medication. The corticosteroid betamethasone is a medication used to increase surfactant in fetal lungs and would be administered to a client who is less than 34 weeks pregnant. Therefore, the nurse would not question administering this medication. Oxytocin, a uterine stimulant, would be administered after a client has experienced an incomplete abortion to help the client expel the fetal fragments. Therefore, the nurse would not question administering this medication. The charge nurse on a surgical floor is making assignments. Which client should be assigned to the most experienced nurse? 1. The 36-year-old client who has undergone an antral irrigation for sinusitis yesterday and has moderate pain. 2. The 6-year-old client scheduled for a tonsillectomy and adenoidectomy this morning who will not swallow medication. 3. The 18-year-old client who had a Caldwell-Luke procedure 3 days ago and has purulent drainage on the drip pad. 4. The 45-year-old client diagnosed with a peritonsillar abscess who requires IVPB antibiotic therapy 4 times a day. The correct answer is 3. The 18-year-old client who had a Caldwell-Luke procedure 3 days ago and has purulent drainage on the drip pad. The post-operative client with purulent drainage could be developing an infection. The experienced nurse would be needed to assess and monitor the client's condition. Any nurse who is capable of administering IVPB medications can care for this client. This client is 1 day post-operative and has moderate pain, which is to be expected after surgery. A less experienced nurse can care for this client. A child about to go to surgery involving the throat area can be expected to have painful swallowing. This does not require the most experienced nurse. In this type of question, you must determine if the situation described is expected or within normal limits. The option that gives unexpected data or data not within normal limits requires a nurse with more knowledge and experience.
The client has been managing angina episodes with nitroglycerin. Which of the following indicate the drug is effective? 1. Decreased chest pain. 2. Increased blood pressure. 3. Decreased blood pressure. 4. Decreased heart rate. The correct answer is 1. Decreased chest pain. Rationale. Nitroglycerin acts to decrease myocardial oxygen consumption. Vasodilation makes it easier for the heart to eject blood, resulting in decreased oxygen needs. Decreased oxygen demand reduces pain caused by heart muscle not receiving sufficient oxygen. While blood pressure may decrease ever so slightly due to the vasodilation effects of nitroglycerin, it is only secondary and not related to the angina the patient is experiencing. Increased blood pressure would mean the heart would work harder, increasing oxygen demand and thus angina. Decreased heart rate is not an effect of nitroglycerin.
These activities are included in the care plan for a 78-year-old patient admitted to the hospital with anemia caused by possible gastrointestinal bleeding. Which activity can the nurse delegate to an experienced assistive personnel? 1. Obtaining stool specimens for the fecal occult blood test. 2. Having the patient sign a colonoscopy consent form. 3. Giving the prescribed polyethylene glycol electrolyte solution. 4. Checking for allergies to contrast dye or shellfish. The correct answer is 1. Obtaining stool specimens for the fecal occult blood test. An experienced AP will have been taught how to obtain a stool specimen for the fecal occult blood test because this is a common screening test for hospitalized patients. Having the patient sign an informed consent form should be done by the healthcare provider who will be performing the colonoscopy. Administering medications and checking for allergies are within the scope of practice of licensed nursing staff. A client who is in a motor vehicle accident has a fractured mandible. Surgery has been performed to immobilize the injury by wiring the jaw. In the immediate post-operative phase, the nurse should 1. Prevent nausea and vomiting. 2. Maintain a patent airway. 3. Provide frequent oral hygiene. 4. Establish a way for the client to communicate. The correct answer is 2. Maintain a patent airway. The priority of care in the immediate post-operative phase is to maintain a patent airway. The nurse should observe the client carefully for signs of respiratory distress. If the client becomes nauseated, antiemetics should be administered to decrease the chance of vomiting with obstruction of the airway and aspiration of vomitus. Providing frequent oral hygiene and an alternative means of communication are important aspects of nursing care, but maintaining a patent airway is most important. The nurse assesses the client's stoma during the initial post-operative period. Which of the following observations should be reported immediately to the physician? 1. The stoma is slightly edematous. 2. The stoma is dark red to purple. 3. The stoma oozes a small amount of blood. 4. The stoma does not expel stool. The correct answer is 2. The stoma is dark red to purple. A dark red to purple stoma indicates inadequate blood supply. Mild edema and slight oozing of blood are normal in the early post-operative period. The colostomy would typically not begin functioning until 2 to 4 days after surgery. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
In a postoperative client, the hematocrit decreased from 36% to 34% on the third day, even though the red blood cell count and hemoglobin value remained stable at 4.5 millions per microliter and 11.9 grams per deciliter, respectively. The nurse should next 1. Check the dressing and drains for frank bleeding. 2. Call the physician. 3. Continue to monitor vital signs. 4. Start oxygen at 2 liters per minute per nasal cannula. The correct answer is 3. The nurse should continue to monitor the client because this value reflects a normal physiologic response. The physician does not need to be called, and oxygen does not need to be started based on these laboratory findings. Immediately after surgery, the client's hematocrit reflects a falsely high value related to the body's compensatory response to the stress of sudden loss of fluids and blood. Activation of the intrinsic pathway and the renin-angiotensin cycle via antidiuretic hormone produces vasoconstriction and retention of fluid for first 1 to 2 days post-operatively. By the 2nd to 3rd day, this response decreases, and the client's hematocrit level is more reflective of the amount of RBCs in the plasma. Fresh bleeding is a less likely occurrence on the 3rd postoperative day, but is not impossible. However, the nurse should have expected to see a decrease in the RBC count and hemoglobin value accompanying the hematocrit. During morning care, a patient with a below-the-knee amputation asked the assistive personnel about prostheses. How will the nurse instruct the AP to respond? 1. You should get a prosthesis so that you can walk again. 2. Wait and ask your healthcare provider that question the next time he comes in. 3. It's too soon to be worrying about getting a prosthesis. 4. I'll ask the nurse to come in and discuss this with you. The correct answer is 4. I'll ask the nurse to come in and discuss this with you. Rationale. The patient is indicating an interest in learning about prostheses. The experienced nurse can initiate discussion and begin educating the patient. Certainly, the HCP can also discuss prostheses with the patient, but the patient's wish to learn should receive a quick response. The nurse can then notify the HCP about the patient's request.
The client calls the clinic and says, "I am having chest pain. I think I'm having another heart attack." Which intervention should the nurse implement first? 1. Call 911 emergency medical services. 2. Instruct the client to take an aspirin. 3. Determine if the client is at home alone. 4. Ask if the client has any sublingual nitroglycerin. The correct answer is 4. Ask if the client has any sublingual nitroglycerin. Because the client has had 1 MI, the client may have sublingual nitroglycerin, a coronary vasodilator, in a pocket and can take it immediately. If the client does not have any on the body, then the nurse should determine if there is anyone in the home that can help the client. The nurse is preparing an amnio infusion for a client who is experiencing severe variable decelerations of the fetal heart rate. Which solution should the nurse expect to administer through the intrauterine pressure catheter? Select all that apply. 1. Normal saline. 2. 5% dextrose in water. 3. Lactated Ringer's solution. 4. Albumin 25% solution. 5. Dextrose and saline. The correct answers are 1. Normal saline and 3. Lactated Ringer's solution. Normal saline is used in amnio infusion. It can cause slight changes in fetal electrolytes, but is an acceptable fluid. Lactated Ringer solution is the preferred fluid for amnio infusion. 5% dextrose in water is not indicated for amnio infusion. Albumin is a blood product prepared from plasma and is not used for this procedure. Dextrose and saline is not indicated for amnio infusion. The client diagnosed with influenza A is being discharged from the emergency department with a prescription for antibiotics. Which statement by the client indicates an understanding of this prescription? 1. These pills will make me feel better fast, and I can return to work. 2. The antibiotics will help prevent me from developing a bacterial pneumonia. 3. If I had gotten this prescription sooner, I could have prevented this illness. 4. I need to take these pills until I feel better, then I can stop taking the rest. The correct answer is 2. The antibiotics will help prevent me from developing a bacterial pneumonia. Secondary bacterial infections often accompany influenza, and antibiotics are often prescribed to help prevent the development of a bacterial infection. Antibiotics will not prevent the flu. Only the flu vaccine will prevent the flu. When people take portions of the antibiotic prescription and stop taking the remainder, an antibiotic-resistant strain of bacteria may develop, and the client may experience a return of symptoms. But this time, the antibiotics will not be effective. A person with a viral infection should not return to work until the virus has run its course, because the antibiotics help prevent complications of the virus, but they do not make the client feel better faster.
If the client displays risk factors for coronary artery disease, such as smoking cigarettes, eating a diet high in saturated fat, or leading a sedentary lifestyle, techniques of behavior modification may be used to help the client change the behavior. The nurse can best reinforce new adaptive behaviors by 1. Explaining how the risk factor behavior leads to poor health. 2. Withholding praise until the new behavior is well established. 3. Rewarding the client whenever the acceptable behavior is performed. 4. Instilling mild fear into the client to extinguish the behavior. The correct answer is 3. Rewarding the client whenever the acceptable behavior is performed. Rationale. A basic principle of behavior modification is that behavior that is learned and continued is behavior that has been rewarded. Other reinforcement techniques have not been found to be as effective as reward.
The charge nurse is making the daily assignments on the medical surgical unit. Which patient is best assigned to a float nurse who has come from the post-anesthesia care unit? 1. A 30-year-old patient with thalassemia major who has an order for subcutaneous infusion of deferoxamine. 2. A 43-year-old patient with multiple myeloma who requires discharge teaching. 3. A 52-year-old patient with chronic gastrointestinal bleeding who has returned to the unit after a colonoscopy. 4. A 65-year-old patient with pernicious anemia who has just been admitted to the unit. The correct answer is 3. A 52-year-old patient with chronic gastrointestinal bleeding who has returned to the unit after a colonoscopy. A nurse who works in the post-anesthesia care unit will be familiar with the monitoring needed for a patient who has just returned from a procedure such as a colonoscopy, which requires moderate sedation or monitored anesthesia care. Care of the other patients requires staff with more experience with various types of hematologic disorders and would be better to assign to nursing personnel who regularly work on the medical surgical unit. A client has returned from surgery during which the jaws were wired as treatment for a fractured mandible. The client is in a stable condition. The nurse is instructing the unlicensed nursing personnel on how to properly position the client. Which instructions about positioning would be appropriate for the nurse to give the UAP? 1. Keep the client in a sideline position with the head slightly elevated. 2. Do not reposition the client without the assistance of a nurse. 3. The client can assume any position that is comfortable. 4. Keep the client's head elevated on 2 pillows at all times. The correct answer is 1. Keep the client in a side-lying position with the head slightly elevated. Immediately after surgery, the client should be placed on the side with the head slightly elevated. This position helps facilitate removal of secretions and decreases the likelihood of aspiration should vomiting occur. A nurse does not need to be present to reposition the client, unless the client's condition warrants the presence of the nurse. Although it is important to elevate the head, there is no need to keep the client's head elevated on 2 pillows unless that position is comfortable for the client. While changing the client's colostomy bag and dressing, the nurse assesses that the client is ready to participate in self-care by noting which of the following. 1. The client asks what time the doctor will visit that day. 2. The client asks about the supplies used during the dressing change. 3. The client talks about the news on the television. 4. The client is upset about the way the night nurse changed the dressing. The correct answer is 2. The client asks about the supplies used during the dressing change. A client who displays interest in the procedure and asks about supplies used for dressings may be ready to participate in self-care. Inquiring about the physician's visit, discussing news events, and discussing a dressing change are behaviors that avoid the subject of the colostomy.
The nurse is administering packed red blood cells to a client. The nurse should first 1. Discontinue the IV catheter if a blood transfusion reaction occurs. 2. Administer the PRBCs through a percutaneously inserted central catheter line with a 20-gauge needle. 3. Flush PRBCs with 5% dextrose and 0.45% normal saline solution. 4. Stay with the client during the first 15 minutes of infusion. The correct answer is 4. The most likely time for a blood transfusion reaction to occur is during the first 15 minutes or first 50 milliliters of the infusion. If a blood transfusion reaction does occur, it is imperative to keep an established IV line so that medication can be administered to prevent or treat cardiovascular collapse in case of anaphylaxis. PRBC should be administered through a 19-gauge or larger needle. A peripherally inserted central catheter line is not recommended in order to avoid a slow flow. RBCs will hemolyze in dextrose or lactated ringer solution and should be infused with only normal saline solution. During the assessment of a patient with fractures of the medial ulna and radius, the nurse finds all of these data. Which assessment findings should the nurse report to the healthcare provider immediately? 1. The patient reports pressure and pain. 2. The cast is in place and is dry and intact. 3. The skin is pink and warm to the touch. 4. The patient can move all the fingers and the thumb. The correct answer is 1. The patient reports pressure and pain. Rationale. Pressure and pain may be caused by increased compartment pressure and can indicate the serious complication of acute compartment syndrome. This situation is urgent. If it is not treated, cyanosis, tingling, numbness, paresis, and severe pain can occur. The other findings are normal and should be documented in the patient's chart.
The nurse is administering 0.5 inch of nitroglycerin paste. How much paste should the nurse apply to the application paper? 1. A, 2, B, 3, C, 4, D. The correct answer is 1. A. The line is in increments of 0.5 inch and the order is 0.5 inch. Therefore, the nurse should apply this much paste. The nurse is caring for the pregnant client in labor. The client has had no prenatal care and reports being dependent on opioids throughout her pregnancy. Which interventions for pain control could be provided to this client? Select all that apply. 1. Epidural anesthesia. 2. Butorphanol IV. 3. Morphine IV. 4. Acetaminophen PO. 5. 1% lidocaine locally. The correct answers are 1. Epidural anesthesia. 3. Morphine IV. 4. Acetaminophen PO. And 5. 1% lidocaine locally. Epidural anesthesia is not contraindicated in the opioid-dependent client and is an acceptable form of pain management. If narcotics can be safely administered, the nurse should not withhold the medication during labor. Giving opioids during acute pain does not enhance an opioid-addicted client's chemical dependence. Acetaminophen administered orally can reduce pain in early labor. 1% lidocaine can be administered by the HCP prior to an episiotomy or for perineal repair. Butorphanol is a narcotic agonist-antagonist and should be avoided in the opioid-dependent client as it can cause acute withdrawal in the mother and in utero withdrawal in the fetus, characterized by fetal tachycardia and fetal death. The nurse is developing a plan of care for a client diagnosed with laryngitis and identifies the client problem, altered communication. Which intervention should the nurse implement? 1. Instruct the client to drink a mixture of brandy and honey several times a day. 2. Encourage the client to whisper instead of trying to speak at a normal level. 3. Provide the client with a blank notepad for writing any communication. 4. Explain that the client's aphonia may become a permanent condition. The correct answer is 3. Provide the client with a blank notepad for writing any communication. Voice rest is encouraged for the client experiencing laryngitis. Aphonia, or inability to speak, is a temporary condition associated with laryngitis. The client with laryngitis is instructed to avoid all alcohol. Alcohol causes increased irritation of the throat. Whispering places added strain on the larynx. Encouraging the use of alcohol, with the exception of a glass of red wine, is not accepted medical practice. Therefore, option 1 could be eliminated. Option 4 has an absolute, permanent, in it, and therefore could be eliminated from consideration.
Alteplase recombinant, or tissue plasminogen activator, TPA, a thrombolytic enzyme, is administered during the first 6 hours after onset of myocardial infarction to 1. Control chest pain. 2. Reduce coronary artery vasospasm. 3. Control the arrhythmias associated with MI. 4. Revascularize the blocked coronary artery. The correct answer is 4. Revascularize the blocked coronary artery. Rationale. The thrombolytic agent TPA, administered intravenously, lyses the clot blocking the coronary artery. The drug is most effective when administered within the first 6 hours after onset of MI. The drug does not reduce coronary artery vasospasm. Nitrates are used to promote vasodilation. Arrhythmias are managed by antiarrhythmic drugs. Surgical approaches are used to open the coronary artery and reestablish a blood supply to the area.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. The nurse is making a room assignment for a newly arrived patient whose laboratory test results indicate pancytopenia. Which patient will be the best roommate for the new patient? 1. Patient with digoxin toxicity. 2. Patient with viral pneumonia. 3. Patient with shingles. 4. Patient with cellulitis. The correct answer is 1. Patient with digoxin toxicity. Patients with pancytopenia are at higher risk for infection. The patient with digoxin toxicity presents the least risk of infecting the new patient. Viral pneumonia, shingles, and cellulitis are infectious processes. A client who has had the jaws wired begins to vomit. What should be the nurse's first action? 1. Insert a nasogastric tube and connect it to suction. 2. Use wire cutters to cut the wire. 3. Suction the client's airway as needed. 4. Administer an antiemetic intravenously. The correct answer is 3. Suction the client's airway as needed. The nurse's first action is to clear the client's airway as necessary. Inserting an NG tube or administering an antiemetic may prevent future vomiting episodes, but these procedures are not helpful when the client is actually vomiting. Cutting the wires is done only as a last resort, or in case of respiratory or cardiac arrest. Which of the following skin preparations would be best to apply around the client's colostomy? 1. Stomahesive. 2. Petroleum jelly. 3. Cornstarch. 4. Antiseptic cream. The correct answer is 1. Stomahesive. Stomahesive is effective for protecting the skin around a colostomy to keep the skin healthy and prevent skin irritation from stoma drainage. Petroleum jelly, cornstarch, and antiseptic creams do not protect the skin adequately and may prevent an adequate seal between the skin and the colostomy bag.
The nurse should instruct a young female adult with sickle cell anemia to do which of the following? Select all that apply. 1. Drink plenty of fluids when outside in hot weather. 2. Avoid being in high altitudes. 3. Be aware that since she is homozygous for hemoglobin S, she carries the sickle cell trait. 4. Know that pregnancy with sickle cell disease increases the risk of a crisis. 5. Avoid flying on commercial airlines. The correct answers are 1, 2, and 4. The nurse should teach the client to drink plenty of fluids to avoid becoming dehydrated. The client should avoid being in high altitudes, such as mountains above 5,000 feet, where there is less oxygen in the air, which may precipitate a sickle cell crisis. The nurse should alert young women with sickle cell anemia that pregnancy increases the risk of a crisis. People who are homozygous for hemoglobin S have sickle cell anemia. The heterozygous form is the sickle cell carrier trait. A client with sickle cell anemia may fly on commercial airlines. The airplane is pressurized and has an adequate oxygen level. A patient who underwent a right above the knee amputation 4 days ago also has a diagnosis of depression. Which prescription would the nurse clarify with the healthcare provider? 1. Give fluoxetine 40 milligrams once a day. 2. Administer acetaminophen with codeine 1 or 2 tablets every 4 hours as needed. 3. Assist a patient to the bedside chair every shift. 4. Reinforce the dressing to the right residual limb as needed. The correct answer is 1. Give fluoxetine 40 milligrams once a day. Rationale. Doses of fluoxetine, a drug used to treat depression, that are greater than 20 milligrams should be given in 2 divided doses, not once a day. The other 3 prescriptions are appropriate for a patient who underwent amputation 4 days earlier.
The client diagnosed with coronary artery disease is prescribed atorvastatin. Which statement by the client warrants the nurse notifying the HCP? 1. I really haven't changed my diet, but I am taking my medication every day. 2. I am feeling pretty good, except I am having muscle pain all over my body. 3. I am swimming at the local pool about 3 times a week for 30 minutes. 4. I am taking this medication first thing in the morning with a bowl of oatmeal. The correct answer is 2. I am feeling pretty good, except I am having muscle pain all over my body. Atorvastatin is an HMG-CoA reductase inhibitor, or a statin. Statins can cause muscle injury, which can lead to myositis, fatal rhabdomyolysis, or myopathy. Muscle pain or tenderness should be reported to the HCP immediately. Usually the medication is discontinued. The nurse is teaching a pregnant client diagnosed with tuberculosis infection about treatments during pregnancy and effects on her newborn. Which statement indicates the client understands the client teaching? 1. My baby will be born with TB and will be given isoniazid to treat the infection. 2. I will not be able to breastfeed, or my newborn could contract TB. 3. I should take supplemental pyridoxine during my pregnancy. 4. I will not take any medications to treat my TB until I have delivered my baby. The correct answer is 3. I should take supplemental pyridoxine during my pregnancy. Pyridoxine is recommended for pregnant clients with TB infections to ensure the fetus gets necessary vitamins. The infant will be tested for congenital TB. However, perinatal transmission is rare. Breastfeeding is not contraindicated in latent TB. Isoniazid, rifampin, and ethambutol are taken daily during pregnancy for treatment of TB. Which task is most appropriate for the nurse to delegate to an unlicensed assistive personnel? 1. Feed a client who is post-operative tonsillectomy the first meal of clear liquids. 2. Encourage the client diagnosed with a cold to drink a glass of orange juice. 3. Obtain a throat culture on a client diagnosed with bacterial pharyngitis. 4. Escort the client diagnosed with laryngitis outside to smoke a cigarette. The correct answer is 2. Encourage the client diagnosed with a cold to drink a glass of orange juice. Clients with colds are encouraged to drink 2,000 milliliters of liquids a day. The UAP could do this. Tonsillectomies cause throat edema and difficulty swallowing. The nurse must observe the client's ability to swallow before this task can be delegated. Throat swabs for culture must be done correctly, or false negative results can occur. The nurse should obtain the swab. Clients with laryngitis are instructed not to smoke. Smoking is discouraged in all healthcare facilities. Sending nursing personnel outside encourages an unhealthy practice, which is not the best use of the personnel. Interventions requiring assessment, teaching, and evaluation cannot be delegated. Levels of activities being delegated should be appropriate for the level of training of the staff member carrying out the task. Tasks delegated must conform to safe healthcare practice.
After the administration of TPA, the nurse should 1. Observe the client for chest pain. 2. Monitor for fever. 3. Review the 12-lead electrocardiogram ECG. 4. Auscultate breath sounds. The correct answer is 1. Observe the client for chest pain. Rationale: although monitoring the 12-lead ECG and monitoring breath sounds are important, observing the client for chest pain is the nursing assessment priority because closure of the previously obstructed coronary artery may recur. Clients who receive TPA frequently receive heparin to prevent closure of the artery after administration of TPA. Careful assessment for signs of bleeding and monitoring of partial thromboplastin time are essential to detect complications. Administration of TPA should not cause fever.
A 67-year-old patient who is receiving chemotherapy for lung cancer is admitted to the hospital with thrombocytopenia. Which statement made by the patient when the nurse is obtaining the admission history is of most concern? 1. I've noticed that I bruise more easily since the chemotherapy started. 2. My bowel movements are soft and dark brown. 3. I take ibuprofen every day because of my history of osteoarthritis. 4. My appetite has decreased since the chemotherapy started. The correct answer is 3. I take ibuprofen every day because of my history of osteoarthritis. Because nonsteroidal anti-inflammatory drugs will decrease platelet aggregation, patients with thrombocytopenia should not use ibuprofen routinely. Patient teaching about this should be included in the care plan. Bruising is consistent with the patient's admission problem of thrombocytopenia. Soft, dark brown stools indicate that there is no frank or occult blood in the bowel movements. Although the patient's decreased appetite requires further assessment by the nurse, this is a common complication of chemotherapy. A nurse teaches a client experiencing heartburn to take 1.5 ounces of Mulox when symptoms appear. How many milliliters should the client take? Blank milliliters. The correct answer is 45 milliliters. 1 ounce equals to 30 milliliters. To solve this problem, you set up the formula as 1 ounce over 30 milliliters equals to 1.5 ounces over x. You cross-multiply 1 times x and 30 times 1.5. You get 1x equals to 45. You divide by 1 on both sides, and you get x equals to 45 milliliters. A client is recovering from an abdominal perineal resection. Which of the following measures would most effectively promote wound healing after the perineal drains have been removed? 1. Taking sitz baths. 2. Taking daily showers. 3. Applying warm, moist dressings to the area. 4. Applying a protected heating pad to the area. The correct answer is 1. Taking sitz baths. Sitz baths are an effective way to clean the operative area after an abdominal perineal resection. Sitz baths bring warmth to the area, improve circulation, and promote healing and cleanliness. Most clients find them comfortable and relaxing. Between sitz baths, the area should be kept clean and dry. A shower will not adequately clean the perineal area. Moist dressings may promote wound contamination and delay healing. A heating pad applied to the area for longer than 20 minutes may cause excessive vasodilation, leading to congestion and discomfort.
The nurse is teaching a client and his family about the client's new diagnosis of hemochromatosis. Which of the following details should the nurse include? 1. Hemochromatosis is an autoimmune disorder that affects the HFE gene. 2. Individuals who are heterozygous for hemochromatosis rarely develop the disease. 3. Individuals who are homozygous for hemochromatosis are carriers of hemochromatosis. 4. Men are at greater risk for hemochromatosis. The correct answer is 2. The nurse should teach the client and family that individuals who are heterozygous for hemochromatosis rarely develop the disease. Men and women are equally at risk for hemochromatosis, but men are diagnosed earlier because women do not usually have manifestations until menopause. Hemochromatosis is the most common genetic disorder in Canada and the United States. Individuals who are homozygous for hemochromatosis receive a defective gene from each parent. Those with homozygous genes may develop the disease. The nurse is caring for a postoperative patient with a hip replacement. Which patient care actions can be delegated to the experienced assistive personnel? Select all that apply. 1. Inspect heels and other bony prominences every 8 hours. 2. Turn and reposition the patient every 2 hours. 3. Ensure that the patient's heels are elevated off the bed. 4. Assess the patient's calf regions for redness and swelling. 5. Check vital signs and oxygen saturation via pulse oximetry. 6. Assess for pain and administer pain medication. The correct answers are 2. Turn and reposition the patient every 2 hours. 3. Ensure that the patient's heels are elevated off the bed. And 5. Check vital signs and oxygen saturation via pulse oximetry. Rationale. The AP scope of practice includes repositioning patients and checking vital signs, and an experienced AP would know how to check pulse oximetry and elevate the patient's heels off the bed. Assessing and inspecting patients is more appropriate to the educational level of the professional nurse.
The client diagnosed with coronary artery disease is instructed to take 81 milligrams of aspirin. Which statement best describes the scientific rationale for prescribing this medication? 1. This medication will help thin the client's blood. 2. Daily aspirin will decrease the incidence of angina. 3. This medication will prevent platelet aggregation. 4. Baby aspirin will not cause gastric distress. The correct answer is 3. This medication will prevent platelet aggregation. When 81 milligrams of aspirin, a baby aspirin, is taken daily, it helps prevent platelet aggregation, which, in turn, helps the blood pass through the narrowed arteries more easily. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. The nurse is assisting the certified registered nurse anesthetist in placing an epidural in a laboring client. Which findings would indicate intravascular injection of the local anesthetic? Select all that apply. 1. Tachycardia. 2. Pruritus. 3. Tinnitus. 4. Sedation. 5. Dizziness. The correct answers are 1. Tachycardia, 3. Tinnitus, and 5. Dizziness. Tachycardia is a symptom of intravascular injection of a local anesthetic. Tinnitus is a symptom of intravascular injection of a local anesthetic. Dizziness is a symptom of intravascular injection of a local anesthetic. Pruritus, itching, is a symptom of an allergic reaction. Intravascular injection does not cause sedation in the client. The nurse is caring for a client diagnosed with a cold. Which is an example of an alternative therapy? 1. Vitamin C, 2,000 milligrams daily. 2. Strict bed rest. 3. Humidification of the air. 4. Decongestant therapy. The correct answer is 1. Vitamin C, 2,000 milligrams daily. Alternative therapies are therapies not accepted as standard medical practice. These may be encouraged as long as they do not interfere with the medical regimen. Vitamin C in large doses is thought to improve the immune system's functions. Bed rest is accepted standard advice for a client with a cold. Humidifying the air helps to relieve congestion and is a standard practice. Decongestant therapy is standard therapy for a cold. Only one of the answer options is not common advice for a client with a cold. When all options but one match each other, then the odd option should be selected as the correct answer.
When monitoring a client who is receiving tissue plasminogen activator, TPA, the nurse should have resuscitation equipment available because reperfusion of the cardiac tissue can result in which of the following? 1. Cardiac arrhythmias. 2. Hypertension. 3. Seizure. 4. Hypothermia. The correct answer is 1. Cardiac arrhythmias. Rationale. Cardiac arrhythmias are commonly observed with administration of TPA. Cardiac arrhythmias are associated with reperfusion of the cardiac tissue. Hypotension is commonly observed with administration of TPA. Seizures and hypothermia are not generally associated with reperfusion of the cardiac tissue.
After a car accident, a patient with a medical alert bracelet indicating hemophilia A is admitted to the emergency department. Which action prescribed by the healthcare provider will the nurse implement first? 1. Transport the patient to the radiology department for cervical spine radiography. 2. Transfuse factor VII concentrate. 3. Type and cross-match for 4 units of packed red blood cells. 4. Infuse normal saline at 250 ml per hour. The correct answer is 2. Transfuse factor VII concentrate. When a hemophiliac patient is at high risk for bleeding, the priority intervention is to maximize the availability of clotting factors. The other prescribed actions should also be implemented rapidly, but do not have as high a priority as administering clotting factors. The nurse has been assigned to provide care for 4 clients. In what order should the nurse assess these clients? 1. A client awaiting surgery for a hiatal hernia repair at 11 a.m. 2. A client with suspected gastric cancer who is on nothing by mouth status for tests. 3. A client with peptic ulcer disease experiencing a sudden onset of acute stomach pain. 4. A client who is requesting pain medication 2 days after surgery to repair a fractured jaw. The correct order is 3. A client with peptic ulcer disease experiencing a sudden onset of acute stomach pain. 4. A client who is requesting pain medication 2 days after surgery to repair a fractured jaw. 2. A client with suspected gastric cancer who is on nothing by mouth status for tests. And 1. A client awaiting surgery for a hiatal hernia repair at 11 a.m. The client with peptic ulcer disease who is experiencing a sudden onset of acute stomach pain should be assessed first by the nurse. The sudden onset of stomach pain could be indicative of a perforated ulcer, which would require immediate medical attention. It is also important for the nurse to thoroughly assess the nature of the client's pain. The client with the fractured jaw is experiencing pain and should be assessed next. The nurse should then assess the client who is NPO for tests to ensure NPO status and comfort. Last, the nurse can assess the client before surgery. When planning diet teaching for the client with a colostomy, the nurse should develop a plan that emphasizes which of the following dietary instructions. 1. Foods containing roughage should not be eaten. 2. Liquids are best limited to prevent diarrhea. 3. Clients should experiment to find the diet that is best for them. 4. A high-fiber diet will produce a regular passage of stool. The correct answer is 3. Clients should experiment to find the diet that is best for them. It is best to adjust the diet of a client with a colostomy in a manner that suits the client rather than trying special diets. Severe restriction of roughage is not recommended. The client is encouraged to drink 2 to 3 liters of fluid per day. A high-fiber diet may produce loose stools.
A client is having a blood transfusion reaction. The nurse must do the following in what order priority from first to last? 1. Notify the attending physician and blood bank. 2. Complete the appropriate transfusion reaction forms. 3. Stop the transfusion. 4. Keep the IV open with normal saline infusion. The correct order is 3, 4, 1, and 2. When the client is having a blood transfusion reaction, the nurse should first stop the transfusion and then keep the IV open with normal saline infusion. Next, the nurse should notify the physician and blood bank, then complete the required forms regarding the transfusion reaction. The emergency department nurse should question which healthcare provider prescription when providing care for an older adult with a fracture of the left ulna. 1. Get x-rays of the left forearm. 2. Give him a Paradine IM for pain. 3. Monitor vital signs every hour. 4. Elevate left arm on pillows. The correct answer is 2. Give meperidine IM for pain. Meperidine should not be used because of its toxic metabolites that can cause seizures and other adverse drug events, especially in the older adult population. X-rays are used to confirm the diagnosis. Vital signs and elevation are common actions for a patient in the emergency department, and elevation can decrease the swelling in the affected extremity.
The client with coronary artery disease is prescribed cholestyramine. Which intervention should the nurse implement when administering the medication? 1. Administer the medication with fruit juice. 2. Instruct the client to decrease fiber when taking the medication. 3. Monitor the cholesterol level before giving medication. 4. Assess the client for upper abdominal discomfort. The correct answer is 1. Administer the medication with fruit juice. Cholestyramine is a bile acid sequestrant. This medication should be administered with water, fruit juice, soup, or pulpy fruit such as pineapple to reduce the risk of esophageal irritation. The nurse is preparing to administer topical benzocaine to a client with a 4th-degree episiotomy. Which interventions should the nurse implement? Rank in order of performance. 1. Position the client on the side with top leg up and forward. 2. Wash hands and don non-sterile examination gloves. 3. Check the client's MAR with the identification band. 4. Ask the client if she is allergic to any cane drugs. 5. Apply the benzocaine to the perineal area. The correct order is 3. Check the client's MAR with the identification band. 4. Ask the client if she is allergic to any cane drugs. 2. Wash hands and don non-sterile examination gloves. 1. Position the client on the side with top leg up and forward. And 5. Apply the benzocaine to the perineal area. The nurse must first determine if this is the right client receiving the right medication. The nurse should always check for allergies. With this medication, cane drugs are anesthetics, and if the client is allergic to lidocaine or novocaine, the client should not receive this medication. Once the nurse determines that this is the right client to receive the right medication and that the client has no allergies, then the nurse must wash his or her hands and use gloves to administer a medication to the perineal area. The position on the side with top leg up and forward allows maximum exposure to the area that should be medicated. After completing all the previous steps, the nurse can apply the medication. The nurse is assessing a 79-year-old client diagnosed with pneumonia. Which signs and symptoms should the nurse expect to assess in the client? 1. Confusion and lethargy. 2. High fever and chills. 3. Frothy sputum and edema. 4. Bradypnea and jugular vein distension. The correct answer is 1. Confusion and lethargy. The elderly client diagnosed with pneumonia may present with weakness, fatigue, lethargy, confusion, and poor appetite, but not have any of the classic signs and symptoms of pneumonia. Fever and chills are classic symptoms of pneumonia, but they are usually absent in the elderly client. Frothy sputum and edema are signs and symptoms of heart failure, not pneumonia. The client has tachypnea, not bradypnea, and jugular vein distension accompanies heart failure.
Prior to administering tissue plasminogen activator, TPA, the nurse should assess the client for which of the following contradictions to administering the drug? 1. Age greater than 60 years. 2. History of cerebral hemorrhage. 3. History of heart failure. 4. Cigarette smoking. The correct answer is 2. History of cerebral hemorrhage. Rationale. A history of cerebral hemorrhage is a contraindication to administration of TPA because the risk of hemorrhage may be further increased. Age greater than 60 years, history of heart failure, and cigarette smoking are not contraindications.
The home health nurse is obtaining a history for a patient who has deep vein thrombosis and is taking warfarin 2 milligrams per day. Which statement by the patient is the best indicator that additional teaching about warfarin may be needed? 1. I have started to eat more healthy foods like green salads and fruit. 2. The doctor said that it is important to avoid becoming constipated. 3. Warfarin makes me feel a little nauseated unless I take it with food. 4. I will need to have some blood testing done once or twice a week. The correct answer is 1. I have started to eat more healthy foods like green salads and fruit. Patients taking warfarin are advised to avoid making sudden dietary changes because changing the oral intake of foods high in vitamin K will have an impact on the effectiveness of the medication. The other statements suggest that further teaching may be indicated, but more assessment for teaching needs is required first. The nurse is caring for a client who has just had an upper GI endoscopy. The client's vital signs must be taken every 30 minutes for 2 hours after the procedure. The nurse assigns an unlicensed nursing personnel to take the vital signs. 1 hour later, the UAP reports the client, who was previously afebrile, has developed a temperature of 101.8 degrees Fahrenheit. What should the nurse do in response to these reported assessment data? 1. Promptly assess the client for potential perforation. 2. Tell the assistant to change the thermometers and retake the temperature. 3. Plan to give the client acetaminophen to lower the temperature. 4. Ask the UAP to bathe the client with tepid water. The correct answer is 1. Promptly assess the client for potential perforation. A sudden spike in temperature following an endoscopic procedure may indicate perforation of the GI tract. The nurse should promptly conduct a further assessment of the client, looking for further indicators of perforation, such as a sudden onset of acute upper abdominal pain, a rigid, board-like abdomen, and developing signs of shock. Telling the assistant to change the thermometers is not an appropriate action and only further delays the appropriate action of assessing the client. The nurse would not administer acetaminophen without further assessment of the client or without a physician's prescription. A suspected perforation would require that the client be placed on nothing by mouth status. Asking the assistant to bathe the client before any assessment by the nurse is inappropriate. Which of the following is an expected outcome for a client who is recovering from an abdominal perineal resection with a colostomy? The client will 1. Maintain a fluid intake of 3,000 milliliters per day. 2. Eliminate fiber from the diet. 3. Limit physical activity to light exercise. 4. Accept that sexual activity will be diminished. The correct answer is 1. Maintain a fluid intake of 3,000 milliliters per day. An expected outcome is that the client will maintain a fluid intake of 3,000 milliliters per day, unless contraindicated. There is no need to eliminate fiber from the diet. The client can eat whatever foods are desired, avoiding those that are bothersome. Physical activity does not need to be limited to light exercise. The client can resume normal activities as tolerated, usually within 6 to 8 weeks. The client's sexual activity may be affected, but it does not need to be diminished. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
Which safety measures will be most important to implement when caring for a client who is receiving 2 units of packed red blood cells? Select all that apply. 1. Verify that the ABO and RH of the 2 units are the same. 2. Infuse a unit of PRBCs in less than 4 hours. 3. Stop the transfusion if a reaction occurs, but keep the line open. 4. Take vital signs every 15 minutes while the unit is transfusing. 5. Inspect the blood bag for leaks, abnormal color, and clots. 6. Use a 22-gauge catheter for optimal flow of a blood transfusion. The correct answers are 2, 3, and 5. The American Association of Blood Banks and Canadian Blood Services recommend that 2 qualified people, such as 2 licensed nurses, compare the name and number on the identification bracelet with the tag on the blood bag. Verifying that the 2 units are the same is not a recommendation. Rather, the verification is always with the client, not with bags of blood. A unit of blood should infuse in 4 hours or less to avoid the risk of septicemia, since no preservatives are used. When a blood transfusion reaction occurs, the blood transfusion should be stopped immediately, but the 4 lines should be kept open so that emergency medications and fluids can be administered. The unit of PRBC should be inspected for contamination by looking for leaks, abnormal color, clots, and excessive air bubbles. When a unit of PRBCs is being transfused, vital signs are assessed before the transfusion begins, after the first 15 minutes, and then every hour until 1 hour after the transfusion has been completed. When PRBCs are being administered, a 20-gauge or larger needle is needed to avoid destroying the red blood cells passing through the lumen and to allow for maximal flow rate. The nurse is mentoring a student nurse who is caring for a patient with carpal tunnel syndrome of the right hand with a neurovascular check ordered every 2 hours, for which action by the student nurse must the nurse intervene. 1. Student nurse checks the patient's radial pulse every 2 hours. 2. Student nurse checks for sensation in the patient's right hand. 3. Student nurse assesses color, temperature, and pain in right wrist and hand. 4. Student nurse instructs the patient to avoid movement because of the pain. The correct answer is 4. Student nurse instructs the patient to avoid movement because of the pain. Rationale. Performing complete neurovascular assessment includes palpation of pulses in the extremities below the level of injury and assessment of sensation, movement, color, temperature, and pain in the injured part. If pulses are not palpable, use of a Doppler helps find pulses in the extremities. After surgery, the patient should be given pain medication and encouraged to move the fingers frequently. Some hand movements, such as lifting heavy objects, may be restricted for 4 to 6 weeks after surgery.
The elderly client diagnosed with coronary artery disease has been taking aspirin daily for more than a year. Which data warrants notifying the HCP? 1. The client has lost 5 pounds in the last month. 2. The client has trouble hearing low tones. 3. The client reports having a funny taste in the mouth. 4. The client has hard, dark, tarry stools. The correct answer is 4. The client has hard, dark, tarry stools. A complication of long-term aspirin use is gastric bleeding, which could result in dark, tarry stools. This data would warrant further intervention. The client in labor has an epidural catheter in place for anesthesia. Which intervention is most important for the labor and delivery nurse? 1. Assist the client with breathing exercises during contractions. 2. Ensure the client's legs are correctly positioned in the stirrups. 3. Have the significant other scrub for the delivery of the baby. 4. Titrate the epidural medication to ensure analgesic effect. The correct answer is 2. Ensure the client's legs are correctly positioned in the stirrups. Because the legs are numb as a result of the epidural, the nurse must ensure the legs are in the stirrups correctly so that the client will not experience neurovascular compromise or any type of injury to the legs when they are in the stirrups. Breathing exercises are important, but the protection of the client's lower extremities while under anesthesia should be a priority for the nurse. Preparing the significant other for the delivery is important, but it is not a priority over the safety of the mother's lower extremities. The anesthesiologist or nurse anesthetist would be responsible for administering the anesthesia during the delivery. The nurse is planning the care of a client diagnosed with pneumonia and writes a problem of impaired gas exchange. Which is an expected outcome for this problem? 1. Performs chest physiotherapy 3 times a day. 2. Able to complete activities of daily living. 3. Ambulates in the hall several times during each shift. 4. Alert and oriented to person, place, time, and events. The correct answer is 4. Alert and oriented to person, place, time, and events. Impaired gas exchange results in hypoxia, the earliest sign-symptom of which is a change in the level of consciousness. Clients do not perform chest physiotherapy. This is normally done by the respiratory therapist. Option 1 is a staff goal, not a client goal. Option 2 would be a goal for self-care deficit, but not for impaired gas exchange. Option 3 would be a goal for the problem of activity intolerance. You should match the answer option to the listed nursing problem. When writing goals for the client, it is important to remember they are written in terms of what is expected of the client.
A client has driven himself to the emergency department. He is 50 years old, has a history of hypertension, and informs the nurse that his father died from a heart attack at age 60. The client has indigestion. The nurse connects him to an electrocardiogram monitor and begins administering oxygen at 2 liters per minute per nasal cannula. The nurse's next action should be to 1. Call for the physician. 2. Start an IV infusion. 3. Obtain a portable chest radiograph. 4. Draw blood for laboratory studies. The correct answer is 2. Start an IV infusion. Rationale. Advanced Cardiac Life Support recommends that at least 1 or 2 IV lines be inserted in one or both of the antecubital spaces. Calling the physician, obtaining a portable chest radiograph, and drawing blood for the laboratory are important but secondary to starting the IV line.
A patient is admitted to the intensive care unit with disseminated intravascular coagulation associated with a gram-negative infection. Which assessment information has the most immediate implications for the patient's care? 1. There is no palpable radial or pedal pulse. 2. The patient reports chest pain. 3. The patient's oxygen saturation is 87%. 4. There is modeling of the hands and feet. The correct answer is 3. The patient's oxygen saturation is 87%. Because the decrease in oxygen saturation will have the greatest immediate effect on all body systems, improvement in oxygenation should be the priority goal of care. The other data also indicate the need for rapid intervention, but improvement of oxygenation is the most urgent need. A client is admitted to the hospital after vomiting bright red blood and is diagnosed with a bleeding duodenal ulcer. The client develops a sudden sharp pain in the mid-epigastric region along with a rigid, board-like abdomen. The nurse should do which of the following first? 1. Administer pain medication as prescribed. 2. Raise the head of the bed. 3. Prepare to insert a nasogastric tube. 4. Notify the physician. The correct answer is 4. Notify the physician. The client is experiencing a perforation of the ulcer, and the nurse should notify the physician immediately. The body reacts to perforation of an ulcer by immobilizing the area as much as possible. This results in board-like abdominal rigidity, usually with extreme pain. Perforation is a medical emergency requiring immediate surgical intervention because peritonitis develops quickly after perforation. Administering pain medication is not the first action, although the nurse later should institute measures to relieve pain. Elevating the head of the bed will not minimize perforation. A nasogastric tube may be used following surgery. A client with colon cancer has developed ascites. The nurse should conduct a focused assessment for which of the following. Select all that apply. 1. Respiratory distress. 2. Bleeding. 3. Fluid and electrolyte imbalance. 4. Weight gain. 5. Infection. The correct answers are 1. Respiratory distress and 3. Fluid and electrolyte imbalance. Ascites limits the movement of the diaphragm, leading to respiratory distress. Fluid shift from the intravascular space precipitates fluid and electrolyte imbalances. Weight gain is not a direct consequence of ascites, but weight loss may result in decreased albumin levels. Decreased albumin in the intravascular space results in decreased oncotic pressure, precipitating movement of fluid out of space. A client with ascites is not at increased risk for infection unless a peritoneal tap is done to remove fluid. The risk of bleeding is a result of alterations in liver enzymes affecting coagulation.
A client who had received 25 milliliters of packed red blood cells has low back pain and pruritus after stopping the infusion. The nurse should take what action next? 1. Administer prescribed antihistamine and aspirin. 2. Collect blood and urine samples and send to the lab. 3. Administer prescribed diuretics. 4. Administer prescribed vasopressors. The correct answer is 2. ABO and Rh incompatible blood causes an antigen-antibody reaction that produces hemolysis or agglutination of red blood cells. At the first indication of any sign/symptom of reaction, the blood transfusion is stopped. Blood and urine samples are obtained from a client and sent to the lab along with the remaining untransfused blood. Hemoglobin in the urine and blood samples taken at the time of the reaction provide evidence of a hemolytic blood transfusion reaction. Antihistamine, aspirin, diuretics, and vasopressors may be administered with different types of transfusion reactions. The nurse is preparing a patient for magnetic resonance imaging. Which action can the nurse delegate to the experienced assistive personnel? 1. Teach the patient what to expect during the test. 2. Instruct the patient to remove metal objects, including zippers. 3. Witness that the patient has signed the consent form. 4. Check and record pre-procedure vital signs. The correct answer is 4. Check and record pre-procedure vital signs. Rationale. The AP scope of practice includes checking and recording patient vital signs. Teaching and instructing, as well as witnessing consent forms, is appropriate to the professional nurse's scope of practice. The AP could remind the patient about the removal of metal objects after the patient receives that instruction.
Which data indicates to the nurse that simvastatin is effective? 1. The client's blood pressure is 132/80. 2. The client's cholesterol level is 180 milligrams per deciliter. 3. The client's LDL cholesterol level is 180 milligrams per deciliter. 4. The client's HDL cholesterol level is 35 milligrams per deciliter. The correct answer is 2. The client's cholesterol level is 180 milligrams per deciliter. Simvastatin is an HMG-CoA reductase inhibitor, or a statin that lowers cholesterol levels. A cholesterol level less than 200 milligrams per deciliter is desirable and indicates the medication is effective. Which assessment data warrants immediate intervention for the client in labor who is receiving an oxytocin infusion via pump? 1. The uterus periodically becomes hard and firm. 2. The client reports an urgency to void. 3. The client denies the urge to push. 4. The fetal heart rate does not return to baseline. The correct answer is 4. The fetal heart rate does not return to baseline. During a contraction, the fetal heart rate will decrease, but should return to the baseline fetal heart rate after the contraction. If this does not occur, it indicates the infant is in distress, and this warrants immediate intervention. This could also be a sign of uterine rupture resulting from overstimulation of the uterus. The oxytocin infusion should be stopped immediately. The uterus becoming hard and firm periodically indicates a contraction, which is expected when administering a uterine stimulant. The client wanting to urinate would be expected because the baby's head is pushing against the bladder. Denying the urge to push indicates the client is not in the last stages of labor. The nurse in a long-term care facility is planning the care for a client with a percutaneous endoscopic gastrostomy feeding tube. Which intervention should the nurse include in the plan of care? 1. Inspect the insertion line at the nares prior to instilling formula. 2. Elevate the head of the bed after feeding the client. 3. Place the client in the Sims position following each feeding. 4. Change the dressing on the feeding tube every 3 days. The correct answer is 2. Elevate the head of the bed after feeding the client. Elevating the head of the bed uses gravity to keep the formula in the gastric cavity and help prevent it from refluxing into the esophagus, which predisposes the client to aspiration. A gastrostomy tube is placed directly into the stomach through the abdominal wall. The nares is the opening of the nostril. The Sims position is the left lateral side-lying flat position. This position is used for administering enemas and can be used to prevent aspiration in clients sedated by anesthesia. The sedated client would not have a full stomach. Dressings on PEG tubes should be changed at least daily. If there is no dressing, the insertion site is still assessed daily.
Crackles heard on lung auscultation indicate which of the following? 1. Cyanosis. 2. Bronchospasm. 3. Airway narrowing. 4. Fluid-filled alveoli. The correct answer is 4. Fluid-filled alveoli. Rationale. Crackles are auscultated over fluid-filled alveoli. Crackles heard on lung auscultation do not have to be associated with cyanosis. Bronchospasm and airway narrowing generally are associated with wheezing sounds.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. A patient with iron deficiency anemia who is taking oral iron supplements is evaluated by the nurse in the outpatient clinic. Which finding by the nurse is of most concern? 1. The patient reports that stools are black. 2. The patient complains of occasional constipation. 3. The patient takes a multivitamin tablet every day. 4. The patient takes an antacid with the iron to avoid nausea. The correct answer is 4. The patient takes an antacid with the iron to avoid nausea. Concurrent use of antacids with iron supplements will decrease absorption of the iron and decrease the efficacy in resolving the patient's anemia. Black stools are expected when taking oral iron. The patient's occasional constipation may indicate a need for information about prevention of constipation while taking iron. Use of a multivitamin tablet is safe when taking iron supplements. When obtaining a nursing history from a client with a suspected gastric ulcer, which signs and symptoms should the nurse assess? Select all that apply. 1. Epigastric pain at night. 2. Relief of epigastric pain after eating. 3. Vomiting. 4. Weight loss. 5. Melena. The correct answers are 3. Vomiting, 4. Weight loss, and 5. Melena. Vomiting and weight loss are common with gastric ulcers. The client may also have blood in the stools, which is melena from gastric bleeding. Clients with a gastric ulcer are most likely to have a burning epigastric pain that occurs about 1 hour after eating. Eating frequently aggravates the pain. Clients with duodenal ulcers are more likely to have pain that occurs during the night and is frequently relieved by eating. A 36-year-old female client has been diagnosed with hemorrhoids. Which of the following factors in the client's history would most likely be a primary cause of her hemorrhoids? 1. Her age. 2. 3 vaginal delivery pregnancies. 3. Her job as a school teacher. 4. Varicosities in her legs. The correct answer is 2. 3 vaginal delivery pregnancies. Hemorrhoids are associated with prolonged sitting or standing, portal hypertension, chronic constipation, and prolonged increased intra-abdominal pressure as associated with pregnancy and the strain of vaginal delivery. Her job as a school teacher does not require prolonged sitting or standing. Age and leg varicosities are not related to the development of hemorrhoids.
A client is to receive EPOIN injections. What laboratory value should the nurse assess before giving the injection? 1. Hematocrit. 2. Partial thromboplastin time. 3. Hemoglobin concentration. 4. Prothrombin time. The correct answer is 1. Epoetin is a recombinant DNA form of erythropoietin, which stimulates the production of red blood cells and therefore causes the hematocrit to rise. The elevation in hematocrit causes an elevation in the blood pressure. Therefore, the blood pressure is a vital sign that should be checked. The partial thromboplastin time, hemoglobin level, and prothrombin time are not monitored for this drug. The nurse is teaching an older patient about risks for fractures and osteoporosis. Which diagnostic test should the nurse teach about when the goal is to establish the patient's bone strength and determine if osteoporosis is present? 1. Computed tomography scan. 2. Magnetic resonance imaging scan. 3. Dual energy X-ray absorptiometry scan. 4. Joint X-rays. The correct answer, 3. Dual energy X-ray absorptiometry scan. Rationale. Testing bone density is the only way to know for sure whether or not a patient has osteoporosis. A diagnostic test commonly prescribed by healthcare providers is dual energy X-ray absorptiometry scan. This type of scan focuses on 2 main areas, the hip and the spine. The forearm can be tested, however, if the hip or spine cannot be tested. The other tests may be prescribed, but are not as commonly used to test bone strength.
The client diagnosed with arterial hypertension develops a cold. Which information regarding over-the-counter medications should the nurse teach? 1. Try to find a medication that will not cause drowsiness. 2. OTC medications are not as effective as a prescription. 3. OTC medications are more expensive than prescriptions. 4. Do not take OTC medication unless approved by the HCP. The correct answer is 4. Do not take OTC medication unless approved by the HCP. Many OTC medications work by causing vasoconstriction, which will increase the client's hypertension. The client should only take medications approved by the HCP that will not affect the client's hypertension. The client should be informed about the dangers of self-medicating with OTC medications. Many OTC medications work by causing vasoconstriction, which will increase the client's hypertension. Efficacy of medications depends on the medication and strength. A nurse is informed that a credentialing team has arrived and is in the process of assessing the quality of care delivered at the hospital. Which organization is associated with the credentialing of hospitals? 1. The Joint Commission. 2. National League for Nursing. 3. American Nurses Association. 4. National Council Licensure Examination. The correct answer is 1. The Joint Commission. The Joint Commission evaluates healthcare organizations' compliance with standards stipulated by the Joint Commission. Accreditation indicates that the organization has the capabilities to provide quality care. In addition, federal and state regulatory agencies and insurance companies require accreditation by the Joint Commission. The National League for Nursing fosters the development and improvement of nursing education and nursing service. The American Nurses Association is the national professional organization for nursing in the United States. Its purposes are to promote high standards of nursing practice and to support the educational and professional advancement of nurses. The nurse is discussing the neonatal blood screening test with a new mother. The nurse knows that the teaching was successful when the mother states that the test screens for the presence in the newborn of which of the following diseases? Select all that apply. 1. Hypothyroidism. 2. Sickle cell disease. 3. Galactosemia. 4. Cerebral palsy. 5. Cystic fibrosis. The correct answers are 1. Hypothyroidism, 2. Sickle cell disease, 3. Galactosemia, and 5. Cystic fibrosis. Congenital hypothyroidism is a malfunction of or complete absence of the thyroid gland that is present from birth. It is screened for in all 50 states. Sickle cell disease is an autosomal recessive disease resulting in abnormally shaped red blood cells. It is screened for in all 50 states. Galactosemia is an incurable autosomal recessive disease characterized by the absence of the enzyme required to metabolize galactose. It is screened for in all 50 states. Cystic fibrosis is an autosomal recessive illness characterized by the presence of thick mucus in many organ systems, most notably the respiratory tract. It is screened for in all 50 states. Cerebral palsy is a disorder characterized by motor dysfunction resulting from a non-progressive injury to brain tissue. The injury may occur during pregnancy, labor, delivery, or shortly after delivery. Physical examination is required to diagnose cerebral palsy. Blood screening is not an appropriate means of diagnosis. It is important to realize that neonatal screening is state-specific. Each state determines which diseases will be screened for. In March 1915, the Advisory Committee on Heritable Disorders in Newborns and Children recommended that all newborns be screened for 32 core disorders and 26 secondary disorders. Unfortunately, many states screen for far fewer disorders.
Which of the following comments indicates that a client understands the nurse's teaching about sertraline? 1. Zoloft will probably cause me to gain weight. 2. This medicine can cause decreased libido. 3. Dry mouth is a permanent side effect of Zoloft. 4. I can take my medicine with St. John's wort. The correct answer is 2. This medicine can cause decreased libido. Rationale. Sertraline, like other selective serotonin reuptake inhibitors, SSRIs, can cause decreased libido. SSRIs do not typically cause weight gain but may cause loss of appetite and weight loss. Dry mouth is a possible side effect, but it is temporary. The client should be told to take sips of water, suck on ice chips, or use sugarless gum or candy. St. John's wort should not be taken with SSRIs because a severe reaction could occur.
When the nurse is assessing a patient with chronic kidney disease who is receiving epoetin alpha injections, which finding most indicates a need to talk with the healthcare provider before giving the medication. 1. Hemoglobin level is 8.9 grams per deciliter. 2. Blood pressure is 198/92. 3. The patient does not like subcutaneous injections. 4. The patient has a history of myocardial infarction. The correct answer is 2. Blood pressure is 198/92. Epoetin alpha can cause hypertension, and blood pressure should be controlled before administering the medication. Because patients with chronic kidney disease have chronic anemia, a hemoglobin level of 8.9 grams per deciliter is not unusual. Although the nurse could ask the HCP about IV administration of the medication, subcutaneous administration requires a lower dose of the medication and is preferred. Epoetin alpha can cause angina or myocardial infarction, but the risk is highest when hemoglobin levels are greater than 11 grams per deciliter. The nurse is caring for a client who has had a gastroscopy. Which of the following may indicate that the client is developing a complication related to the procedure? Select all that apply. 1. The client has a sore throat. 2. The client has a temperature of 100 degrees Fahrenheit. 3. The client appears drowsy following the procedure. 4. The client has epigastric pain. 5. The client experiences hematemesis. The correct answers are 2. The client has a temperature of 100 degrees Fahrenheit. 4. The client has epigastric pain. And 5. The client experiences hematemesis. Following a gastroscopy, the nurse should monitor the client for complications, which include perforation and the potential for aspiration. An elevated temperature, epigastric pain, or the vomiting of blood are all indications of a possible perforation and should be reported promptly. A sore throat is a common occurrence following a gastroscopy. Clients are usually sedated to decrease anxiety, and the nurse would anticipate that the client will be drowsy following the procedure. Which position would be best for the client in the early post-operative period after a hemorrhoidectomy? 1. High Fowlers. 2. Supine. 3. Side-lying. 4. Trendelenburgs. The correct answer is 3. Side-lying. Positioning in the early post-operative phase should avoid stress and pressure on the operative site. The prone and side-lying positions are ideal from a comfort perspective. A high Fowler's or supine position will place pressure on the operative site and is not recommended. There is no need for Trendelenburg's position.
When beginning IV erythropoietin therapy, the nurse should do which of the following? Select all that apply. 1. Check the hemoglobin levels before administering subsequent doses. 2. Shake the vial thoroughly to mix the concentrated white, milky solution. 3. Keep the multi-dose vial refrigerated between scheduled twice-a-day doses. 4. Administer medication through the IV line without other medications. 5. Adjust the initial doses according to the client's changes in blood pressure. 6. Instruct the client to avoid driving and performing hazardous activity during the initial treatment. The correct answers are 4, 5, and 6. Erythropoietin is administered to decrease the need for blood transfusions by stimulating red blood cell production. The medication should be administered through the IV line without other medications to avoid a reaction. The hematocrit, a simple measurement of the percentage of RBCs in the total blood volume, is used to monitor this therapy. When initiating IV erythropoietin therapy, the nurse should monitor the hematocrit level so that it rises no more than 4 points in any 2-week period. In addition, the initial doses of erythropoietin are adjusted according to the client's changes in blood pressure. The nurse should tell the client to avoid driving and performing hazardous activity during the initial treatment due to possible dizziness and headaches secondary to the adverse effect of hypertension. The hematocrit, not the hemoglobin level, is used for monitoring the effectiveness of therapy. The vial of erythropoietin should not be shaken because it may be biologically inactive. The solution should not be used if it is discolored. The nurse should not re-enter the vial once it has been entered. It is a one-time use vial. All remaining erythropoietin should be discarded since it does not contain preservatives. The nurse is receiving a patient with peripheral vascular disease from the post-anesthesia care unit after a SIME amputation of the right lower extremity. At which level on this diagram would the nurse expect to find the amputation? 1A, 2B, 3C, 4D. The correct answer is 3C. Rationale. When a patient has a SIME amputation, most of the foot is removed but the ankle remains. Advantages of the surgery over below the knee include that the patient can still be weight-bearing and that there is less pain.
The client with the flu is prescribed the OTC cough suppressant dextromethorphan. Which information should the nurse teach regarding this medication? 1. Take the medication every 4 to 8 hours as needed for cough. 2. The medication can cause addiction if taken too long. 3. Do not drive or operate machinery while taking the drug. 4. Do not take a beta blocker while taking this medication. The correct answer is 1. Take the medication every 4 to 8 hours as needed for cough. Dextromethorphan is relatively safe in the recommended dose range of 10 to 30 milligrams every 4 to 8 hours. At these levels, it does not produce respiratory depression and side effects are not common. Dextromethorphan is an antitussive. This medication does not have the potential to cause addiction. This medication does not produce drowsiness, so driving or operating machinery while taking dextromethorphan is acceptable. The medication does not slow the heart rate, and there is no reason for a client not to take a prescribed beta blocker medication while taking dextromethorphan. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. A nurse must administer a medication. Which should the nurse do first? 1. Verify the prescription for accuracy. 2. Check the client's identification armband. 3. Ensure the medication is in the medication cart. 4. Determine the appropriateness of the prescribed medication. The correct answer is 1. Verify the prescription for accuracy. The administration of medications is a dependent function of the nurse. The primary healthcare provider's prescription should be verified for accuracy. The prescription must include the name of the client, the name of the drug, the size of the dose, the route of administration, the number of times per day to be administered, and any related parameters. Although checking the client's identification armband is essential for the safe administration of a medication, it is not the first step when preparing to administer a medication to a client. Although ensuring that the medication is available may be done as a time management practice, it is not the first step when preparing to administer a medication to a client. A nurse is legally responsible for the safe administration of medications. Therefore, the nurse should assess if a medication prescription is reasonable. However, this is not the first step when preparing to administer a medication to a client. The nursery nurse is careful to wear gloves when admitting neonates into the nursery. Which of the following is the scientific rationale for this action? 1. Meconium is filled with enteric bacteria. 2. Amniotic fluid may contain harmful viruses. 3. The high alkalinity of fetal urine is caustic to the skin. 4. The baby is at high risk for infection and must be protected. The correct answer is 2. Amniotic fluid may contain harmful viruses. Amniotic fluid is a reservoir for viral diseases like HIV and hepatitis B. If the woman is infected with those viruses, the amniotic fluid will be infectious. Meconium is a sterile stool. The newborn will not produce gastrointestinal bacteria until a few days after delivery. Fetal urine is not highly alkaline. Although babies are at high risk for infection, there is no need for nurses to wear gloves routinely when caring for the babies. Immediately after delivery, the nurse is protecting himself or herself from the baby, not the other way around. By wearing gloves, the nurse is practicing standard precautions per the Centers for Disease Control and Prevention to protect himself or herself from viruses that may be present in the amniotic fluid and on the neonate's body. This question illustrates how important it is for you to read each possible answer very carefully. For example, you may be tempted to choose choice 1, but the fact that the option states that meconium contains enteric bacteria makes that answer incorrect.
A client with major depression and psychotic features is admitted involuntarily to the hospital. He will not eat because his bowels have turned to jelly, which the client states is punishment for his wickedness. The client requests to leave the hospital. The nurse denies the request because commitment papers have been initiated by the primary healthcare provider. Which of the following should the nurse identify as a criterion for the client to be legally committable? 1. Evidence of psychosis. 2. Being gravely disabled. 3. Risk of harm to self or others. 4. Diagnosis of mental illness. The correct answer is 2. Being gravely disabled. Rationale. Criteria for commitment include being gravely disabled and posing a harm to self or others. This client is not threatening to harm himself or to harm others. The client is gravely disabled because of his inability to care for himself, namely, not eating because of his delusion. Evidence of psychosis or psychotic symptoms or diagnosis of a mental illness alone does not make the client legally eligible for commitment.
A 22-year-old patient with stage 1 Hodgkin disease is admitted to the oncology unit for radiation therapy. During the initial assessment, the patient tells the nurse, "Sometimes I'm afraid of dying." Which response is most appropriate at this time? 1. Many individuals with this diagnosis have some fears. 2. Perhaps you should ask the doctor about medication. 3. Tell me a little bit more about your fear of dying. 4. Most people with stage 1 Hodgkin disease survive. The correct answer is 3. Tell me a little bit more about your fear of dying. More assessment about what the patient means is needed before any interventions can be planned or implemented. All of the other statements indicate an assumption that the patient is afraid of dying of Hodgkin disease, which may not be the case. A client admitted to the hospital with peptic ulcer disease tells the nurse about having black tarry stools. The nurse should 1. Encourage the client to increase fluid intake. 2. Advise the client to avoid iron-rich foods. 3. Place the client on contact precautions. 4. Report the finding to the healthcare provider. The correct answer is 4. Report the finding to the healthcare provider. Black tarry stools are an important warning sign of bleeding in peptic ulcer disease. Digested blood in the stool causes it to be black. The odor of the stool is very offensive. The nurse should instruct the client to report the incidence of black stools promptly to the primary healthcare provider. Increasing fluids or avoiding iron-rich foods will not change the stool color or consistency if the stools contain digested blood. Until other information is available, it is not necessary to initiate contact precautions. The nurse instructs the client who has had a hemorrhoidectomy not to use sitz baths until at least 12 hours post-operatively to avoid inducing which of the following complications? 1. Hemorrhage. 2. Rectal spasm. 3. Urine retention. 4. Constipation. The correct answer is 1. Hemorrhage. Applying heat during the immediate post-operative period may cause hemorrhage at the surgical site. Moist heat may relieve rectal spasms after bowel movements. Urine retention caused by reflex spasm may also be relieved by moist heat. Increasing fiber and fluid in the diet can help prevent constipation.
A client is afraid of receiving vitamin B12 injections because of potential toxic reactions. Which is the nurse's best response to relieve these fears? 1. Vitamin B12 will cause ringing in the ears before a toxic level is reached. 2. Vitamin B12 may cause a very mild rash initially. 3. Vitamin B12 causes mild nausea, but nothing toxic. 4. Vitamin B12 is generally free of toxicity because it is water-soluble. The correct answer is 4. Vitamin B12 is a water-soluble vitamin. When water-soluble vitamins are taken in excess of the body's needs, they are filtered through the kidneys and excreted. Vitamin B12 is considered to be non-toxic. Adverse reactions that have occurred are believed to be related to impurities or to preservative in B12 preparations. Ringing in the ears, rash, and nausea are not considered to be related to vitamin B12 administration. The nurse is providing care for a patient with a connective tissue disorder exacerbation for whom the healthcare provider has prescribed an IV dose of methylprednisolone 20 milligrams in 50 milliliters normal saline to be infused over 30 minutes. At what rate will the nurse set the IV infusion pump to administer this drug correctly? The correct answer is 100 milliliters per hour. Rationale. The formula is volume in ml multiplied by 60 divided by time in minutes. You multiply 50 times 60 and divide by 30 minutes. The end result is 100.
The HCP prescribed amoxicillin clavulanate for a client diagnosed with chronic obstructive pulmonary disease who has a cold. Which intervention should the nurse implement? 1. Discuss the prescription with the HCP because antibiotics do not help viral infections. 2. Teach the client to take all the antibiotics as ordered. 3. Encourage the client to seek a second opinion before taking the medication. 4. Ask the client if he or she is allergic to sulfa drugs or shellfish. The correct answer is 2. Teach the client to take all the antibiotics as ordered. Amoxicillin clavulanate is an antibiotic. Clients prescribed antibiotics should always be taught to take all the medication as ordered to prevent resistant strains of bacteria from developing. Antibiotics do not treat viral infections, but HCPs will frequently prescribe prophylactic antibiotics for clients with comorbid conditions, such as COPD, to prevent a secondary bacterial infection. There is no reason for a second opinion, as this is standard medical practice. This is a penicillin preparation, not a sulfa medication or iodine. Which factor is unique to malpractice when comparing negligence and malpractice? 1. The action did not meet standards of care. 2. Inappropriate care is an act of commission. 3. There is harm to the client as a result of the care. 4. There is a contractual relationship between the nurse and client. The correct answer is 4. There is a contractual relationship between the nurse and client. Only malpractice is misconduct performed in professional practice, where there is a contractual relationship between the client and nurse that results in harm to the client. There is a violation of standards of care with both negligence and malpractice. Negligence and malpractice both involve acts of either commission or omission. The client must have sustained injury, damage, or harm with both negligence and malpractice. A full-term newborn was just born. Which nursing intervention is important for the nurse to perform first? 1. Remove wet blankets. 2. Assess APGAR score. 3. Insert eye prophylaxis. 4. Elicit the Moro reflex. The correct answer is 1. Remove wet blankets. When newborns are wet, they can become hypothermic from heat loss resulting from evaporation. They may then develop cold stress syndrome. The first APGAR score is not done until 60 seconds after delivery. The wet blankets should have been removed from the baby well before that time. Eye prophylaxis can be delayed until after the parents have begun bonding with their baby. Although the baby's central nervous system must be carefully assessed, reflex assessment should be postponed until after the baby is dried and is breathing on his or her own. This is a prioritizing question. Every one of the actions will be performed after the birth of the baby. The nurse must know which action is performed first. Because hypothermia can compromise a neonate's transition to extrauterine life, it is essential to dry the baby immediately to minimize heat loss through evaporation. It is important for you to review cold stress syndrome.
A 68-year-old client on day 2 after hip surgery has no cardiac history, but reports having chest heaviness. The first nursing action should be 2. 1. Inquire about the onset, duration, severity, and precipitating factors of the heaviness. 2. Administer oxygen via nasal cannula. 3. Offer pain medication for the chest heaviness. 4. Inform the physician of the chest heaviness. The correct answer is 1. Inquire about the onset, duration, severity, and precipitating factors of the heaviness. Rationale. Further assessment is needed in this situation. It is premature to initiate other actions until further data have been gathered. Inquiring about the onset, duration, location, severity, and precipitating factors of the chest heaviness will provide pertinent information to convey to the physician.
After the nurse receives a change of shift report, which patient should be seen first? 1. A 26-year-old patient with thalassemia who has a hemoglobin level of 8 grams per deciliter and orders for a blood transfusion. 2. A 44-year-old patient admitted 3 days previously for sickle cell crisis who is scheduled for a computed tomographic scan. 3. A 50-year-old patient with stage 4 non-Hodgkin lymphoma who is crying and saying, "I'm not ready to die." 4. A 69-year-old patient with chemotherapy-induced neutropenia who has an oral temperature of 100.1 degrees Fahrenheit. The correct answer is 4. A 69-year-old patient with chemotherapy-induced neutropenia who has an oral temperature of 100.1 degrees Fahrenheit. Any temperature elevation in a neutropenic patient may indicate the presence of a life-threatening infection, so actions such as drawing blood for culture and administering antibiotics should be initiated quickly. The other patients need to be assessed as soon as possible, but are not critically ill. A client with peptic ulcer disease is taking a histamine 2 receptor antagonists. What is the expected outcome of this drug? 1. Heal the ulcer. 2. Protect the ulcer surface from acids. 3. Reduce acid concentration. 4. Limit gastric acid secretion. The correct answer is 4. Limit gastric acid secretion. Histamine 2 receptor antagonists reduce gastric acid secretion. Antisecretory or proton pump inhibitors, such as omeprazole, help ulcers heal quickly in 4 to 8 weeks. Cytoprotective drugs, such as sucralfate, protect the ulcer surface against acid, bile, and pepsin. Antacids reduce acid concentration and help reduce symptoms. The nurse teaches the client who has had rectal surgery the proper timing for sitz baths. The client has understood the teaching when the client states that it is most important to take a sitz bath. 1. First thing each morning. 2. As needed for discomfort. 3. After a bowel movement. 4. At bedtime. The correct answer is 3. After a bowel movement. Adequate cleaning of the anal area is difficult but essential. After rectal surgery, sitz baths assist in this process, so the client should take a sitz bath after a bowel movement. Other times are dictated by client comfort. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
A client with microcytic anemia is having trouble selecting food from the hospital menu. Which food is best for the nurse to suggest for satisfying the client's nutritional needs? 1. Egg yolks. 2. Brown rice. 3. Vegetables. 4. Tea. The correct answer is 2. Brown rice is a source of iron from plant sources. Other sources of non-heme iron are whole grain cereals and breads, dark green vegetables, legumes, nuts, dried fruits, oatmeal, and sweet potatoes. Egg yolks have iron, but it is not as well absorbed as iron from other sources. Vegetables are a good source of vitamins that may facilitate iron absorption. Tea contains tannin, which combines with non-heme iron, preventing its absorption. Which question will the nurse ask the student nurse who is assigned to do an enteral feeding for a patient with a small bore feeding tube? 1. Have you evaluated the nutritional status of the patient? 2. Is the patient tolerating the supine position after feedings? 3. Have you had any problems checking the residual? 4. Is the patient developing any problems related to the feedings? The correct answer is 3. Have you had any problems checking the residual? Rationale. A disadvantage of small bore feeding tubes is that they are prone to clogging, and checking for residuals can be difficult. If the tube gets clogged, it may have to be removed and reinserted. Placing the patient in a supine position is incorrect. The head of the bed needs to be elevated 30 degrees to 45 degrees during feedings, and for 30 to 60 minutes after the feeding to reduce the risk of aspiration.
The mother of a teenage girl asks the nurse why her daughter would have many boxes of pseudoephedrine in her room. Which statement is the nurse's best response? 1. Has your child always had allergy problems? 2. Teenagers will try to take care of their own health problems. 3. Has your daughter's behavior at school or at home changed recently? 4. Remove the medication and say nothing to your daughter about it. The correct answer is 3. Has your daughter's behavior at school or at home changed recently? Pseudoephedrine is an antihistamine and is used in the manufacture of methamphetamines. This situation could indicate the teenager is involved with the drug culture, taking or manufacturing drugs. The nurse should assess for signs of drug involvement. A nurse completes an incident report after a client falls while getting out of bed unassisted. Which is the purpose of this report? 1. Ensure that all parties have an opportunity to document what happened. 2. Help establish who is responsible for the situation. 3. Make data available for quality control analysis. 4. Document the situation on the client's chart. The correct answer is 3. Make data available for quality control analysis. Incident reports help to identify patterns of risk so that corrective action plans can take place. The nurse who identified or created the potential or actual harm completes the incident report. The report identifies the people involved in the incident, describes the incident, and records the date, time, location, actions taken, and other relevant information. Documentation should be as factual as possible and avoid accusations. Questions of liability are the responsibility of the courts. An incident report is not part of the client's clinical record, and reference to the report should not be made in the client's clinical record. To reduce the risk of hypoglycemia in a full-term newborn weighing 2,900 grams, what should the nurse do? 1. Maintain the infant's temperature above 97.7 degrees Fahrenheit / 36.5 degrees Celsius. 2. Feed the infant glucose water every 3 hours until breastfeeding well. 3. Assess blood glucose levels every 3 hours for the first 12 hours. 4. Encourage the mother to breastfeed every 4 hours. The correct answer is 1. Maintain the infant's temperature above 97.7 degrees Fahrenheit / 36.5 degrees Celsius. Hypothermia in the neonate is defined as a temperature below 97.7 degrees Fahrenheit. Cold stress syndrome may develop if the baby's temperature is below that level. A healthy neonate does not need supplemental feedings, and if supplements are needed, they should be either formula or breast milk. There is no indication in the STEM that glucose assessments are needed for this baby. Babies should be breastfed every 2 to 3 hours. Feedings every 4 hours are not frequent enough. It is important for the student to know that a baby weighing 2,900 grams is an average-sized baby. They range 2,500 to 4,000 grams. In addition, because no other information is included in the STEM, you must assume that the baby is healthy. The answers, therefore, should be evaluated in terms of the healthy newborn. Hypoglycemia can result when a baby develops cold stress syndrome because babies must metabolize food to create heat. When they use up their food stores, they become hypoglycemic.
The nurse is assessing an older adult with a pacemaker who leads a sedentary lifestyle. The client reports being unable to perform activities that require physical exertion. The nurse should further assess the client for which of the following? 1. Left ventricular atrophy. 2. Irregular heartbeats. 3. Peripheral vascular occlusion. 4. Pacemaker placement. The correct answer is 1. Left ventricular atrophy. Rationale. In older adults who are less active and do not exercise the heart muscle, atrophy can result. Disuse or deconditioning can lead to abnormal changes in the myocardium of the older adult. As a result, under sudden emotional or physical stress, the left ventricle is less able to respond to the increased demands on the myocardial muscle. Decreased cardiac output, cardiac hypertrophy, and heart failure are examples of the chronic conditions that may develop in response to inactivity, rather than in response to the aging process. Irregular heartbeats are generally not associated with an older sedentary adult's lifestyle. Peripheral vascular occlusion or pacemaker placement should not affect response to stress.
A client with a peptic ulcer reports epigastric pain that frequently causes the client to wake up during the night. The nurse should instruct the client to do which activities? Select all that apply. 1. Obtain adequate rest to reduce stimulation. 2. Eat small, frequent meals throughout the day. 3. Take all medications on time as prescribed. 4. Sit up for 1 hour when awakened at night. 5. Stay away from crowded areas. The correct answers are 1. Obtain adequate rest to reduce stimulation. 2. Eat small, frequent meals throughout the day. 3. Take all medications on time as prescribed. And 4. Sit up for 1 hour when awakened at night. The nurse should encourage the client to reduce stimulation that may enhance gastric secretion. The nurse can also advise the client to utilize health practices that will prevent recurrences of ulcer pain, such as avoiding fatigue and elimination of smoking. Eating small, frequent meals helps to prevent gastric distension, if not actively bleeding, and decreases distension and release of gastrin. Medications should be administered promptly to maintain optimum levels. After awakening during the night, the client should eat a small snack and return to bed, keeping the head of the bed elevated for an hour after eating. It is not necessary to stay away from crowded areas. A client has been placed on long-term sulfasalazine therapy for treatment of ulcerative colitis. The nurse should encourage the client to eat which of the following foods to help avoid the nutrient deficiencies that may develop as a result of this medication. 1. Citrus fruits. 2. Green leafy vegetables. 3. Eggs. 4. Milk products. The correct answer is 2. Green leafy vegetables. In long-term sulfasalazine therapy, the client may develop folic acid deficiency. The client can take folic acid supplements, but the nurse should also encourage the client to increase the intake of folic acid in his diet. Green leafy vegetables are a good source of folic acid. Citrus fruits, eggs, and milk products are not good sources of folic acid.
A client with macrocytic anemia has a burn on the foot and reports watching television while lying on a heating pad. Which action should be the nurse's first response? 1. Assess for potential abuse. 2. Check for diminished sensations. 3. Document the findings. 4. Clean and dress the area. The correct answer is 2. Macrocytic anemias can result from deficiencies in vitamin B12 or ascorbic acid. Only vitamin B12 deficiency causes diminished sensations of peripheral nerve endings. The nurse should assess for peripheral neuropathy and instruct the client in self-care activities for diminished sensation to heat and pain. The burn could be related to abuse, but this conclusion would require more supporting data. The findings should be documented, but the nurse will want to address the client's sensations first. The decision of how to treat the burn should be determined by the physician. When a patient is being prepared for a colonoscopy procedure, which task is most suitable to delegate to assistive personnel? 1. Explaining how to assume the side-lying position. 2. Reinforcing the need for a clear liquid diet. 3. Administering laxatives as needed. 4. Administering an enema to prepare the bowel. The correct answer is 2. Reinforcing the need for a clear liquid diet. Rationale. The AP can reinforce dietary and fluid restrictions after the nurse has explained the information to the patient. Teaching the patient about what to expect is the nurse's duty. An enema is not typically part of the bowel prep, but might be ordered if the bowel is not empty or well visualized. The AP may administer enemas with special training and under certain circumstances, such as home care, but in this situation it is unlikely that this task will be delegated to the AP. Medication administration should be performed by the nurse.
The client with the flu has been taking acetylcysteine. Which adverse effect should the nurse assess for? 1. Bronchospasm. 2. Nausea. 3. Fever. 4. Drowsiness. The correct answer is 1. Bronchospasm. Acetylcysteine is a mucolytic. Mucomist can cause bronchospasm, which will impair the client's breathing, not improve it. An adverse reaction is a reason to immediately discontinue the medication. Nausea is a side effect of many medications and can usually be managed by taking the medication with food. A side effect is not an adverse effect. Fever would result from the cold, flu, or infection, not from the medication. Drowsiness is caused by some cold and flu preparations, usually antihistamines. Mucomist causes the client to expectorate secretions, which will keep the client awake. A nurse says, "If you do not let me do this dressing change, I will not let you eat dinner with the other clients in the dining room." Which legal term is related to this statement? 1. Battery. 2. Assault. 3. Negligence. 4. Malpractice. The correct answer is 2. Assault. The statement in option 2 is an unjust threat. Assault is the threat to harm another person without cause. The statement in option 1 is not an example of battery. Battery is the actual willful touching of another person that may or may not cause harm. The statement in option 3 is not an example of negligence. Negligence occurs when harm or injury is caused by an act of either commission or omission. The statement in option 4 is not an example of malpractice. Malpractice is negligence by a professional person as compared with the actions of another professional person in a similar circumstance when a contract exists between the client and nurse. A mother asks the nurse to tell her about the responsiveness of neonates at birth. Which of the following answers is appropriate? Select all that apply. 1. Babies have a poorly developed sense of smell until they are 2 months old. 2. Babies respond to all forms of taste well, but they prefer to eat sweet things like breast milk. 3. Babies are especially sensitive to being touched and cuddled. 4. Babies are nearsighted with blurry vision until they are about 3 months of age. 5. Babies respond to many sounds, especially to the high-pitched tone of the female voice. The correct answers are 2. Babies respond to all forms of taste well, but they prefer to eat sweet things like breast milk. 3. Babies are especially sensitive to being touched and cuddled. And 5. Babies respond to many sounds, especially to the high-pitched tone of the female voice. Babies respond to all forms of taste. They prefer sweet things. Babies' sense of touch is considered to be the most well-developed sense. Babies hear quite well once the amniotic fluid is absorbed from the ear canal. All newborns' hearing is tested prior to discharge from the newborn nursery. If a baby is found to be hearing impaired, the baby should receive early intervention. All of the baby's senses are well developed at birth. Babies see quite well at 8 to 12 inches. They prefer to look at the human face.
Following diagnosis of angina pectoris, a client reports being unable to walk up 2 flights of stairs without pain. Which of the following measures would most likely help the client prevent this problem? 1. Climb the steps early in the day. 2. Rest for at least an hour before climbing the stairs. 3. Take a nitroglycerin tablet before climbing the stairs. 4. Lie down after climbing the stairs. The correct answer is 3. Take a nitroglycerin tablet before climbing the stairs. Rationale. Nitroglycerin may be used prophylactically before stressful physical activities, such as stair climbing, to help the client remain pain-free. Climbing the stairs early in the day would have no impact on decreasing pain episodes. Resting before or after an activity is not as likely to help prevent an activity-related pain episode.
A client with peptic ulcer disease reports being nauseated most of the day and now feeling lightheaded and dizzy. Based upon these findings, which nursing actions would be most appropriate for the nurse to take? Select all that apply. 1. Administering an antacid hourly until nausea subsides. 2. Monitoring the client's vital signs. 3. Notifying the physician of the client's symptoms. 4. Initiating oxygen therapy. 5. Reassessing the client in an hour. The correct answers are 2. Monitoring the client's vital signs, and 3. Notifying the physician of the client's symptoms. The symptoms of nausea and dizziness in a client with peptic ulcer disease may be indicative of hemorrhage and should not be ignored. The appropriate nursing actions at this time are for the nurse to monitor the client's vital signs and notify the physician of the client's symptoms. To administer an antacid hourly or to wait 1 hour to reassess the client would be inappropriate. Prompt intervention is essential in a client who is potentially experiencing a gastrointestinal hemorrhage. The nurse would notify the physician of assessment findings and then initiate oxygen therapy if prescribed by the physician. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. The nurse is assigning clients for the evening shift. Which of the following clients are appropriate for the nurse to assign to a licensed practical nurse to provide client care? Select all that apply. 1. A client with Crohn's disease who is receiving total parenteral nutrition. 2. A client who underwent inguinal hernia repair surgery 3 hours ago. 3. A client with an intestinal obstruction who needs a Cantor tube inserted. 4. A client with diverticulitis who needs teaching about take-home medications. 5. A client who is experiencing an exacerbation of his ulcerative colitis. The correct answers are 2. A client who underwent inguinal hernia repair surgery 3 hours ago, and 5. A client who is experiencing an exacerbation of his ulcerative colitis. The nurse should consider client needs and scope of practice when assigning staff to provide care. The client who is recovering from inguinal hernia repair surgery and the client who is experiencing an exacerbation of ulcerative colitis are appropriate clients to assign to a licensed practical nurse, as the care they require falls within the scope of practice for a licensed practical nurse. It is not within the scope of practice for the licensed practical nurse to administer TPN, insert nasoenteric tubes, or provide client teaching related to medications.
Which of the following is a late symptom of polycythemia vera? 1. Headache. 2. Dizziness. 3. Pruritus. 4. Shortness of breath. The correct answer is 3. Pruritus is a late symptom that results from abnormal histamine metabolism. Headache and dizziness are early symptoms from engorged veins. Shortness of breath is an early symptom from congested mucous membranes and ineffective gas exchange. Which laboratory results would the nurse check to determine if there are untoward effects associated with vomiting, nasogastric suction, or lavage? 1. White blood cell counts. 2. Hematocrit and hemoglobin. 3. Serum electrolytes. 4. Blood urea nitrogen and serum creatinine. The correct answer is 3. Serum electrolytes. Rationale. The nurse monitors all laboratory results, but vomiting, nasogastric suction, and lavage can cause fluid and electrolyte imbalances. Fluid loss can cause hemoconcentration and artificially elevated levels for hematocrit, hemoglobin, and blood urea nitrogen. Blood urea nitrogen is generally more affected by fluid loss than serum creatinine. The WBC count could be elevated because of stress, inflammation, or infection.
Which OTC herb should be usually recommended for a client with a cold who has mild hypertension? 1. Hawthorn. 2. Ginger. 3. Garlic. 4. Golden seal. The correct answer is 3. Garlic. Garlic is used for colds and the flu and can also be given for hypertension. It causes mild vasodilation and will not make hypertension worse. Hawthorn is used for mild hypertension, congestive heart failure, and angina, but it does nothing for a cold or the flu. Golden seal is used for respiratory, digestive, and urinary infections, but it increases the effectiveness of some antihypertensive medications, beta blockers, and antidysrhythmics. It should be used with caution in clients who have cardiovascular disease, diabetes mellitus, or glaucoma. Nursing practice is influenced by the doctrine of respondit superior, which is the basic concept related to this theory of liability. 1. Nurses must respond to the Supreme Court when they commit acts of malpractice. 2. Healthcare facilities are responsible for the negligent actions of the nurses whom they employ. 3. Nurses are responsible for their actions when they have contractual relationships with clients. 4. The law absolves nurses from being sued for negligence if they provide inappropriate care at the scene of an accident. The correct answer is 2. Healthcare facilities are responsible for the negligent actions of the nurses whom they employ. The ancient legal doctrine respondit superior means let the master answer. By virtue of the employer-employee relationship, the employer is responsible for the conduct of its employees. This is unrelated to respondit superior. Negligence and malpractice, which are unintentional torts, are litigated in local courts by civil actions between individuals. Individual responsibility is unrelated to respondit superior. A nurse can have an independent contractual relationship with a client. When a nurse works for an agency, the contract between the nurse and client is implied. In both instances, the nurse is responsible for the care provided. This is unrelated to respondit superior. Good Samaritan laws do not provide absolute immunity. Nurses must function as a reasonable, prudent nurse would function in a similar situation. Nurses can be held responsible if there is gross departure from the normal standard of care or if there is willful wrongdoing on the nurse's part. A mother, one day postpartum from a 3-hour labor and a spontaneous vaginal delivery, questions the nurse because her baby's face is purple. Upon examination, the nurse notes petechiae over the scalp, forehead, and cheeks of the baby. The nurse's response should be based on which of the following? 1. Petechiae are indicative of severe bacterial infections. 2. Rapid deliveries can injure the neonatal presenting part. 3. Petechiae are characteristic of the normal newborn rash. 4. The injuries are a sign that the child has been abused. The correct answer is 2. Rapid deliveries can injure the neonatal presenting part. When neonates speed through the birth canal during rapid deliveries, the presenting parts become bruised. The bruising often takes the form of petechial hemorrhages. Petechiae can be present as a result of an infectious disease, for example, meningococemia. In this situation, however, there is no indication that an infection is present. Erythema toxicum, the newborn rash, is characterized by papules or pustules on an erythematous base. There is nothing in the scenario to suggest that child abuse has occurred. Although this question is about the neonate, the key to answering the question is knowledge of the normal length of a vaginal labor and delivery. Multiparous labors average about 8 to 10 hours, and primiparous labors can last more than 20 hours. The 3-hour labor noted in the stem of the question is significantly shorter than the average labor. The neonate, therefore, has progressed rapidly through the birth canal and, as a result, is bruised.
The client who experiences angina has been told to follow a low cholesterol diet. Which of the following meals would be best? 1. Hamburger, salad, and milkshake. 2. Baked liver, green beans, and coffee. 3. Spaghetti with tomato sauce, salad, and coffee. 4. Fried chicken, green beans, and skim milk. The correct answer is 3. Spaghetti with tomato sauce, salad, and coffee. Rationale: pasta, tomato sauce, salad, and coffee would be the best selection for the client following a low cholesterol diet. Hamburgers, milkshakes, liver, and fried foods tend to be high in cholesterol.
The nurse is teaching a client with polycythemia vera about potential complications from this disease. Which manifestation should the nurse include in the client's teaching plan? Select all that apply. 1. Hearing loss. 2. Visual disturbance. 3. Headache. 4. Orthopnea. 5. Gout. 6. Weight loss. The correct answers are 2, 3, 4, and 5. Polycythemia vera, a condition in which too many red blood cells are produced in the blood serum, can lead to an increase in the hematocrit and hypervolemia, hyperviscosity, and hypertension. Subsequently, the client can experience dizziness, tinnitus, visual disturbances, headaches, or feeling of fullness in the head. The client may also experience cardiovascular symptoms, such as heart failure, and increased clotting time or symptoms of an increased uric acid level, such as painful, swollen joints. Hearing loss and weight loss are not manifestations associated with polycythemia vera. The nurse would be most concerned about a prescription for a total parenteral nutrition fat emulsion for a patient with which condition? 1. Gastrointestinal obstruction. 2. Severe anorexia nervosa. 3. Chronic diarrhea and vomiting. 4. Fractured femur. The correct answer is 4. Fractured femur. Rationale: a patient with a fractured femur is at risk for fat embolism, so a fat emulsion should be used with caution. TPN is commonly used for patients with GI obstruction, severe anorexia nervosa, and chronic diarrhea or vomiting.
The client who has been using oxymetazoline nasal spray for several weeks reports to the nurse that the spray no longer seems to work to clear the nasal passages. Which information should the nurse teach? 1. Increase the amount of sprays used until the desired effect has been reached. 2. This type of medication can cause rebound congestion if used too long. 3. Alternate the oxymetazoline with a saline nasal spray every 2 hours. 4. Place the oxymetazoline nasal spray in a vaporizer at night for the best results. The correct answer is 2. This type of medication can cause rebound congestion if used too long. Oxymetazoline is a nasal decongestant. Oxymetazoline is recommended for short-term relief of nasal congestion for clients older than the age of 6. This medication is for short-term use only. Longer use can cause a rebound congestion that can be difficult to resolve. Oxymetazoline should be used every 10 to 12 hours only. Using it more often increases the chance of developing a dependence on the medication and rebound congestion. Oxymetazoline nasal spray is to be used intranasally. It is not an additive for a vaporizer. When attempting to administer a 10 p.m. sleeping medication, the nurse assesses that the client appears to be asleep. Which should the nurse do? 1. Withhold the drug. 2. Notify the primary healthcare provider. 3. Awaken the client to administer the drug. 4. Administer it later if the client awakens during the night. The correct answer is 3. Awaken the client to administer the drug. Administering a medication is a dependent function of the nurse. The prescription should be followed as written if the prescription is reasonable and prudent. This medication was not a PRN medication, but rather a standing prescription. This is a violation of the primary healthcare provider's prescription. Drug administration is a dependent nursing function. Notifying the primary healthcare provider is unnecessary. The drug should be administered as prescribed, not at a later time. A 2-day-old breastfeeding baby born via normal spontaneous vaginal delivery has just been weighed in the newborn nursery. The nurse determines that the baby has lost 3.5% of the birth weight. Which of the following nursing actions is appropriate? 1. Do nothing because this is a normal weight loss. 2. Notify the neonatologist of the significant weight loss. 3. Advise the mother to bottle feed the baby at the next feed. 4. Assess the baby for hypoglycemia with a glucose monitor. The correct answer is 1. Do nothing because this is a normal weight loss. The baby has lost less than 4% of its birth weight. Babies often lose between 5% and 10% of their birth weight. A loss greater than 10% is considered pathological. Supplementation is not needed at this time. There is no indication in the stem that the baby is at high risk for hypoglycemia.
Which of the following symptoms should the nurse teach the client with unstable angina to report immediately to the physician? 1. A change in the pattern of the chest pain. 2. Pain during sexual activity. 3. Pain during an argument. 4. Pain during or after a physical activity. The correct answer is 1. A change in the pattern of the chest pain. Rationale. The client should report a change in the pattern of chest pain. It may indicate increasing severity of coronary artery disease. Pain occurring during stress or sexual activity would not be unexpected, and the client may be instructed to take nitroglycerin to prevent this pain. Pain during or after an activity, such as lawn mowing, also would not be unexpected. The client may be instructed to take nitroglycerin to prevent this pain or may be restricted from doing such activities.
When a client is diagnosed with aplastic anemia, the nurse should assess the client for changes in which of the following physiologic functions. 1. Bleeding tendencies. 2. Intake and output. 3. Peripheral sensation. 4. Bowel function. The correct answer is 1. Aplastic anemia decreases the bone marrow production of red blood cells, white blood cells, and platelets. The client is at risk for bruising and bleeding tendencies. A change in the client's intake and output is important, but assessment for the potential for bleeding takes priority. Change in the peripheral nervous system is a priority problem specific to clients with vitamin B12 deficiency. change in bowel function is not associated with aplastic anemia. For a patient with short bowel syndrome, the nurse would question the prescription of which enteral formula: 1. High sodium content. 2. High fat content. 3. High protein content. 4. Modified carbohydrate content. The correct answer is 2. High fat content. Rationale: patients with short bowel syndrome have impaired fat absorption as a result of limited surface area. Formulas with high sodium content would not be prescribed for heart failure. High protein formulas can contribute to dehydration if adequate water is not given. Modified carbohydrate content is prescribed for patients with chronic obstructive pulmonary disease when they require nutritional support.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. Which statement is the scientific theory for prescribing zinc preparations for a client with a cold? 1. Zinc binds with the viral particle and reduces the symptoms of a cold. 2. Zinc decreases the immune system's response to a virus. 3. Zinc activates viral receptors in the body's immune system. 4. Zinc blocks the virus from binding to the epithelial cells of the nose. The correct answer is 4. Zinc blocks the virus from binding to the epithelial cells of the nose. Theoretically, zinc blocks viral binding to nasal epithelium. Observation has shown that increased amounts of zinc can prevent the binding and prevent the development of symptoms of the rhinovirus. Zinc does not bind the viral particle. Symptoms are diminished by blocking the ability of the virus to bind with the nasal lining. Zinc is a micronutrient found in the body that helps to increase the body's immune system. Activating viral receptors would increase the symptoms of a cold. Which is the primary purpose of the American Nurses Association Standards of Clinical Nursing Practice? 1. Define the philosophy of nursing practice. 2. Establish criteria for quality nursing practice. 3. Identify the legal definition of nursing practice. 4. Determine educational standards for nursing practice. The correct answer is 2. Establish criteria for quality nursing practice. The American Nurses Association Standards of Clinical Nursing Practice describe the nature and scope of nursing practice and the responsibilities for which nurses are accountable. A philosophy incorporates the values and beliefs about the phenomena of concern to a discipline. The American Nurses Association Standards of Clinical Nursing Practice reflect, not define, a philosophy of nursing. Each nurse and nursing organization should define its own philosophy of nursing. The laws of each state define the practice of nursing within the state. Educational standards are established by accrediting bodies, such as the National League for Nursing Accrediting Commission, the Commission on Collegiate Nursing Education, and state education departments. 4 newborns are in the neonatal nursery, none of whom is crying or in distress. Which of the babies should the nurse report to the neonatologist? 1. 16-hour-old baby who has yet to pass meconium. 2. 16-hour-old baby whose blood glucose is 50 milligrams per deciliter. 3. 2-day-old baby who is breathing irregularly at 70 breaths per minute. 4. 2-day-old baby who is excreting a milky discharge from both nipples. The correct answer is 3 2-day-old baby who is breathing irregularly at 70 breaths per minute. Normal neonatal breathing is 30 to 60 breaths per minute. This baby is tachypneic. Meconium should pass within 24 hours of delivery. This baby's glucose level is within normal limits. A milky discharge, which is milk, is normal. It results from the drop in maternal hormones in the neonatal system following delivery.
The physician refers the client with unstable angina for a cardiac catheterization. The nurse explains to the client that this procedure is being used in this specific situation to 1. Open and dilate blocked coronary arteries. 2. Assess the extent of arterial blockage. 3. Bypass obstructed vessels. 4. Assess the functional adequacy of the valves and heart muscle. The correct answer is 2. Assess the extent of arterial blockage. Rationale. Cardiac catheterization is done in clients with angina primarily to assess the extent and the severity of the coronary artery blockage. A decision about medical management, angioplasty, or coronary artery bypass surgery will be based on the catheterization results. Coronary bypass surgery would be used to bypass obstructive vessels, although cardiac catheterization can be used to assess the functional adequacy of the valves and heart muscle. In this case, the client has unstable angina and therefore would need the procedure to assess the extent of arterial blockage.
Metoprolol is added to the pharmacologic therapy of a diabetic female diagnosed with stage 2 hypertension, initially treated with furosemide and ramipril. An expected therapeutic effect is 1. Decrease in heart rate. 2. Lessening of fatigue. 3. Improvement in blood sugar levels. 4. Increase in urine output. The correct answer is 1. The effect of a beta blocker is a decrease in heart rate, contractility, and afterload, which leads to a decrease in blood pressure. The client at first may have an increase in fatigue when starting the beta blocker. The mechanism of action does not improve blood sugar or urine output. The nurse is caring for a patient with peptic ulcer disease. Which assessment finding is the most serious? 1. Projectile vomiting. 2. Burning sensation 2 hours after eating. 3. Coffee ground emesis. 4. Board-like abdomen with shoulder pain. The correct answer is for board-like abdomen with shoulder pain. Rationale. A board-like abdomen with shoulder pain is a symptom of a perforation, which is the most lethal complication of peptic ulcer disease. A burning sensation is a typical report and can be controlled with medications. Projectile vomiting can signal an obstruction. Coffee ground emesis is typical of slower bleeding, and the patient will require diagnostic testing.
The client diagnosed with the flu is prescribed the cough medication hydrocodone. Which information should the nurse teach the client regarding this medication? 1. Teach the client to monitor the bowel movements for constipation. 2. Tell the client that it is fine to drive or operate machinery while taking this medication. 3. Instruct the client to plan for rest periods, as this medication usually causes insomnia. 4. Explain that this medication is more effective when taken with a mucolytic. The correct answer is 1. Teach the client to monitor the bowel movements for constipation. Hydrocodone is an opioid and can slow the peristalsis of the bowel, resulting in constipation. The client should be aware of this and increase the fluid intake and use bulk laxatives and stool softeners if needed. Opioids can cause drowsiness, so driving or operating machinery should be discouraged. Opioids usually cause the client to be drowsy and not have insomnia. Hydrocodone is a cough suppressant and a mucolytic is an expectorant. These are opposite-acting medications. A nurse is considering the faith development theory by James Fowler while assessing several clients. Which clients does the nurse expect to assume responsibility for their own beliefs about faith? 1. Older adolescents. 2. Young adolescents. 3. Older school-age children. 4. Young school-age children. The correct answer is 1. Older adolescents. Rationale. Older adolescents and young adults assume responsibility for their own commitments, beliefs, and attitudes about faith. This reflects the individuative reflective stage of faith development. The pediatrician has ordered vitamin K0, 0.5 milligrams IM for a newborn. The medication is available as 2 milligrams per milliliters. How many milliliters should the nurse administer to the baby? Calculate to the nearest hundredth. To solve this problem, you set up the formula as 2 milligrams over 1 milliliters equals to 0.5 milligrams over x. You cross-multiply 2 times x and 0.5 times 1. You get 2x equals to 0.5. You divide 2 on both sides, and you get x equals to 0.25 milliliters. This is the amount that the nurse should administer for each dose.
The client is scheduled for a percutaneous transluminal coronary angioplasty to treat angina. Priority goals for the client immediately after PTCA should include 1. Minimizing dyspnea. 2. Maintaining adequate blood pressure control. 3. decreasing myocardial contractility. 4. Preventing fluid volume deficit. The correct answer is 4. Preventing fluid volume deficit. Rationale. Because the contrast medium used in PTCA acts as an osmotic diuretic, the client may experience diuresis with resultant fluid volume deficit after the procedure. Additionally, potassium levels must be closely monitored because the client may develop hypokalemia due to the diuresis. Dyspnea would not be anticipated after this procedure. Maintaining adequate blood pressure control should not be a problem after the procedure. Increased myocardial contractility would be a goal, not decreased contractility.
A client is taking clonidine for treatment of hypertension. The nurse should teach the client about which of the following common adverse effects of this drug. Select all that apply. 1. Dry mouth. 2. Hyperkalemia. 3. Impotence. 4. Pancreatitis. 5. Sleep disturbance. The correct answers are 1, 3, and 5. Clonidine is a central-acting adrenergic antagonist. It reduces sympathetic outflow from the central nervous system. Dry mouth, impotence, and sleep disturbances are possible adverse effects. Hyperkalemia and pancreatitis are not anticipated with use of this drug. The nurse is taking an initial history for a patient seeking surgical treatment for obesity, which findings should be called to the attention of the surgeon. 1. Obesity for approximately 5 years. 2. History of counseling for body dysmorphic disorder. 3. Failure to reduce weight with other forms of therapy. 4. Body weight 100% above the ideal for age, gender, and height. The correct answer is 2. History of counseling for body dysmorphic disorder. Rationale. Body dysmorphic disorder is a preoccupation with an imagined physical defect. Corrective surgery can exacerbate this disorder when the patient continues to feel dissatisfied with the results. The other findings are criterion indicators for this treatment.
The nurse in a medical unit is administering 9 o'clock medications. Which medication should the nurse question administering? 1. Acetylcysteine to a client who is coughing forcefully. 2. Cefazolin IV piggyback to a client diagnosed with the flu. 3. Diphenhydramine to a client who is congested. 4. Dextromethorphan to a client who has pneumonia. The correct answer is 1. Acetylcysteine to a client who is coughing forcefully. Acetylcysteine is a mucolytic. An adverse effect of mucomist is bronchospasm. This client should be assessed for bronchospasm before administering a dose of mucomist. Cefazolin is an antibiotic. Antibiotics are frequently administered to clients with viral infections to prevent secondary bacterial infections. This client is considered at risk, or the client would not be in a hospital receiving care. There is no reason to question this medication. Diphenhydramine is an antihistamine. Antihistamines are prescribed for congestion, so there is no reason to question this medication. Dextromethorphan is an antitussive. A symptom of pneumonia is a cough, so there is no reason to question this medication. A nurse cares for a group of clients. A client experiencing which of the following situations does the nurse anticipate will have the hardest time coping? 1. Scheduled for a biopsy. 2. Unable to control the course of illness. 3. Challenged by a multiplicity of stressors. 4. Having to relocate to an assisted living facility. The correct answer is 3. Challenged by a multiplicity of stressors. Rationale. As the multiplicity of stressors increases, it becomes harder for a person to cope. As each stress is added, the accumulated impact is greater than just the sum of each individual stressor. A nurse is doing a newborn assessment on a new admission to the nursery. Which of the following actions should the nurse make when evaluating the baby for developmental dysplasia of the hip? Select all that apply. 1. Grasp the baby's legs with the thumbs on the inner thighs and forefingers on the outer thighs. 2. Gently adduct and abduct the baby's thighs. 3. Palpate the trochanter during hip rotation. 4. Place the baby in a fetal position. 5. Compare the lengths of the baby's legs. The correct answers are 1. Grasp the baby's legs with the thumbs on the inner thighs and forefingers on the outer thighs. 2. Gently adduct and abduct the baby's thighs. 3. Palpate the trochanter during hip rotation. And 5. Compare the lengths of the baby's legs. With the baby placed flat on its back, the practitioner grasps the baby's thighs using his or her thumbs and index fingers. When assessing for Ortolani sign, the baby's thighs are abducted. When performing the Barlow test, the baby's thighs are adducted. With the baby's hips and knees at 90-degree angles, the hips are abducted. With developmental dysplasia of the hip, the trochanter dislocates from the acetabulum. The nurse would feel the dislocation while palpating the trochanter. Legs are extended to assess for equal leg lengths and for equal thigh and gluteal folds. When performing both the Ortolani and Barlow tests, the baby is placed flat on his or her back. When assessing for symmetry of leg lengths and tissue folds, the baby is placed in both the supine and prone positions. The order of the steps of the Ortolani procedure is 1. The nurse places the baby on the baby's back. 2. The nurse grasps the baby's thighs with a thumb on the inner aspect and forefingers over the trochanter. 3. With the knees flexed at 90-degree angles, the hips are abducted. And 4. The nurse palpates the trochanter to assess for hip laxity. The Barlow test is performed by 1. Adducting the baby's legs, 2. Gently pushing the legs posteriorly, and 3. Feeling to note any slippage of the trochanter out of the acetabulum. Galeazzi sign, to assess for uneven knee heights, can also be performed. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
Which of the following is not a risk factor for the development of atherosclerosis? 1. Family history of early heart attack. 2. Late onset of puberty. 3. Total blood cholesterol level greater than 220 milligrams per deciliter. 4. Elevated fasting blood glucose concentration. The correct answer is 2. Late onset of puberty. Rationale. Late onset of puberty is not generally considered to be a risk factor for the development of atherosclerosis. Risk factors for atherosclerosis include family history of atherosclerosis, cigarette smoking, hypertension, high blood cholesterol level, male gender, diabetes mellitus, obesity, and physical inactivity.
A client with hypertensive emergency is being treated with sodium nitroprusside, nipride, in a dilution of 50 milligrams per 250 milliliters. How many micrograms of nipride are in each milliliter? Blank micrograms. The correct answer is 200 micrograms. First, calculate the number of milligrams per milliliter. You do this by dividing 50 by 250, which equals to 0.2 milligrams. So it's 0.2 milligrams per 1 milliliter. 1 milligram equals to 1,000 micrograms. So you multiply 0.2 milligrams by 1,000, which equals to 200 micrograms. The nurse is taking a report on an older patient who was admitted with abdominal pain, nausea, vomiting, and diarrhea. The patient also has a history of chronic dementia. Which comment by the night shift nurse is most concerning? 1. The patient has a flat effect in rambling and repetitive speech. 2. The patient has memory impairments and thinks the year is 1948. 3. The patient lacks motivation and demonstrates early morning awakening. 4. The patient has a fluctuating level of consciousness and mood swings. The correct answer is 4. The patient has a fluctuating level of consciousness and mood swings. Rationale. A fluctuating level of consciousness and mood swings are associated more with acute delirium, which could be caused by many things, such as electrolyte imbalances, sepsis, or medications. Information about the patient's baseline behavior is essential. However, based on knowledge of pathophysiology, the nurse knows that flat effect in rambling and repetitive speech, memory impairments, and disorientation to time are behaviors typically associated with chronic dementia. Lack of motivation and early morning awakening are associated with depression. A sudden change in the level of consciousness and mental status of a patient signals a need to conduct further assessment for an acute process. This question requires the ability to differentiate between acute and chronic disease processes and accompanying symptoms.
The male client diagnosed with COPD tells the nurse that he has been expectorating rusty-colored sputum. Which medication should the nurse anticipate the HCP prescribing? 1. Prednisone. 2. Nicotine. 3. Dextromethorphan. 4. Ceftriaxone. The correct answer is 4. Ceftriaxone. Ceftriaxone is an antibiotic. The client's rusty-colored sputum indicates an infection, and an antibiotic should be ordered. Rocephin is a broad-spectrum antibiotic. Prednisone is a glucocorticoid. Clients diagnosed with COPD are commonly prescribed a steroid medication to decrease inflammation in the lungs. This client should already be taking this or a similar medication. The client should quit smoking, if still smoking. A transdermal nicotine system, such as Habitrol, would be anticipated to aid the client. Dextromethorphan is an antitussive. The client may require an antitussive, but more likely would require a mucolytic to help to expectorate the thick, tenacious sputum associated with COPD. A client with terminal cancer is willing to try new therapies. Which stage of Kubler-Ross stages of grieving does the nurse identify that the client is experiencing? 1. Denial. 2. Depression. 3. Bargaining. 4. Acceptance. The correct answer is 3. Bargaining. Rationale. A client in the bargaining stage of grieving seeks to avoid the loss and will try new therapies to gain more time. A nurse notes that a 6-hour-old neonate has cyanotic hands and feet. Which of the following actions by the nurse is appropriate? 1. Place the child in an isolette. 2. Administer oxygen. 3. Swaddle the baby in a blanket. 4. Apply pulse oximeter. The correct answer is 3. Swaddle the baby in a blanket. The baby's extremities are cyanotic as a result of the baby's immature circulatory system. Swaddling helps to warm the baby's hands and feet. There is no evidence in the stem that would warrant placing the child in an isolette. Cyanotic hands and feet are not signs of hypoxia in the neonate. There is no evidence in the stem that would warrant monitoring with the pulse oximeter. You must be familiar with the differences between normal findings of the newborn and those of an older child or adult. Acrocyanosis, which is bluish cyanotic hands and feet, is normal in the very young neonate resulting from his or her immature circulation to the extremities.
As an initial step in treating a client with angina, the physician prescribes nitroglycerin tablets, 0.3 milligrams given sublingually. This drug's principal effects are produced by 1. Antispasmodic effects on the pericardium. 2. Causing an increased myocardial oxygen demand. 3. Vasodilation of peripheral vasculature. 4. Improved conductivity in the myocardium. The correct answer is 3. Vasodilation of peripheral vasculature. Nitroglycerin produces peripheral vasodilation, which reduces myocardial oxygen consumption and demand. Vasodilation in coronary arteries and collateral vessels may also increase blood flow to the ischemic areas of the heart. Nitroglycerin decreases myocardial oxygen demand. Nitroglycerin does not have an effect on pericardial spasticity or conductivity in the myocardium.
The nurse is discussing medications with a client with hypertension who has a prescription for furosemide daily. The client needs further education when the client states which of the following? 1. I know I should not drive after taking my Lasix. 2. I should be careful not to stand up too quickly when taking Lasix. 3. I should take the Lasix in the morning instead of before bed. 4. I need to be sure to also take the potassium supplement that the doctor prescribed along with my Lasix. The correct answer is 1. Furosemide is a diuretic often prescribed for clients with hypertension or heart failure. The drug should not affect a client's ability to drive safely. Lasix may cause orthostatic hypotension, and clients should be instructed to be careful when changing from supine to sitting to standing position. Diuretics should be taken in the morning if possible to prevent sleep disturbance due to the need to get up to void. Lasix is a loop diuretic that is not potassium sparing. Clients should take potassium supplements as prescribed and have their serum potassium levels checked at prescribed intervals. In the care of a patient with gastroesophageal reflux disease, which task would be appropriate to delegate to assistive personnel? 1. Sharing successful strategies for weight reduction. 2. Encouraging the patient to express concerns about lifestyle modification. 3. Reminding the patient not to lie down for 2 to 3 hours after eating. 4. Explaining the rationale for eating small frequent meals. The correct answer is 3. Reminding the patient not to lie down for 2 to 3 hours after eating. Rationale. Reminding the patient to follow through on advice given by the nurse is an appropriate task for the AP. The nurse should take responsibility for teaching rationale, discussing strategies for the treatment plan, and assessing patient concerns.
The female client is being admitted to a medical unit with a diagnosis of pneumonia. Which intervention would the nurse implement? Rank in order of performance. 1. Start an IV access line. 2. Administer the IVPB antibiotic. 3. Teach to notify the nurse of any vaginal itching. 4. Obtain sputum and blood cultures. 5. Place an identity band on the client. The correct order is 5. Place an identity band on the client. 4. Obtain sputum and blood cultures. 1. Start an IV access line. 2. Administer the IVPB antibiotic. And 3. Teach to notify the nurse of any vaginal itching. The laboratory technician who will draw the blood cultures will need the band to identify the client before drawing the specimen, and the nurse will need the band before administering the medication. Checking for the right client is one of the 6 rights of medication administration. Cultures are obtained prior to the initiation of antibiotics to prevent skewing of the results. An IV line must be initiated before the nurse can administer IV medications. IV antibiotics should be administered within 1 to 2 hours of the order being written. This should always be considered a now medication. Superinfections are a potential complication of antibiotic therapy. Vaginal yeast infections occur when the good bacteria are killed off by the antibiotic. Diarrhea from destruction of intestinal flora is also a possibility. A nurse gives a client in a nursing home a choice about which color shirt to wear. Which level need, according to Maslow's hierarchy of needs, has the nurse just met? 1. Self-esteem. 2. Physiological. 3. Safety and security. 4. Love and belonging. The correct answer is 1. Self-esteem. Rationale. Choosing which color shirt to wear provides a person with the opportunity to make a choice and supports feelings of independence, competence, and self-respect, which all contribute to a positive self-esteem. A couple is asking the nurse whether or not their son should be circumcised. On which fact should the nurse's response be based? 1. Boys should be circumcised for them to establish a positive self-image. 2. Boys should not be circumcised because there is no medical rationale for the procedure. 3. Experts from the Centers for Disease Control and Prevention argue that circumcision is desirable. 4. A statement from the American Academy of Pediatrics asserts that circumcision is optional. The correct answer is 4. A statement from the American Academy of Pediatrics asserts that circumcision is optional. The American Academy of Pediatrics, although acknowledging that there are some advantages to circumcision, states that there is not enough evidence to suggest that all baby boys be circumcised. There is no evidence that circumcision status affects a boy's self-image. No official statements have been published regarding the rationality of performing circumcisions. The CDC has made no policy statement on circumcision.
A client has a throbbing headache when nitroglycerin is taken for angina. The nurse should instruct the client that 1. Acetaminophen, Tylenol, or ibuprofen, Advil can be taken for this common side effect. 2. Nitroglycerin should be avoided if the client is experiencing this serious side effect. 3. Taking the nitroglycerin with a few glasses of water will reduce the problem. 4. The client should lie in a supine position to alleviate the headache. The correct answer is 1. Acetaminophen, Tylenol, or ibuprofen, Advil can be taken for this common side effect. Rationale. Headache is a common side effect of nitroglycerin that can be alleviated with aspirin, acetaminophen, or ibuprofen. The sublingual nitroglycerin needs to be absorbed in the mouth, which will be disrupted with drinking. Lying flat will increase blood flow to the head and may increase pain and exacerbate other symptoms, such as shortness of breath.
In teaching the client with hypertension to avoid orthostatic hypotension, the nurse should emphasize which of the following instructions? Select all that apply. 1. Plan regular times for taking medications. 2. Arise slowly from bed. 3. Avoid standing still for long periods. 4. Avoid excessive alcohol intake. 5. Avoid hot baths. The correct answers are 2 and 3. Changing positions slowly and avoiding long periods of standing may limit the occurrence of orthostatic hypotension. Scheduling regular medication times is important for blood pressure management, but this aspect is not related to the development of orthostatic hypotension. Excessive alcohol intake and hot baths are associated with vasodilation. The patient needs diagnostic testing to confirm symptoms of peptic ulcer disease, and a healthcare provider tells the nurse that the patient prefers non-invasive methods. Which brochure is the nurse most likely to prepare for the patient? 1. 3 simple ways to detect H. pylori using your blood, breath, or stool. 2. How your doctor uses a barium contrast study to detect peptic ulcer disease. 3. Esophagogastroduodenoscopy, the major diagnostic test for peptic ulcer disease. 4. Common questions and answers about nuclear medicine scans. The correct answer is 1. 3 simple ways to detect H. pylori using your blood, breath, or stool. Rationale. H. pylori is frequently associated with peptic ulcer disease, and the organism can be detected through breath, blood, or stool. Esophagogastroduodenoscopy is the best test for peptic ulcer disease. However, it is considered an invasive procedure. A barium contrast study may be ordered for a patient who cannot undergo an endoscopy. A nuclear medicine scan may be ordered if gastrointestinal bleeding is present or to detect gastric emptying disorders.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. The client diagnosed with emphysema is admitted to the surgical unit for a cholecystectomy. Which post-operative interventions should the nurse implement? Select all that apply. 1. Have the patient turn, cough, and breathe deeply every 2 hours. 2. Administer oxygen to the client at 4 liters per minute. 3. Assess the surgical dressing every 4 hours. 4. Medicate frequently with morphine 15 mg IV push. 5. Use the incentive spirometer every 4 hours. The correct answers are 1. Have the patient turn, cough, and breathe deeply every 2 hours. 3. Assess the surgical dressing every 4 hours. And 5. Use the incentive spirometer every 4 hours. Clients undergoing surgery are encouraged to turn, cough, and deep breathe a minimum of every 2 hours. Clients diagnosed with chronic lung disease are frequently prescribed long-term steroid therapy. Steroids delay wound healing. The nurse should assess the wound to determine that the surgical incision is healing as desired. The client should use the incentive spirometer to help prevent pneumonia. Every 4 hours is an appropriate time span. The client should be administered oxygen at 1 to 3 liters per minute. Clients with chronic lung disease have developed carbon dioxide narcosis. High levels of carbon dioxide have destroyed the client's first stimulus for breathing. Oxygen hunger is the body's backup system for sustaining life. Administering oxygen at levels above 2 liters per minute at rest and 3 liters per minute during activity may cause the client to stop breathing. A nurse is assessing a child in relation to the stages of Jean Piaget's theory of cognitive development. Which behavior indicates that the child has reached the formal operation stage of cognitive development according to Piaget? 1. Utilizes deductive reasoning when examining alternatives. 2. Uses logical thought to organize collected information. 3. Investigates objects by placing them in the mouth. 4. Employs language to communicate with others. The correct answer is 1. Utilizes deductive reasoning when examining alternatives. Rationale. Utilizing deductive reasoning to examine alternatives reflects the formal operation stage of cognitive development. These individuals use symbols related to abstract concepts and are capable of hypothetical and deductive reasoning. A baby boy is to be circumcised by the mother's obstetrician. Which of the following actions shows that the nurse is being a patient advocate? 1. Before the procedure, the nurse prepares the sterile field for the physician. 2. The nurse refuses to unclothe the baby until the doctor orders something for pain. 3. The nurse holds the feeding immediately before the circumcision. 4. After the procedure, the nurse monitors the site for signs of bleeding. The correct answer is 2. The nurse refuses to unclothe the baby until the doctor orders something for pain. The nurse is being a patient advocate because the baby is unable to ask for pain medication. The American Academy of Pediatrics has made a policy statement that pain medications be used during all circumcision procedures. Circumcision is a surgical procedure that requires a sterile field and sterile technique. The nurse is performing safe practice in this situation. If a baby feeds immediately before the circumcision, he may aspirate his feeds. This is safe practice. Making sure the baby is not hemorrhaging at the incision site is also an example of safe nursing practice. Nurses perform a variety of roles. Being a safe practitioner is an essential role of the nurse. Just as important, and quite different, however, is the role of patient advocate, that is, providing support for the rights of a client who is unable to speak for or support himself or herself.
How should the nurse instruct the client with unstable angina to use sublingual nitroglycerin tablets when chest pain occurs? 1. Sit down and then take one tablet every 2 to 5 minutes until the pain stops. 2. Sit down and then take one tablet and rest for 15 minutes. Call the physician if pain persists after 15 minutes. 3. Sit down and then take one tablet. Then if the pain persists, take additional 2 tablets in 5 minutes. Call the physician if pain persists after 15 minutes. 4. Sit down and then take one tablet. If pain persists after 5 minutes, call 911. The correct answer is 4. Sit down and then take one tablet. If pain persists after 5 minutes, call 911. Rationale. The nurse should instruct the client that correct protocol for using sublingual nitroglycerin involves immediate administration when chest pain occurs. Sublingual nitroglycerin appears in the bloodstream within 2 to 3 minutes and is metabolized within about 10 minutes. The client should sit down and place the tablet under the tongue. If the chest pain is not relieved within 5 minutes, the client should call 911. Although some physicians may recommend taking a second or third tablet spaced 5 minutes apart and then calling for emergency assistance, it is not appropriate to take 2 tablets at once. Nitroglycerin acts within 2 to 3 minutes, and the client should not wait 15 minutes to take further action. The client should call 911 to obtain emergency help rather than calling the physician.
The nurse is teaching a client with hypertension about taking atenolol. The nurse should instruct the client to 1. Avoid sudden discontinuation of the drug. 2. Monitor the blood pressure annually. 3. Follow a 2-gram sodium diet. 4. Discontinue the medication if severe headaches develop. The correct answer is 1. Atenolol is a beta-adrenergic antagonist indicated for management of hypertension. Sudden discontinuation of this drug is dangerous because it may exacerbate symptoms. The medication should not be discontinued without a physician's prescription. Blood pressure needs to be monitored more frequently than annually in a client who is newly diagnosed and treated for hypertension. Clients are not usually placed on a 2-gram sodium diet for hypertension. The nurse is providing the immediate postoperative care for a patient who had fundoplication to reinforce the lower esophageal sphincter for the purpose of a hiatal hernia repair. What is the priority action in the care of this patient? 1. Elevate the head of the bed at least 30 degrees. 2. Assess the nasogastric tube for yellowish-green drainage. 3. Assist the patient to start taking a clear liquid diet. 4. Assess the patient for gas bloat syndrome. The correct answer is 1. Elevate the head of the bed at least 30 degrees. Rationale. The primary concern in the immediate postoperative period is the potential for airway complications. Elevating the head at least 30 degrees decreases the chance for aspiration and facilitates respiratory effort. The other options are also correct, but will occur later in the postoperative period. The ABCs, airway, breathing, and circulation, underlie the priorities of care when the patient has an invasive procedure. You can use the concept of gas exchange to answer this question, even if you are not familiar with the specific details of the procedure.
The nurse is discharging a client diagnosed with COPD. Which discharge instructions should the nurse provide regarding the client's prescription for prednisone? 1. Take all the prednisone as ordered until the prescription is empty. 2. Take the prednisone on an empty stomach with a full glass of water. 3. Stop taking the prednisone if a noticeable weight gain occurs. 4. Do not abruptly discontinue taking the prednisone. The correct answer is 4. Do not abruptly discontinue taking the prednisone. Prednisone is a glucocorticoid steroid. Prednisone is not abruptly discontinued because cortisol is necessary to sustain life, and the adrenal glands stop producing cortisol while the client is taking it exogenously. Prednisone can produce gastric distress. It is given with food to minimize the gastric discomfort. Weight gain is a side effect of steroid therapy, and the client should not stop taking the medication if this occurs. This medication must be tapered off to prevent a life-threatening complication if the client is to stop the medication. A nurse is caring for a client who is exposed to a stressful event. Which statement about the general adaptation syndrome should the nurse consider when caring for this client? 1. A stressful event is an iatrogenic stress. 2. An individual exposed to a stressful event will adapt in a unique way. 3. A stressful event will precipitate an autonomic nervous system response. 4. An individual exposed to a stressful event eventually will achieve homeostasis. The correct answer is 3. A stressful event will precipitate an autonomic nervous system response. Rationale. Stressors precipitate the general adaptation syndrome, which is a neuroendocrine response and part of the autonomic nervous system. Using the Neonatal Infant Pain Scale, NIPS, a nurse is assessing the pain response of a newborn who has just had a circumcision. The nurse is assessing a change in which of the following signs, symptoms. Select all that apply. 1. Heart rate. 2. Blood pressure. 3. Temperature. 4. Facial expression. 5. Breathing pattern. The correct answers are 4. Facial expression, and 5. Breathing pattern. Facial expression is one variable that is evaluated as part of the NIPS. Breathing pattern is one variable that is evaluated as part of the NIPS. Although assessed in other pain scales, the heart rate is not part of the NIPS. Blood pressure is not assessed in any infant pain scale. Temperature is not assessed in any infant pain scale. You should be familiar with the pain rating scales and use them clinically because neonates cannot communicate their pain to the nurse. The scoring variables that are evaluated when assessing neonatal pain using the NIPS are facial expression, crying, breathing patterns, movement of arms and legs, and state of arousal. Other tools for assessing pain in the neonate are the Pain Assessment Tool, the Neonatal Post-Op Pain Scale, and the Premature Infant Pain Profile.
A client with angina is taking nifedipine. The nurse should teach the client to 1. Monitor blood pressure monthly. 2. Perform daily weights. 3. Inspect gums daily. 4. Limit intake of green leafy vegetables. The correct answer is 3. Inspect gums daily. Rationale. The client taking nifedipine should inspect the gums daily to monitor for gingival hyperplasia. This is an uncommon adverse effect, but one that requires monitoring and intervention if it occurs. The client taking nifedipine might be taught to monitor blood pressure, but more often than monthly. These clients would not generally need to perform daily weights or limit intake of green leafy vegetables.
The nurse teaches a client who has recently been diagnosed with hypertension about following a low-calorie, low-fat, low-sodium diet. Which of the following menu selections would best meet the client's needs? 1. Mixed green salad with blue cheese dressing, crackers, and cold cuts. 2. Ham sandwich on rye bread and an orange. 3. Baked chicken, an apple, and a slice of white bread. 4. Hot dogs, baked beans, and celery and carrot sticks. The correct answer is 3. Processed and cured meat products. such as cold cuts, ham, and hot dogs, are all high in both fat and sodium and should be avoided on a low-calorie, low-fat, low-salt diet. Dietary restrictions of all types are complex and difficult to implement with clients who are basically asymptomatic. A patient with chronic hepatitis C has been taking a daily dose of the antiviral medication ledapaspir, so Fospivir for the past month. Which information is the most important for the nurse to communicate to the healthcare provider? 1. The patient reports mild headaches that come and go. 2. The patient complains of feeling chronically tired. 3. The patient has missed a period and is having unprotected sex. 4. The patient reports nausea and occasional diarrhea. The correct answer is 3. The patient has missed a period and is having unprotected sex. Rationale. During pregnancy, this medication is prescribed with caution and only if clearly needed. The healthcare provider must discuss the risk versus benefits with the patient and then decide to continue or discontinue the medication. Headache, fatigue, nausea, and diarrhea are common adverse effects of ledapaspir, sofosbuvir, and should be reported if persistent or recurrent.
The nurse is preparing to administer medications in a pulmonary unit. Which medication should the nurse administer first? 1. Prednisone for a client diagnosed with chronic bronchitis. 2. Oxygen via nasal cannula at 2 liters per minute for a client diagnosed with pneumonia. 3. Lactic acidophilus to a client receiving IVPB antibiotics. 4. Cephalexin to a client being discharged. The correct answer is 2. Oxygen via nasal cannula at 2 liters per minute for a client diagnosed with pneumonia. Oxygen is considered a medication and should be a priority whenever it is ordered. A client diagnosed with pneumonia will have some amount of respiratory compromise, and the ordered 2 liters per minute indicates a client with a chronic lung disease. This is the priority medication. Prednisone is a glucocorticoid steroid. This is an oral preparation and one that can be given daily. This is not the first medication to be administered. Lactic acidophilus is a biologic replacement and is administered to replace the good bacteria in the body destroyed by the antibiotic, but it does not need to be administered first. Cephalexin is an oral antibiotic, but this client is being discharged, indicating the client's condition has improved. This client could wait until the oxygen is initiated. A nurse is facilitating a support group for people who are coping with the death of a significant other. Which client behavior reflects complicated grieving? 1. Remarrying within 6 months after the death of a wife. 2. Being continuously angry 3 months after the death of a parent. 3. Exhibiting indicators of depression 9 months after the death of a husband. 4. Keeping a child's room unchanged for 4 years after the death of the child. The correct answer is 4. Keeping a child's room unchanged for 4 years after the death of the child. Rationale. Keeping a deceased child's room unchanged for years is outside the usual limits of grieving. Often, a person can get stuck in a stage of grieving and is unable to progress to the next stage. Keeping a room unchanged for years reflects an inability to face the reality of the loss or to deal with the feelings associated with the loss. A nurse is teaching a mother how to care for her 3-day-old son's circumcised penis. Which of the following actions demonstrates that the mother has learned the information? 1. The mother cleanses the glands with a cotton swab dipped in hydrogen peroxide. 2. The mother covers the glands with antifungal ointment after rinsing off any discharge. 3. The mother squeezes soapy water from the washcloth over the glands. 4. The mother replaces the dry, sterile dressing before putting on the diaper. The correct answer is 3. The mother squeezes soapy water from the washcloth over the glands. Squeezing soapy water over the penis cleanses the area without irritating the site and causing the site to bleed. Hydrogen peroxide is not used when cleansing the circumcised penis. Antifungals are not indicated in this situation. Dry dressings are not applied to the circumcised penis. It is, however, usually recommended to liberally apply petroleum jelly to the site before diapering. The petroleum jelly may be applied directly to the penis via a sterile dressing or via a petroleum jelly-impregnated gauze. The circumcised penis has undergone a surgical procedure, but to apply a dry dressing is potentially injurious. If the dressing adheres to the newly circumcised penis, the incision could bleed. You should be aware that with routine cleaning, as cited previously, circumcisions usually heal quickly and rarely become infected. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
The nurse is developing a teaching plan for a client who will be starting a prescription for Zocor, simvastatin, 40 milligrams per day. The nurse should instruct the client about which of the following? Select all that apply. 1. Take once a day in the morning. 2. If you miss a dose, take it when you remember it, but do not double the dose if you do not remember to take it until it is time for your next dose. 3. Limit greens such as lettuce in the diet to prevent bleeding. 4. Be sure to take the pill with food. 5. Report muscle pain or tenderness to your healthcare provider. 6. Continue to follow a diet that is low in saturated fats. The correct answers are 2. If you miss a dose, take it when you remember it, but do not double the dose if you do not remember to take it until it is time for your next dose. 5. Report muscle pain or tenderness to your healthcare provider. And 6. Continue to follow a diet that is low in saturated fats. Rationale. Zocor, simvastatin, is used in combination with diet and exercise to decrease elevated total cholesterol. The client should take Zocor in the evening, and the nurse should instruct the client that if a dose is missed, to take it as soon as remembered, but not to take at the same time as the next scheduled dose. It is not necessary to take the pill with food. The client does not need to limit greens. Limiting greens is appropriate for clients taking Coumadin, but the nurse should instruct the client to avoid grapefruit and grapefruit juice, which can increase the amount of the drug in the bloodstream. A serious side effect is myopathy, and the client should report muscle pain or tenderness to the healthcare provider.
A client who has diabetes is taking metoprolol for hypertension. Which of the following information should the nurse include in the teaching plan? Select all that apply. 1. These tablets should be taken with food at same time each day. 2. Do not crush or chew the tablets. 3. Notify the healthcare provider if pulse is 82 beats per minute. 4. Have a blood glucose level drawn every 6 to 12 months during therapy. 5. Use an appropriate decongestant if needed. 6. Report any fainting spells to the healthcare provider. The correct answers are 1, 2, 4, and 6. Metoprolol is a beta-adrenergic blocker indicated for hypertension, angina, and myocardial infarction. The tablet should be taken with food at the same time each day. They should not be chewed or crushed. The healthcare provider should be notified if pulse falls below 50 for several days. Blood glucose should be checked regularly during therapy, since increased episodes of hypoglycemia may occur. It may mask evidence of hypoglycemia such as palpitations, tachycardia, and tremor. Use of any OTC decongestants, asthma and cold remedies, and herbal preparations must be avoided. Fainting spells may occur due to exercise or stress, and the dosage of the drug may need to be reduced or discontinued. Which patient is the most appropriate to assign to an LPN/LVN under the supervision of an RN? 1. A patient with oral cancer who is scheduled for a glossectomy in the morning. 2. An obese patient who has returned from surgery after a vertical banded gastroplasty. 3. A patient with anorexia nervosa who has muscle weakness and decreased urine output. 4. A patient with intermittent nausea and vomiting after chemotherapy. The correct answer is 4. A patient with intermittent nausea and vomiting after chemotherapy. Rationale. Nausea and vomiting are common after chemotherapy. Administration of antiemetics and fluid monitoring can be done by an LPN/LVN. The RN should perform the preoperative teaching for the glossectomy patient. Patients returning from surgery need extensive assessment. The patient with anorexia is showing signs of hypokalemia and is at risk for cardiac dysrhythmias.
The client reporting acid when lying down at night asks the nurse if there is any medication that might help. Which statement is the nurse's best response? 1. There are no medications to treat this problem, but losing weight will sometimes help the symptoms. 2. There are several over-the-counter and prescription medications available to treat this. You should discuss this with your healthcare provider. 3. Have you had any x-rays or other tests to determine if you have cancer or some other serious illness? 4. Acid reflux at night can lead to serious complications. You need to have tests done to determine the cause. The correct answer is 2. There are several over-the-counter and prescription medications available to treat this. You should discuss this with your healthcare provider. PPIs, H2 blockers, and antacids all treat the symptoms of acid reflux. The nurse should encourage the client to discuss which medication is best with the HCP. Sometimes losing weight will help relieve symptoms, but the client did not ask about lifestyle modifications. The symptoms do not indicate cancer. The nurse should not scare the client. Acid reflux can lead to complications, including adult-onset asthma that should be treated, but most HCPs will empirically treat the symptoms of acid reflux before ordering tests to determine the cause or possible complications. The client is admitted to the telemetry unit diagnosed with acute exacerbation of congestive heart failure. Which signs and symptoms would the nurse expect to find when assessing this client? 1. Apical pulse rate of 110 and 4 plus pitting edema of feet. 2. Thick white sputum and crackles that clear with cough. 3. The client sleeping with no pillow and eupnea. 4. Radial pulse rate of 90 and capillary refill time less than 3 seconds. The correct answer is 1. Apical pulse rate of 110 and 4 plus pitting edema of feet. The client with congestive heart failure would exhibit tachycardia, dependent edema, fatigue, third heart sounds, lung congestion, and change in mental status. The client usually has pink frothy sputum and crackles that do not clear with coughing. The client would report sleeping on at least 2 pillows, if not sleeping in an upright position, and labored breathing, not eupnea, which means normal breathing. In a client diagnosed with heart failure, the apical pulse, not the radial pulse, is the best place to assess the cardiac status. In option 3, the word no is an absolute term, and usually absolutes, such as no, never, always, and only, are incorrect because there is no room for any other possible answer. If you're looking for abnormal data, then you should exclude the options that have normal values in them, such as eupnea, pulse rate of 90, and capillary refill time less than 3 seconds. The parent of a newborn asks, "Will my baby spit out the formula if it is too hot or too cold?" Which is the nurse's best response? 1. Babies have a tendency to reject hot fluids, but not cold fluids, which could result in abdominal discomfort. 2. Babies have a tendency to reject cold fluids, but not hot fluids, which could result in esophageal burns. 3. Your baby would most likely spit out formula that was too hot, but your baby could swallow some of it, which could result in a burn. 4. Your baby is too young to be physically capable of spitting out fluids and will automatically swallow anything. The correct answer is 4. Your baby is too young to be physically capable of spitting out fluids and will automatically swallow anything. Swallowing is a reflex in neonates. Infants younger than 6 weeks cannot voluntarily control swallowing. The infant is not capable of selectively rejecting fluid because swallowing is a reflex until 6 weeks. You should eliminate answers 1, 2, and 3 because they suggest that the infant is capable of selectively rejecting fluids.
The client is having status epilepticus and is prescribed IV diazepam. The client has an IV of D5W 75 milliliters per hour in the right arm and a saline lock in the left arm. Which intervention should the nurse implement? 1. Dilute the diazepam and administer over 5 minutes via the existing IV. 2. Do not dilute the medication and administer at the port closest to the client. 3. Question the order because diazepam cannot be administered with D5W. 4. Inject 3 milliliters of normal saline in the saline lock and administer diazepam undiluted. The correct answer is for inject 3 milliliters of normal saline in the saline lock and administer diazepam undiluted. Rationale: the nurse should administer the diazepam, a benzodiazepine, undiluted through the saline lock. Diazepam is oil-based and should not be diluted. It should not be administered in an existing IV line if another option is available. The nurse does not need to question the order because there is an existing saline lock.
An older adult with a history of hypertension is admitted with diagnosis of dehydration. The client is becoming increasingly confused and weak. The client reports taking 1 tablet of hydrochlorothiazide daily, and the prescription is written for 1/2 tablet. The nurse should obtain additional information about 1. Decreased drug half-life of the hydrochlorothiazide. 2. Decreased hepatic blood flow. 3. Increased GI activity. 4. Increased urinary elimination. The correct answer is 2. Aging causes decreased hepatic blood flow. Decreased drug metabolism, which occurs with aging, along with more drug in circulation, means the drug will remain in the body longer and produce greater drug effects. The client has also taken more drug than prescribed, increasing the opportunity for more drug action to occur. When there is decreased metabolism of drugs, an increase in the half-life will occur most especially in the older adult. In older adults, transit time is slower, allowing more drug to be absorbed. Increased urinary elimination would mean that drug elimination could be higher, not lower, and accumulating in the body. For patients with peptic ulcer disease, what is the most important lifestyle modification? 1. Avoiding caffeine. 2. Decreasing alcohol intake. 3. Smoking cessation. 4. Controlling stress. The correct answer is 3. Smoking cessation. Rationale: smoking is associated with peptic ulcer disease. The other lifestyle modifications may be desirable, but the current evidence does not show strong linkage to the development of or recovery from peptic ulcer disease.
The nurse in a medical unit has received the morning report. Which medication should the nurse administer first? 1. Pantoprazole to a client on call to surgery. 2. Calcium carbonate to a client reporting indigestion. 3. Bismuth to a client diagnosed with an ulcer. 4. Famotidine to a client diagnosed with gastroesophageal reflux disease. The correct answer is 1. Pantoprazole to a client on call to surgery. Pantoprazole is a proton pump inhibitor. A medication for a client on call to surgery is a priority. The client's surgery could be delayed if the medication has not been administered when the call to surgery comes. Calcium carbonate is an antacid. This would be the second medication to administer, as this client has a report of discomfort. Bismuth is an antimicrobial. This medication is a routine medication and could be administered at any time. Famotidine is an H2 blocker. This medication is a routine medication and could be administered at any time. The nurse is developing a nursing care plan for a client diagnosed with congestive heart failure. A nursing diagnosis of decreased cardiac output related to inability of the heart to pump effectively is written. Which short-term goal would be best for the client? The client will 1. Be able to ambulate in the hall by date of discharge. 2. Have an audible S1 and S2 with no S3 heard by end of shift. 3. Turn, cough, and deep breathe every 2 hours. 4. Have a pulse oximeter reading of 98% by day 2 of care. The correct answer is 2. Have an audible S1 and S2 with no S3 heard by end of shift. Audible S1 and S2 sounds are normal for a heart with adequate output. An audible S3 sound might indicate left ventricular failure, which could be life-threatening. Ambulating in the hall by day of discharge would be a more appropriate goal for an activity intolerance nursing diagnosis. Option 3 is a nursing intervention, not a short-term goal for this client. A pulse oximeter reading would be a goal for impaired gas exchange, not for cardiac output. When reading a nursing diagnosis or problem, you must be sure that the answer selected addresses the problem. An answer option may be appropriate care for the disease process, but may not fit with the problem or etiology. Remember, when given an etiology in a nursing diagnosis, the answer will be doing something about the problem. In this question, you should look for an answer that addresses the ability of the heart to pump blood. The mother of a newborn asks the nurse why the infant has to nurse so frequently. Which is the best response? 1. Formula tends to be more calorically dense, and formula-fed babies require fewer feedings than breastfed babies. 2. The newborn stomach capacity is small, and peristalsis is slow. 3. The newborn stomach capacity is small, and peristalsis is more rapid than in older children. 4. Breastfed babies tend to take longer to complete a feeding than formula-fed babies. The correct answer is 3. The newborn stomach capacity is small, and peristalsis is more rapid than in older children. The small stomach capacity and rapid movement of fluid through the digestive system account for the need for small, frequent feedings. The caloric content of breast milk and formula tends to be similar. Peristalsis in infants is greater than in older children. Breastfed babies and formula-fed babies do not necessarily have a difference in feeding time. You should eliminate answers 1 and 4 because they both form generalizations that are not supported by current literature.
The client newly diagnosed with a seizure disorder also has type 2 diabetes. The HCP prescribes phenytoin for the client. Which intervention should the nurse implement? 1. Instruct the client to monitor his or her blood glucose more closely. 2. Explain that the phenytoin will not affect the client's anti-diabetic medication. 3. Discuss the need to discontinue oral hypoglycemic medication and take insulin. 4. Call the HCP to discuss prescribing the phenytoin. The correct answer is 1. Instruct the client to monitor his or her blood glucose more closely. Rationale. Serum glucose must be monitored more closely because phenytoin may inhibit insulin release, thus causing an increase in glucose level. Options 2 is not a true statement. Diazepam may affect the client's anti-diabetic medication. Option 3 is not a true statement. The client can still take oral hypoglycemic medications. The nurse should call and discuss any questionable medication with the HCP, but there is no reason to discuss diazepam, a benzodiazepine being prescribed for a client with type 2 diabetes.
A client diagnosed with primary hypertension is taking chlorothiazide. The nurse determines teaching about this medication is effective when the client makes the following statement. Select all that apply. 1. I will take my weight daily at the same time each day. 2. I will not drink alcoholic beverages while on this medication. 3. I will reduce salt intake in my diet. 4. I will reduce my dosage if I have severe dizziness. 5. I will use sunscreen if I have prolonged exposure to sunlight. 6. Take the drug late in the evening. The correct answers are 1, 2, 3, and 5. Chlorothiazide causes increased urination and decreased swelling and weight loss. It is important to check and record weight 2 to 3 times per week at same time of day with similar amount of clothing. Clients should not drink alcoholic beverages or take other medications without the approval of the healthcare provider. Reducing sodium intake in the diet helps diuretic drugs to be more effective and allows smaller doses to be taken. Smaller doses are less likely to cause adverse effects, and hence excessive table salt, as well as salty food, should be avoided. Chlorothiazide is a diuretic that is prescribed for lower blood pressure and may cause dizziness and faintness when the patient stands up suddenly. This can be prevented or decreased by changing positions slowly. If dizziness is severe, the healthcare provider must be notified. Diuretics may cause sensitivity to sunlight, hence the need to avoid prolonged exposure to sunlight, use sunscreens, and wear protective clothing. Chlorothiazide causes increased urination and must be taken early in the day to decrease nighttime trips to the bathroom. Fewer bathroom trips mean less interference with sleep and less risk of falls. For the postoperative care of a morbidly obese patient, which task best utilizes the expertise of the LPN/LVN under the supervision of the RN team leader? 1. Obtaining an oversized blood pressure cuff and a large-size bed. 2. Setting up a reinforced trapeze bar. 3. Assisting in the planning of toileting, turning, and ambulation. 4. Assigning tasks to assistive personnel and other ancillary staff. The correct answer is 3. Assisting in the planning of toileting, turning, and ambulation. Rationale. The LPN/LVN can offer valuable assistance in planning the interventions, but the RN has ultimate responsibility for the care plan. The LPN/LVN can delegate and assign tasks to APs. However, if the RN is a team leader, It is better if APs are not receiving instructions from multiple people. Obtaining equipment should be delegated to an AP. A physical therapist should set up specialized equipment.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. Which statement is the scientific rationale for administering a proton pump inhibitor to a client diagnosed with gastroesophageal reflux disease? 1. PPI medications neutralize the gastric secretions. 2. PPI medications block H2 receptors on the parietal cells. 3. PPI medications inhibit the enzyme that generates gastric acid. 4. PPI medications form a protective barrier against acid and pepsin. The correct answer is 3. PPI medications inhibit the enzyme that generates gastric acid. PPIs inhibit the enzyme that generates gastric acid. Antacids, not PPIs, neutralize gastric secretions. H2 blockers block receptors on the parietal cells. Mucosal barrier agents form a protective barrier against acid and pepsin. The nurse is developing a discharge teaching plan for the client diagnosed with congestive heart failure. Which interventions should be included in the plan? Select all that apply. 1. Notify healthcare provider of a weight gain of more than 1 pound in a week. 2. Teach client how to count the radial pulse when taking digoxin, a cardiac glycoside. 3. Instruct client to remove the salt shaker from the dinner table. 4. Encourage client to monitor urine output for change in color to become dark. 5. Discuss the importance of taking the loop diuretic furosemide at bedtime. The correct answers are 2. Teach client how to count the radial pulse when taking digoxin, a cardiac glycoside, and 3. Instruct client to remove the salt shaker from the dinner table. The client should not take digoxin if the radial pulse is less than 60. The client should be on a low-sodium diet to prevent water retention. The client should notify the HCP of weight gain of more than 2 or 3 pounds in one day. The color of the urine should not change to a dark color. If anything, it might become lighter, and the amount will increase with diuretics. Instruct the client to take the diuretic in the morning to prevent nocturia. A 4-month-old has had vomiting and diarrhea for 24 hours. The infant is fussy, and the anterior fontanelle is sunken. The nurse notes the infant does not produce tears when crying. Which task will help confirm the diagnosis of dehydration? 1. Urinalysis obtained by bagged specimen. 2. Urinalysis obtained by sterile catheterization. 3. Analysis of serum electrolytes. 4. Analysis of cerebrospinal fluid. The correct answer is 3. Analysis of serum electrolytes. The analysis of serum electrolytes offers the most information and assists with the diagnosis of dehydration. The information obtained from a urinalysis of an infant is not as helpful as serum electrolytes. The infant has limited ability to concentrate urine, so the specific gravity is not usually affected. A urinalysis does not need to be obtained by catheterization. Although critical in diagnosing meningitis, a lumbar puncture and analysis of cerebrospinal fluid are not done to confirm dehydration. Infants have limited ability to concentrate urine, so answers 1 and 2 can be eliminated immediately.
The female client diagnosed with epilepsy tells the nurse, "I am very scared to get pregnant since I am taking medication for my epilepsy." Which statement is the nurse's best response? 1. You are scared because you take medication for your epilepsy. 2. Can you tell me more about what is concerning you? 3. You should not get pregnant when you are taking anticonvulsants. 4. Have you discussed your concerns with your HCP? The correct answer is 2. Can you tell me more about what is concerning you? Rationale. Option 1 is a therapeutic response that is used to encourage the client to ventilate feelings, but the nurse should provide factual information to this client. The nurse should explore the reasons for the client's fears in order to be able to give her information that would help her make a decision about becoming pregnant, as many anticonvulsant medications have teratogenic properties. A female client with epilepsy can give birth to an infant without epilepsy. The client should discuss a potential pregnancy with a significant other, but this is not addressing the client's concerns.
Which intervention would be most likely to assist a client with hypertension in maintaining an exercise program? 1. Giving the client a written exercise program. 2. Explaining the exercise program to the client's spouse. 3. Reassuring the client that he or she can do the exercise program. 4. Tailoring a program to the client's needs and abilities. The correct answer is 4. Tailoring or individualizing a program to the client's lifestyle has been shown to be an effective strategy for changing health behaviors. Providing a written program, explaining the program to the client's spouse, and reassuring the client that he or she can do the program may be helpful, but are not as likely to promote adherence as individualizing the program. A patient with proctitis needs a rectal suppository. A senior nursing student assigned to care for this patient tells a nurse that she is afraid to insert a suppository because she has never done it before. What is the most appropriate action in supervising the student? 1. Give the medication and tell the student to talk to the instructor. 2. Ask the student to leave the clinical area because she is unprepared. 3. Reassign the patient to another nurse and send the student to observe. 4. Show the student how to insert the suppository and talk to the instructor. The correct answer is 4. Show the student how to insert the suppository and talk to the instructor. Rationale. Showing the student how to insert the suppository meets both the immediate patient need and the student's learning need. The instructor can address the student's fears and long-term learning needs after he or she is aware of the incident. It is preferable that students express fears and learning needs. The other options will discourage the student's future disclosure of clinical limitations and need for additional training.
Which statement is an advantage to administering a histamine 2 blocker rather than an antacid to a client diagnosed with gastroesophageal reflux disease? 1. Antacids are more potent than H2 blockers in relieving the symptoms of gastroesophageal reflux disease. 2. H2 blockers have more side effects than antacids. 3. H2 blockers are less expensive than antacids. 4. H2 blockers require less frequent dosing than antacids. The correct answer is 4. H2 blockers require less frequent dosing than antacids. H2 blockers require less frequent administration than do antacids, which require frequent administration 7 or more times a day for therapeutic effects. The fewer times a client is expected to take a medication, the more likely the client is to comply with a medication regimen. H2 blockers actually block the production of gastric acid and have a longer effect than an antacid. An increase in side effects would not be an advantage. Antacids are usually less expensive than H2 blockers. The nurse enters the room of the client diagnosed with congestive heart failure. The client is lying in bed gasping for breath, is cool and clammy, and has buccal cyanosis. Which intervention would the nurse implement first? 1. Sponge the client's forehead. 2. Obtain a pulse oximetry reading. 3. Take the client's vital signs. 4. Assist the client to a sitting position. The correct answer is 4. Assist the client to a sitting position. The nurse must first put the client in a sitting position to decrease the workload of the heart by decreasing venous return and maximizing lung expansion. Then, the nurse could take vital signs and check the pulse oximeter and then sponge the client's forehead. Sponging the client's forehead would be appropriate, but it is not the first intervention. Obtaining a pulse oximeter reading would be appropriate, but it is not the first intervention. Taking the vital signs would be appropriate, but it is not the first intervention. In a question that asks the nurse to set priorities, all the answer options can be appropriate actions by the nurse for a given situation. You should apply some guidelines or principles, such as Maslow's hierarchy of needs, to determine what will give the client the most immediate assistance. A 4-month-old is brought to the emergency department with severe dehydration. The heart rate is 198, and her blood pressure is 68/38. The infant's anterior fontanelle is sunken. The nurse notes that the infant does not cry when the intravenous line is inserted. The child's parents state that she has not held anything down in 18 hours. The nurse obtains a fingerstick blood sugar of 94. Which would the nurse expect to do immediately? 1. Administer a bolus of normal saline. 2. Administer a bolus of D10W. 3. Administer a bolus of normal saline with 5% dextrose added to the solution. 4. Offer the child an oral rehydrating solution, such as Pedialyte. The correct answer is 1. Administer a bolus of normal saline. Dehydration is corrected with the administration of an isotonic solution, such as normal saline or lactated ringer solution. Solutions containing dextrose should never be administered in bolus form because they may result in cerebral edema. Severe dehydration is not usually corrected with oral solutions. Children with altered levels of consciousness should be kept NPO. You should immediately eliminate answers 2 and 3 because they both suggest administering glucose in bolus form, which is always contraindicated in pediatric clients. Answer 4 should be eliminated because the infant is severely dehydrated and not responding to painful stimulation, which is suggested by the lack of a cry on intravenous insertion.
The client newly diagnosed with epilepsy is prescribed an anticonvulsant medication. Which information should the nurse tell the client? 1. The medication dosage will start low and gradually increase over a few weeks. 2. The dosage prescribed initially will be the dosage prescribed for the rest of your life. 3. The HCP will prescribe a loading dose and decrease dosage gradually. 4. The dose of medication will be adjusted monthly until a serum drug level is obtained. The correct answer is 1. The medication dosage will start low and gradually increase over a few weeks. Rationale. Anticonvulsant dosages usually start low and gradually increase over a period of weeks until the serum drug level is within therapeutic range or the seizures stop. It is incorrect to state that the dosage prescribed will be the dosage for the rest of the client's life, but it is correct to state that the client will most likely be on the medication for the rest of his or her life. The medication is started in low dosages and gradually increased. The dose of medication will be adjusted until a serum drug level is reached, but it will be more frequently than monthly.
The client realizes the importance of quitting smoking, and the nurse develops a plan to help the client achieve this goal. Which of the following nursing interventions should be the initial step in this plan? 1. Review the negative effects of smoking on the body. 2. Discuss the effect of passive smoking on environmental pollution. 3. Establish the client's daily smoking pattern. 4. Explain how smoking worsens high blood pressure. The correct answer is 3. A plan to reduce or stop smoking begins with establishing the client's personal daily smoking pattern and activities associated with smoking. It is important that the client understands the associated health and environmental risks, but this knowledge has not been shown to help clients change their smoking behavior. A nursing student is performing a colostomy irrigation. When would the nurse intervene? 1. Student hangs the prepared irrigation container on the bed rail. 2. The student puts 500 to 1,000 milliliters of lukewarm water in the container. 3. Student cleans, rinses, and dries the skin and applies a new drainage pouch. 4. The student encourages the patient to walk for 30 to 45 minutes for secondary evacuation. The correct answer is 1. Student hangs a prepared irrigation container on the bed rail. Rationale. The nurse will remind the student that the container has to be hung at shoulder level. If the container is too low, the flow will be sluggish. If the container is below the entry site, the solution will flow retrograde. If the container is too high, the solution will flow too quickly and cause cramping. The other actions are correct.
Which side effects should the nurse explain to the male client who is prescribed cimetidine? 1. The medication can cause indigestion and heartburn. 2. The medication can cause impotence and gynecomastia. 3. The medication can cause insomnia and hypervigilance. 4. The medication can cause Zollinger-Ellison syndrome. The correct answer is 2. The medication can cause impotence and gynecomastia. Cimetidine is an H2 blocker. Over time, cimetidine can cause males to become impotent, have decreased libido, and have breast development. Cimetidine, an H2 blocker, is used to treat indigestion and heartburn. Cimetidine can cause lethargy and somnolence, not insomnia and hypervigilance. Cimetidine is used to treat Zollinger-Ellison syndrome, a syndrome characterized by hypersecretion of gastric acid and the formation of peptic ulcers. The nurse is assessing the client diagnosed with congestive heart failure. Which signs and symptoms would indicate that the medical treatment has been effective? 1. The client's peripheral pitting edema has gone from 3+ to 4+. 2. The client is able to take the radial pulse accurately. 3. The client is able to perform ADLs without dyspnea. 4. The client has minimal jugular vein distension. The correct answer is 3. The client is able to perform ADLs without dyspnea. Being able to perform activities of daily living without shortness of breath would indicate the client's condition is improving. The client's heart is a more effective pump and can oxygenate the body better without increasing fluid in the lungs. Pitting edema changing from 3+ to 4+ indicates a worsening of the CHF. The client's ability to take the radial pulse would evaluate teaching, not medical treatment. Any jugular vein distension indicates that the right side of the heart is failing, which would not indicate effective medical treatment. When asked to determine whether treatment is effective, the test taker must know the signs and symptoms of the disease being treated. An improvement in the signs and symptoms indicates effective treatment. The nurse is caring for a 2-year-old child who was admitted to the pediatric unit for moderate dehydration due to vomiting and diarrhea. The child is restless with periods of irritability. The child is afebrile with a heart rate of 148 and a blood pressure of 90/42. Baseline laboratory tests reveal the following: sodium 152, chloride 119, and glucose 115. The parents state that the child has not urinated in 12 hours. After establishing a saline lock, the nurse reviews the physician's orders. Which order should the nurse question? 1. Administer a saline bolus of 10 milliliters per kilogram, which may be repeated if the child does not urinate. 2. Recheck serum electrolytes in 12 hours. 3. After the saline bolus, begin maintenance fluids of D5/1/4 normal saline with 10 milliequivalents potassium chloride per liter. 4. Give clear liquid diet as tolerated. The correct answer is 3. After the saline bolus, begin maintenance fluids of D5/1/4 normal saline with 10 milliequivalents potassium chloride per liter. Potassium is contraindicated because the child has not yet urinated. Potassium is not added to the maintenance fluid until kidney function has been verified. The child with dehydration secondary to vomiting and diarrhea is placed on a clear liquid diet. Fluid boluses of normal saline are administered according to the child's body weight. It is not unusual to have to repeat the bolus multiple times in order to see an improvement in the child's condition. It is important to monitor serum electrolytes frequently in the dehydrated child. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
The nurse is preparing to administer phenytoin IV push. The client has an IV of D5W0.45 normal saline at 50 milliliters per hour. Which intervention should the nurse implement? 1. Administer the phenytoin undiluted over 5 minutes via the port closest to the client. 2. Dilute the medication with normal saline and administer over 2 minutes. 3. Flush tubing with normal saline. Administer diluted phenytoin and then flush with normal saline. 4. Insert a saline lock in the other arm and administer the medication undiluted. The correct answer is 3. Flush tubing with normal saline, administer diluted phenytoin, and then flush with normal saline. Rationale: phenytoin cannot be administered with dextrose because it will cause precipitation. Phenytoin should be diluted in a saline solution, and the IV tubing should be flushed before and after administration because a dextrose solution will cause drug precipitation. There is no reason for the nurse to cause more pain to the client by starting a saline lock because the IV tubing is already in place and can be flushed before and after the administration of phenytoin. Anytime a nurse administers an IV push medication, the nurse should dilute the medication. This causes less pain for the client, helps prevent infiltration of the vein, and allows the nurse to administer the medication over the correct amount of time if it is diluted to a 10 milliliters bolus.
When teaching a client about propranolol hydrochloride, the nurse should base the information on the knowledge that propranolol, 1. blocks beta-adrenergic stimulation and thus causes decreased heart rate, myocardial contractility, and conduction. 2. increases norepinephrine secretion and thus decreases blood pressure and heart rate. 3. is a potent arterial and venous vasodilator that reduces peripheral vascular resistance and lowers blood pressure. 4. is an angiotensin-converting enzyme inhibitor that reduces blood pressure by blocking the conversion of angiotensin 1 to angiotensin 2. The correct answer is 1. Propranolol is a beta-adrenergic blocking agent. Actions of propranolol include reducing heart rate, decreasing myocardial contractility, and slowing conduction. Propranolol does not increase norepinephrine secretion, cause vasodilation, or block conversion of angiotensin 1 to angiotensin 2. Which task, related to a nasogastric tube, can be delegated to an experienced assistive personnel? 1. removing the NG tube at the prescribed time. 2. securing the tape if the patient accidentally dislodges the tube. 3. disconnecting the suction to allow ambulation to the toilet. 4. checking the suction after the patient has ambulated. The correct answer is 3. disconnecting the suction to allow ambulation to the toilet. Rationale. Disconnecting the tube from suction is an appropriate task to delegate, but the nurse must give specific instructions or verify that the AP knows how to do this task. Suction should be reconnected by the nurse so that correct pressure is checked. If the AP is permitted to reconnect the tube, the nurse is still responsible for checking that the pressure setting is correct. During removal of the tube, there is a potential for aspiration, so the nurse should perform this task. If the tube is dislodged, the nurse should recheck placement before it is secured.
The home healthcare nurse is caring for a male client diagnosed with a hiatal hernia and reflux. Which data indicates the medication therapy is effective? 1. The client takes the antacid 1 hour before and 3 hours after a meal. 2. The client reports indigestion after eating a large meal. 3. The client states that he did not wake up with heartburn during the night. 4. The client has lost 3 pounds in the past 2 weeks. The correct answer is 3. The client states that he did not wake up with heartburn during the night. Option 3 indicates an improvement in symptoms and that the medication is effective. Option 1 indicates client compliance with the dosing regimen for antacids, not that the medication is effective. The return of symptoms in Option 2 indicates the medication is not effective. In Option 4, losing weight would not indicate that a medication for hiatal hernia is effective. The nurse is assessing the client diagnosed with congestive heart failure. Which laboratory data would indicate that the client is in severe congestive heart failure? 1. An elevated B-type natriuretic peptide. 2. An elevated creatine kinase. 3. A positive D-dimer. 4. A positive ventilation perfusion scan. The correct answer is 1. An elevated B-type natriuretic peptide. BNP is a specific diagnostic test. Levels higher than normal indicate congestive heart failure, with the higher the number, the more severe the CHF. An elevated CKMB would indicate a myocardial infarction, not severe CHF. CKMB is an isoenzyme. A positive D-dimer would indicate a pulmonary embolus. A positive ventilation perfusion scan would indicate a pulmonary embolus. The parent of a 5-year-old states that the child has been having diarrhea for 24 hours, vomited twice 2 hours ago, and now claims to be thirsty. The parent asks what to offer the child because the child is refusing Pedialyte. Which is the nurse's most appropriate response? 1. You can offer clear diet soda such as Sprite and ginger ale. 2. Pedialyte is really the best thing for your child, who, if thirsty enough, will eventually drink it. 3. Pedialyte is really the best thing for your child. Allow your child some choice in the way to take it by offering small amounts in a spoon, medicine cup, or syringe. 4. It really does not matter what your child drinks as long as it is kept down. Try offering small amounts of fluids in medicine cups. The correct answer is 3. Pedialyte is really the best thing for your child. Allow your child some choice in the way to take it by offering small amounts in a spoon, medicine cup, or syringe. Pedialyte is the first choice, as recommended by the American Academy of Pediatrics. Offering the child appropriate choices may allow the child to feel empowered and less likely to refuse the Pedialyte. Small, frequent amounts are usually better tolerated. When Pedialyte is not tolerated, it is usually recommended that clear sodas and juices be diluted. Diet beverages are not recommended because the sugar is needed to help the sodium be reabsorbed. Pedialyte is the best choice. If the child is not encouraged to drink Pedialyte, the child may become severely dehydrated. Other ways to encourage oral rehydration need to be considered. Offering small amounts of liquids is important. The type of beverage does matter because many fluids may increase vomiting and diarrhea. You should eliminate answer 2 because it offers an ultimatum to a child. The child is likely to refuse the Pedialyte, worsening the state of dehydration.
The 55-year-old African-American male client presents to the emergency department with blurred vision, slurred speech, and left-sided weakness. The client has a history of hypertension and benign prostatic hypertrophy. Which statement regarding the client's medications should the nurse ask at this time? 1. Have you been taking over-the-counter herbs to treat the BPH? 2. Do you take an aspirin every day to prevent heart attacks and strokes? 3. Do you eat green, leafy vegetables frequently? 4. Have you been taking medications routinely to control the hypertension? The correct answer is 4. Have you been taking medications routinely to control the hypertension? Rationale. Many medications for hypertension have the adverse effect of causing erectile dysfunction, which many men are hesitant to discuss with their HCP, and a man may simply stop taking the medication to avoid the side effect. The nurse should assess how the client has been controlling his hypertension and ask specifically about erectile dysfunction related to hypertensive medication. Hypertension is a risk factor for developing other cardiovascular diseases, including stroke. This client has 2 risk factors for developing a stroke: hypertension and his racial background. The nurse should ask all clients about taking OTC preparations when being admitted, but this question would have no bearing on the clients presenting symptoms of a stroke. The client has symptoms of a stroke. Whether he was taking an aspirin to prevent a potential problem is irrelevant. The client has a problem at this time. Green, leafy vegetables are high in vitamin K, the antidote for Coumadin. The client has no reason to be taking an anticoagulant at this time.
The client has had hypertension for 20 years. The nurse should assess the client for 1. Renal insufficiency and failure. 2. Valvular heart disease. 3. Endocarditis. 4. Peptic ulcer disease. The correct answer is 1. Renal disease, including renal insufficiency and failure, is a complication of hypertension. Effective treatment of hypertension assists in preventing this complication. Valvular heart disease, endocarditis, and peptic ulcer disease are not complications of hypertension. The nurse is planning a treatment and prevention program for chronic bowel incontinence for an older patient. Which intervention should the nurse try first? 1. Administer a glycerin suppository 15 minutes before evacuation time. 2. Insert a rectal tube at specified intervals each day. 3. Assist the patient to the commode or toilet 30 minutes after meals. 4. Use incontinence briefs or adult-sized diapers. The correct answer is 3. Assist the patient to the commode or toilet 30 minutes after meals. Rationale. The goal of bowel training is to establish a pattern that mimics normal defecation, and many people have the urge to defecate after a meal. If this is not successful, a suppository can be used to stimulate the urge. The use of incontinence briefs is embarrassing for the patient, and they must be changed frequently to prevent skin breakdown. Routine use of rectal tubes is not recommended because of the potential for damage to the mucosa and sphincter tone.
The nurse is preparing to administer esomeprazole. Which intervention should the nurse implement? Select all that apply. 1. Order an infusion pump for the client. 2. Elevate the client's head of the bed. 3. Check the client's ID with the medication administration record. 4. Check for allergies to cephalosporin. 5. Ask the client his or her date of birth. The correct answers are 2. Elevate the client's head of the bed. 3. Check the client's ID with the medication administration record. And 5. Ask the client his or her date of birth. The head of the bed is elevated for the client to be able to swallow the medication. The nurse must check the medication administration record with the client's ID band to ensure the correct client is receiving the medication. The Joint Commission requires that 2 patient identifiers be used to determine the right patient. Most healthcare facilities use the client's name and date of birth as these identifiers. An IV pump is not needed. Esomeprazole is a PPI, not a cephalosporin. Cephalosporins are a class of antibiotics. The healthcare provider has ordered an angiotensin-converting enzyme inhibitor for the client diagnosed with congestive heart failure. Which discharge instructions should the nurse include? 1. Instruct the client to take a cough suppressant if a cough develops. 2. Teach the client how to prevent orthostatic hypotension. 3. Encourage the client to eat bananas to increase potassium level. 4. Explain the importance of taking the medication with food. The correct answer is 2. Teach the client how to prevent orthostatic hypotension. Orthostatic hypotension may occur with ACE inhibitors as a result of vasodilation. Therefore, the nurse should instruct the client to rise slowly and sit on the side of the bed until equilibrium is restored. If a cough develops, the client should notify the healthcare provider because this is an adverse reaction, and the HCP will discontinue the medication. ACE inhibitors may cause the client to retain potassium. Therefore, the client should not increase potassium intake. An ACE inhibitor should be taken 1 hour before meals or 2 hours after a meal to increase absorption of the medication. The nurse is caring for a 9-month-old with diarrhea secondary to rotavirus. The child has not vomited and is mildly dehydrated, which is likely to be included in the discharge teaching. 1. Administer loperamide as needed. 2. Administer bismuth subsalicylate as needed. 3. Continue breastfeeding per routine. 4. The infant may return to day care 24 hours after antibiotics have been started. The correct answer is 3. Continue breastfeeding per routine. Breastfeeding is usually well tolerated and helps prevent death of intestinal villi and malabsorption. Antibiotics are not effective in viruses. Children should not return to daycare while they are still having diarrhea. Loperamide slows intestinal motility and allows overgrowth of organisms and should therefore be avoided. Bismuth subsalicylate slows intestinal motility and allows overgrowth of organisms and should therefore be avoided. You can eliminate answer 4 because antibiotics are not effective with viruses such as rotavirus. Answers 1 and 2 can be eliminated because antidiarrheal agents are not recommended in the pediatric population.
The nurse in the emergency department is preparing to administer alteplase to a client whose initial symptoms of a stroke began 2 hours ago. Which interventions should the nurse implement? Select all that apply. 1. Check the client's armband for allergies. 2. Check the results of the client's CT scan of the brain. 3. Teach the client this medication dissolves clots. 4. Dilute the medication with normal saline and administer over 2 minutes. The correct answers are 1. Check the client's armband for allergies, and 2. Check the results of the client's CT scan of the brain. Rationale: the nurse should always check the client's armband prior to administering medication. There are 3 types of strokes: thrombotic, embolic, and hemorrhagic. The nurse must know that the client has not had a hemorrhagic stroke before hanging a medication that destroys clots. Administering alteplase, a thrombolytic medication, to a client who has had a hemorrhagic stroke can result in the client's death. Teaching the client can be done after the medication has been administered. Patient teaching is generally secondary to the immediate, life-saving administration of this time-critical drug. Informed consent is necessary, but detailed teaching can wait until the drug is safely infusing or later, and the patient may be too acutely ill or neurologically impaired to fully grasp the information at the moment of administration.
The nurse is developing a care plan with an older adult with hypertension and is instructing the client that hypertension can be a silent killer. The nurse should instruct the client to report signs of which of the following diseases that are often a result of undetected high blood pressure. 1. Cerebrovascular accidents. 2. Liver disease. 3. Myocardial infarction. 4. Pulmonary disease. The correct answer is 1. Hypertension is referred to as a silent killer for adults because until the adult has significant damage to other systems, the hypertension may go undetected. CVAs can be related to long-term hypertension. Liver or pulmonary disease is not generally associated with hypertension. Myocardial infarction is generally related to coronary artery disease. In which case would fecal microbiota transplantation be considered for a patient with Clostridium difficile infection, CDI? 1. Patient has had multiple recurrences of CDI treated with vancomycin or fidaxomicin. 2. Patient has CDI and a healthy donor who meets the criteria for donation is available. 3. Patient has had a recurrence of CDI after receiving a full course of metronidazole. 4. Patient has many risk factors for CDI and has poor nutritional and fluid reserves. The correct answer is 1. Patient has had multiple recurrences of CDI treated with vancomycin or fidaxomicin. Rationale: FMT is considered after the failure of medication therapy and after multiple recurrences. Vancomycin or fidaxomicin is the first-line therapy. Rifaximin is an adjunctive post-vancomycin treatment regimen for patients with recurrent CDI. Previously, metronidazole was considered a first-line treatment. However, it is now used only when vancomycin or fidaxomicin are not an option for the patient.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. The nurse is discharging a client diagnosed with gastroesophageal reflux disease. Which information should the nurse include in the teaching? 1. There are no complications of gastroesophageal reflux disease as long as you take the medications. 2. Notify the HCP if the medication does not resolve the symptoms. 3. Immediately after a meal, lie down for at least 45 minutes. 4. If any discomfort is noted, take an NSAID for the pain. The correct answer is 2. Notify the HCP if the medication does not resolve the symptoms. There may be several complications of gastroesophageal reflux disease. Adult-onset asthma and Barrett's esophagus leading to cancer of the esophagus are 2 complications of gastroesophageal reflux disease. The chance of developing these problems is less if the GERD is adequately treated, but there are no guarantees. The client should be instructed to sit upright for at least 60 minutes following a meal to prevent reflux from occurring. NSAIDs can increase gastric distress. Ulcers caused by NSAIDs use may be asymptomatic, or the symptoms may be attributed to the GERD. The client should use the prescribed H2 receptor blocker, PPI, or an antacid to relieve the discomfort associated with gastroesophageal reflux disease. The nurse on the telemetry unit has just received the AM shift report. Which client should the nurse assess first? 1. The client diagnosed with myocardial infarction who has an audible S3 heart sound. 2. The client diagnosed with congestive heart failure who has 4+ sacral pitting edema. 3. The client diagnosed with pneumonia who has a pulse oximeter reading of 94%. 4. The client with chronic renal failure who has an elevated creatinine level. The correct answer is 1. The client diagnosed with myocardial infarction who has an audible S3 heart sound. An S3 heart sound indicates left ventricular failure, and the nurse must assess this client first because it is an emergency situation. The nurse would expect a client with CHF to have sacral edema of 4+. The client with an S3 would be in a more life-threatening situation. A pulse oximeter reading of greater than 93% is considered normal. An elevated creatinine level is expected in a client diagnosed with chronic renal failure. Which child can be discharged without further evaluation? 1. A 2-year-old who has had 24 hours of watery diarrhea that has changed to bloody diarrhea in the past 12 hours. 2. A 3-year-old who had a relapse of one diarrhea episode after restarting a normal diet. 3. A 6-year-old who has been having vomiting and diarrhea for 2 days and has decreased urine output. 4. A 10-year-old who has just returned from a scout camping trip and has had several episodes of diarrhea. The correct answer is 2. A 3-year-old who had a relapse of one diarrhea episode after restarting a normal diet. It is common for children to have a relapse of diarrhea after resuming a regular diet. Diarrhea containing blood needs further evaluation to determine the source of the blood, and the child's blood counts and electrolyte balance need to be tested. Children who have had vomiting and diarrhea for more than 2 days require evaluation to determine whether IV rehydration and hospital admission are necessary. Diarrhea following a camping trip needs further evaluation because it may be caused by bacteria or parasites. You should eliminate answers 1 and 3 because they describe children who may have altered electrolytes and blood counts due to prolonged diarrhea.
The long-term care facility nurse is caring for a client diagnosed with a cerebrovascular accident 6 months ago who has residual cognitive deficits. The HCP has ordered alprazolam to be administered at bedtime. Which interventions should the nurse initiate for this client? Select all that apply. 1. Offer toileting every 2 hours. 2. Move the client close to the nurse's station. 3. Administer the medication at 2100. 4. Administer the medication with a full glass of water. 5. Do not administer if the client's apical pulse is less than 60 beats per minute. The correct answers are 1. Offer toileting every 2 hours. 2. Move the client close to the nurse's station. And 3. Administer the medication at 2100. Rationale: alprazolam, an anti-anxiety medication, has a side effect of drowsiness, which is why the HCP chose this medication for the client, to help the client rest at night. The client has cognitive deficits and should be on fall precautions. So it is hoped that assisting the client to the bathroom every 2 hours will prevent the client from falling while trying to get to the bathroom. The client at risk for falling should be as near the nursing station as possible. This allows the staff to keep a closer watch on the client. The medication is ordered for bedtime, usually 2100 in most healthcare facilities. Giving the medication with a full glass of water would increase the client's need to get up during the night to use the bathroom, increasing the risk of falling. This medication does not require the apical pulse being monitored prior to administering the medication.
A hospitalized client who is being treated for hypertension with furosemide, atenolol, and ramipril develops a second-degree heart block Mobitz type 1. Which of the following actions should the nurse take? 1. Administer a 250 milliliters fluid bolus. 2. Withhold atenolol. 3. Prepare for cardioversion. 4. Set up for an arterial line. The correct answer is 2. The client may be asymptomatic and the underlying cause should be assessed. Drugs that block the AV node should be avoided, such as beta blockers, calcium channel blockers, digoxin, and amiodarone. Symptomatic clients are treated with atropine and transcutaneous pacing. There is no indication for a fluid bolus, cardioversion, or arterial line. The charge nurse is reviewing the medication administration records for several patients. Which situation needs to be brought to the attention of the prescribing healthcare provider? 1. A patient with gastroesophageal reflux disease is receiving omeprazole. 2. An older adult patient with constipation is getting psyllium 3 times a day. 3. A patient who needs a bowel prep is getting a polyethylene glycol electrolyte solution. 4. A patient with abdominal pain secondary to diverticulitis is receiving bisacodyl. The correct answer is 4. A patient with abdominal pain secondary to diverticulitis is receiving bisacodyl. Rationale: bisacodyl is a laxative and laxatives should not be administered to patients with undiagnosed abdominal pain, cramps, or nausea. Appendicitis, diverticulitis, ulcerative colitis, acute surgical abdomens, and bowel obstruction are also contraindications for laxative use. The other patients are receiving medications that are appropriate for their conditions. Omeprazole is a proton pump inhibitor that reduces stomach acid and relieves heartburn. Psyllium is a bulk-forming laxative that is used to treat constipation. The medication needs to be taken with a full glass of water. Polyethylene glycoelectrolyte solution is a laxative solution that is prescribed to prepare the colon for procedures, such as a colonoscopy.
The nurse is discharging a client 2 days post-operative hiatal hernia repair. Which discharge instructions should the nurse include? Select all that apply. 1. Take all of the prescribed antibiotic. 2. Eat 6 small meals per day. 3. Use the legs to bend down, not the back. 4. Take esomeprazole twice a day. 5. Use the pain medication when the pain is at 8 through 10. The correct answers are 1. Take all of the prescribed antibiotic. 2. Eat 6 small meals per day. And 3. Use the legs to bend down, not the back. Prophylactic antibiotics are frequently prescribed both pre-surgery and post-surgery. The client should be instructed to take all the medication as directed. Hiatal hernia repair may not last, and the client should continue the recommended lifestyle modifications, such as eating small meals. Part of the lifestyle modifications for hiatal hernia is to limit pressure on the abdominal cavity, especially after a meal. Using the leg muscles to bend down, rather than bending over, should be taught to the client. Esomeprazole is administered daily, not twice a day. For the best relief, pain medication should be taken at the onset of the pain. The client should not wait until the pain is an 8 to 10 before taking the pain medication. The nurse and an unlicensed assistive personnel are caring for 4 clients on a telemetry unit. Which nursing task would be best for the nurse to delegate to the UAP? 1. Assist the client to go down to the smoking area for a cigarette. 2. Transport the client to the intensive care unit via a stretcher. 3. Provide the client going home discharge teaching instructions. 4. Help position the client who is having a portable X-ray done. The correct answer is 4. Help position the client who is having a portable X-ray done. The UAP can assist the X-ray technician in positioning the client for the portable X-ray. This does not require clinical judgment. Allowing the UAP to take a client down to smoke is not supportive of the medical treatment regimen that discourages smoking. The client going to the ICU would be unstable, and the nurse should not delegate to a UAP any nursing task that involves an unstable client. The nurse cannot delegate teaching. You must be knowledgeable about the individual state's Nurse Practice Act regarding what a nurse may delegate to unlicensed assistive personnel. Generally, the answer options that require a higher level of knowledge or ability are reserved for licensed staff. The nurse receives a call from the parent of a 10-month-old who has vomited 3 times in the past 8 hours. The parent describes the baby as playful and wanting to drink. The parent asks the nurse what to give the child. Select the nurse's best response. 1. Replace the next feeding with regular water and see if that is better tolerated. 2. Do not allow your baby to eat any solids. Give half the normal formula feeding and see if that is better tolerated. 3. Do not let your baby eat or drink anything for 24 hours to give the stomach a chance to rest. 4. Give your child 0.5 ounce of Pedialyte every 10 minutes. If vomiting continues, wait an hour and then repeat what you previously gave. The correct answer is 4. Give your child 0.5 ounce of Pedialyte every 10 minutes. If vomiting continues, wait an hour and then repeat what you previously gave. Offering small amounts of clear liquids is usually well tolerated. If the child vomits, make them NPO for an hour to allow the stomach to rest and then restart fluids. The child in this scenario is described as playful and therefore does not appear to be at risk for dehydration. Free water should not be given because it does not contain any electrolytes and can lead to critical electrolyte imbalances. Formula should be avoided, and clear liquids such as Pedialyte should be offered. 24 hours is too long for the infant to remain NPO. The infant needs to drink a rehydration solution, such as Pedialyte, in order to avoid severe dehydration. You should eliminate answers 1 and 3 because they could cause harm to the infant.
The client diagnosed with a stroke has been prescribed phenytoin. Which statement explains the scientific rationale for prescribing this medication? 1. The client's stroke was caused by some damage to cerebral tissue. 2. The stroke caused damage to the brain tissue that could result in seizures. 3. Hemorrhagic strokes leave residual blood in the brain that causes seizures. 4. This medication can help the client with cognitive deficits think more clearly. The correct answer is 2. The stroke caused damage to the brain tissue that could result in seizures. Rationale: stroke caused loss of function in areas of the brain leads to a problem with nerve impulse transmission. This blocked transmission can initiate a seizure. Phenytoin is an anticonvulsant. Strokes cause damage to the cerebral tissue. The brain does not cause the damage to itself. If the client survives a hemorrhagic stroke, the body will reabsorb the blood. There should not be any residual blood. Anticonvulsants do not increase cognitive ability.
What question is a home health nurse most likely to ask the patient to evaluate the efficacy of cimetidine? 1. Are you still having problems with constipation? 2. Has the medication helped to relieve the acid indigestion? 3. Did the medication relieve the nausea and vomiting? 4. Do you feel like your appetite has improved? The correct answer is 2. Has the medication helped to relieve the acid indigestion? Rationale: cimetidine is available over the counter and is used to relieve heartburn, acid indigestion, and sour stomach.
The adult client recently has been diagnosed with asthma. Which medication is recommended to treat this problem? 1. Omeprazole daily. 2. Amoxicillin twice daily. 3. Loratadine daily. 4. Prednisone daily. The correct answer is 1. Omeprazole daily. Omeprazole is a PPI. Up to 90% of adult-onset asthma is the result of gastroesophageal reflux disease. Treating gastric reflux will treat asthma. Amoxicillin is a penicillin-derived antibiotic. The client is diagnosed with asthma, not an infection. There is no reason to administer an antibiotic. Loratadine is an antihistamine. Antihistamines such as Claritin are used to treat allergic reactions to pollens, dust, or other irritating substances. They are not effective against asthma. Prednisone is a glucocorticoid. Glucocorticoids are prescribed daily for clients with chronic lung diseases, such as emphysema or chronic bronchitis. A client with asthma would not be prescribed a daily steroid. The charge nurse is doing shift assignments for the medical floor. Which client should be assigned to the most experienced nurse? 1. The client diagnosed with congestive heart failure who is being discharged in the morning. 2. The client who is having frequent incontinent liquid bowel movements and vomiting. 3. The client with an apical pulse rate of 116, a respiratory rate of 26, and a blood pressure of 94/62. 4. The client who is complaining of chest pain with inspiration and a non-productive cough. The correct answer is 3. The client with an apical pulse rate of 116, a respiratory rate of 26, and a blood pressure of 94/62. The client in option 3 is exhibiting signs and symptoms of shock, which makes this client the most unstable. An experienced nurse should care for this client. The client in option 1 is stable because discharge is scheduled for the following day. Therefore, this client does not need to be assigned to the most experienced nurse. The client in option 2 is more in need of custodial nursing care than care from the most experienced nurse. Therefore, the charge nurse could assign a less experienced nurse to this client. The complaints in option 4 usually indicate muscular or pleuritic chest pain. Cardiac chest pain does not fluctuate with inspiration. This client does not require the care of an experienced nurse as much as does the client with signs of shock. The parents of a 4-year-old ask the nurse how to manage their child's constipation. Select the nurse's best response. 1. Add 2 ounces of apple or pear juice to the child's diet. 2. Be sure your child eats a lot of fresh fruits, such as apples and bananas. 3. Encourage your child to drink more fluids. 4. Decrease bulky foods, such as whole grain breads and brown rice. The correct answer is 3. Encourage your child to drink more fluids. Increasing fluid consumption helps to decrease the hardness of the stool. Whole grain bread and brown rice are high in fiber and help decrease constipation. 2 ounces of apple juice is most likely not a sufficient quantity to alter a 4-year-old child's bowel movements. Although fresh fruits help decrease constipation, option 3 is the better answer choice than option 2. Answer 1 decreases constipation in an infant, but not in a preschooler.
The 44-year-old female client presents to the emergency department diagnosed with a stroke. Which of the client's current medication regimen is a risk factor for developing a stroke? 1. Propranolol. 2. Furosemide. 3. Estradiol/norgestimate. 4. Metformin. The correct answer is 3. Estradiol/norgestimate. Rationale: propranolol, a beta blocker, is administered for cardiac dysrhythmias and hypertension and for migraine headache prophylaxis. The medication could help prevent a stroke by lowering the blood pressure. Furosemide is a loop diuretic. Loop diuretics have an indirect ability to lower the blood pressure by decreasing the volume of fluid in the body. This would decrease the risk of a stroke. Estradiol/norgestimate is a combination hormone used to prevent conception. Combination oral contraceptives have been associated with venous and arterial thromboembolism, pulmonary embolism, myocardial infarction, and thrombotic stroke. Adverse reaction to metformin glucophage, a biguanide, is lactic acid buildup, not stroke.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
The nurse is caring for an obese postoperative patient who underwent surgery for bowel resection. As the patient is moving in bed, he comments, "Something popped open." Upon examination, the nurse notes wound evisceration. Place the steps in order for handling this complication. 1. Cover the intestine with sterile moistened gauze. 2. Stay calm and stay with the patient. 3. Check the vital signs, especially blood pressure and pulse. 4. Ask assistive personnel to get sterile supplies. 5. Put the patient into a semi-fowler position with knees slightly flexed. 6. Prepare the patient for surgery as ordered. 7. Ask the charge nurse to call the surgeon. The correct order is 2. Stay calm and stay with the patient. 5. Put the patient into semi-fowler position with knees slightly flexed. 3. Check the vital signs, especially blood pressure and pulse. 7. Ask charge nurse to call the surgeon. 4. Ask assistive personnel to get sterile supplies. 1. Cover the intestine with sterile moistened gauze. And 6. Prepare the patient for surgery as ordered. Rationale: stay calm and stay with the patient. Any increase in intra-abdominal pressure will worsen the evisceration. Placement of the patient in a semi-fowler position with knees flexed will decrease the strain on the site. Continuously monitor vital signs while the charge nurse notifies the surgeon. An AP can obtain sterile supplies. Covering the site protects the tissue. Ultimately, the patient will need emergency surgery.
The client diagnosed with ulcerative colitis is prescribed mesalamine. Which information should the nurse discuss with the client? 1. Explain to the client that undissolved tablets may be expelled in stool. 2. Discuss the importance of taking the medication on an empty stomach only. 3. Tell the client to avoid drinking any type of carbonated beverages. 4. Instruct the client not to crush, break, or chew the tablets or capsules. The correct answer is 4. Instruct the client not to crush, break, or chew the tablets or capsules. Mesalamine is an aspirin derivative. The tablets must be swallowed whole because they are specially formulated to release the medication after it has passed through the stomach. The client should notify the HCP if undissolved tablets or capsules are found in the stool because this is not expected. This medication can be taken with or without food. Food does not affect the effectiveness of the medication. There are no restrictions on foods, beverages, or activities when taking this medication unless the HCP directs otherwise. The client diagnosed with congestive heart failure is complaining of leg cramps at night. Which nursing interventions should be implemented? 1. Check the client for peripheral edema and make sure the client takes a diuretic early in the day. 2. Monitor the client's potassium level and assess the client's intake of bananas and orange juice. 3. Determine if the client has gained weight and instruct the client to keep the legs elevated. 4. Instruct the client to ambulate frequently and perform calf muscle stretching exercises daily. The correct answer is 2. Monitor the client's potassium level and assess the client's intake of bananas and orange juice. The most probable cause of the leg cramping is potassium excretion as a result of diuretic medication. Bananas and orange juice are foods that are high in potassium. The client with peripheral edema will experience calf tightness but would not have leg cramping, which is the result of low potassium levels. The timing of the diuretic will not change the side effect of leg cramping resulting from low potassium levels. Weight gain is monitored in clients with CHF, and elevating the legs would decrease peripheral edema by increasing the rate of return to the central circulation, but these interventions would not help with leg cramps. Ambulating frequently and performing leg stretching exercises will not be effective in alleviating leg cramps. A child is diagnosed with chronic constipation that has been unresponsive to dietary and activity changes. Which pharmacological measure is most appropriate? 1. Natural supplements and herbs. 2. Stimulant laxative. 3. Osmotic agent. 4. Pharmacological measures are not used in pediatric constipation. The correct answer is 3. Osmotic agent. A stool softener is the drug of choice because it will lead to easier evacuation. Natural supplements and herbs are not recommended because the safety and efficacy are not standardized. A stimulant laxative is not the drug of choice because it may increase abdominal discomfort and may lead to dependency. Although diet and activity modification are tried first, medications are sometimes needed. You should eliminate answer 4 because it implies that medications are never given to the constipated child. In healthcare, there are very few cases of never and always.
The client diagnosed with chronic hypertension is prescribed furosemide and enalapril. The client's blood pressures for the last 3 weeks have averaged 178/95, and the HCP has added atenolol to the client's current medication regimen. Which statement is the scientific rationale for including this medication in the client's regimen? 1. Achieving a lower average blood pressure will help to prevent a stroke. 2. The other medications are not effective without the addition of atenolol. 3. The atenolol will potentiate the effects of loop diuretics. 4. The HCP will taper off the enalapril and eventually discontinue it. The correct answer is 1. Achieving a lower average blood pressure will help to prevent a stroke. Rationale. Hypertension is a risk factor for developing a stroke. Some clients require multiple medications to control their hypertension. If option 2 was true, then atenolol would be the only medication the client needs. Beta blockers are frequently used in combination with other antihypertensive medications to control a client's blood pressure. Atenolol, a beta blocker, does not potentiate the effectiveness of loop diuretics. Beta blockers, not ACE inhibitors, enalapril, must be tapered off when discontinuing them to prevent rebound cardiac dysrhythmias. The HCP is adding the beta blocker to the current medications.
A nurse in a clinic is caring for clients in a variety of age groups. Which age group should the nurse anticipate will have the highest potential to demonstrate regression when ill? 1. Infants. 2. Toddlers. 3. Adolescents. 4. Young adults. The correct answer is 2. Toddlers. Rationale. Toddlers are less able to understand and interpret what is happening to them when ill. Therefore, they commonly regress to a previous level of development in an attempt to reduce anxiety. Infants already demonstrate behavior on the most basic level. Adolescents generally want to behave in an adult manner and therefore demonstrate a controlled behavioral response to illness. Although some young adults may regress to an earlier level of development as a coping strategy, regression commonly is not used as a defense mechanism when coping with illness. The nurse is providing postoperative care for a patient who underwent laparoscopic cholecystectomy. What should be reported immediately to the healthcare provider? 1. The patient cannot void 5 hours postoperatively. 2. The patient reports shoulder pain. 3. The patient reports right upper quadrant pain. 4. Output does not equal input for the first few hours. The correct answer is 3. The patient reports right upper quadrant pain. Rationale. Right upper quadrant pain is a sign of hemorrhage or bile leakage. The ability to void should return within 6 hours post-operatively. Right shoulder pain is related to unabsorbed carbon dioxide and will be resolved by placing the patient in a Sims position. For the first several hours after surgery, output is not expected to equal input.
The client diagnosed with inflammatory bowel disease is prescribed sulfasalazine. Which intervention should the nurse implement when administering this medication? 1. Ensure the client drinks at least 2,000 milliliters of water daily. 2. Administer the medication once a day with breakfast. 3. Explain that the medication may cause slight bruising. 4. Assess the client's stool for steatorrhea and mucus. The correct answer is 1. Ensure the client drinks at least 2,000 milliliters of water daily. Sulfasalazine is a sulfonamide antibiotic. Increasing fluid intake dilutes the drug, which helps to prevent crystalluria from occurring. The medication is administered every 6 to 8 hours, not once a day. Instruct the client to report any bruising or bleeding because it could be a sign of a drug-induced blood disorder. This medication will not cause fat, frothy stools. Therefore, the nurse does not need to assess the stool. The nurse has written an outcome goal, demonstrates tolerance for increased activity for a client diagnosed with congestive heart failure. Which intervention should the nurse implement to assist the client to achieve this outcome? 1. Measure intake and output. 2. Provide 2 grams sodium diet. 3. Weigh client daily. 4. Plan for frequent rest periods. The correct answer is 4. Plan for frequent rest periods. Scheduling activities and rest periods allows the client to participate in his or her own care and addresses the desired outcome. Measuring the intake and output is an appropriate intervention to implement for a client with CHF, but it does not address getting the client to tolerate activity. Dietary sodium is restricted in clients with CHF, but this is an intervention for decreasing fluid volume, not for increasing tolerance for activity. Daily weighing monitors fluid volume status, not activity tolerance. With questions involving nursing diagnoses or goals and outcomes, you should realize that all activities referred to in the answer options may be appropriate for the disease, but may not be specific for the desired outcome. Which instructions for a child diagnosed with encopresis should the nurse question? Select all that apply. 1. Limit the intake of milk. 2. Offer a diet high in protein. 3. Obtain a complete dietary log. 4. Follow up with a child psychologist. 5. After dinner, have the child sit on the toilet for 10 minutes. The correct answers are 2. Offer a diet high in protein, and 4. Follow up with a child psychologist. A diet high in protein will cause more constipation. The child and family would not be encouraged initially to seek counseling unless a psychological component to the encopresis had been identified. Dairy products are limited because they can lead to constipation. A complete dietary log should be kept to correlate the foods that lead to constipation. Children with constipation/encopresis are advised to sit on the toilet for 10 minutes after dinner to take advantage of the gastrocolic reflex.
The elderly client diagnosed with a stroke is being discharged. When preparing the discharge instructions, the nurse notes many medications that are ordered to be taken at different times of the day. Which intervention should the nurse implement first? 1. Complete a comprehensive chart for the client to use. 2. Refer the client to a home healthcare agency for follow-up. 3. Teach the client to return to the HCP office for follow-up. 4. Discuss the multiple medications and times with the HCP. The correct answer is 4. Discuss the multiple medications and times with the HCP. Rationale. The client has had a stroke and may have difficulty complying with multiple medications and different administration times. Research indicates that the fewer medication administration times during the day, the better the compliance with taking the medication as ordered. The nurse should discuss simplifying the medication regimen with the HCP. Option 1 could be done if the nurse and HCP cannot simplify the medication routine. Option 2 need to be done based on the nurse's evaluation of the client's situation, but it is not the first intervention. Option 3 should be done, but it is not the first intervention and does not address the problem of many medications and multiple administration times.
When the nurse assesses an adult client, which client behavior may indicate an unresolved developmental task of infancy? 1. Avoiding assistance from others. 2. Rationalizing unacceptable behaviors. 3. Being overly concerned about cleanliness. 4. Apologizing constantly for small mistakes. The correct answer is 1. Avoiding assistance from others. Rationale. People who avoid help from others and who would rather do things themselves generally have not completely resolved the developmental task of trust versus mistrust during infancy. Rationalizing unacceptable behaviors is a defense mechanism, not an indication of an unresolved developmental task of infancy. Rationalization is used to justify in some socially acceptable way ideas, feelings, or behavior through explanations that appear to be logical. Option 3 relates more to the anal stage of Freud's psychosexual theory of development. Freud believed that when toilet training is approached in a rigid and demanding manner, a child develops into an adult who is overly concerned with orderliness and cleanliness. Option 4 indicate an unresolved conflict of autonomy versus shame and doubt associated with the 18-month to 3-year-old age group. One of the developmental tasks of this age group is learning right from wrong. When parents are overly critical and controlling, a child may be overly self-judgmental and become an adult who feels the need to apologize for small mistakes constantly. An older adult patient tells the home health nurse that he puts 17 grams of polyethylene glycol in a large cup of coffee every morning. Which assessment will the nurse perform first? 1. Assess for signs and symptoms of dehydration or electrolyte imbalances. 2. Assess for signs and symptoms of malnutrition and nutritional deficiencies. 3. Ask the patient to describe frequency and consistency of bowel movements. 4. Ask the patient what he understands about the purpose of the medication. The correct answer is 3. Ask the patient to describe frequency and consistency of bowel movements. Rationale. The patient is taking the recommended dose of polyethylene glycol. Polyethylene glycol is used for the treatment of chronic constipation, so the nurse would assess the effect that the medication is having on bowel movements. Older adult patients generally have a greater risk for dehydration, fluid and electrolyte imbalances, and nutritional deficiencies, so these would be included in routine assessment. Reviewing understanding of medications is always a good idea if the nurse has time.
The client diagnosed with severe ulcerative colitis is prescribed azathioprine. Which assessment data concerning the medication warrants immediate intervention by the nurse? 1. Reports of a sore throat, fever, and chills. 2. Reports of 10 to 20 loose stools a day. 3. Reports of abdominal pain and tenderness. 4. Reports of dry mouth and oral mucosa. The correct answer is 1. Reports of a sore throat, fever, and chills. Azathioprine is an immunosuppressant and can cause a decrease in the number of blood cells in the bone marrow. Signs or symptoms that would warrant intervention by the nurse include sore throat, fever, chills, unusual bleeding or bruising, pale skin, headache, confusion, tachycardia, insomnia, and shortness of breath. 10 to 20 loose, watery stools a day are characteristic of an acute exacerbation of ulcerative colitis and would not warrant intervention by the nurse secondary to the medication. Abdominal pain and tenderness are characteristic of an acute exacerbation of ulcerative colitis and would not warrant intervention by the nurse secondary to the medication. Dehydration may occur with ulcerative colitis, but it does not warrant intervention by the nurse secondary to the medication. Which cardiac enzyme would the nurse expect to elevate first in a client diagnosed with a myocardial infarction? 1. Creatine kinase. 2. Lactate dehydrogenase. 3. Troponin. 4. White blood cells. The correct answer is 3. Troponin. Troponin is the enzyme that elevates within 1 to 2 hours. CPKMB elevates in 12 to 24 hours. LDH elevates in 24 to 36 hours. White blood cells elevate as a result of necrotic tissue, but this is not a cardiac enzyme. You should be aware of the words cardiac enzyme, which would eliminate option 4 as a possible answer. The word in the stem is first. This question requires you to have knowledge of laboratory values. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. The nurse is caring for an infant diagnosed with Hirschsprung disease. The mother states she is pregnant with a boy and wants to know if her new baby will likely have the disorder. Which is the nurse's best response? 1. Genetics play a small role in Hirschsprung disease, so there is a chance the baby will develop it as well. 2. There is no evidence to support a genetic link, so it is very unlikely the baby will also have it. 3. It is rarely seen in boys, so it is not likely your new baby will have Hirschsprung disease. 4. Hirschsprung disease is seen only in girls, so your new baby will not be at risk. The correct answer is 1. Genetics play a small role in Hirschsprung disease, so there is a chance the baby will develop it as well. There is a genetic component to Hirschsprung disease, so any future siblings are also at risk. Hirschsprung disease is seen in both males and females, but is more common in males. You can eliminate answers 3 and 4 because they are similar and therefore would not likely be the correct answer.
The nurse is caring for a client diagnosed with a hemorrhagic stroke. Which medication should the nurse question administering? 1. Clopidogrel, 2. Mannitol, 3. Nifedipine, 4. Dexamethasone. The correct answer is 1. Clopidogrel. Rationale: the client has experienced a bleed into the cranium. Clopidogrel, an antiplatelet, interferes with the client's clotting ability. This medication should be held and discussed with the HCP. There is no reason to question giving a medication that will decrease intracranial pressure. Mannitol is the diuretic of choice for this client. It is an osmotic diuretic, which has the best effect on the cranial tissues. Nifedipine is a calcium channel blocker that will decrease the client's blood pressure, which is elevated in clients with increased intracranial pressure. Dexamethasone, a glucocorticoid, will decrease edema, resulting in decreased intracranial pressure.
A 70-year-old client tells the nurse about experiencing problems with sleep and requests sleeping medication. Which concept associated with drug therapy and quality of sleep is important for the nurse to explain when providing nursing care for this client? 1. Sedatives are not well tolerated by older adults. 2. Anti-anxiety drugs are the least helpful to support sleep. 3. Effectiveness of hypnotics increases with prolonged use. 4. Melatonin is a drug of choice for long-term use in sleep disorders. The correct answer is 1. Sedatives are not well tolerated by older adults. Rationale: sedatives are not well tolerated by older adults because a decrease in the metabolism and excretion of the drug can result in toxicity. In addition, older adults may experience idiosyncratic effects. Anti-anxiety drugs depress the central nervous system and therefore are helpful in supporting sleep. The effectiveness of hypnotics decreases, not increases, with prolonged use. They should be used only as a short-term intervention because tolerance and rebound insomnia occur in approximately 4 weeks. Although melatonin demonstrates promise as a drug to support sleep, it is not the drug of choice because its safety and efficacy for long-term use are not yet established. In the care of a patient with acute viral hepatitis, which task would be delegated to assistive personnel? 1. Emptying the bedpan while wearing gloves. 2. Engaging the patient in diversional activities. 3. Monitoring dietary preferences. 4. Reporting signs and symptoms of jaundice. The correct answer is 1. Emptying the bedpan while wearing gloves. Rationale: the AP should use infection control precautions for the protection of self, employees, and other patients. Monitoring is a nurse responsibility. APs can report valuable information. However, they are not responsible for detecting signs and symptoms that can be subtle or hard to detect, such as skin changes. Engaging patients in diversional activities is the ideal. However, it is rarely possible on a busy medical surgical unit.
The client diagnosed with a severe acute exacerbation of Crohn's disease is prescribed total parenteral nutrition, TPN. Which interventions should the nurse implement when administering TPN? Select all that apply. 1. Monitor the client's glucose level every 6 hours. 2. Administer the TPN on an IV pump. 3. Assess the peripheral IV site every 4 hours. 4. Check the TPN according to the 6 rights prior to administering. 5. Encourage the client to eat all of the food offered at meals. The correct answers are 1. Monitor the client's glucose level every 6 hours, 2. Administer the TPN on an IV pump, and 4. Check the TPN according to the 6 rights prior to administering. TPN is 50% dextrose. Therefore, the client's blood glucose level should be checked every 6 hours. Sliding scale regular insulin coverage is usually ordered. TPN should always be administered using an IV pump and not via gravity. Fluid volume resulting from an overload of TPN could cause a life-threatening hyperglycemic crisis. TPN must be administered via a subclavian line because a peripheral line will collapse as a result of the hyperosmolarity of the TPN and phlebitis may occur. The client with severe acute exacerbation of Crohn's is NPO to rest the bowel. When on TPN, the client is usually NPO because the TPN provides all necessary nutrients. Therefore, the nurse would not encourage the client to eat food. Along with persistent crushing chest pain, which signs/symptoms would make the nurse think that the client is experiencing a myocardial infarction. 1. Mid-epigastric pain and pyrosis. 2. Diaphoresis and cool clammy skin. 3. Intermittent claudication and pallor. 4. Jugular vein distension and dependent edema. The correct answer is 2. Diaphoresis and cool clammy skin. Diaphoresis is a systemic reaction to the MI. The body vasoconstricts to shunt blood from the periphery to the trunk of the body. This, in turn, leads to cold, clammy skin. Mid-epigastric pain would support a diagnosis of peptic ulcer disease. Pyrosis is belching. Intermittent claudication is leg pain secondary to decreased oxygen to the muscle, and pallor is paleness of the skin as a result of decreased blood supply. Neither is an early sign of MI. Jugular vein distension and dependent edema are symptoms of congestive heart failure, not of MI. The nurse is caring for an infant newly diagnosed with Hirschsprung disease. What does the nurse understand about this infant's condition? Select all that apply. 1. There is a lack of peristalsis in the large intestine and an accumulation of bowel contents, leading to abdominal distension. 2. There is excessive peristalsis throughout the intestine, resulting in abdominal distension. 3. There is a small bowel obstruction, leading to ribbon-like stools. 4. There is inflammation throughout the large intestine, leading to accumulation of intestinal contents and abdominal distension. 5. There is an accumulation of bowel contents, leading to non-passage of stools. The correct answers are 1. There is a lack of peristalsis in the large intestine and an accumulation of bowel contents, leading to abdominal distension, and 5. There is an accumulation of bowel contents, leading to non-passage of stools. In Hirschsprung disease, a portion of the large intestine has an area lacking in ganglion cells. This results in a lack of peristalsis, as well as an accumulation of bowel contents and abdominal distension. There is accumulation of stool above the aganglionic bowel, which does not allow stool to pass through. There is a lack of peristalsis at the aganglionic section of the bowel. Hirschsprung disease does not include a small bowel obstruction. Hirschsprung disease does not present with inflammation throughout the large intestine.
The nurse is preparing to administer an oral medication to a client diagnosed with a stroke. Which intervention should the nurse implement? Select all that apply. 1. Crush all oral medications and place them in pudding. 2. Elevate the head 30 degrees. 3. Ask the client to swallow a drink of water. 4. Have suction equipment at the bedside. 5. Insert a nasogastric tube to administer medications. The correct answers are 1. Crush all oral medications and place them in pudding, and 3. Ask the client to swallow a drink of water. Rationale. Some medications can be crushed and administered in pudding if the client has difficulty swallowing, but the nurse needs to be aware that enteric-coated or time-release medications should not be crushed. The client's ability to swallow must be assessed before attempting to administer any oral medication. Water is the best fluid to use because it will not damage the lungs if aspirated. The head of the bed should be elevated to 90 degrees when the client is swallowing food or medications. Equipment is usually charged to the client. The nurse should first determine if suction equipment is needed prior to setting it up. The client's medications are being administered orally. Therefore, the nurse should not insert a nasogastric tube.
Which concept is reflective of Erik Erikson's theory of personality development? 1. Defense mechanisms help people to cope with anxiety. 2. Moral maturity is a central theme in all stages of development. 3. Achievement of developmental goals is affected by the social environment. 4. 2 continual processes, assimilation and accommodation, stimulate intellectual growth. The correct answer is 3. Achievement of developmental goals is affected by the social environment. Rationale. Erik Erikson expanded on Freud's theory of personality development by giving equal emphasis to the influence of a person's social and cultural environment. He stressed that psychosocial development depends on an interactive process between the physical and emotional variables during a person's life at 8 distinct stages. Each stage requires resolution of a developmental conflict that has opposite outcomes, and that requires interaction within the self and with others in the environment. Sigmund Freud, not Erik Erikson, identified that defense mechanisms are used to reduce anxiety by preventing conscious awareness of threatening thoughts or feelings. Lawrence Kohlberg, not Erik Erikson, established a framework for understanding the development of moral maturity, which is the ability to recognize independently what is right and what is wrong. Assimilation and accommodation of new information necessary to stimulate intellectual growth comprise a concept basic to Jean Piaget's theory of cognitive development, not Erikson's theory of personality development. Assimilation involves the process of organizing new information into one's present body of knowledge, and accommodation involves rearranging and restructuring thought processes to deal with the imbalance caused by new information and thereby increase understanding. The nurse is caring for a patient with cirrhosis and portal hypertension. Which statement by the patient is cause for greatest concern? 1. I'm very constipated and have been straining during bowel movements. 2. I can't button my pants anymore because my belly is so swollen. 3. I have a tight sensation in my lower legs when I forget to put my feet up. 4. When I sleep, I have to sit in a recliner so that I can breathe more easily. The correct answer is 1. I'm very constipated and have been straining during bowel movements. Rationale. Portal hypertension increases pressure in the venous system and contributes to the development of esophageal varices, which are very fragile. Straining increases thoracic or abdominal pressure, which can cause a sudden rupture of fragile blood vessels with massive hemorrhage. The patient could have fluid accumulation in the abdomen that may be mild and hard to detect or severe enough to cause orthopnea. Patients will compensate for orthopnea by assuming a more upright position. This symptom warrants additional investigation. Dependent peripheral edema can also be observed but is less urgent. Generally, respiratory issues are the priority. However, this question calls for knowledge of pathophysiology of cirrhosis and portal hypertension. Rupture with hemorrhage is the most serious complication.
The client diagnosed with inflammatory bowel disease, taking mesalamine reports, nausea, vomiting, and diarrhea. Which intervention should the clinic nurse take? 1. Instruct the client to quit taking the medication immediately. 2. Tell the client to take lansoprazole with the medication. 3. Advise the client to keep taking the medication, but notify the HCP. 4. Explain that these symptoms are expected and will resolve with time. The correct answer is 3. Advise the client to keep taking the medication, but notify the HCP. Mesalamine is an aspirin derivative. These are side effects of the medication, and the HCP should be notified, but the client should not stop taking the medication. The client should not quit taking the medication abruptly because that would result in an acute exacerbation of the inflammatory bowel disease. Lansoprazole is a PPI. A PPI will not help treat these symptoms. These symptoms will not resolve with time and should be reported to the HCP. The client diagnosed with rule-out myocardial infarction is experiencing chest pain while walking to the bathroom. Which action should the nurse implement first? 1. Administer sublingual nitroglycerin. 2. Obtain a stat electrocardiogram. 3. Have the client sit down immediately. 4. Assess the client's vital signs. The correct answer is 3. Have the client sit down immediately. Stopping all activity will decrease the need of the myocardium for oxygen and may help decrease the chest pain. The nurse must assume the chest pain is secondary to decreased oxygen to the myocardium and administer a sublingual nitroglycerin tablet, which is a coronary vasodilator, but this is not the first action. An ECG should be ordered, but it is not the first intervention. Assessment is often the first nursing intervention, but when the client has chest pain and a possible MI, the nurse must first take care of the client. Taking vital signs would not help relieve chest pain. Whenever you want to select an assessment intervention, be sure to think about whether that intervention will help the client, especially if the client is experiencing pain. Do not automatically select the answer option that is assessment. The nurse is caring for a 3-month-old being evaluated for possible Hirschsprung disease. His parents call the nurse and show her his diaper containing a large amount of mucus and bloody diarrhea. The nurse notes that the infant is irritable and his abdomen appears very distended. Which should be the nurse's next action? 1. Reassure the parents that this is an expected finding and not uncommon. 2. Call a code for a potential cardiac arrest and stay with the infant. 3. Immediately obtain all vital signs with a quick head-to-toe assessment. 4. Obtain a stool sample for occult blood. The correct answer is 3. Immediately obtain all vital signs with a quick head-to-toe assessment. All vital signs need to be evaluated because the child with enterocolitis can quickly progress to a state of shock. A quick head-to-toe assessment will allow the nurse to evaluate the child's circulatory system. All cases of bloody diarrhea need to be evaluated because this may be a sign of enterocolitis, which is a potentially fatal complication of Hirschsprung disease. For option 2, although this is a potentially critical complication, calling a code is not necessary at this time because the infant is irritable and not unconscious. It is not a priority to test the stool for occult blood because there is obvious blood in the sample. You should select answer 3 because there is not enough information to determine the status of the child. Obtaining vital signs will help the nurse to assess the situation.
The nurse in the ICU is caring for a client diagnosed with a left cerebral artery thrombotic stroke who received a thrombolytic medication in the ED. Which intervention should be implemented? 1. Administer oral ticlopidine. 2. Place the client in the Trendelenburg position. 3. Keep the client turned to the right side and high Fowler's position. 4. Monitor heparin infusion. The correct answer is 4. Monitor heparin infusion. Rationale: ticlopidine and antiplatelet may be ordered in the future once the cause of the thrombus is determined, but this would not be ordered in the ICU. The Trendelenburg position is head down and would increase intracranial pressure. There is no reason to restrict the client to lying on the right side, and high Fowler's is sitting upright. This would be a difficult position for the client to maintain. The client should have the head of the bed elevated approximately 30 degrees to decrease intracranial pressure by gravity drainage. The anticoagulant medication heparin is administered to prevent clot reformation after lysis of the clot by the thrombolytic, and its infusion should be monitored.
A nurse is planning a teaching session for an older adult about a prescribed medication regimen, which is a major concern about older adults that the nurse should consider. 1. They experience an increase in absorption of drugs from the gastrointestinal tract. 2. They are less motivated to follow a prescribed drug regimen. 3. They are less likely to learn due to a decline in intelligence. 4. They have a decreased risk for adverse reactions to drugs. The correct answer is 2. They are less motivated to follow a prescribed drug regimen. Rationale: the literature documents that older adults are at high risk for non-adherence to a medication regimen because of its complexity. The larger the number of medications and the larger the number of doses per day, the higher the risk of non-adherence. One study indicated that the adherence rate was 87% for daily dosing, 81% for doses twice a day, 77% for doses 3 times a day, and 39% for doses 4 times a day. Other reasons for not fully adhering to a drug regimen include inconvenience, side effects, financial limitations, and/or perceived ineffectiveness of the drugs.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
For patients coming to the ambulatory care gastrointestinal clinic, which task would be most appropriate to assign to an LPN/LVN? 1. Teaching a patient self-care measures for an ulcer. 2. Assisting the healthcare provider to incise and drain a pilonidal cyst. 3. Evaluating a patient's response to sitz baths for an anorectal abscess. 4. Describing the basic pathophysiology of an anal fistula to a patient. The correct answer is 2. Assisting the healthcare provider to incise and drain a pilonidal cyst. Rationale. Assisting with procedures for patients in stable condition with predictable outcomes is within the educational preparation of the LPN/LVN. Teaching the patient about self-care or pathophysiology and evaluating the outcome of interventions are responsibilities of the RN.
The nurse administered 25 units of insulin isophane to a client with type 1 diabetes at 1600 hour. Which intervention should the nurse implement? 1. Assess the client for hypoglycemia around 1800 hour. 2. Ensure the client eats the nighttime snack. 3. Check the client's serum blood glucose level. 4. Serve the client the supper tray. The correct answer is 2. Ensure the client eats the nighttime snack. The nurse needs to ensure the client eats the nighttime snack to help prevent nighttime hypoglycemia. Insulin isophane is an intermediate-acting insulin that peaks 6 to 8 hours after administration. Therefore, the client would experience signs of hypoglycemia around 2200 hour to 2400 hour. A serum blood glucose level would have to be done with a venipuncture, and the blood sample must be taken to the laboratory. If the client needed the blood glucose checked, it should be done with a glucometer at the bedside. The supper tray would not help prevent a hypoglycemic reaction because the insulin isophane humulin N is an intermediate-acting insulin that peaks in 6 to 8 hours. The 66-year-old male client has his blood pressure checked at a health fair. The BP is 168/98. Which action should the nurse implement first? 1. Recommend that the client have his blood pressure checked in 1 month. 2. Instruct the client to see his healthcare provider as soon as possible. 3. Discuss the importance of eating a low-salt, low-fat, low-cholesterol diet. 4. Explain that this BP is within the normal range for an elderly person. The correct answer is 2. Instruct the client to see his healthcare provider as soon as possible. The diastolic blood pressure should be less than 85 according to the American Heart Association. Therefore, this client should see the healthcare provider. This BP is elevated, and the client should have his BP checked frequently, but not before seeking medical treatment. Teaching is important, but the nurse must first make sure the client sees the healthcare provider for a thorough checkup and antihypertensive medication prescription. Diet alone should not be recommended by the nurse. This is not the normal range for an elderly person's blood pressure. The diastolic should be less than 85. Remember, the question asks which action should be implemented first. Therefore, there is more than one answer that is appropriate, but the first to be implemented should be the one that directly affects the client.
A family member requests relief from caring for a relative who has a history of excessive intake of alcohol and a rapidly debilitating malignancy. To which resource should the nurse refer the family member for respite care? 1. Hospice. 2. Meals on Wheels. 3. Ambulatory Care Center. 4. Substance Misuse Treatment Center. The correct answer is 1. Hospice. Rationale. A hospice program is an example of an agency that may provide or arrange for respite care in a healthcare facility or in the home. The caregiving role is physically and emotionally grueling, and family members may need relief from the caregiving role or a break to attend a family function or go on vacation. Meals on Wheels does not provide respite care. It provides nutritious, low-cost meals for homebound people so that they can remain in their own homes. Ambulatory care centers do not provide respite care. Ambulatory care centers provide care for people with conditions that do not require hospitalization. Services may include diagnosis and treatment of disease and illness, as well as simple surgical procedures in which the client returns home the same day. A substance misuse treatment center does not provide respite care. It provides a specialized service in the care and treatment of individuals who misuse alcohol or drugs. A nurse is caring for several children on a pediatric unit. Children in which age group should the nurse expect will be most unstable and challenging with regard to the development of a personal identity? 1. Toddlerhood. 2. Adolescence. 3. Childhood. 4. Infancy. The correct answer is 2. Adolescence. Rationale. Adolescents, 12 to 20 years. Identity versus role confusion, have more multiple and complex milestones than individuals in any other stage of development. These milestones are physiological, psychological, and social. The multiplicity of these stressors can have a major impact on the development of the adolescent's personal identity and sense of self. Although toddlers, 18 months to 3 years, early childhood, autonomy versus shame and doubt, experience a number of developmental milestones, toddlerhood is not as unstable or complex as another stage of development. Toddlers explore and test the environment, develop independence, and have a beginning ability to control the self. Although children in early childhood or toddlerhood, 18 months to 3 years, autonomy versus shame and doubt, and late childhood, 3 to 6 years, initiative versus guilt, experience a number of developmental milestones, their development is not as unstable or complex as that of another age group. The main tasks of childhood are achievement of self-control, initiation of one's own activities, and development of purpose and competence. Although infants, birth to 18 months, trust versus mistrust, experience a number of developmental milestones, their development is not as unstable or complex as that of another age group. The main tasks of infancy are to adjust to living in and responding to the environment and to develop trust. A patient underwent an exploratory laparotomy 2 days ago. The healthcare provider should be called immediately for which assessment finding: 1. Abdominal distension and rigidity. 2. Absent or hypoactive bowel sounds. 3. Nausea and occasional vomiting. 4. Displacement of the nasogastric tube. The correct answer is 1. Abdominal distension and rigidity. Rationale. Distension and rigidity can signal hemorrhage or peritonitis. The HCP may also decide that these symptoms require a medication to stimulate peristalsis. Absence of bowel sounds is expected within the first 24 to 48 hours. Nausea and vomiting are not uncommon and are usually self-limiting, and an as-needed prescription for an antiemetic is usually part of the routine postoperative care. The NG tube should be assessed for displacement, and the correct position of the tube must be confirmed. The nurse then secures the tube as necessary.
The nurse is teaching the client with type 1 diabetes how to use an insulin pen injector. Which information should the nurse discuss with the client? 1. Instruct the client to dial in the number of insulin units needed to inject. 2. Demonstrate the proper way to draw up the insulin in an insulin syringe. 3. Discuss that the insulin pen injector must be used in the abdominal area only. 4. Explain that the traditional insulin syringe is less painful than the injector pen. The correct answer is 1. Instruct the client to dial in the number of insulin units needed to inject. The insulin pen injector resembles a fountain pen. It contains a disposable needle and insulin-filled cartridge. When the client operates the insulin pen, the correct dose is obtained by turning the dial to the number of insulin units needed. The insulin pen injector does not require drawing up insulin in a syringe. The insulin pen injector can be used in any subcutaneous site where traditional insulin can be injected. Most clients state that there is less injection pain associated with the insulin pen than there is with the traditional insulin syringe. The nurse is teaching the client recently diagnosed with essential hypertension. Which instruction should the nurse provide when discussing exercise? 1. Walk at least 30 minutes a day on flat surfaces. 2. Perform light weightlifting 3 times a week. 3. Recommend high-level aerobics daily. 4. Encourage the client to swim laps once a week. The correct answer is 1. Walk at least 30 minutes a day on flat surfaces. Walking 30 to 45 minutes a day will help to reduce blood pressure, weight, and stress, and will increase a feeling of overall well-being. Isometric exercises should be discouraged because performing them can raise the systolic blood pressure. The client should walk, cycle, jog, or swim daily, but high-level aerobic exercise may increase the client's blood pressure. Swimming laps is recommended, but it should be daily, not once a week.
After arriving at a home location that has a history of domestic violence, a home care nurse believes that the environment may be unsafe. Which is the best nursing action? 1. Leave the home immediately. 2. Defuse the situation in the home. 3. Call the police for a personal escort. 4. Complete the visit quickly while remaining alert. The correct answer is 1. Leave the home immediately. Rationale. Nurses must remove themselves immediately from any environment that they believe is unsafe. Attempting to defuse the situation may make the situation worse and place the nurse at additional risk. Calling the police may inflame the situation or take too long for an officer to arrive. Attempting to complete the visit may place the nurse at additional risk. A hospice nurse is providing emotional support for 8 young children of a dying mother. At which age do children first recognize that death is irreversible, universal, and natural? 1. 9 years of age. 2. 6 years of age. 3. 15 years of age. 4. 12 years of age. The correct answer is 1. 9 years of age. Rationale. A 9-year-old child has a more realistic understanding of death than a younger child and recognizes that death is universal, irreversible, and natural. A 9-year-old child has a beginning knowledge of his or her own mortality and may fear death. A 6-year-old child is developing an understanding of the differences among the concepts of past, present, and future. A 6-year-old child believes that death is temporary, can be caused by bad thoughts, and may be a punishment, and that magic can make the dead person alive. Recognizing that death is irreversible, universal, and natural occurs at an earlier age than 15 years. Recognizing that death is irreversible, universal, and natural occurs at an earlier age than 12 years. Which instruction will the RN give to the LPN/LVN to determine if the prescribed dronabinol, medical marijuana, is having the desired therapeutic effect? 1. Monitor and report bouts of nausea and vomiting. 2. Monitor the frequency and amount of diarrheal episodes. 3. Ask the patient if heartburn has decreased or resolved. 4. Assess for abdominal pain in the upper right quadrant. The correct answer is 1. Monitor and report bouts of nausea and vomiting. Rationale. Dronabinol medical marijuana is prescribed to treat nausea and vomiting.
The nurse is teaching a client with newly diagnosed type 1 diabetes about insulin therapy. Which statements indicate the client needs more teaching concerning insulin therapy? Select all that apply. 1. If I have a headache or start getting nervous, I will drink some orange juice. 2. If I pass out at home, a family member should give me a glucagon injection. 3. Because I am taking my insulin daily, I do not have to adhere to a diabetic diet. 4. I will check my blood glucose with my glucometer at least once a day. 5. I should administer my insulin in my abdomen for best absorption. The correct answer is 3. Because I am taking my insulin daily, I do not have to adhere to a diabetic diet. Even with insulin therapy, the client should adhere to the American Diabetic Association diet, which recommends carbohydrate counting. The statement in option 3 indicates the client needs more teaching. Headache, nervousness, sweating, tremors, and rapid pulse are signs of a hypoglycemic reaction and should be treated with a simple acting carbohydrate, such as orange juice, sugar-containing drinks, and hard candy. If a client cannot drink or eat a simple carbohydrate for hypoglycemia, then the client should receive a glucagon injection to treat the hypoglycemic reaction. Monitoring and documenting the blood glucose level is encouraged to determine the effectiveness of the treatment regimen. The abdominal area best absorbs insulin. Therefore, the client does not need more teaching. The healthcare provider prescribes an ACE inhibitor for the client diagnosed with essential hypertension. Which statement is the most appropriate rationale for administering this medication? 1. ACE inhibitors prevent beta receptor stimulation in the heart. 2. This medication blocks the alpha receptors in the vascular smooth muscle. 3. ACE inhibitors prevent vasoconstriction and sodium and water retention. 4. ACE inhibitors decrease blood pressure by relaxing vascular smooth muscle. The correct answer is 3. ACE inhibitors prevent vasoconstriction and sodium and water retention. Angiotensin-converting enzyme inhibitors prevent the conversion of angiotensin I to angiotensin II, and this, in turn, prevents vasoconstriction and sodium and water retention. Beta-adrenergic blocking agents, not ACE inhibitors, prevent the beta receptor stimulation in the heart, which decreases heart rate and cardiac output. Alpha-adrenergic blockers, not ACE inhibitors, block alpha receptors in the vascular smooth muscle, which decreases vasomotor tone and vasoconstriction. Vasodilators, not ACE inhibitors, reduce blood pressure by relaxing vascular smooth muscle, especially in the arterioles.
A nurse must collect information about a community to identify its needs. which is the most significant assessment by the nurse. 1. The demographics of the community. 2. What the community thinks is important. 3. How many support services are available. 4. Environmental data as they relate to public safety. The correct answer is 2. What the community thinks is important. Rationale. The members in the community are the primary source of data about the community and its needs. Just as the client is the center of the healthcare team when caring for an individual, the collective membership of a community is the center of the healthcare team when caring for the healthcare needs of a community. A school nurse is teaching a class of adolescents about nutrition. Which age group should the nurse identify as having the highest energy expenditure and nutrient requirements? 1. End of the life cycle. 2. Middle adult years. 3. Early adult years. 4. First year of life. The correct answer is 4. First year of life. Rationale. During the first year of life, nutritional needs per unit of body weight are the greatest in comparison to any other time during the lifespan. Birth weight generally doubles in 4 to 6 months and triples by the end of the first year. Older adults experience decreases in basal metabolic rate, lean body mass, and physical activity that contribute to a decrease in caloric needs. Energy expenditure decreases, and nutritional needs stabilize during the middle adult years. People in other age groups have greater needs for nutrients to meet physiological demands than do those in the middle adult years. Although young adults tend to be active and require nutrients adequate to meet high energy expenditure, physical growth slows and the basal metabolic rate begins to stabilize, so they require fewer calories than do other age groups.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
The nurse is caring for a patient who was recently admitted for severe diverticulitis. Which task is appropriate to delegate or assign for the care of this patient? 1. Tell the unit secretary to call radiology and schedule a barium enema. 2. Ask the LPN/LVN to give as needed laxatives for constipation. 3. Instruct the nursing student to help the patient ambulate up and down the hall. 4. Tell assistive personnel to save a stool specimen to test for occult blood. The correct answer is 4. Tell assistive personnel to save a stool specimen to test for occult blood. Rationale. Diverticulitis can cause chronic or severe bleeding, so if there is no obvious blood in the stool may be tested for occult blood. A barium enema is not usually ordered because of the danger of perforation. Laxatives and ambulation increase intestinal motility and are to be avoided in the initial phase of treatment. If a barium enema, PRN laxative, or ambulation is prescribed, the nurse should check with a healthcare provider before delegating or assigning the intervention.
The nurse administered 12 units of regular insulin to the patient with type 1 diabetes at 0700 hour. Which meal prevents the client from experiencing hypoglycemia? 1. Breakfast. 2. Lunch. 3. Supper. 4. Nighttime snack. The correct answer is 1. Breakfast. Regular insulin peaks in 2 to 4 hours. Therefore, the breakfast meal would prevent the client from developing hypoglycemia. Lunch would cover an 0700-hour dose of insulin isophane, an intermediate-acting insulin. Supper would cover a 1600-hour dose of regular insulin, a short-acting insulin. The nighttime snack would cover a 1600-hour dose of insulin isophane, an intermediate-acting insulin. The nurse is administering a beta blocker to the client diagnosed with essential hypertension. Which intervention should the nurse implement? 1. Notify the healthcare provider if the potassium level is 3.8 milliequivalents per liter. 2. Question administering the medication if the BP is less than 90/60. 3. Do not administer the medication if the client's radial pulse is greater than 100 beats per minute. 4. Monitor the client's BP while he or she is lying, standing, and sitting. The correct answer is 2. Question administering the medication if the BP is less than 90/60. The nurse should question administering the beta blocker if the BP is low because this medication will cause the blood pressure to drop even lower, leading to hypotension. The potassium level is within normal limits, and it is not usually checked prior to administering beta blockers. The nurse would not administer the medication if the apical pulse were less than 60 beats per minute. The nurse needs to assess the blood pressure only once prior to administering the medication.
A woman is concerned about her children accidentally ingesting her husband's prescribed medications. Where should the home care nurse teach the mother to keep medications? 1. On a high shelf. 2. In a locked cabinet. 3. In a medicine cabinet in the bathroom. 4. On a shelf in the back of the refrigerator. The correct answer is 2. In a locked cabinet. Rationale. A locked area is the safest place to store prescribed as well as over-the-counter medications to prevent accidental ingestion by children. A high shelf, medicine cabinet in the bathroom, a shelf in the back of the refrigerator are not safe places to keep medications. Children have natural curiosity, problem-solving abilities, and the agility to climb to a top shelf. A nurse determines that, according to Erickson, establishing relationships based on commitment mainly occurs in which stage of psychosocial development? 1. Middle-age adulthood. 2. Young adulthood. 3. Adolescence. 4. Infancy. The correct answer is 2. Young adulthood. Rationale. Young adults, 18 to 25 years. Intimacy versus isolation. Strive to establish mature relationships, commit to suitable partners, and develop social and work roles acceptable to society. Unsuccessful resolution results in self-absorption, egocentricity, and emotional isolation. Middle-aged adults, 25 to 45 years. Generativity versus stagnation. Strive to fulfill life goals associated with family, career, and society, as well as to give to and care for others. Adolescents, 12 to 20 years. Identity versus role confusion. Strive to make the transition from childhood to adulthood with a sense of personal self. Infants, newborn to 18 months. Trust versus mistrust. Strive to have their needs met through interacting with others. When their needs are consistently met, they develop a sense of trust in their caregivers. A patient is admitted to the medical surgical unit for observation after being evaluated in the emergency department for blunt trauma to the abdomen. Which instructions would the RN give to assistive personnel? 1. Check the patient's skin temperature and report if the skin feels cool. 2. Check the urometer every hour and observe for red or pink-tinged urine. 3. Check vital signs every hour and report all of the values. 4. Check the patient's pain and report worsening of pain or discomfort. The correct answer is 3. Check vital signs every hour and report all of the values. Rationale. The AP can take vital signs and report all of the values to the RN. In this case, all of the values are needed to detect trends. In other cases, the nurse may decide to give parameters for reporting. The RN should assess skin temperature and pain. The RN must also closely monitor the urine output, which is an indicator of perfusion and fluid status. In addition, red or pink urine can signal damage to the urinary system, transfusion reaction, or rhabdomyolysis.
The client diagnosed with type 1 diabetes is reporting a dry mouth, extreme thirst, and increased urination. Which interventions should the nurse implement? Select all that apply. 1. Administer 1 amp of IV 50% glucose. 2. Prepare to administer IV regular insulin. 3. Inject insulin isophane subcutaneously in the abdomen. 4. Hang an IV infusion of D5W at a keep open rate. 5. Check the client's blood glucose level via a glucometer. The correct answers are 2. Prepare to administer IV regular insulin, and 5. Check the client's blood glucose level via a glucometer. The client's signs and symptoms indicate the client is experiencing diabetic ketoacidosis, which is treated with IV regular insulin. These are signs, symptoms of DKA. Therefore, checking the client's blood glucose level is an appropriate intervention. 1 amp of 50% glucose would be used to treat a severe hypoglycemic reaction, and this client does not have signs or symptoms that indicate hypoglycemia. In fact, the client has signs and symptoms of hyperglycemia. Insulin isophane is an intermediate-acting insulin, which is not used to treat hyperglycemia. An IV of D5W would cause the client to have further signs and symptoms of DKA. Therefore, the nurse should not administer the IV. The male client diagnosed with essential hypertension has been prescribed an alpha-adrenergic blocker. Which intervention should the nurse discuss with the client? 1. Eat at least 1 banana a day to help increase the potassium level. 2. Explain that impotence is an expected side effect of the medication. 3. Take the medication on an empty stomach to increase absorption. 4. change position slowly when going from lying to sitting position. The correct answer is 4. Change position slowly when going from lying to sitting position. Orthostatic hypotension may occur when the blood pressure is decreasing and may lead to dizziness and lightheadedness, so the client should change position slowly. The potassium level is not affected by an alpha-adrenergic blocker. Impotence is a major cause of noncompliance with taking prescribed medications for hypertension in male clients. Noncompliance should be reported to the HCP immediately so the medication can be changed. The medication can be taken on an empty or a full stomach, depending on whether the client becomes nauseated after taking the medication. To answer this question correctly, you should understand the side effects of medications. If you do not know the side effects, you may realize that hypertension is being treated and that hypotension is the opposite of hypertension and might be a complication of treating hypertension. Only option 4 refers to hypotension, providing advice on how to avoid orthostatic hypotension.
A client's contract for home care services is about to end, but the client still requires care. On which factor will the continuation of services initially depend? 1. Nursing documentation of the need for care. 2. Retrospective audits of quality management. 3. Client satisfaction with the care being provided. 4. Presence of a primary healthcare provider's prescription. The correct answer is 1. Nursing documentation of the need for care. Rationale. Case management by the nurse in the home care setting includes determining whether a client is ready for discharge or requires a continuation of services. The nurse must document objectively the status of the client to convince those making the decision that the client requires a continuation of services. Nursing documentation is the initial intervention that supports the decision to continue home care services. Quality management activities are unrelated to whether a client is to receive a continuation of services or is to be discharged from a home health care program. Ongoing quality management programs are designed to monitor the quality of care being delivered and identify problem areas so that efforts can be employed to improve care. Dissatisfaction with the services of a home health agency may influence whether or not the client and/or family wants a continuation of services. However, satisfaction or dissatisfaction should not influence whether the client still needs the services of the home health care agency. Ultimately, a primary health care provider's prescription is necessary to initiate home care services, continue health care services, and identify interventions to be performed by nurses that are within the scope of nursing practice. However, the health care provider's prescriptions take into consideration nursing documentation of the need for care and input from agency managers and the client's insurer. Which common physiological change associated with aging should the nurse assess for an older adult? Select all that apply. 1. Increase in sebaceous gland activity. 2. Deterioration of joint cartilage. 3. Loss of social support system. 4. Decreased hearing acuity. 5. Increased need for sleep. The correct answers are 2. Deterioration of joint cartilage and 4. Decreased hearing acuity. Rationale. Older adults generally experience a deterioration of the hyaline cartilage surface of joints, which tears, allowing bones to be in direct contact with each other. Often, this results in the formation of spurs or projecting points that limit joint motion. Hearing acuity decreases, particularly in relation to high-pitched sounds, because of atrophy in the organ of chordae and cochlear neurons, loss of sensory hair cells, and degeneration of the stria vascularis. Although sebaceous glands increase in size with age, the amount of sebum produced decreases, hastening the evaporation of water from the stratum corneum and resulting in cracked, dry skin. Loss of a social support system is a psychosocial, not physiological, change commonly experienced by older adults. Older adults have the same need for sleep as younger individuals. However, it is more difficult for older adults to obtain the quality and quantity of sleep desired. Chemical, structural, and functional changes in the nervous system disrupt circadian rhythms and sleep. After a nasogastric tube is inserted, which assessment finding is cause for greatest concern? 1. The patient reports that the tube is irritating nose and throat feels sore. 2. Gastric contents have a coffee ground appearance. 3. The patient demonstrates coughing and cannot speak clearly. 4. Gastric fluid is bright red and has small clots. The correct answer is 3. The patient demonstrates coughing and cannot speak clearly. Rationale. Coughing and an inability to speak or difficulty in speaking clearly suggests that the tube has been inserted into the trachea. The tube should be removed immediately. Bright red blood with clots indicates active bleeding. This should be immediately reported to the healthcare provider. Coffee ground appearance of gastric contents indicates old blood. This finding should also be reported but is less urgent. Irritation of the throat and around the nares is commonly reported. Perform hygiene around the nares as needed. Irritation of the throat usually subsides, but an anesthetic throat spray may offer some temporary relief.
The client newly diagnosed with type 1 diabetes asks the nurse, "Why should I get an external portable insulin pump?" Which statement is the nurse's best response? 1. It will cause you to have fewer hypoglycemic reactions, and it will control blood glucose levels better. 2. Insulin pumps provide an automatic memory of the date and time of the last 24 boluses. 3. The pump injects intermediate-acting insulin automatically into the vein to maintain a normal blood glucose level. 4. The portable pump is the easiest way to administer insulin to someone with type 1 diabetes and is highly recommended. The correct answer is 1. It will cause you to have fewer hypoglycemic reactions, and it will control blood glucose levels better. A portable insulin pump is a battery-operated device that uses rapid-acting insulin, Lispro, Humalog, or Novolog. It delivers continuous release of a small amount of insulin and bolus doses with meals. This provides fewer hypoglycemic reactions and better blood glucose levels. The pumps do provide a memory of boluses, but that is not the nurse's best response to explain why a client should get an external portable insulin pump. External portable insulin pumps are only used to deliver rapid-acting insulin subcutaneously. Intermediate and long-acting insulins are not used with an external portable insulin pump because of unpredictable control of blood glucose. The insulin pump is not recommended as the initial way to administer insulin because the success of the insulin pump depends on the client's knowledge and compliance. Initially, most clients start injecting insulin with a syringe and then graduate to the pumps. The nurse just received the AM shift report. Which client should the nurse assess first? 1. The client diagnosed with coronary artery disease who has a BP of 170/100. 2. The client diagnosed with deep vein thrombosis who is complaining of chest pain. 3. The client diagnosed with pneumonia who has a pulse oximeter reading of 98%. 4. The client diagnosed with ulcerative colitis who has non-bloody diarrhea. The correct answer is 2. The client diagnosed with deep vein thrombosis who is complaining of chest pain. The chest pain could be a pulmonary embolus secondary to deep vein thrombosis and requires immediate intervention by the nurse. The blood pressure in option 1 is elevated, but it is not life-threatening. A pulse oximeter reading of greater than 93% is within normal limits. Non-bloody diarrhea is an expected sign of ulcerative colitis and would not require immediate intervention by the nurse.
A nurse identifies the healthcare needs of the members of a community, which is the nurse's most efficient initial approach to meet these needs. 1. Involve community leaders to work within the political arena to obtain funding for programs. 2. Write research grants to explore the community's health needs in more detail. 3. Design educational programs that address the identified community needs. 4. Make clients aware of the resources in the community. The correct answer is 4. Make clients aware of the resources in the community. Rationale. Option 4 is the most efficient initial approach to meeting the identified needs of the members of the community. The use of currently available resources is more efficient than the other options presented. Option 1 is not the most efficient approach. This may be necessary if present resources are not available to meet the needs of the community. In Option 2, the health needs of the members of the community are identified already. Further study at this time does not appear to be appropriate. In Option 3, designing educational approaches is not the most efficient approach. This may eventually be done after an action in another option is implemented first. A nurse is facilitating a mother's class, and the women begin discussing experiences that reflect the intellectual development of their children. Each woman describes a situation that reflects one of the stages of Jean Piaget's theory about logical thinking. Place the situations described in order, beginning with the sensomotor stage and ending with formal operations. 1. My son touched the radiator and got burned. He'll never do that again. 2. My son is learning math and is getting 100s on his tests. He is so smart. 3. My daughter is on the debating team in school. We go to inter-school meets. 4. My daughter asked an obese lady if she had a baby in her stomach. I was so embarrassed. The correct order is 1. My son touched the radiator and got burned. He'll never do that again. 4. My daughter asked an obese lady if she had a baby in her stomach. I was so embarrassed. 2. My son is learning math and is getting 100s on his tests. He is so smart. 3. My daughter is on the debating team in school. We go to inter-school meets. Rationale. The sensory motor stage, birth to 2 years, is governed by sensations in which simple learning takes place. It progresses from reflex activity through repetitive behaviors to imitative behavior. These children are curious, experiment, and learn primarily through trial and error. The preoperational stage, 2 to 7 years, involves thinking that is concrete and tangible. These children cannot reason beyond the observable. Also, their thinking is transductive. That is, knowledge of one characteristic is transferred to another. The concrete operational stage, 7 to 11 years, reflects an increasing ability to use symbols and understand relationships between things and ideas. Judgments are made based on what they reason rather than just what they see. Also, they develop the concept of conservation. That is, physical remain the same even though outward appearances may change. The formal operational stage, 11 to 15 years, involves thinking that is abstract, theoretical, philosophical, and hypothetical. Thinking is characterized by flexibility, adaptability, and drawing logical conclusions.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
Patients who are undernourished or starved for prolonged periods are at risk for refeeding syndrome when nourishment is first given. What is the priority nursing assessment to prevent complications associated with this syndrome? 1. Monitor for peripheral edema, crackles in the lungs, and jugular vein distension. 2. Monitor for decreased bowel sounds, nausea, bloating, and abdominal distension. 3. Observe for signs of secret purging and ingestion of water to increase weight. 4. Assess for alternating constipation and diarrhea and pale clay-colored stools. The correct answer is 1. Monitor for peripheral edema, crackles in the lungs, and jugular vein distension. Rationale. Refeeding syndrome occurs when aggressive and rapid feeding results in fluid retention and heart failure. Electrolytes, especially phosphorus, should be monitored, and the patient should be observed for signs of fluid overload. Changes in bowel sounds, nausea, and distension may occur but are also appropriate for any patient with nutritional issues or for patients receiving enteral feedings. Observing for purging and water ingestion would be appropriate for a patient with an eating disorder. Changes in stool patterns may occur, but are not related to refeeding syndrome.
The nurse in the medical department is preparing to administer insulin Lispro to a client diagnosed with type 1 diabetes. Which intervention should the nurse implement? 1. Ensure the client is wearing a MedicAlert bracelet. 2. Administer the dose according to the regular insulin sliding scale. 3. Assess the client for hyperosmolar, hyperglycemic, non-ketotic coma. 4. Make sure the client eats the food on the meal tray that is at the bedside. The correct answer is 4. Make sure the client eats the food on the meal tray that is at the bedside. Insulin Lispro peaks in 30 minutes to 1 hour. Therefore, the client needs to eat when or shortly after the medication is administered to prevent hypoglycemia. Because the client is in the hospital, the client must have a hospital identification band. A MedicAlert bracelet would be needed when the client is not in the hospital. Insulin Lispro is not regular insulin. It is fast-acting insulin. It is not administered according to the regular insulin sliding scale. The peak time for insulin Lispro is 30 minutes to 1 hour. Regular insulin peaks in 2 to 4 hours. A client with type 1 diabetes will experience DKA. A client with type 2 diabetes will experience hyperosmolar, hyperglycemic, non-ketotic coma. The client diagnosed with essential hypertension asks the nurse, "Why do I have high blood pressure?" Which response by the nurse would be most appropriate? 1. You probably have some type of kidney disease that causes the high BP. 2. More than likely you have had a diet high in salt, fat, and cholesterol. 3. There is no specific cause for hypertension, but there are many known risk factors. 4. You are concerned that you have high blood pressure. Let's sit down and talk. The correct answer is 3. There is no specific cause for hypertension, but there are many known risk factors. There is no known cause for essential hypertension, but many factors, both modifiable and non-modifiable, are risk factors for essential hypertension. Kidney disease leads to secondary hypertension. Secondary hypertension is elevated blood pressure resulting from an identifiable underlying process. A high-salt, high-fat, high-cholesterol diet is a risk factor for essential hypertension, but it is not the only cause. Therefore, option 2 would be an incorrect answer. Option 4 is a therapeutic reply that is inappropriate because the client needs facts. When clients request information, the exchange should not address emotions. Just facts should be given. Therefore, option 4 can be eliminated as a correct answer.
A home care nurse is performing an initial client and home assessment, which is the most essential assessment that must be made by the nurse. 1. Can the home environment support the safety of the client? 2. Is the family willing to participate in the client's recovery? 3. Does the client have the potential for self-care? 4. Can the client participate in the plan of care? The correct answer is 1. Can the home environment support the safety of the client? Rationale. The first and most important assessment made by the home care nurse focuses on determining whether the client's home environment is safe. Safety and security are one of the more basic needs identified by Maslow's hierarchy of needs. Although it is often helpful when family members participate in a home care client's recovery, it is not necessary. A client's potential for self-care is not a criterion for receiving home care services. Clients who have little or no potential for self-care receive home care services. Clients who are unable to participate in the plan of care because they are mentally, emotionally, or physically disabled are still eligible for home care. A nurse identifies which word is being related to a principle of growth and development. Select all that apply. 1. Predictable. 2. Sequential. 3. Integrated. 4. Complex. 5. Static. The correct answers are 1. Predictable. 2. Sequential. 3. Integrated. And 4. Complex. Rationale. Growth and development comprise an orderly process that follows a predictable path. There are 3 predictable patterns. Cephalocaudal, proceeding from head to toe, proximal-distal, progressing from gross motor to fine motor movements, and symmetrical, both sides developing equally. Growth is marked by measurable changes in the physical aspects of the life cycle, and development is marked by behavioral changes that occur because of achievement of developmental tasks and their resulting functional abilities and skills. Growth and development follow a sequential timetable whereby multiple dynamic changes occur in a systematic and orderly manner. Individuals grow and develop in the physiological, cognitive, psychosocial, moral, and spiritual realms in an integrated way, with each one influencing the others. Growth and development comprise a complex process that involves multiple influencing variables, such as genetics, experience, health, culture, and environment. The word static means stationary, stagnant, or fixed. Growth and development are dynamic and progressive. The patient with advanced cirrhosis has massive ascites, peripheral dependent edema in the lower extremities, nausea and vomiting, and dyspnea related to pressure on the diaphragm. Which indicator is the most reliable for tracking fluid retention? 1. Auscultating the lung fields for crackles every day. 2. Measuring the abdominal girth every morning. 3. Performing daily weights with the same amount of clothing. 4. Checking the extremities for pitting edema and comparing with baseline. The correct answer is 3. Performing daily weights with the same amount of clothing. Rationale. All of these measures should be performed for total care of the patient. However, weighing the patient every day is considered the single best indicator of fluid volume.
Which assessment data best indicates the client with type 1 diabetes is adhering to the medical treatment regimen? 1. The client's fasting blood glucose is 100 milligrams per deciliter. 2. The client's urine specimen has no ketones. 3. The client's glycosylated hemoglobin is 5.8%. 4. The client's glucometer reading is 120 milligrams per deciliter. The correct answer is 3. The client's glycosylated hemoglobin is 5.8%. A glycosylated hemoglobin gives the average of the blood glucose level over the past 3 months and indicates adherence to the medical treatment regimen. A glycosylated hemoglobin level of 5.8% is close to normal and indicates that the client is adhering to the treatment regimen. The fasting blood glucose level is obtained after the client is NPO for 8 hours. This blood result does not indicate adherence to the treatment regimen. If the client has no ketones in the urine, it indicates that the body is not breaking down fat for energy, but it does not indicate adherence to the treatment regimen. A glucometer reading of 120 milligrams per deciliter indicates a normal blood glucose level, but it is a one-time reading and does not indicate adherence to the medical treatment regimen. The nurse is teaching the dietary approaches to stop hypertension diet to a client diagnosed with essential hypertension. Which statement indicates that the client understands teaching concerning the DASH diet? 1. I should eat at least 4 to 5 servings of vegetables a day. 2. I should eat meat that has a lot of white streaks in it. 3. I should drink no more than 2 glasses of whole milk a day. 4. I should decrease my grain intake to no more than twice a week. The correct answer is 1. I should eat at least 4 to 5 servings of vegetables a day. The DASH diet has proved beneficial in lowering blood pressure. It recommends eating a diet high in vegetables and fruits. The DASH diet recommends 2 or fewer servings of lean meats, which have very few white streaks. The white streaks indicate the meat is high in fat. The DASH diet recommends 2 to 3 servings of non-fat or low-fat milk, not whole milk. The DASH diet recommends 7 to 8 servings of grain a day.
During the process of performing a community assessment, the nurse invites members of the community to come to a meeting and share opinions and concerns about a particular issue, which is this method of data collection. 1. An opinion survey. 2. A community forum. 3. A demographic assessment. 4. An observation of participants. The correct answer is 2. A community forum. Rationale. A forum is defined as an opportunity for open discussion, inviting people from the community to share opinions and concerns about a particular issue for the purpose of collecting data is called a community forum. An opinion survey is designed to collect each individual person's perspective about the problem being studied. Results are tallied to identify the major concerns. Opinion surveys generally are questionnaires. A demographic assessment is a quantitative study of the characteristics of a population. A demographic assessment might include information such as distribution of the population by gender, size, growth, density, and ethnicity. Direct observation is a method of data collection that may be used to determine whether individuals follow a specific procedure or behave in an expected manner. A nurse identifies that a client in middle adulthood is experiencing a developmental crisis. Which of the person's behaviors supports this conclusion? Select all that apply. 1. Unable to mentor children in the next generation. 2. Difficulty in developing peer relationships. 3. Inability to achieve feelings of success. 4. Incapable of delaying satisfaction. 5. Failure to face eventual death. The correct answers are 1. Unable to mentor children in the next generation, and 3. Inability to achieve feelings of success. Rationale. A task associated with middle adulthood is sharing of self and performing activities that promote the growth of others, particularly those in the next generation. A major task of middle adulthood is successfully fulfilling lifelong goals that involve family, career, and society. If these goals are not achieved, a crisis often is precipitated. Developing peer relationships is one of the developmental tasks of the 6 to 12-year-old child and adolescent, not the middle-aged adult. Delaying satisfaction is one of the developmental tasks of the 18-month to 3-year-old child, not the middle-aged adult. Facing death is one of the developmental tasks of the 65-year-old and older adult, not the middle-aged adult. The nurse hears in the handoff report that, 1 hour ago, the healthcare provider requested that the patient be given the maximum dose of magnesium hydroxide. Which instruction is the nurse most likely to give to assistive personnel? 1. Patient will frequently need assistance to the bathroom for bowel evacuation. 2. Patient may experience some dizziness when ambulating or changing position. 3. Patient is frequently vomiting and may need linen and gown changes. 4. Patient needs to be encouraged and assisted to eat and drink as much as possible. The correct answer is 1. Patient will frequently need assistance to the bathroom for bowel evacuation. Rationale. The maximum dose of magnesium hydroxide is given for bowel evacuation and cleansing. It is expected that the medication should take effect within 2 to 6 hours.
The nurse is discussing storage of insulin vials with the client. Which statement indicates the client understands the teaching concerning the storage of insulin? 1. I will keep my unopened vials of insulin in the refrigerator. 2. I can keep my insulin in the trunk of my car, so I will have it at all times. 3. It is all right to put my unopened insulin vials in the freezer. 4. If I pre-fill my insulin syringes, I must use them within 1 to 2 days. The correct answer is 1. I will keep my unopened vials of insulin in the refrigerator. This statement indicates the client understands the medication teaching. Keeping the insulin in the refrigerator will maintain the insulin's strength and potency. Once the insulin vial is opened, it may be kept at room temperature for 1 month. Insulin vials should not be placed in direct sunlight or in a high-temperature area, such as the trunk of a car, because it will lose its strength. Insulin should not be kept in the freezer because freezing will cause the insulin to break down and lose its effectiveness. Pre-filled syringes should be stored in the refrigerator and should be used within 1 to 2 weeks, not 1 to 2 days. The client diagnosed with essential hypertension is taking a loop diuretic daily. Which assessment data would require immediate intervention by the nurse? 1. The telemetry reads normal sinus rhythm. 2. The client has a weight gain of 2 kilograms within 1 to 2 days. 3. The client's blood pressure is 148/92. 4. The client's serum potassium level is 4.5 milliequivalents per liter. The correct answer is 2. The client has a weight gain of 2 kilograms within 1 to 2 days. Rapid weight gain, for example, 2 kilograms in 1 to 2 days, indicates that the loop diuretic is not working effectively. 2 kilograms equals 4.4 pounds. 1 liter of fluid weighs 1 kilogram. Normal sinus rhythm indicates that the client's heart is working normally. The blood pressure in option 3 is not life-threateningly high and does not require immediate intervention. Loop diuretics cause an increase in potassium excretion in the urine. Therefore, the potassium level should be assessed, but 4.5 milliequivalents per liter is within normal limits. The phrase, requires immediate intervention, should make you think that the correct answer will be abnormal assessment data, data that require medical intervention, or are life-threatening.
A nurse must conduct a community assessment. Which information should the nurse collect first? 1. General health of community members. 2. Characteristics of community members. 3. Physical environment of the community. 4. Social services available in the community. The correct answer is 2. Characteristics of community members. Rationale. Clients are the center of all healthcare, including community healthcare. Acquiring core information about the people in the community is the first stage in assessing a community. Core characteristics about the members of a community include information such as vital statistics, values and beliefs, demographics, religious groups, and so on. A nurse identifies that an adult has an unresolved developmental conflict associated with adolescence. Which behavior supports this conclusion? Select all that apply. 1. Being overly concerned about following daily routines. 2. Requiring excessive attention from others. 3. Relying on oneself rather than others. 4. Failing to express a sense of self. 5. Lacking goals in life. The correct answers are 4. Failing to express a sense of self, and 5. Lacking goals in life. Rationale. A main developmental task of adolescence is being capable of determining who you are. An inability to express a sense of self later in life reflects an unresolved conflict of identity versus role confusion. A main developmental task of adolescence is forming a sense of personal identity as a foundation for the tasks of young adulthood, making decisions regarding career choices, and selecting a mate. An adult who has difficulty setting goals in life indicates an unresolved conflict of identity versus role confusion. 1. This relates to Freud's anal stage of development. According to Freud, if a parent is strict, overbearing, and oppressive during toilet training, the child may develop traits of an anal retentive personality. Seeking excessive attention from others is most likely the result of an unresolved task of the 6 to 12-year-old age group, industry versus inferiority. Seeking attention often is an attempt to increase self-esteem. People who have difficulty accepting help from others, or who would rather do things themselves, generally have not completely resolved the developmental task of infancy. Trust versus mistrust.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
A patient with end-stage liver disease is talking to the nurse about being on the transplant list. Which statement by the patient is cause for greatest concern? 1. I have a family history of diabetes. 2. I had symptoms of asthma when I was a kid. 3. I guess I should cut back on my alcohol consumption. 4. I am not very good about taking prescribed medication. The correct answer is 3. I guess I should cut back on my alcohol consumption. Rationale. If alcohol abuse has contributed to liver failure, a person's intent to continue alcohol consumption might be an exclusion for a liver transplant, so the nurse should conduct an additional assessment about this comment. The comment about the difficulty in taking prescription medications should also be investigated because a true inability to follow the treatment regimen could exclude a patient from being on a transplant list.
Which statement best describes the pharmacodynamics of insulin? 1. Insulin causes the pancreas to secrete glucose into the bloodstream. 2. Insulin is metabolized by the liver and muscle and excreted in the urine. 3. Insulin is needed to maintain colloidal osmotic pressure in the bloodstream. 4. Insulin lowers blood glucose by promoting the use of glucose in the body cells. The correct answer is 4. Insulin lowers blood glucose by promoting use of glucose in the body cells. The statement in option 4 explains the pharmacodynamics, which is the drug's mechanism of action or way that insulin is utilized by the body. Over time, elevated glucose levels in the bloodstream can cause long-term complications, including nephropathy, retinopathy, and neuropathy. Insulin lowers blood glucose by promoting the use of glucose in body cells. The pancreas does not secrete glucose. It secretes insulin, which is the key that opens the door to allow glucose to enter the body cells. Glucose enters the body through the gastrointestinal system. The statement in option 2 explains the pharmacokinetics of insulin and how the body metabolizes it and excretes it in urine. Pharmacokinetics is the process of drug movement to achieve drug interaction. Insulin does not maintain colloidal osmotic pressure. Albumin, a product of protein, maintains colloidal osmotic pressure. The client diagnosed with essential hypertension asks the nurse, "I don't know why the doctor is worried about my blood pressure. I feel just great." Which statement by the nurse would be the most appropriate response? 1. Damage can be occurring to your heart and kidneys even if you feel great. 2. Unless you have a headache, your blood pressure is probably within normal limits. 3. When was the last time you saw your doctor? Does he know you are feeling great? 4. Your blood pressure reflects how well your heart is working. The correct answer is 1. Damage can be occurring to your heart and kidneys even if you feel great. You should select the option that provides the client with correct information in a non-threatening, non-judgmental approach. Even if the client feels great, the blood pressure can be elevated, causing damage to the heart, kidney, and blood vessels. A headache may indicate an elevated blood pressure, but the client with essential hypertension can be asymptomatic and still have a very high blood pressure reading. This response does not answer the client's question as to why the doctor is worried about the client's blood pressure. The blood pressure does not necessarily reflect how well the heart is working. Many other diagnostic tests assess how well the heart is working, including an electrocardiogram, an ultrasound, and a chest X-ray.
A home care nurse is providing care for a family supporting a client with a chronic illness, which is the most important factor the nurse should teach caregivers who care for a family member who has a stable but chronic illness and is living in the home. 1. Have extra equipment and supplies for emergencies. 2. Plan a daily and monthly schedule of activities. 3. Keep a daily journal of the client status. 4. Tend to themselves as well as the client. The correct answer is 4. Tend to themselves as well as the client. Rationale. Caregiver role strain experienced by a family member is a serious concern of home care nurses. Caregivers often fail to address their own health needs because of the extraordinary burden of the caregiver role, which can jeopardize their own health and well-being. Caregivers should be encouraged to delegate responsibilities to other family members, Get adequate sleep, rest, and nutritional intake. Seek assistance from agencies that provide respite services. Take time for leisure activities and a vacation. And join a caregiver support group. Option 1 is a good idea. It is not the most important factor a home care nurse can convey to a person caring for a family member in the home. Option 2 might contribute to efficiency, as well as gaining a feeling of control over the activities that must be accomplished. It is not the most important factor a home care nurse can convey to a person caring for a family member in the home. A nurse is assessing a 4-year-old child's growth and development. Which activity should the nurse expect the child to be capable of performing? Select all that apply. 1. Dresses self. 2. Uses toy tools. 3. Hops on one foot. 4. Rides a 2-wheel bicycle. 5. Swims using the freestyle stroke. The correct answers are 1. Dresses self. 2. Uses toy tools. And 3. Hops on one foot. Rationale. Preschool-age children have the fine motor skills to open and close zippers and buttons. Preschool-age children have the motor skills necessary to manipulate a toy tool, such as a hammer. Preschool-age children have the gross motor skills and balance to be able to hop and skip on one foot, balance on one foot, and perform a broad jump. Preschool-age children do not have the strength and balance to ride a 2-wheel bicycle. A preschooler usually can ride a tricycle. School-age children, not preschool-age children, usually are able to ride a 2-wheel bicycle. Preschool-age children do not have the strength and coordination to swim using the freestyle stroke. Some preschool-age children are able to do the doggy paddle. School-age children, not preschool-age children, usually are able to swim using the freestyle stroke. The nurse is supervising a nursing student who is caring for a patient who had a cholecystectomy. There is a T-tube in place. The nurse would intervene if the student performed which action? 1. Maintain the patient in a semi-fowler position. 2. Check the amount, color, and consistency of the drainage. 3. Gently aspirated the drainage from the tube. 4. Inspected the skin around the tube for redness or irritation. The correct answer is 3. Gently aspirated the drainage from the tube. Rationale. T-tubes should not be irrigated, aspirated, or clamped without specific directions from the healthcare provider. All of the other actions are appropriate in the care of this patient.
The client diagnosed with type 2 diabetes is prescribed the medication glipizide. Which statement by the client warrants intervention by the nurse? 1. I have to eat my diabetic diet even if I am taking this medication. 2. I will need to check my blood glucose level at least once a day. 3. I usually have 1 glass of wine with my evening meal. 4. I do not like to walk every day, but I will if it will help my diabetes. The correct answer is 3. I usually have 1 glass of wine with my evening meal. Glipizide is a sulfonylurea which stimulates the pancreatitis to secrete more insulin. Sulfonylureas and biguanides may cause an antabuse-like reaction when taken with alcohol, causing the client to become nauseated and vomit. Advise the client to abstain from alcohol and to avoid liquid over-the-counter medications that may contain alcohol. Alcohol also increases the half-life of the medication and can cause a hypoglycemic reaction. The client with type 2 diabetes does not need to walk daily to keep the glucose level within normal limits. Walking 3 times a week will help control stress and help decrease weight if the client is overweight. The client with type 2 diabetes must adhere to the prescribed diet to help keep the blood glucose level within the normal range. Delaying or missing a meal can cause hypoglycemia. The statement in option 1 would not warrant intervention by the nurse. The client should check blood glucose levels to determine if the medication is effective. Therefore, the statement in option 2 would not warrant intervention by the nurse. Which individual is at greatest risk for developing hypertension? 1. 45-year-old African American attorney. 2. 60-year-old Asian American shop owner. 3. 40-year-old Caucasian nurse. 4. 55-year-old Hispanic teacher. The correct answer is 1. 45-year-old African American attorney. African Americans have a higher risk of developing hypertension compared to other ethnic groups. This is due to genetic factors and higher prevalence of risk factors such as obesity and diabetes within this population. Additionally, age is a risk factor for hypertension, with the risk increasing as individuals get older. Therefore, the 45-year-old African American attorney is at the greatest risk for developing hypertension compared to the other individuals mentioned?
A community health nurse is to care for a client who was just discharged from an acute care facility after receiving initial medical care for tuberculosis. The family recently immigrated to the country from another country. Place the following interventions in the order in which they should be performed by the nurse. 1. Explore community resources that can help support the client and family. 2. Perform an assessment of the client and home environment. 3. Meet with the client and family in their home. 4. Review the client's medical record. 5. Identify client and family needs. The correct order is 4. Review the client's medical record. 3. Meet with the client and family in their home. 2. Perform an assessment of the client and home environment. 5. Identify client and family needs. And 1. Explore community resources that can help support the client and family. Rationale. Before meeting with the client and family, the nurse should obtain as much information about the client as possible. An assessment of the home environment can be performed only in the home. The client's family members should be included when feasible because they may provide emotional support and/or be involved with physical care of the client. A health history and physical assessment of the client should be performed by the community health nurse. The information on the client's clinical record may not reflect the client's current status. The home must be assessed to ensure that it is a safe environment for the client and that care can be delivered adequately to meet the client's needs. The nurse, in conjunction with the client, must identify present needs. Once this is accomplished, then goals and objectives can be identified and a plan of care formulated. Once a plan of care is formulated, then the nurse, in conjunction with the client, can identify community resources that may assist them in attaining the goals and objectives of the plan of care. An older adult patient tells the home health nurse that she is taking methylcellulose for chronic constipation, which behavior is cause for greatest concern. 1. Patient primarily eats white bread and drinks low-fat milk. 2. Patient takes the methylcellulose 3 or 4 times a day. 3. Patient takes the medication with a few sips of water. 4. Patient does not promptly act on the urge to defecate. The correct answer is 3. Patient takes the medication with a few sips of water. Rationale. Methylcellulose can cause esophageal obstruction if taken with insufficient amounts of fluid. Intestinal obstruction is also a possibility if the passage is slowed or impeded. The patient should be reminded that 3 times a day is the acceptable dose range. High fiber and a prompt response to the urge to defecate should be encouraged to restore natural and normal bowel movements.
Which statement best describes the scientific rationale for prescribing metformin? 1. This medication decreases insulin resistance, improving blood glucose control. 2. This medication allows the carbohydrates to pass slowly through the large intestine. 3. This medication will decrease the hepatic production of glucose from stored glycogen. 4. This medication stimulates the beta cells to release more insulin into the bloodstream. The correct answer is 3. This medication will decrease the hepatic production of glucose from stored glycogen. Metformin is a biguanide that works to prevent gluconeogenesis in the liver. The scientific rationale for administering metformin is that it diminishes the increase in serum glucose following a meal and blunts the degree of postprandial hyperglycemia by preventing gluconeogenesis. A thiazolidinedione, pioglitazone, or rosiglitazone, not a biguanide like metformin, is prescribed to decrease insulin resistance. An alpha-glucosidase inhibitor, acarbose or miglitol, is administered to allow carbohydrates to pass slowly through the intestine. Glucophage does not do this. Meglitinide, repaglinide, sulfonylurea, or natglinide is prescribed to stimulate the beta cells to release more insulin into the bloodstream. The nurse is teaching a class on arterial essential hypertension. Which modifiable risk factors would the nurse include when preparing this presentation? 1. Include information on retinopathy and nephropathy. 2. Discuss sedentary lifestyle and smoking cessation. 3. Include discussions on family history and gender. 4. Provide information on a low-fiber and high-salt diet. The correct answer is 2. Discuss sedentary lifestyle and smoking cessation. Remember to look at the adjectives. The stem of the question is asking about modifiable risk factors. A sedentary lifestyle is discouraged in clients with hypertension. Daily isotonic exercises are recommended. Smoking increases the atherosclerotic process in vessels, causes vasoconstriction of vessels, and adheres to hemoglobin, decreasing oxygen levels. Retinopathy and nephropathy are complications of uncontrolled hypertension, not modifiable risk factors. Family history and gender are non-modifiable risk factors. The question is asking for information on modifiable risk factors. A low-salt diet is recommended because increased salt intake causes water retention, which increases the workload of the heart. A high-fiber diet is recommended because it helps decrease cholesterol levels.
Which statement reflects hospice care in the healthcare delivery system? Select all that apply. 1. Clients predicted to have less than half a year to receive services. 2. It assists families to care for their dying relatives at home. 3. Care is less expensive than in the acute care setting. 4. Support is given to the client and family members. 5. Hospice is a method of care rather than a location. The correct answers are 1. Clients predicted to have less than half a year to receive services. 2. It assists families to care for their dying relatives at home. 3. Care is less expensive than in the acute care setting. 4. Support is given to the client and family members. And 5. Hospice is a method of care rather than a location. Rationale. To be eligible for hospice services, individuals are predicted to have less than 6 months to live. It is a service to support clients and their families through the process of dying. Most hospice care is delivered in clients' homes supported by a team of healthcare providers and volunteers. However, there are inpatient hospice programs, palliative care units in hospitals, and residential hospice settings. The majority of hospice care is provided in the home. The home is a less expensive setting than other healthcare settings because family members provide most of the care, supported by a team of professionals, non-professionals, and volunteers. Hospice services provide supportive care, physical care, and promotion of the quality of life for the terminally ill client and family members. In addition, hospice care assists family members with bereavement and adjustment after the death of the client. Hospice is not a location, but a concept. It provides supportive, palliative services that focus on managing pain, treatment of symptoms, and helping clients maintain their quality of life so they can live the remainder of their lives to the fullest. A male nurse tells an older male patient that he needs to perform a digital examination of the rectum to check for possible fecal impaction. The patient responds, "I'm not letting any male nurse get near me." What should the nurse do first? 1. Explain that the procedure is a nursing action, not a sexual advance. 2. Ask the charge nurse to reassign that patient to a different nurse. 3. Document that the patient refused to allow the examination. 4. Ask the patient if the presence of a female staff member would be acceptable. The correct answer is 4. Ask the patient if the presence of a female staff member would be acceptable. Rationale. The nurse is likely to feel upset, even angry. However, ideally, the nurse focuses on the patient and tries to find a solution that allows the care to continue. Having a female witness in the room may reassure the patient that nothing untoward will happen. If the patient continues to express hostility and rejection, then the nurse could ask the charge nurse to reassign the patient. In cases of emergency, the nurse would acknowledge the patient's feelings, but politely and firmly explain that the intervention can't be delayed. All attempts and interventions should be documented.
The nurse is discussing oral glyburide with the client diagnosed with type 2 diabetes. Which information should the nurse discuss with the client? 1. Instruct the client to take the oral hypoglycemic medication with food. 2. Explain that hypoglycemia will not occur with oral medications. 3. Tell the client to notify the HCP if a headache, nervousness, or sweating occurs. 4. Recommend that the client check the ketones in the urine every morning. The correct answer is 1. Instruct the client to take the oral hypoglycemic medication with food. Glyburide is a sulfonylurea that stimulates the pancreatitis to secrete more insulin. The oral hypoglycemic medication should be administered with food to decrease gastric upset. The client receiving oral hypoglycemic medications can experience hypoglycemic reactions, as can clients receiving insulin. In option 3, these are signs or symptoms of hypoglycemia, and the client should be able to treat this without notifying the HCP. Ketones are a byproduct of the breakdown of fats, which usually does not occur in clients with type 2 diabetes because the client has enough insulin to prevent breakdown of fats, but not enough to keep the blood glucose level within an acceptable level. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. The client comes to the clinic complaining of muscle cramping and pain in both legs when walking for short periods of time. Which medical term would the nurse document in the client's record? 1. Peripheral vascular disease. 2. Intermittent claudication. 3. Deep vein thrombosis. 4. Dependent rubor. The correct answer is 2. Intermittent claudication. Intermittent claudication is the classic symptom of arterial occlusive disease. The test taker could eliminate options 1 and 3 as possible answers if the words medical term were noted. Both options 1 and 3 are disease processes, not medical terms. Peripheral vascular disease is a broad term that encompasses both venous and arterial peripheral problems of the lower extremities. Deep vein thrombosis is characterized by calf tenderness, calf edema, and a positive Hohmann's sign. Dependent rubor is a sign of arterial occlusive disease. The legs are pale when elevated, but are dark red when in the dependent position.
Identify the nursing intervention that reflects tertiary healthcare delivery. Select all that apply. 1. Providing emotional support to family members after the death of a relative. 2. Teaching a client how to use a wheelchair after a stroke. 3. Implementing a prescribed hemodialysis treatment. 4. Administering an influenza vaccine. 5. Changing a dressing after surgery. The correct answers are 1. Providing emotional support to family members after the death of a relative. 2. Teaching a client how to use a wheelchair after a stroke. And 3. Implementing a prescribed hemodialysis treatment. Rationale. Providing bereavement services is an example of a tertiary healthcare service. Tertiary care is associated with rehabilitation, long-term care, and care of the dying. Healthcare delivery includes primary, secondary, and tertiary care. Teaching a client how to use a wheelchair after a stroke is an example of a tertiary healthcare service. Tertiary services provide care related to rehabilitation. Implementing a prescribed hemodialysis treatment is an example of tertiary healthcare. Tertiary healthcare includes providing palliative care and supporting comfort and quality of life, as well as maximizing abilities in light of chronic or irreversible conditions. Immunizations are an example of primary, not tertiary, healthcare delivery. Primary healthcare is concerned with promoting health, preventing disease, and providing environmental protection and health education. Changing a dressing after surgery is care associated with the secondary, not tertiary, level of healthcare delivery. Secondary healthcare is associated with acute care, complex diagnosis and treatment of disease and illness, and emergency care. The patient has portal hypertension and hepatic encephalopathy secondary to liver disease and is being treated with lactulose. Which laboratory result will the nurse check first to see if the medication is having the desired effect? 1. White blood cell count. 2. Ammonia level. 3. Potassium level. 4. Platelet count. The correct answer is 2. Ammonia level. Rationale. The healthy liver breaks down ammonia, but in liver disease, the ammonia accumulates and serum levels increase. Lactulose helps by enhancing intestinal excretion of ammonia.
The client diagnosed with type 2 diabetes is receiving the combination oral medication glyburide metformin. Which data indicates the medication is effective? 1. The client's skin turgor is elastic. 2. The client's urine ketones are negative. 3. The serum blood glucose level is 118 milligrams per deciliter. 4. The client's glucometer level is 170 milligrams per deciliter. The correct answer is 3. The serum blood glucose level is 118 milligrams per deciliter. Glyburide metformin contains both the sulfonylurea and biguanide. The serum blood glucose level should be within normal limits, which is 70 to 110 milligrams per deciliter. A level of 118 milligrams per deciliter is close to normal. Therefore, the medication can be considered effective. An elastic skin turgor is expected and normal, but it does not indicate that the anti-diabetic medication is effective. Urine ketones should be negative because there should not be a breakdown of fat in clients with type 2 diabetes, but this does not indicate the effectiveness of the medication. A self-monitoring blood glucose level of 170 milligrams per deciliter is above a normal glucose level. This indicates the medication is not effective. Which instructions should the nurse include when providing discharge instructions to a client diagnosed with peripheral arterial disease? 1. Encourage the client to use a heating pad on the lower extremities. 2. Demonstrate to the client the correct way to apply an elastic support hose. 3. Instruct the client to walk daily for at least 30 minutes. 4. Tell the client to check both feet for red areas at least once a week. The correct answer is 3. Instruct the client to walk daily for at least 30 minutes. Walking promotes the development of collateral circulation to ischemic tissue and slows the process of atherosclerosis. External heating devices are avoided to reduce the risk of burns. An elastic support hose reduces the circulation to the skin and are avoided. The feet must be checked daily, not weekly.
Which activity is an example of an intervention associated with secondary healthcare delivery? Select all that apply. 1. Conducting a cardiac risk assessment for middle-aged adults. 2. Teaching a low-fat diet to a person with high cholesterol. 3. Immunization of a child during the first year of life. 4. Providing a class on smoking cessation. 5. Monthly breast self-examinations. The correct answer is 5. Monthly breast self-examinations. Rationale. Monthly breast self-examinations are associated with secondary healthcare services because they are concerned with detection of breast cancer. Option 1 is a primary, not secondary, healthcare delivery. Risk assessments for specific diseases are included in primary healthcare services. Primary healthcare services are concerned with generalized health promotion and specific protection against disease. In option 2, a low-fat diet generally is part of a medical management program for a person who is overweight or who has high cholesterol. This is a tertiary, not secondary healthcare service. Tertiary healthcare services are associated with attempts to reduce the extent and severity of a health problem in an effort to limit disability, as well as restore and maintain function. In option 3, administering an immunization is a primary, not secondary healthcare service. Primary healthcare services include protecting people from disease. Providing a class on smoking cessation is associated with primary, not secondary healthcare. Primary healthcare is associated with health promotion and illness prevention. The nurse is reviewing medication lists for patients who are being treated for peptic ulcer disease. The nurse is most likely to question the use of which medication? 1. Ibuprofen. 2. Omeprazole. 3. Amoxicillin. 4. Clarithromycin. The correct answer is 1. Ibuprofen. Rationale. Ibuprofen is a non-steroidal anti-inflammatory drug, and NSAIDs are thought to be one of the aggravating factors of peptic ulcer disease. Omeprazole, amoxicillin, and clarithromycin are used as a triple combination therapy for the treatment of peptic ulcer disease.
The client with type 2 diabetes has been admitted into the medical department with a wound on the left leg that will not heal. The HCP prescribes sliding scale insulin. The client tells the nurse, "I don't want to have to take shots. I take pills at home." Which statement is the nurse's best response? 1. If you can't keep your glucose under control with pills, you must take insulin. 2. You should discuss the insulin order with your HCP because you don't want to take it. 3. You are worried about having to take insulin. I will sit down and we can talk. 4. During illness, you may need to take insulin to keep your blood glucose level down. The correct answer is 4. During illness, you may need to take insulin to keep your blood glucose level down. Blood glucose levels elevate during times of stress, surgery, or serious infection. The client with type 2 diabetes may need to be given insulin temporarily to help keep the blood glucose level within normal limits. The statement in option 1 is a threatening type of statement and is not the nurse's best response. Insulin may need to be prescribed in times of stress, surgery, or serious infection. Therefore, the nurse should explain this to the client and not refer the client to the HCP. Option 4 is a therapeutic response, and the client needs to have factual information. Therapeutic responses are used to encourage the client to ventilate feelings. The nurse is teaching the client diagnosed with arterial occlusive disease. Which interventions should the nurse include in the teaching? Select all that apply. 1. Wash legs and feet daily in warm water. 2. Apply moisturizing cream to the feet. 3. Buy shoes in the morning hours only. 4. Do not wear any type of knee stocking. 5. wear clean white cotton socks. The correct answers are 1. Wash legs and feet daily in warm water. 2. Apply moisturizing cream to the feet. 4. Do not wear any type of knee stocking. And 5. Wear clean white cotton socks. Cold water causes vasoconstriction, and hot water may burn the client's feet. Therefore, warm water should be recommended. Moisturizing prevents drying of the feet. Option 4 will further decrease circulation to the legs. Colored socks have dye, and dirty socks may cause foot irritation that may lead to breaks in the skin. Option 3 could be eliminated as a correct answer right off the bat because of the word only, which is an absolute word. There are very few absolutes in healthcare.
An older adult woman who has left-sided paralysis because of a brain attack is being cared for by a daughter in the home in which the daughter lives with her husband. The home care nurse interviews each member of the family separately, based on the significant information in each interview, which is the most important initial nursing intervention. 1. Be sensitive to the client's cultural beliefs. 2. Arrange respite care for the client's daughter. 3. Reinforce the daughter's responsibility to care for her mother. 4. Encourage the husband to help his wife with the care of his mother-in-law. The correct answer is 1. Be sensitive to the client's cultural beliefs. Rationale. Beliefs and values usually are held long-term and are ingrained within one's view of self. It is essential that nurses respect a client's beliefs and values, particularly for non-traditional healing practices, as long as they are not harmful to the client. Demonstrating respect and a non-judgmental attitude will help promote a trusting nurse-client relationship. In option 2, arranging respite care for the daughter is premature at this time. This may eventually become necessary. Option 3 is an inappropriate intervention by the nurse. Only the daughter can come to the conclusion that it is her responsibility to care for her mother. Option 4, this is not the priority. This intervention may be done after a discussion with the client, daughter, and husband.
You can get the NCLEX Mastery Bundle now. Link is in the description, or you can get it at alphanurseguide.com.